Okay, so welcome back to the GDC English channel. For what? For this series. For which series? The Thalapathy of NIPER series, where we will be live 12 hours straight in a day, in which we will be revise the pharma portion as well as the non-pharma portion. And you know what? This series is going to be responsible for your better version before the NIPER. Yeah. Good morning, everyone. Good morning. Welcome back to this series, guys. And I truly welcome you all over here because this is the exact series which I wanted to be upload over here for you guys only, because everyone knows, sir, NIPER is all just about model paper marathon. But what about this? This is the series which shape your AIR, which changes the AIR. All right. And that is why we are here to build the all India rankers from the South region, right? That's why we are here over here. Good morning, �々𝙀𝙎𝙎𝙬𝙀𝙍. Good morning, Shravani. Good morning, Filtered. Good morning, Navneetan. All right, guys. Those who are watching this one, thank you so much for being here. And I truly welcome you all over this Thalapathy series of NIPER, in which we will be going 12 hours straight live with different faculties with their respective subjects. Right? So, and you know what? At the end of the series, I mean, after 3 days, you will be feeling like, sir, I have got adrenaline on my veins. You have got adrenaline on my veins, and sir, this adrenaline is definitely going to work for me onto the examination hall when you are writing your NIPER exam on your respective centers. Right? Good morning, everyone. Good morning. Good morning. Hana? So, can you feel some adrenaline in your veins? Just tell me into the comment section. Are you feeling some adrenaline in your veins or not? Yes or no? I want the answer. Once you start feeling that adrenaline, now it's the time for that adrenaline to bind onto some receptors. And what are the receptors that we study in pharmacology, right? All right, all right, all right. Okay, guys. Okay, fine. So, make yourself a Thalapathy now, because we all Thalapathis of here of GDC English will make you even a more better Thalapathy version of yours. Okay, so make sure you remember my words. After 3 days, you'll be feeling that adrenaline and you'll be feeling that damn confidence in your head that, sir, no one is going to stop me to get the better version of myself, to get that dream AIR into the NIPER JEE 2026. So make sure you remember that. GPAT Discussion Center. That's a short GDC, but G for greatness, D for dedication, and C for consistency that we usually give to you over here. Okay, so make sure you continue all these things. All right. All right, guys, are we good to go? Just give me a thumbs up or give me a fire emoji now. Just give me a fire emoji now, because this series is not just less than a fire itself. So that's why I want that fire emoji into that comment section, guys. Chalo, come on. Then we can start this one. Yep. Yeah. Fire, 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 fire. Yes, exactly. That's what I want, right? That's what I want. And that's fire should be remained till 3 days. Okay. And even after that, when you were writing your NIPER JEE examination. Okay. So make sure this thing in your damn subconscious mind. All right. Chalo, let's go with the first question. All right, guys. Let's go with the first question that we have. Okay, so here we have 150 MCQs for the pharmacology. And you know it, that what kind of pharmacology we deal with, right? Even the NIPER question maker also know it, that how GDC produce the rankers, That's what we are here to solve this 150 MCQs. Okay? All right, guys. All right, let's go ahead now. So, which statement best describes the mechanism of the action of thiazide diuretics, guys? Okay, so this is the question from thiazide diuretics. Okay, ready to roar? Yes, yes, yes. Yeah, come on. Simple question over here. Hai. The people like you, the students like you, the champs like you. This question is so easy for you. Anna. Right? Right? So this one, which statement describes the mechanism of action of thiazide diuretics? Okay, so thiazide diuretics blocks sodium potassium ATPase pump into the late DCT. Alright. Inhibits sodium chloride co-transporter into the early DCT, or inhibits sodium chloride co-transporter in late DCT. Inhibit carbonic anhydrase inhibitor in PCT. What's that, guys? What's that? Yep. Ritax says B, Filtered says B, Ambadipudi says B, Shravani B, Ritax, okay. Lakshman, Navneethan, Shivani Sharma B, Pranay Kumar Madi B. Very nice, very nice. So the answer over here is B only, because thiazides act onto the distal convoluted tubule. To be precise, early distal convoluted tubule, just to inhibit this sodium chloride co-transporter. And now if I talk about over here, sodium potassium 2 chloride, then sodium potassium 2 chloride co-transporter in ascending loop of Henle. Ascending loop of Henle. Then which drug would be binding onto this one, guys? Then which drug will be binding onto this one? Yeah, over here, sodium potassium 2 chloride. That's your furosemide. Exactly. That's your loop diuretics. Very nice, champions. Or okay, now if I talk about this, inhibit carbonic anhydrase inhibitor in PCT, that will be your what? That will be your acetazolamide, right? That will be your acetazolamide. And now let's talk about more in detail about the acetazolamide, because acetazolamide is one of the most favorite drugs for the NIPER question makers, right? Now let's talk about more. Now let's talk about more over here. Okay, so acetazolamide is the drug of choice for what? Acetazolamide is the drug of choice for what, guys? Drug of choice for mountain sickness, right? Mountain sickness. Okay, mountain sickness arises. Now if I talk about motion sickness, then which drug is useful for that? That is your hyoscine. Hana? Hyoscine is very much useful as in your motion sickness. What about morning sickness, guys? What about morning sickness? Morning sickness, we do have what? We do have your doxylamine, right? Doxylamine for your motion sickness. Okay, so these kinds of sickness you have to be prepared for that. Okay, motion sickness, hyoscine. Hana? This mountain sickness, acetazolamide. This morning sickness, doxylamine. Do not confuse with any kind of sickness over here. All right. Okay, glaucoma, mountain sickness, epilepsy, carbonic anhydrase inhibitor, decrease aqueous humor, cause metabolic acidosis, cause urinary alkalosis. Very good, Murugan Kulkarni. Very nice, very nice. Apart from that, if I talk about acetazolamide, yes, acetazolamide is one of the drug which is useful in closure angle glaucoma. Closure angle glaucoma, right? Closure angle glaucoma. Also in open angle glaucoma they have been used. but specifically used in closure angle glaucoma. Very nice, champions. Very nice. Very nice. Very good. Very good. All right, let's go ahead now. Let's go ahead now. Okay. So the answer would be over here. Simple. Sodium chloride co-transporter in early DCT. Yes. Chalo. Very nice. Okay. This classification of the mechanism of action, right? Very important. CAS, carbonic anhydrase inhibitor, proximal convoluted tubule. Loop diuretics, ascending loop of Henle. Thiazide, early distal tubule. Potassium sparing, late distal convoluted tubule as well as collecting duct. Osmotic diuretics will be your descending loop of Henle. All right. Yep. Chalo. Now let's go ahead. Okay. The action of which class of enzyme inhibitors can be reversed by adding an access substrate? That is through pharmacodynamics only. That is through pharmacodynamics only over here. Okay. The action of the which class of enzyme inhibitor can be reversed by adding an access substrate? Uncompetitive inhibitors, competitive inhibitors, non-specific inhibitors, or allosteric inhibitors. What's that, guys? So simple, so simple, so simple. Chalo, chalo, come on, come on, come on, come on. Yeah. Yeah. Good evening. अभी भी नशे में हो है ना देविक? Non-stop series. Yes, non-stop series. Exactly, exactly. है ना? All right. Over here, if I talk about, this is your competitive inhibitor. Sir, what happens in competitive inhibitor, sir? We don't wanna just mug up all the things over here, no? So that's why Divanshu sir is here. That's why all the teachers are here. They will not be going to mug you up with the concept. They will make you learn the concept. What's that? What's that, guys? For example, this is your enzymatic site. It seems to be like a rajma or kidney bean, but still, for example, this is your active site. Okay, this is your active site over here. Okay, all right. This is your active site, and now you have the substrate and you have inhibitor, right? For example, this is your substrate and this is your inhibitor. So they will be acting or they will be competing dishum for which thing? For this active thing, that is your active site, right? This is your active site, Hana. And over here, if I talk about this inhibitor will be in competition, right? But this inhibitor has more binding capacity as compared to that substrate. So what will happen? Inhibitor is going to bind onto this active site. This is your enzyme. This is your substrate. This is your inhibitor. Inhibitor is going to bind onto this site. That's your active site. So what will happen? What will happen to the Km value and what will happen to the Vmax value, guys? Tell me. What is going to be happen with Km value? What is going to happen with Vmax value? Km is nothing but the affinity of a substrate to bind with enzyme. Km is what? The affinity of the substrate to bind with enzyme, that is your Km. But the substrate is not even binding, no? Substrate is not even binding. So affinity remains same, that is your constant. Km remains constant. Yeah? Or what? Huh? Km remains constant or what, guys? Km doesn't remain constant. What's that? Yeah, Km increase. Exactly. Km remains increase because, the affinity is inversely proportional, affinity is inversely proportional to the Km value, right? Affinity is inversely proportional to the Km value. So F substrate is not going to bind onto that enzyme. That's why Km is going to increase. But still, there is no binding of the substrate to the enzyme. What will happen? There will be no activity, no enzymatic activity. So Vmax will be same, right? Vmax will be same over here. Km is going to be increase. Exactly. Very nice. Very nice. Okay. Now, if I talk about this one, uncompetitive inhibitor. So, uncompetitive inhibitor pe what is going to be happen? Same. Km as well as Vmax. Both are going to be decrease. Both are going to be decrease. In non-competitive, in non-competitive, this inhibitor is not going to bind onto this active site. This inhibitor is going to bind onto the is going to bind onto the allosteric side. For example, this is the allosteric side. Inhibitor is going to bind over here. So Km remains same. In non-competitive inhibitor, Km remains same, but Vmax is going to be decrease. Vmax is going to be decrease because Km is nothing but what? Affinity, right? Km is nothing but affinity and Vmax is going to be decreased down. Exactly filtered. Very nice. Okay. Chalo. Next question, guys. Next question. Competitive inhibitor. Hana? Yes. In competitive inhibitor, this inhibition can be surmountable. Surmountable means once you add more amount of substrate into that substrate can, overcome the inhibition of competitive inhibitor, right? That's why it is written as surmountable over here. Okay, chalo. Now, a new drug molecule is first tested to simple. Bacha knows. Everyone knows. It is your healthy people, sick people, animals, or none of the above. Yeah, guys. Simple. Yes. Guys. Anyone? Over here. Simple one, right? A new drug molecule will be always first tested on what? That's your no, Shravani, no, Ritax, no. Animals. Animals, and that's what you do in NIPERs, In NIPERs, what do? You don't study onto the clinical trials. You don't study onto the clinical trial. You study onto the animal. That's why animal studies are done into your NIPER. And that's a part of your research as well, right? So, before any kind of the drug, if it has to come into the market, it has to be first tested onto the animals only, right? It has to be first tested onto the animals only, and that is what needs to be as preclinical trials, right? Preclinical trial, right? Preclinical trial. Understood? Over here, preclinical trial are responsible for testing of a new drug molecule into the animals, right? Now, can you guys tell me which application is filed just after the preclinical trial? Yeah, anyone? Which application is filed just after the clinical trial? Preclinical trial, I'm asking. Yeah, anyone? Preclinical trial, we do have what? INDA, right? INDA is going to be filed. It's not ANDA tropylium. It's not ANDA. It's INDA. That is your investigational new drug application, right? Investigational new drug application over here, which is filed just after the preclinical trial, just after the preclinical trial over here, right? And once the preclinical trial done, INDA is filed to which regulatory authority? Which authority over here? CDSCO. CDSCO is the regulatory authority of India, right? And after that, phase clinical trials are start. That has been done onto the humans. First phase, that is on your humans. Say, you can say healthy volunteers, healthy humans, right? Healthy people. Then after that, phase 2, phase 3, and after phase 3, what do you observe? After phase 3, NDA or ANDA is filed. ANDA or ANDA is filed, right? NDA is what? New drug application. For example, if there is a newly synthesized drug, newly isolated drug, that will be going towards NDA. And if there is a generic drug, then it will be going towards ANDA. ANDA. Ana? So what is that? Abbreviated new drug application. So remember that. Remember that, guys. Okay. This is all should be clear now. Alright. Chalo. Let's go ahead. Animals is your correct answer. Okay. Chalo. Scorpion sting causing severe hypertension is treated with. Okay. Scorpion sting cause severe hypertension is treated with. What's that, guys? Scorpion sting causing severe hypertension. Scorpion sting. Yeah. ANDA for generic. And yes, exactly. Very nice, very nice. Over here, scorpion sting causing severe hypertension. What are the hypertension? That hypertension is leads through vasoconstriction, guys. That leads to through vasoconstriction. Then only BP will be increased and then hypertension. You know that. Whenever the scorpion sting bites you, right? Scorpion bites you, so that will lead to the vasoconstriction in your veins, that will lead to the BP. But over here, which drug is going to release that hypertension, that release the vasoconstriction? So out of which drugs over here, which is going to bind onto the alpha 1 receptor? Alpha 1 receptor, because alpha 1 receptor is present onto the blood vessels, which leads to vasoconstriction, right? Over here, if I talk about atropine, atropine is acting onto the M1, M2, M3, and M4, and M5, right? Over here, prazosin, yes. Prazosin is your alpha 1 selective blocker. Alpha 1 selective blocker, and that is what the drug of choice for your scorpion sting. Okay, make sure you remember that. Prazosin is not a drug of choice for benign prostate hyperplasia filtered. Prazosin associated with postural hypertension, that is right. Prazosin associated with postural hypertension with clonidine as well, postural hypotension with clonidine as well. But if I talk about in BPH, what do I talk about? BPH, benign prostate hyperplasia, then congeners, the derivatives, not derivatives, we can say the colleagues of prazosin. These are your tamsulosin, as well as sildosin, doxazosin, terazosin. These are useful in your benign prostate hyperplasia, right? These are going to useful in your benign prostate hyperplasia. Now, benign prostate hyperplasia, sure, these are being useful and very much marketed right now. Tamsulosin, sildosin, very much marketed right now with prostate hyperplasia kind of condition, right? But if the person is having prostate, plus cataract, if the person is having prostate with cataract, and then if you use this tamsulosin, what is going to happen? Do you know what is going to happen? What is going to happen, guys? That is nothing but your floppy iris syndrome. Okay, floppy iris syndrome will be taking place with this one, prostate plus cataract condition. If tamsulosin is taken into the prostate plus cataract condition, then floppy iris syndrome will be taking place, right? Importance, exactly. Who said that importance? Yeah, Pranay Kumar, exactly, guys. Very nice. So this is your one. Naloxone, naloxone is useful in your morphine antagonist, right? Morphine antagonist. Glucagon, if I talk about, guys, glucagon is useful in the poisoning of which drug? Yeah, glucagon is useful in the poisoning of which drug, guys? Glucagon. Come on. Yeah, glucagon is a drug of choice for the poisoning of beta blockers, and insulin poisoning, as well as insulin poisoning. Make sure you remember this one also, guys. Beta blockers and insulin poisoning, we can use this atropine. Glucagon. Atropine can be used in physostigmine poisoning, right? Also, along with this cobra bite, right? Along with this scorpion sting, we do have cobra bite as well. Cobra bite. Many of the student gets confused over here. Scorpion sting, cobra bite. Now, which drug is over here can be used in cobra bite, guys? Cobra bite. We can use Neostigmin can be used as a drug of choice. Okay, drug of choice. That's your in cobra bite. All right. So make sure you remember this one. All right. Chalo. Let's go ahead. Prazosin. This table is very much important. You can expect around 2 to 3 questions. At least 2 questions you can expect from this table, guys. I'm telling you. 2 questions from this table only. Okay. Chalo. After that, an extension of the normal pharmacological effects of a drug or its metabolite is termed as, okay, an extension of the normal pharmacological effects of a drug or its metabolite is termed as, okay, extension we are talking about, extension of the normal pharmacological effects. What is that? Yeah, acetylcholinesterase poisoning, exactly, Satyam. And that's what I said. Now, physostigmine it is being used. And physostigmine can be used over here. Now, this one, an extension of the normal pharmacological effects of a drug or its metabolite is termed as type A ADR, type B, type C, or type E. Type A is nothing but your augmented, right? Type A is nothing but your augmented over here. B for bizarre, B for bizarre, C for chronic, and D for delayed. Yeah. So what is going to be the correct answer over here? Yeah. Anyone? That's your type A. Exactly. Type A is going to be your correct answer over here, which is your augmented, which you can simply say that is your predictable in nature, right? Predictable in nature and dose dependent, right? Dose dependent, right? That is your augmented one. All right, that is your augmented one over here, predictable as well as dose dependent. Okay, chalo, let's go ahead now. Okay, A augmented reactions are direct extensions of the known pharmacological effects. Known pharmacological effects means predictable, right? That's what I said. Type B is unpredictable as well as your dose independent over here as well, right? Okay, now benzoic acid, salicylic acid, and nystatin are agents used for the preparation of candida injections can be treated with. Okay, is it your antifungal ointment, anti-eczematous ointment, antibiotic ointment, or emollients case? What's that? Yep. Anyone? Benzoic acid, salicylic acid, and nystatin are agents used for the preparation of candida. Candida injections can be treated with. What's that? Anyone? Candida. Candida I'm talking about. So the answer would be obviously your antifungal ointment. Candidiasis. Candidiasis is nothing but your fungal infection. Anna, the fungal infections, you'll be needing what? Antifungal ointment. Right? Antifungal ointment. Obviously. Right? Chalo. Now, which of the drug is selective phosphodiesterase 4 inhibitor useful in your COPD? Okay. Inhibitor in your used in COPD. What is that, guys? Theophylline, aminophylline, roflumilast, or salmeterol? Yeah, simple, simple. Phosphodiesterase 4 inhibitor. Phosphodiesterase 4 inhibitor. Theophylline, methylxanthines. These are what? PDE3, PDE3, PDE3. Theophylline, aminophylline. These are your PD3 inhibitor. Roflumilast. Yes, the roflumilast is considered to be as your PDE4 inhibitor. PDE4 inhibitor. And salmeterol, that's your LABA. That is your LABA, long-acting beta agonist, right? Long-acting beta 2 agonist, right? LABA. Over here, roflumilast is very much useful as considered to be as your PDE4. If I talk about PDE4, there is one another drug, guys. There is one another drug which going to inhibit PDE4. What's that? What's that, guys? Do you know? That's a anticholinergic drug. That's a anticholinergic drug. What is that? What's that? Yeah, PDE4. That is nothing but your drotaverine. Drotaverine, है ना? Drotaverine is useful in your menstrual cramps, है ना? Drotaverine is useful in your menstrual cramps. Okay, very much marketed right now these days. Menstrual cramps में, or you can say like simply in dysmenorrhea. Simply in dysmenorrhea, is the condition where 𝘎𝑡𝑎𝑣𝑎𝑟ine is being used. Okay, make sure you remember this one. All right, guys, let's go right now. Roflumilast is going to be the correct answer. Methylxanthines. Okay. All right. Now, mixed edema coma is severe complication of which disease? Mixed edema. Mixed edema, guys. Mixed edema coma is severe complication of which condition? Hyperthyroidism, hypothyroidism, Cushing syndrome, or Addison disease. Exactly, Sumit and Riya Kumari. Very nice. Very nice, guys. Over here, if I talk about mixed edema coma, what is mixed edema? What is mixed edema, guys? When the thyroid levels, you can say your T3 and T4 gets what? Reduce in men. Reduce in men. That is considered to be as your what? Mixed edema. Mixed edema, right? Mixed edema. Hana? So what is that? What is that? T3 and T4 levels is decrease in men. What is that? Hypothyroidism, hypothyroidism, Cushing syndrome, or Addison disease? Yeah, that way your hypothyroidism. Exactly, Sumit. Very nice. Hana? Hypothyroidism would be your correct answer. What if I talk about cretinism? What if I talk about cretinism then? Cretinism is nothing but same thing. T3 and T4 levels decrease in children. T3 and T4 level decrease in children. The C for cretinism and C for children. This is how you can learn, right? M for mixed edema, M for men. This is how you can learn over here, okay? Now, if I talk about hyperthyroidism, that is considered to be as your Graves disorder. Hana? Graves disorder. Graves disease, you can say. Cushing syndrome, when the adrenocorticotropic level, ACTH level is going to be increased, that's your Cushing syndrome. When ACTH level is going to be decreased, then it is considered to be as your Addison disease. Okay. So yeah, this one is going to be your correct answer. Hypothyroidism. Exactly. Now, here you can see cretinism in children, mixed edema in adults, that is men, goiter, deficiency of iodine, swelling over here. After that, hyperthyroidism, Graves disease, that's what I told you over here. Now, which of the following hormone are also known to be as a lactogenic hormone? Oh, simple, guys. That would be answer in just few seconds. What is that? Yeah, lactogenic hormone. Lactogenic hormone, corticosteroids, exactly. Yes, over here. Is it your prolactin, estrogen, progesterone, or all of these? Lactogenic. Lactogen powder, Lactogen. Lactogen what? Lactogen milk, right? That is what? Milk production. So out of this, which one is responsible for the milk production, guys? Milk production, guys. Milk production. So once you write milk production over here you can see pro. Here you can see pro, and pro means lactin, prolactin. The milk production is going to be increased with prolactin, right? But the ejection of milk is done through which hormone, guys? Yeah, come on. Ejection of milk from the myoepithelial cells of the mammary gland. Yeah. Which hormone is responsible for the ejection of milk over here? Anyone? Yep. Ejection of milk. That is through oxytocin, right? Oxytocin. So make sure you remember this one. Milk production, pro means lactin, prolactin. Ejection of milk, that's your oxytocin. Okay, make sure you remember this one. Very good, Shravani, Vanshika, Sumit, and Pranay Kumar. Very nice. That is your oxytocin. Okay, now, which of the following is a cholinergic drug useful in Alzheimer disease? Alzheimer disease, guys. Alzheimer disease. Memantine, donepezil, levodopa, or bromocriptine. Alzheimer disease. I'm talking about simple, right? Simple, 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 simple. Huh? This seems to be simple. Why? Because you have done the homework of yours. You have done the hard work of yours. You have done the sacrifices of yours. And that's why you can say, sir, this question is so simple. This question is so simple. Remember these things. What you are going to face over here, if it feels simple, that means you have done a lot for this, right? Now, memantine, donepezil, levodopa, or bromocriptine. Obviously, that would be your donepezil over here, which is considered to be as a cholinergic drug useful in your Alzheimer disease, right? Apart from that, if you talk about tacrine, right? Tacrine was considered to be as the drug of choice for Alzheimer's earlier, okay? Earlier. But now it got banned. But now it got banned, right? Now it got banned just because of the hepatotoxicity. Hepatotoxicity. Which city? Hepatotoxicity over here, okay? This is your correct answer. Memantine is your NMDA antagonist, right? NMDA antagonist over here. Hana? Memantine is nothing but NMDA antagonist, which has also been useful in your skeletal muscle relaxant. Hana? Levodopa and bromocriptine, these are been useful in your Parkinsonism. Parkinsonism, right? Chalo. Okay, donepezil is going to be your correct answer. Now, prostaglandin analog misoprostol protects the stomach by. Okay. Okay. This one, guys. This one. Simple, easy, right? Prostaglandin analog, that is misoprostol, which is nothing but your PGE1. PGE1, right? PGE1 protects what? The stomach by inhibiting the H plus K plus ATPase, promoting mucus and bicarbonate secretion, neutralizing acid directly, or blocking H2 receptors. What's that? Yeah. Anyone? Inhibiting S plus K plus ATPase, that is nothing but PPIs. Okay? PPIs, proton pump inhibitor, omeprazole, pantoprazole, lansoprazole, right? Promoting mucus and bicarbonate secretion. Yes. Trishul Yadav, exactly. Anna Ritax, very good. That's your B over here because prostaglandin is going to increase the synthesis of mucus, right? Because the prostaglandin is used to increase the secretion of mucus as well as bicarbonate secretion so that the acidity remains down, right? Neutralizing the acid directly, that is your antacids, blocking H2 receptor, that's your cimetidine, famotidine, ranitidine, those kinds of things. Okay, now if I talk about PPIs, right? Misoprostol can be used. Misoprostol can be used in your ulcer, peptic ulcer, but the drug of choice is only PPIs. Remember that. Misoprostol, that's your PGE1, can be used, but over here, the drug of choice is PPIs only. Misoprostol can cause abortion also. Remember that. This can cause abortion also. PGE1, misoprostol, abortion, right? Okay, chalo. All right. Anything else? Yeah. One more thing. PPIs, may we do have omeprazole, omeprazole, right? Omeprazole containing what, guys? Enzyme inhibitor activity. Enzyme inhibitor activity in your omeprazole, right? And omeprazole is very much safe in your pregnancy as well. This thing, yeah, this question. Omeprazole is your enzyme inhibitor. This already came in 2023 NIPER JEE questions. Okay, so make sure you remember this one. Okay, now H2 receptors, H2 receptor, H2 antagonist. If I talk about cimetidine, so this is also considered to be as your enzyme inhibitor. Enzyme inhibitor over here. Okay, cimetidine enzyme inhibitor. Exactly, guys. Okay, now this one. Next question. Okay, which of the following drugs exhibit zero order kinetics or toxic dose? Okay, simple, easy. Do I have to tell you anything? Yes, cimetidine is a prototype. Exactly. Prototype gynecomastia. Very nice. Even omeprazole can also cause gynecomastia. Very good, guys. Shravani. Yes. Over here, zero order. zero order kinetics at high or toxic doses. What's that? Paracetamol, aspirin, amoxicillin, or metformin? Yeah, anyone? 0 watt power, remember? Remember 0 watt power. W for warfarin, A for aspirin, as well as alcohol, right? T for theophylline, T for tolbutamide, and P for phenytoin. Yeah. Out of this, which you can see? Aspirin over here, right? Aspirin over here is considered to be as your what? Zero order kinetics, right? Make sure you remember this one. Aspirin over here. Okay? Chalo. Okay. Next question. Okay. Which adrenergic receptor is present on the postsynaptic blood vessels? Okay. Postsynaptic blood vessels I am talking about. Alpha 1, alpha 2, beta 1 or beta 2? Yeah, 0 watt power. Exactly, Pranay Kumar. Hana? Very nice, very nice, very nice. Okay, this one. Alpha 1, alpha 2, beta 1, beta 2. Yeah. What's that? Simple? Easy? Yes. Alpha 1? Yes, that is what present in your postsynaptic blood vessels. Alpha 2? Presynaptic. You know? Presynaptic. Right? Beta 1? Present in your heart. Also in JG cells of kidney, right? Beta 2, all smooth muscles as well as skeletal muscles and glands also, and glands also. Here you can see that's your smooth muscles, lungs, gastric mucosa, uterus, also you can say skeletal muscles, blood vessels as well, your glands, these are all have the innervation of B2. If I talk about alpha 1, it has innervation of GQ receptor. Alpha 2, if I talk about over here, this is an autoreceptor that is GI, beta 1 and beta 2 both are GS, even beta 3 is also GS over here, right? Lazy receptor, exactly. Okay, everyone see beta alpha 2. Okay, alpha 2 is present post synaptic blood vessels. Alpha 1 is your blood vessels. Acha. Fine. So sorry guys, post-synaptic is your correct answer over here. Tabun, sarin and soman. Tabun, sarin and soman are examples of reversible cholinesterase inhibitor, carbamates, nerve gas or anti-muscarinic agents. Yeah, what's that? Anyone? Tabun, sarin, soman are examples of reversible cholinesterase inhibitor, carbamates, nerve gas or anti-muscarinic agents. Yeah, anyone? Tabun, sarin, soman? That is nothing but your nerve gases, right? Nerve gases over here, which comes under your organophosphates, right? Organophosphates. Now, antihistaminic drug salbutamol acts by the following receptor. Okay, anti-asthmatic. Sorry, yeah, anti-asthmatic. I was reading this antihistaminic. Okay, anti-asthmatic drug salbutamol, which is nothing but your Saba, Sabash. Saba is what? Short acting beta 2 agonist, right? Short acting beta 2 agonist. So is it acting onto your beta 1 receptor agonist? No. Beta 2 receptor agonist, alpha 1 receptor agonist, beta 3 receptor agonist. What's that? That is your nothing but beta 2 receptor agonist over here, right? Beta 2 receptor agonist. Remember? Salbutamol, terbutaline, and that's what we are over here. Salbutamol is going to be your correct answer. Beta 2 receptor agonist. Okay. Now, if I talk about this one, guys, beta 3 receptor, this is crucial. Beta 3 receptor antagonist, if I ask. Beta 3 receptor antagonist. So, what will be the drug which will be acting onto the beta 3 receptor as an antagonist? Yeah. Anyone? Beta 3 receptor antagonist, I am asking. Yeah. Anyone? Beta 3 receptor antagonist. Anyone? Mirabegron, right? This is one of the drug which is acting onto the beta 3 receptor, and beta 3 receptor is present in your urinary bladder, right? Urinary bladder, adipose tissue, adipose tissue, as well as your what? Coronary arteries, coronary arteries. Okay, so urinary bladder. For specific for this, the drug of choice is your mirabagrone. That is not statins. Okay, chalo, mirabagrone guys. All right. Now, heart rate of a patient on imipramine rises to 120 per minute and has blood vision. The effects is due to, okay, imipramine, desipramine, imipramine. Yeah, anyone? What's that? Is it through anti-muscarinic effect of imipramine, epinephrine potentiator, ganglionic blocker, or alpha adrenergic antagonist? What's that? Yeah, over here. Over here, guys. This one. Yeah, this one, guys. Heart rate of a patient, that is through anti-muscarinic effect of the imipramine, because imipramine is your tricyclic antidepressant. Tricyclic antidepressant have some anticholinergic activity as well. That's why we can say that is your anti-muscarinic effect of imipramine over here, right? Okay, now here you can see it has TCA, and TCA has significant anti-muscarinic anticholinergic activity. That's why heart rate is tachycardia and blood vision can takes place over here. All right, chalo. A patient with asthma should avoid which kind of topical glaucoma medication due to potential bronchospasm? Okay, topical glaucoma. Topical glaucoma medication due to potential bronchospasm. Okay, prostaglandin analog, topical beta blocker, like timolol, topical carbonic anhydrase inhibitor like dorzolamide, or alpha 2 agonist like brimonidine. Yeah. So this is a combination of things right over here. Na? The one patient is suffering from glaucoma and the same person is suffering from your asthma as well. Hai na? So which drug should be avoided in glaucoma condition so that the condition doesn't worsen over here in asthma condition? Okay, so make sure you correlate all those things. So what's that? Yeah. Anyone? Anyone? Okay, prostaglandin analog. Prostaglandin analog, these are nothing but your PGF2 alpha, Hana, that we used. PGF2 alpha analog that we used, Hana. What's that? Latanoprost, bimatoprost. It doesn't have any kind of the thing with bronchospasm, Hana. Topical beta blockers like timolol. Yes, beta blocker. Beta blocker, I am asking, no? Beta blocker, I am saying. So timolol is nothing but non-selective beta blocker, right? Non-selective beta blocker. That is your non-selective beta blocker over here. So non-selective beta blocker, that means it will be acting onto the beta 2 receptor as well. Non-selective hai, so we can say it is acting onto the beta 1, beta 2 as well as beta 3, all three receptors. So beta 2 blocker, and beta 2 is present in your lungs. So what will happen? This antagonize this beta 2 and hence bronchospasm can take place. So B is going to be your correct answer. Timolol. Okay. Make sure you remember this concept over here. Timolol. Okay. Yes. Topical beta blockers like timolol. Exactly. Non-selective beta adrenergic blocker used as eye drop to reduce intraocular pressure in glaucoma. Blocks beta receptor in the ciliary body. That's the all thing. But beta receptor 2 also going to be blocked through this what? Through this timolol. That's why it can cause the bronchospasm, right? What is the primary neurotransmitter released by preganglionic afferent nerves in the sympathetic nervous system? Okay. What's that? Sympathetic nervous system. Okay, guys. Simple. Simple, simple, simple. Which kind of neurotransmitter? Sympathetic. I told you, no? I told you in the starting. Once your sympathetic system gets activated, adrenaline starts running in your veins over here, right? So what's the correct answer? Simple. Adrenaline is going to be your correct answer. Sympathetic system to adrenaline, or you can say epinephrine. Hana? Glycine and GABA, these are your inhibitory in nature. Inhibitory in nature. Hana? Acetylcholine and adrenaline, these are your mixed kind of nature. Okay, make sure you remember. Okay, acetylcholine in your parasympathetic condition, and glycine and GABA, these in your CNS में, if you have inhibitory kind of condition, then glycine and GABA are being used over here. Okay. Oi. Acha, okay. See over here, guys. Preganglionic. Preganglionic, they are asked. Not postganglionic, right? Preganglionic, they have asked. This and that. So here it will be your acetylcholine and here it will be your adrenaline. Okay. And this is your receptors over here. Hana? So this preganglionic part, Hana? And this is your postganglionic part over here. Postganglionic part. So adrenaline would be here, but preganglionic is your acetylcholine. Okay. Chalo. So sorry. Okay. Now, sand eyes are caused by. Okay, guys. Okay. Sand eyes are caused by simple timolol, latanoprost, 𝘿𝙗𝑎𝑟𝑏𝑖𝑛 or apraclonidine. Chalo. Anyone? Anyone of you? Yes, who can answer this one? This question I have talked into the class as well. I think Shravani can answer. Shravani, are you here? Hana? Yes, Pranay. Always as ACH onto the preganglion. Exactly. Hana? Yeah. Anyone over here who can answer this one? Simple, easy question. Hana? Sand eyes are nothing but caused by PGF2 alpha. PGF2 alpha analog. Okay, PGF2 alpha analog. Is it your timolol, latanoprost, 𝘿𝙗𝑎𝑟𝑏𝑖𝑛 or apraclonidine? Yeah. 𝘿𝙗𝑎𝑟𝑏𝑖𝑛? अरे नहीं यार. 𝘿𝙗𝑎𝑟𝑏𝑖𝑛. Sand eyes. PGF2 alpha, right? No issues. Now, which combination may help or to prevent the respiratory paralysis in cobra envenomation? Okay. Respiratory paralysis in cobra envenomation. Okay, over here. So this one, neostigmine plus adrenaline, atropine plus adrenaline, neostigmine plus atropine, or physostigmine plus propanolol. Okay, which one is it, guys? Which combination may help to prevent respiratory paralysis in cobra envenomation? Cobra, guys. Cobra. I told you something about cobra. Yeah. What is cobra over here? Which one is used? Obviously, that would be your neostigmine. But along with what? Adrenaline or atropine? Adrenaline or atropine? What's that? Yeah. That is your neostigmine plus atropine. That's what I told you earlier before. Na? Neostigmine is useful in your cobra bite with atropine over here, not with adrenaline. Alright, chalo. Now, dinoprostone is an analog of NIPER JEE 2021. Okay, PGE1, PGF2, PGI2 or PGE2. Dinoprostone, guys. Dinoprostone. PGE1, PGF2, PGI2, PGE2. By the way, this one is also very much important, guys. The table of this derivative, names of that derivative, PGE1 का क्या नाम है, PGE2 का क्या नाम है that is what going to be very much important in the context of your NIPER examination over here. Dinoprostone is nothing but your PGE2. Okay, dinoprostone, PGE2. Here you can see natural prostaglandins, PGE2, dinoprostone. Okay, over here dinoprost, PGF2 alpha. Simple. What is the difference between? Here you can see dinoprostone, PGE2, but dinoprost is PGF2 alpha, right? And alprostadil, PGE1. Alprostadil in PGE1. Alprostadil is useful in your erectile dysfunction, also used to open the patent ductus arteriosus. Patent ductus arteriosus, that you have to remember over here. Okay, chalo, nice. Meloxicam belongs to which class of non-steroidal anti-asthmatic anti-inflammatory drug? NSAIDs. Okay, guys, meloxicam. Meloxy में मिलावट है ना? I said meloxicam is mixed. Whatever it seems to be, that it will be coming onto the preferential one, but it will not. It will not. What's that over here? Yeah. Selective COX inhibitor तो not allowed. है ना? Preferential COX 2, selective COX 1 not allowed. Preferential COX 1 होता ही नहीं है ना? Preferential COX 2 inhibitor, obviously that is your preferential COX 2 inhibitor. It seems to be like enolic acid derivative of the non-selective COX inhibitor, right? It seems to be, but meloxicam is not just like the tanoxicam. It is different. That's why it is having milavat. Melo means mixing of the substitution, right? So it goes under preferential COX-2 inhibitor over here, right? A is going to be your correct answer. Anna, preferential COX-2 inhibitor, exactly. Here you can see enolic acid derivative. See, enolic acid derivative, pyroxycam, tanoxycam, cam. But, preferential COX-2 inhibitor, here you can see meloxicam. मिलावट है you know मिलावट है, that's your meloxicam preferential COX-2 inhibitor. Okay, simple, you can say and me. Okay, A for aceclofenac, N for nimesulide, D for diclofenac, M for meloxicam, and E for etodolac. And me is the trick to remember this one. Okay, chalo. All right. Flush, flare, and wheal is associated with injection of which drug? Okay, बच्चा knows. बच्चा knows. है ना? Ergocalciferol, adrenaline, atropine, or histamine. Flush, flare, and wheal. What's that? Yeah, exactly, Pranay Kumar. That's what I said over here. No, nimesulide and diclofenac. Over here, that's your flush, flare, and wheal. That is nothing but the injection of histamine, right? That's your allergic reaction. By the way, this is important. Triple response is important, but what is that? That is also important. What is under that? Triple response. Red spot, vasodilation. Red spot is due to the vasodilation. Wheal, exudation of fluid. E, exudation of fluid. Flare is your spread redness. Flare, redness. Okay, this is how you have to remember, guys. Histamine, triple response. This is important. Red spot, vasodilation. Wheal, exudation of fluid, and flare is your spreading of redness. Okay, chalo. Which histaminic receptor is also known to be as your autoreceptor? Okay, autoreceptor, guys. H1, H2, H3, or H4? Autoreceptor. Simple. Yeah, H1 is your GQ mediated. H2 is your GS mediated. But H3 if I talk about, H3 is your considered to be as GI mediated autoreceptor, right? H3? Yes. H3, I think so, no? H1. Acha. H3, guys. H3. 5HT1. Yeah. 5HT1. That is your GI. 5HT1 is your GI. H3 is your autoreceptor. H3 is your histaminic. 5HT1, that's your serotonergic receptor. Serotonergic receptor H1, that's your GI. 5HT1 serotonergic receptor, that's your GI over here. Okay, so make sure you remember this, Sumit. Okay, chalo guys. All right. H1 is GQ, H2 is GS, and H3 is your GI mediated. All right, chalo. Okay. Now, drug of choice for acute migraine is what? Methysergide, sumatriptan, ergotamine, or propanolol? Propanolol. Drug of choice for acute migraine, guys. Acute migraine. Yeah. Acute migraine. QT migraine. Drug of choice for acute migraine. Methysergide, sumatriptan, ergotamine, or propanolol. Yeah. Anyone? That's your sumatriptan, right? Sumatriptan, because it is acting onto the 5HT 1B 1D, right? 1B 1D, 5HT 1B 1D, sumatriptan acts on. Methysergide, ergotamine, propanolol, these are your prophylactic agent. These are your prophylactic agent over here, right? Prophylactic agent over here. Okay, chalo. Propanolol, prophylaxis. Remember this one. Propanolol, prophylaxis. Okay, ergotamine. And if I talk about ergometrin, then ergotamine is useful in migraine for sure. But where we can use this ergometrin? Where we can use this ergometrin, guys? Tell me this one. Ergometrin can be used in where? 5-HT produces contraction of smooth muscles and platelet aggregation via receptor. Okay, produces contraction of smooth muscles and platelet aggregation via receptor. Okay, smooth muscles का contraction that will be leading towards increased BP, है ना? Increased BP, right? So BP के लिए we do have ketenserin. We do have ketenserin, right? And ketenserin, that is our antihypertensive drug. Antihypertensive drug over here, है ना? तो antihypertensive drug ketenserin is acting on to which one? Uterine contraction, exactly, है ना? This ketenserin is going to act onto the 5-HT2 receptor, because this 5-HT2 receptor is responsible for the contraction as well as platelet aggregation. So that's why 5-HT2 is going to be your correct answer over here. Okay. Out of this, one more thing, guys. 5-HT1 is nothing but your GI mediated. Okay. 5-HT2 is nothing but GQ mediated. GQ, that's why contraction. See, GQ, that's why contraction calcium, right? 5-HT3 is the only serotonergic receptor which is your ligand gated ion channel. Ligand gated ion channel. 5-HT4, that's your prokinetic and GS. 5-HT4 से लेकर के 7 तक, 5-HT4 to 5-HT7, these are your GS mediated coupled receptor, right? Prokinetic drugs acting onto the 5-HT4 receptor over here. Okay, so 5-HT2 would be your correct answer. Yeah, exactly. 5-HT2, right? Here you can see GI, okay, 5-HT2 GQ, 5-HT2 GQ, 5-HT3 ligand gated, and 5-HT4, that's your GS over here. Okay, now, which of the following disease is not caused by a virus? Okay, which is not caused by a virus? AIDS, tuberculosis, COVID-19, or hepatitis? Yeah, anyone? AIDS, tuberculosis, COVID-19, or hepatitis? NIPER 2024. Simple, very easy question over here. Yeah, is it your AIDS, tuberculosis, COVID-19, or hepatitis? Huh? Virus I am talking about, right? Very simple, basic, simple one. Hepatitis is caused, bacha. Hepatitis is caused by RNA as well as DNA virus. Okay, hepatitis B is happened through DNA virus, whereas hepatitis A and C, these are associated with RNA virus. AIDS, you know, HIV virus, है ना? HIV. Tuberculosis, what is the causative what is the causative one organism for tuberculosis? Huh? Mycobacterium. Bacterium. What is that? Mycobacterium, what is that? Parasite, no? Is it a virus? Is it a virus? Huh? COVID-19, bachcha knows that's your RNA virus, you know. COVID-19, coronavirus, है ना? So tuberculosis would be your correct answer. Simple. Focus. Understood. Analyze each and every option. Then only you will get the correct answer with accuracy. Okay. Chalo. Anti-TB day, 24th of March. Exactly. Very nice. Now, which drug is contraindicated in gout? Okay. Which drug is contraindicated in gout? Is it your paracetamol, clarithromycin, aspirin, or endomethacin? Yeah, guys. Yeah, simple. In gout, I am talking about paracetamol, clarithromycin, aspirin, or endomethacin. That's your aspirin only, right? Aspirin only, because high dose of aspirin acts as a uric agent that forces the kidney to excrete the uric acid. It is rarely used for this purpose due to severe side effect. That's why it is contraindicated. At low concentration, commonly prescribed for cardioprotection. For example, your antiplatelet action. What is that mg? What is that mg for antiplatelet action? 75 to 325 mg for antiplatelet action, guys. Okay, make sure you remember this one. Okay, now Montelukast acts onto which of the following receptors to block the action of leukotrienes LTC4 and LTD4? Yeah, cis leukotrienes 1, S2 receptor, CB2 receptor, or muscarinic receptor? What's that? Cis leukotriene 1 receptor. That's your montelukast as well as what? Zafirlukast. And there is a adverse drug reaction of montelukast as well as zafirlukast. What's that, guys? Montelukast as well as zafirlukast. That is nothing but Churg-Strauss syndrome. What is that? Churg-Strauss syndrome, right? Churg-Strauss syndrome is the adverse drug reaction, ADR of what? ADR of your montelukast, right? Chalo, very nice. Okay, now, okay. What is the drug of choice for obsessive compulsive disorder, guys? Okay, obsessive compulsive disorder, OCD, where the person seems to be like very much focused towards cleaning all the things again and again and again and again. Obsessive for cleaning, So what is that? Imipramine, fluoxetine, benzodiazepine, or alprazolam? What's that? What's that, guys? Over here, That is your fluoxetine, That's a SSRI, selective serotonin reuptake inhibitor, fluoxetine, right? That has been used in your OCD. Okay. First line SSRIs, fluoxetine, fluoxamine, sertraline, paroxetine, escitalopram, and citalopram. Okay, now this one. Which of the following anti-seizure medications primarily acts by blocking T-type calcium? Oh, yeah, T-type calcium channel in the thalamic neurons. Yeah, what's that? What's that? Is it your phenytoin, carbamazepine, ethosuximide, or phenobarbital? Simple answer is your ethosuximide, which can be useful in your T-type calcium channel blocker antagonist, which is a drug of choice for absence seizures, drug of choice for your absence seizures, right? And if I talk about over here, absence seizure is also known to be as your petit mal epilepsy, petit mal epilepsy, right? Epilepsy. Where if I talk about this carbamazepine can cause Stevens-Johnson syndrome. Stevens-Johnson syndrome, carbamazepine, useful in your partial seizure. Drug of choice for your partial seizures, right? Partial seizures over here. Okay, so make sure you remember this one. All right, ethosuximide. Yeah. And which of the following ingredients has neither specific antitussive or nor expectorant nor bronchodilator action, but is commonly present in proprietary cough formulations? Okay. Nor antitussive, not expectorant, nor bronchodilator. Okay. Commonly present in proprietary cough formulation. What's that? What's that, guys? Sodium channel. Ambroxol, chlorpheniramine, noscapine, or guaifenesin? Yeah. That is your chlorpheniramine, which is your antihistaminic drug, right? Which is your antihistaminic drug. Like noscapine is your non-opioid. Noscapine is your non-opioid. Guaifenesin is your expectorant, right? Noscapine has been used, Sumit. Noscapine is your non-opioid, which has been used as a antitussive agent. Okay. Chalo, antitussive. First generation H1 antihistaminic. Noscapine here you can see antitussive, non-opioids. Okay. The last line drug used to treat most antibiotic resistant bacterial infections. Okay, now bacterial infections. Last line drug. Most antibiotic resistance bacterial infection. Is it your carbapenems, fluoroquinolones, macrolide, or cephalosporin? Yeah. Anyone? Anyone over here? Yeah, that is your nothing but carbapenems, which is having high toxicity, but that can be used in your highly resistant, most antibiotic resistant infections. Okay, even in respiratory failure, also this carbapenems is being used. Okay, carbapenems is being used. Exactly, very nice, Sumit. Okay, now the following anti-asthma drug is not a bronchodilator. Not a bronchodilator. Okay, ipratropium bromide, that's your anticholinergic for sure. Anticholinergic for sure, which is being used as a bronchodilator. Theophylline, yes, it has been used. Theophylline is your methyl xanthines, Theophylline is nothing but your methyl xanthines, xanthines. Okay. Here, if I talk about formoterol, the formoterol is your LABA, long-acting beta-2 agonist. Sodium chromoglycate doesn't consider to be as your bronchodilator. Okay. Sodium chromoglycate. Exactly. Very nice. Shavani, Tamila, Rasi, Sumit D, mast cell stabilizer. Exact. Mast cell stabilizer. Sangam. Yes, yes. Chromoglycate, ketotifen, nedochromyl. These are your sodium. These are your mast cell stabilizer. Okay. Now, what is the primary hormone found in O pill, which allows us to use this safely by a broader demographic? By a broader demographic. Estrogen, progesterone, estrogen with varying dose, high dose estrogen. That's your progestin, guys, over here. Maximum of the oral contraceptive drugs, you can see progestin. That's your progesterone only. Hana? So make sure you remember this one. Progestin over here. Okay. The time drugs takes to reach the effective concentration or steady state concentration depend on its what? Depend on its plasma protein binding, plasma concentration, circulation, rate of elimination from the body, or rate of absorption in the body. Yeah. Steady state concentration, guys. Steady state level. Simple. Yeah. Meropenem. Exactly. And over here, steady state concentration, plasma protein binding, plasma concentration in circulation, rate of elimination from the body, rate of absorption in the body. What's that? Yeah, come on. Hmm. Hmm. Yes, that is obviously going to be a rate of elimination of the body. Hana, the more amount of the drug that is eliminated of the body, Hana, that is the only thing which is considered to be as the next dose. Hana, for the next dose, that is considered to be as, for example, clearance. Hana, clearance is considered to be as directly proportional to what? For the maintenance dose. For the maintenance dose of your steady state concentration, you have given the loading dose at the first time. You have given to the loading dose for the first time. That is considered to be as directly proportional for volume of distribution, right? But what if I talk about maintenance dose? The maintenance dose is considered to be as for your clearance, directly proportional for your clearance over here. Okay, so make sure you remember that clearance. So clearance as well as rate of elimination, all considered to be as same. And how much half-life? How much half-life? 4 to 5 half-life T half is required for your steady state concentration maintenance, right? Okay. Okay, guys. Now, which drug reduces insulin resistance by activating PPAR gamma receptors? Okay. PPAR gamma receptors. PPAR gamma, metformin, pioglitazone, sitagliptin, or acarbose. Simple, right? Simple. Yeah, metformin, you know that is acting onto the AMPK activators. AMPK activator, है ना? Pioglitazone, rose पियो थोड़ा थोड़ा, rosiglitazone, right? Pioglitazone as well as rosiglitazone. These are the ones which are having PPAR gamma receptor activation, right? Pioglitazone is associated with what? Bladder cancer. Bladder cancer. Right? Rose is banned. Rose is banned just because of the myocardial infarction, CHF. है ना? That is also banned. Okay, so we don't use these kinds of drug, rosiglitazone and pioglitazone now because it has pioglitazone having bladder cancer kind of the thing, rosiglitazone MI as well as CHF, renal failure as well. है ना? So we don't use PPAR gamma. G for gamma, G for gamma and G for glucose. Okay, make sure you don't confuse between PPR alpha and PPR gamma. PPR alpha is associated with your anti-hyperlipidemic drug, है ना? Anti-hyperlipidemic drug. PPR gamma, G for glucose, G for diabetes, obviously G for gamma over here. Okay, so PPR gamma, pioglitazone is going to be the correct answer, right? Chalo. Is it written anywhere? No, not written. Okay. Octreotide is useful for what? Octreotide, 𝘿𝙬𝙎, osteoarthritis, pancreatitis, or constipation. Octreotide, guys. Octreotide, acromegaly, that is your, what's that? Decrease in growth or increase in growth? Increase in growth, yes. Increase in growth in adults. In adults, that is considered to be as your acromegaly. But octreotide is what? Octreotide is nothing but D2 blocker. है ना? D2 blocker. So where it will be using? PPR alpha fibric acid derivative. Exactly, Vanshika Tyagi. Very nice, guys. Very nice. है ना? Acromegaly. Acromegaly. Yes, acromegaly is going to be your correct answer, right? Now, is your long-acting analog somatostatin. Somatostatin is a growth hormone release inhibitor, obviously decreasing down the dopamine. है ना? चलो. Fenformin is banned due to aplastic anemia, nephrotoxicity, lactobacillus, or ketoacidosis. Do I have to tell you? Do I have to tell you this one? This is very simple question. Yeah, this is very simple question over here. Very simple. Fenformin is banned due to aplastic anemia, nephrotoxicity, lactic acidosis, or ketoacidosis. Yeah, that is nothing but your lactic acidosis, right? Fenformin, metformin, that's in your same category, anti-diabetic drug, AMPK activator, biguanides, lactic acidosis, right? But if I talk about that one, fenformin is banned, right? Lactic acidosis. But if I talk about metformin, metformin can do megaloblastic anemia. Megaloblastic anemia. Okay. Just because of the vitamin B12 deficiency. Vitamin B12 deficiency. Okay. Remember this one. Metformin, M for metformin, M for megaloblastic anemia. Okay. Yes, exactly. Tamilorasi. Yes, Tamilorasij. Okay. Yeah, this is going to be your correct answer. Lactic acidosis. AMPK activator. Okay. Identify the oral hypoglycemic agent that is chemically as heterocyclic cyclohexyl sulfonylureas analog. Sulfonylureas analog. Okay. So is it your acetohexamide, glyburide, that is also considered to be as a glipizide, glipizide, or tolazolamide? Tolazamide. Yeah. Anyone? Which one is correct? Over here. This is your glipizide, guys. Glipizide, heterocyclic cyclohexyl sulfonylureas once. Okay, sulfonylureas, sulfonylureas is going to increase the secretion of insulin, right? Insulin secretion enhancers. All right. We do have two kinds of drugs. For example, first generation and second generation. First generation, chlorpropamide as well as tolbutamide. Second generation, 4G drugs, glibenclamide, glimepiride, glyburide, and gliclazide, right? Glipizide as well. Okay, so these are the ones. Okay, now chlorpromazine medication can decrease the level of which thing? Chlorpromazine medication. Chlorpromazine is nothing but your antipsychotic drug. है ना? Chlorpromazine is nothing but your antipsychotic drug, right? Chlorpromazine is nothing but your antipsychotic drug. है ना? Antipsychotic drug, obviously it will be acting out of the dopamine. Do it have any serotonin activity except activity? Do it have any serotonin activity? Yeah. Yes or no? No, it doesn't have any serotonin activity over here. Okay. So make sure remember, because it is your typical antipsychotic, not an atypical. This is your typical. Typical antipsychotics will be only acting onto the dopamine T2 blocker. Where if I talk about atypical, the atypical will be acting onto the 5-HT2A2C receptor. Okay. No, it's A only. Which of the following are the endogenous ligands with highest selectivity for mu receptors? Okay, mu receptor, guys. Bacha knows dynorphins, enkephalins, endorphin, endomorphin, and endoformin 2, or substance P. What's that? Yeah. Anyone? Yeah. Over here. That is your endomorphin as well as endomorphin 2. Okay. Chalo. All right. Now, most intravenous general anesthetic agent act predominantly through. Okay, guys. Most intravenous I'm talking about. Intravenous general anesthesia acts against 5-HT receptor, dopamine receptor, GABA receptor, or alpha 2 receptor. What's that? Simple question. General anesthetic agent acts through serotonin, dopamine, GABA, or alpha 2. Obviously, that would be what? That would be what? Huh? GABA A receptor, because GABAergic activity, if increased, you will be in a sedative kind of condition. Okay, so make sure you remember that GABA activity is the one responsible for the anesthesia kind of a thing. Okay, the molecular target for reserpine, net, COMT, GAT, or VMAT2. Yeah, over here, the molecular target of reserpine. Reserpine is going to do what? Reserpine is going to do what? Reserpine is going to inhibit the storage vesicle, storage of something. What? Adrenaline. Yeah, storage of adrenaline into the storage vesicle. So which transporter is going to inhibit? NET, norepinephrine transporter. COMT1 to no. GAT1 no. Or is it VMAT2? What's that? NET or VMAT2? That's your VMAT2 over here. Vesicular monoamine transporter 2. Vesicular monoamine transporter 2 would be your correct answer, right? Okay. Now, which drug can cause progressive visual field constriction? Okay. Visual field constriction. Phenobarbital, vigabatrin, 𝙂𝙁𝙎, or valproate. Yeah. Phenobarbital, vigabatrin, 𝙂𝙁𝙎, or valproate. These are your vigabatrin, which acts against your what? Which acts against your GABA transaminase enzyme, right? GABA transaminase enzyme, Okay, GABA transaminase enzyme irreversibly inhibits and it can cause field constriction. That's your tunnel vision. Remember this keyword, tunnel vision, that is associated with vigabatrin. Okay, vigabatrin, irreversible visual field constriction, tunnel vision, valproate, neural tube defects. Remember this, neural tube defects, 𝙂𝙁𝙎, fatigue and GI distress, phenobarbital, sedation and dependence. Right now, antagonist of benzodiazepine is simple. Plenty of time they have asked. That is nothing but your picrotoxin, atropine, flumazenil only, which is acting onto the GABA A site, right? GABA A site competitive inhibitor at GABA A site. That's your flumazenil, right? Naloxone is been used in your morphine poisoning, atropine, physostigmine, picrotoxin. That is a non-competitive inhibitor, right? Picrotoxin is your non-competitive inhibitor of GABA. Okay, make sure you remember this one. All right. Now, the following anti-epileptic drug is also effective in maniac depressive illness. Okay, maniac depressive illness, mania kind of condition. All of a once, the person can be in a very happy state, or very angry state, or in a sad state. Conversion of a mood, maniac. 𝙂𝙁𝙎, primidone, phenobarbital, or carbamazepine. That's your carbamazepine is going to be your correct answer, right? Now, bipolar mood disorder. Okay. Now, antidepressant drug that can be useful in nocturnal enurances. Guys. Nocturnal enurances is nothing but your bedwetting, right? Bedwetting. That all, I think, of the children has done in their lifetime, even once, for the ones they have been done. Is that so, guys? Do you had complaint of bedwetting when you were so young? When you were so young, सबने किया है वो, है ना? What do you think? Is it your imipramine, fluoxamine, phenelzine, or bupropion? What do you think, guys? Imipramine, fluoxamine, phenelzine, or bupropion? That's it, your imipramine, desipramine, that can be useful through your nasal spray. Through your nasal spray for your nocturnal enurances, imipramine. Okay, chalo. For childhood enurances, on a short-term basis. Okay, chalo. Desmopressin is the first choice drug for nocturnal enurances. Okay, which of the following shows predominant withdrawal hypertension? Okay, withdrawal hypertension, guys. Simple. Withdrawal hypertension. Is it guanethidine, losartan, clonidine, or propranolol? Once you stop the taking drug, it will be increase in BP after some time? Is it your guanethidine, losartan, clonidine, or propranolol? Yeah. Anyone? Simple, easy question, right? Huh? Which one is it? That's your clonidine. है ना? Postural hypertension, then reflex mechanism takes place. That's your clonidine. Alpha 2 adrenergic agonist, rebound hypertension. Yes. Rebound hypertension. Clonidine, if I talk about, the clonidine is also been used where? Where clonidine is also been used? That is also been used in your ADHD, if you remember. ADHD, attention deficit hyper, uh, uh, attention deficit hyperkinetic disorder, right? ADHD, you have to remember over here. Okay. Now, which drug is the traditional first line choice for the treatment of absence disease? Absence disease. At the time of explanation only, I told you. At the time of explanation only, I told you that 𝙂𝙎𝙎𝘾𝙄𝙎𝙎 is the one which can be used in the treatment of absence seizure, which is your petit mal epilepsy, which is your petit mal epilepsy. 𝙂𝙎𝙎𝙾 T-type calcium channel blocker, absence seizures, right? Over here. How it can be propranolol, Pranay Kumar? Huh? Just because you have an starting alphabet of your name as P, so propranolol. Is that so? No, 𝙂𝙎𝙎𝙾𝙄𝙎𝙎, right? So, which of the following is not a proton pump inhibitor? Okay. Proton pump inhibitor, which is not over here. Famotidine, omeprazole, pantoprazole, or lansoprazole. It is just like a, how many of you are not preparing for NIPER? Everyone is preparing for NIPER, right? Famotidine, omeprazole, pantoprazole, or lansoprazole. Over here, omeprazole, pantoprazole, or lansoprazole. Which one is it? That is your famotidine, right? Famotidine is going to be your correct answer, which is your H2 receptor antagonist, right? H2 receptor antagonist. Okay. Chalo, very nice. Famotidine. Okay. Okay. Which component of an antacid suspension is not responsible for acid neutralization? Magnesium hydroxide, aluminium hydroxide, calcium carbonate, or simethicone? Which one is it? Yeah. Which component of an antacid, which component of an antacid suspension is not responsible for acid neutralization? Magnesium hydroxide, aluminium hydroxide, calcium carbonate, or simethicone? Yeah. Anyone over here? What's the correct answer? That's your 𝘎𝐾one. Exactly. Tamilarasij. Okay. Now, magnesium hydroxide, aluminum hydroxide, calcium carbonate acts as the active alkaline ingredients. You know, aluminium has constipation property, magnesium has diarrheal property, right? Whereas simethicone doesn't neutralize the acidic, it is an anti-flatulent, which is a defoaming agent that decreases the surface tension of gas bubbles to help break them up. Okay, help relieving the pressure and bloating as well as gas. Okay, which of the following drugs acts as a ulcer protective agent? Ulcer protective agents, guys. Sodium citrate, ambroxol, sucralfate, or cimetidine. Ulcer protective, they are asking, right? Ulcer protective, they are asking. Sodium citrate, that's systemic antacid. Ambroxol, no, that's your mucolytic agent, right? That's your mucolytic agent, है ना? Sucralfate, yes, that is considered to be as your ulcer protective agent. It only works if pH is less than 4. If pH is less than 4, then only this sucralfate can work. Remember? Yeah. Sucralfate can only work when the pH is less than 4 only over here. है ना? Otherwise, sucralfate will not polymerize and will not having any kind of the protective agent activity, right? Okay. Sucralfate. The new WHO formula for ORS dose does not contain which of these things is not containing into the ORS, oral rehydration solution. Yeah, sodium chloride, potassium chloride, sodium citrate, or calcium chloride. What's that? Guys, sodium chloride, potassium chloride, sodium citrate, or calcium chloride. What's that? Anyone? Sucralfate plus antacid. Exactly, Tamirasu. है ना? Okay, that's your calcium chloride. ClCl2 is not present into the ORS over here. Here you can see, है total osmolarity is important. 245 milliosmol per liter. Okay, 245 milliosmol per liter. That is important. If you can't able to remember this one, make sure you remember this total osmolarity. Okay, 245 milliosmol per liter. Okay, now antidiarrheal agents includes all except antidiarrheal agents. Antidiarrheal, है ना, which can be causing the constipation, है ना, if used earlier, है ना. Many of the people I saw, they would have come into the pharmacy shop of anyone. They would be saying, "Sir, my stomach is upset. My stomach is upset." So pharmacy owner used to say, "What kind of upset? Constipation or diarrhea? Tell me." है ना. So the person says, "Sir, I am having diarrhea, है ना, loose stools I am having, है ना." So now the patient has taken 2 medication of antidiarrheal drug, and now the patient has taken 2 drugs at the same time. So what will happen? Now, in respect of the diarrhea, constipation takes place, and after that, the drug, after that, the drug will be causing the constipation, and that patient again went out to the pharmacy shop. Now, sir, give me anti-constipation drugs. Okay. So over here, this one is the magnesium sulfate is going to be your correct answer over here. Okay. Chalo. Okay. Acetyl. Okay. Now this one. Sorry. So sorry. Atropine acts as a competitive antagonist. Is attractive. Obviously, that would be your acetylcholine. Okay. Okay. Rate limiting step. Rate limiting step. Rate limiting step in the synthesis of noradrenaline involves in the enzymes. What's that? Okay. Involves in the enzymes. Is it a monoamine oxidase, dopa decarboxylase, dopa beta hydroxylase, or tyrosine hydroxylase? Synthesis of noradrenaline, guys. Synthesis of noradrenaline, I'm asking. Yeah. Synthesis of noradrenaline. You know that phenylalanine converts into tyrosine, right? Converts into tyrosine, and this tyrosine converts into L-dopa just because of the presence of tyrosine hydroxylase. Tyrosine hydroxylase, right? Tyrosine hydroxylase. है ना? After that, this L-dopa converts into noradrenaline, right? Yeah, L-dopa converts into dopamine, right? Dopamine through dopa decarboxylase enzyme. Dopa decarboxylase enzyme. Dopa decarboxylase enzyme, है ना. Now dopamine is converted into noradrenaline just because of the dopamine beta hydroxylase. Dopamine beta hydroxylase, है ना. Dopamine beta hydroxylase, and this happens into your storage vesicle. This happens into your storage vesicle, right? Remember? So that is your dopa beta hydroxylase. C is going to be your correct answer over here. C, guys, C. Tyrosine hydroxylase, that's your rate limiting step. Okay, rate limiting step. But noradrenaline synthesis, may you have dopamine beta hydroxylase, that's for sure. But if I talk about, yeah, rate limiting step, they are asking, na? Rate limiting step, what would be your tyrosine hydroxylase? But specifically, if I talk about, specifically, if they wouldn't ask you the rate limiting step, then it would be dopamine. But they have asked rate limiting step, then it would be your tyrosine hydroxylase. Okay, tyrosine hydroxylase. Simple. I'm telling you again, if they wouldn't have asked you this rate limiting step, then the answer would be dopamine beta hydroxylase, because that is the only enzyme which is responsible for the conversion of dopamine into noradrenaline. But rate limiting step they have asked, then it will be your tyrosine hydroxylase. Okay, and me tyrosine, this enzyme is inhibited by me tyrosine, right? Me tyrosine. Okay, chalo. Okay. What is megaloblastic anemia? Caused by iron deficiency, destruction of blood vessel cells, vitamin B12, or chronic blood loss? Yeah. Come on. That is your vitamin B12 only, है ना? Vitamin B12. Vitamin B9, then folic acid. Folic acid, you have, megaloblastic anemia. Over here, vitamin B12. Okay, chalo. Example of HMG coenzyme reductase inhibitor, NIPER JEE 2024. Come on, guys. Simple. है ना? HMG coenzyme reductase inhibitor. Statins, obviously, right? Statins is the correct answer. But what is the adverse drug reaction of statins? That is your muscle pain. That is nothing but your muscle pain, right? And muscle pain is associated as a keyword which is known to be as your rhabdomyolysis, which is your rhabdomyolysis. Okay, rhabdomyolysis, you have to remember. Okay, now if I talk about fibrate, the fibrate is your PPAR alpha, PPAR alpha activator. Oxacin, Silin, no. If I talk about this, the drug which is essential, you can say the drug which is safe in your pregnancy for lowering down the lipids, that is your what? Bile acid sequestrant. Bile acid sequestrant, guys. Okay, that contains what, guys? That contains cholesterol, है ना? Cholesterol, cholestyramine, these are your drug of choice in pregnancy. Drug of choice in pregnancy over here. Alright? Chalo, statins is going to be your correct answer. Now, which of the anticoagulant is the fastest acting, guys? Fastest acting. Yeah, anyone? Fastest acting? Over here? Hmm. Fastest acting, that's your heparin, obviously, because that has been given through parenteral, right? That has been given through parenteral. Hana? Protamine sulfate is the drug of choice for the, you can say, antidote. You can say antidote is of the heparin poisoning, right? Heparin poisoning may we have protamine sulfate as a antidote. Hana? In warfarin, warfarin, that is your oral anticoagulant, coumarin agent, right? And this vitamin K1, vitamin K1 is being used in your warfarin poisoning, right? Warfarin poisoning may vitamin K1 is being used, right? Okay. Now, which of the following is given to treat thrombocytopenia secondary to anti-cancer therapy is also known to stimulate the progenitor megakaryocyte. Okay, progenitor megakaryocyte, guys, over here. Progenitor megakaryocyte, that is nothing but your 𝘎𝙁𝑉𝑘𝑖N. Okay, over here. 𝘎𝙁𝑉𝑘𝑖N is a recombinant form of interleukin 11 used to prevent the treat chemotherapy induced thrombocytopenia. Okay, remember this one. Filgrastim, plenty of time they have asked, guys. Filgrastim, recombinant granulocyte colony stimulating factor. Okay, granulocyte colony stimulating factor over here. Okay, dose of vitamin K in case of serious bleeding is what? Vitamin K. Vitamin K is useful in warfarin poisoning. Is it your 2.5 mg, 5 mg, 10 mg, or 20 mg? Yeah, guys. What's that? Dose of vitamin K in serious bleeding? 2.5, 5, 10, or 20? That's your 10 mg over here. Okay, vitamin K. Which immunoglobulin crosses the placenta? Okay, which immunoglobulin crosses the placenta? Crosses the placenta, that means it guards the placenta, right? It's guards. Placenta is what? Placenta guards your fetus, right? Guards the fetus. Guards means G, G for I, G, G. Simple, right? G, G over here. Guards, and over here IgG. Okay, this is the way that you can learn. Okay, IgG. Now, cleft lip is caused by which of the following drug? Cleft lip, cleft palate, cleft palate. Levetiracetam, phenytoin, sodium valproate, or phenobarbital. Cleft palate, guys. Simple, simple, simple. Cleft palate. Yeah, IgG. Exactly, Shravani. Nikita Kumari. Exactly. C. Tamila Rasai. Yeah. Tamila Rasaj. Okay. Abdul Ghaffar C. Yeah. Over here, cleft lip is caused by which of the following drug? Levetiracetam, phenytoin, sodium valproate, or phenobarbital. That's your phenytoin only, है ना? Phenytoin, as well as you can say your ACE inhibitor also have cleft lip, cleft palate. Okay, chalo, cleft palate. Now, drug of choice for acyclovir resistant herpes infection. Okay, acyclovir resistant herpes infection. Is it your cidofovir, ganciclovir, valacyclovir, or foscarnet? Yeah, anyone? Simple question. Simple question. Drug of acyclovir. If acyclovir doesn't cause any kind of the effectiveness, then which kind of the drug will you be taking? That is your foscarnet, right? Foscarnet are the ones which can be useful for that. Okay. Now, which of the following drug is commonly administered as a rectal suppository to control febrile seizures in the children? Control febrile seizure in children. Phenytoin, diazepam, carbamazepine, or verapamil. Oh, sorry, valproic acid. And into the general pharmacology, when we were talking about the route of administration, this diazepam only, when you can take it through rectal route, that has been useful in your febrile seizures in children. है ना? B को lock कर दिया जाए. Yes, Tamil says that's your B. Exactly. B, it's not D. B only. Okay, diazepam. All right. Drug for migraine which is anti-epileptic. Okay, drug for migraine which is anti-epileptic. Topiramate, lamotrigine, carbamazepine, or vigabatrin. Okay, which of the anti-epileptic drug also been used for your migraine? That is nothing but your topiramate. Topiramate acting onto the sodium channel. है ना? Sodium channel blocker. Topiramate would be your correct answer. Okay, topiramate. All right. Sodium channels enhances the GABA activity, antagonize the AMPK activator. Okay, so this is going to be your correct answer. Now, ACE inhibitor. ACE inhibitor are contraindicated in bilateral renal artery stenosis because, okay, bilateral renal artery stenosis, ACE inhibitor. Because why? Why is that so? Yeah, angiotensin 2 has direct effect on GFR, enhance bradykinin action, hyperrenism affects renal parenchyma, or affects prostaglandins. What's that? Anyone? Dhruvi says B. Okay. Shravani says B. ACE inhibitor are contraindicated in bilateral renal artery stenosis. Angiotensin has direct effect on GFR, enhances bradykinin action, hyperrenism affects renal parenchyma. Okay, that would be considered to be as somewhat logical. Affects prostaglandins. Prostaglandins, no. C would be, I think so, correct answer. No, A is correct answer. Angiotensin 2 has direct effect on GFR. Yeah, obviously, na. Obviously, angiotensin, because angiotensin decreases the excretion of sodium as well as H2O, right? Decreases the sodium as well as H2O because it is going to increase the sodium and water reabsorption. That's why it has effectiveness onto the GFR, right? Simple. Now, most commonly used for the treatment of syphilis. Okay, guys. Simple. Which one is when useful as a treatment of syphilis? Ciprofloxacin, penicillin, gentamicin, or dexamethasone? Ciprofloxacin, penicillin, gentamicin, or dexamethasone? Over here. Yeah. Anyone? Penicillin is going to be your correct answer, I think so, because that is your drug of choice for syphilis. Okay. Last man, if you remember the trick, last man, penicillin, right? Penicillin is going to be your correct answer. Yes. Syphilis is your sexually transmitted disease. Sexually transmitted disease caused by bacterium Treponema pallidum. Yeah. So over here. And what about that one, guys? What about that one? 𝙤𝙎𝙎𝙎 reaction. 𝙤𝙎𝙎𝙎 reaction. Yeah. 𝙤𝙎𝙎𝙎 reaction is considered to be as a hypersensitivity reaction when penicillin injections takes place in syphilitic patients and the breakdown of spirochetal bacteria है ना over here. That's your 𝙤𝙎𝙎𝙎 reaction. Fever है ना, cold, That is what 𝘎𝙬𝙎𝘶 reaction over here, right? Metabolite of drug causes methemoglobinemia. Okay, methemoglobinemia. Yeah, aspirin are used to treat that one. Kavishura, Kavishura. Aspirin are used to treat the 𝘎𝙬𝙎𝑃 reaction, not useful in that. Okay, not causing that. Okay, that is you have to remember. Penicillin can cause 𝘎𝙬𝙎𝑃 reaction. Metabolic of drug causes methemoglobinemia, imipramine, dapsone. Dapsone, obviously, that's your G6PD. If you remember, G6PD deficiency, dapsone, right? Chalo. What is the drug of choice to treat methemoglobinemia, guys? Okay. Methemoglobinemia, methylene blue, aspirin, iron, or dapsone. Aspirin and corticosteroids can given. Yes, exactly. Exactly. Yeah. Over here, methemoglobinemia, methylene blue, aspirin, iron, or dapsone. Methylene blue, aspirin, iron, or dapsone. Yes, anyone? What's the correct answer over here? Methylene blue, aspirin, iron, or dapsone? Yeah, that would be your methylene blue, right? Methylene blue can be the drug of choice for methemoglobinemia, right? Dapsone can cause. Okay, now fetal gasping syndrome is associated with maternal exposure to. Okay, fetal gasping syndrome is associated with maternal exposure to chloramphenicol, benzyl alcohol, sulfonylureas, sulfonamides, or methotrexate. Yeah, anyone? Chloramphenicol, benzyl alcohol, sulfonamide, or methotrexate, gasping syndrome. That is your benzyl alcohol, guys. Okay, low IQ baby, benzyl alcohol. Okay, these are the things. Which of the following oral anti-diabetic drug is insulin secretagogue? Okay, insulin secretagogue. Insulin secretagogue are nothing but that is going to increase the insulin secretion. Increase the insulin secretion, right? So, is it your metformin, pioglitazone, netaglinide, or carbose? Insulin secretion enhancers are having two drugs only. What are those? First one is your sulfonylureas, right? Second one is your meglitinides, tinides. Okay, these two drugs are responsible for increase the insulin secretion. Apart from that, yeah, DPP4 inhibitor also you can say. DPP4 inhibitor also you can say. But that has not been used widely for that. Okay, so metformin and pioglitazone. Metformin comes under AMPK activator, you know that? AMPK activator. Pioglitazone, that comes under PPAR gamma. PPAR gamma. Netaglinide, yes. Netaglinide is the one which comes under your meglitinides, right? Meglitinides. Acarbose is your alpha glucosidase inhibitor. Alpha glucosidase inhibitor, right? Alpha glucosidase inhibitor. This question was asked in your GPAT 2026, this year only. GPAT 2026, acarbose alpha glucosidase inhibitor, right? Netaglinide, same condition with sulfonylureas. These are going to do what? Inhibit the ATP sensitive potassium channel, and hence depolarization will be taking place, and exocytosis through calcium, insulin will be out of the pancreatic beta cell, and that's how insulin secretion takes place. So netaglinide would be your correct answer, which comes under meglitinides. Okay, meglitinides. Okay. Yeah, netaglinide. All right. Okay, guys. So till now, what do you think of this one? Just asking. What do you think of this one? Explanation wise and the question wise, is it going to be helpful for you or not? Yeah, yes or no? Yes or no, guys? Is it going to be helpful for you or not? The question wise as well as the explanation wise. Yeah. What's that? Chalo. All right, no worries. The drug of choice for the treatment of thyrotoxicosis during pregnancy. Okay, thyrotoxicosis during pregnancy. Thyrotoxicosis is nothing but what? Thyrotoxicosis is nothing but when you have increased thyroid T3 and T4 levels. Increased T3 and T4 levels. Yes. So is it your what? Carbimazole, iodine therapy, propylthiouracil, or methimazole? Yes. Yes, yes, absolutely. It's good, sir. Very helpful. Okay, that's all we want, na? That's all we want. If we are doing something and you are liking it and you are uh, producing the good ranks or getting the good result, that's all we want, right? That itself a gift from you, to us. All right? Okay, chala, chala, chala. Over here, what's that? What's that, guys? That's your propylthiouracil, which is safest drug, which is safest drugs in your pregnancy. Drug of choice in your pregnancy. P for pregnancy, P for propylthiouracil. Okay? Chalo. Okay, now propylthiouracil. All right. Now, which of the following is a peripherally direct acting skeletal muscle relaxant? Okay, guys, peripherally directly acting, centrally peripherally directly acting. Okay, directly acting they are asked. Skeletal muscle relaxant. Dantrolene, baclofen, chlorzoxazone, or diazepam. Yeah. What's that over here? Yeah. What's that? Dantrolene, baclofen, chlorzoxazone, or diazepam. Guys. That's your dantrolene only, which directly, I told you not directly acting. That's why it is going to be do what? It is going to be decrease the direct level of calcium. Decrease calcium level directly over here. है ना? Baclofen is your GABA B agonist. GABA B agonist, right? Chlorzoxazone and diazepam are also used as your skeletal muscle relaxant. Okay, dantrolene would be your correct answer over here. All right, chalo. Succinylcholine is known for its ultra short duration of action, a few minutes. How is it primarily eliminated from the body? Okay. How is it primarily eliminated from the body? Just like the acetylcholine. Succinylcholine, acetylcholine. Why is it so? Hepatic microsomal enzymes, renal excretion unchanged, hydrolysis by plasma pseudocholinesterase, or excretion via bile. Simple. Yeah, baclofen is centrally acting. Exactly. Baclofen is your centrally acting. Yeah. What's that, guys? Over here, hydrolysis by plasma pseudocholinesterase, because succinylcholine is just like a congener of acetylcholine, right? By the way, guys, if you are still watching till here right now, make sure you have liked this session. Okay, make sure you have clicked the like button. Click the liked button of your this channel. Okay, this video over here. Okay, chalo guys, that's what I want over here. Right now, the alpha and beta receptor have opposite action onto the following tissue organ except. Okay, opposite action onto the tissue following except alpha and beta receptor. Okay, the contraction of arteriole and veins, contraction of arteriole and veins, contraction of uterus, contraction of intestinal muscles, or insulin secretion. Yeah, contraction of uterus to nahi, contraction of intestinal muscles nahi, arterioles and veins or insulin secretion. Yeah, anyone? Insulin secretion or contraction of arterial and veins? What do you think? What do you think? Intestinal muscle. How it can be that? Acha, except they have asked. Oh, except they have asked, no? Except they have asked, so C would be your correct answer. Insulin secretion, contraction of arterial veins, contraction of uterus also somehow, but C is not going to be your correct answer, except they are asked. Okay. Entacapone and tolcapone are which type of enzyme inhibitors? Okay, guys. Okay, these are been useful in your. These are useful in your Parkinsonism, if you remember. है useful in your Parkinsonism, right? Useful in your Parkinsonism. So is it your MAO B inhibitors, COMT inhibitor, acetylcholinesterase inhibitor, or dopa decarboxylase inhibitor? What's that? Yeah, anyone? Entacapone and tolcapone, these are your COMT inhibitor, which is nothing but your catechol-O-methyl transferase inhibitor. Catechol-O-methyl transferase inhibitor, right? Catechol-O-methyl transferase inhibitor, COMT inhibitor. Out of which they can ask one more question over here, that out of this entacapone as well as tolcapone, entacapone and tolcapone, which one is acting peripherally as well as centrally? Now tell me this. Now tell me this one. Which of the drug is acting peripherally as well as centrally, guys? Yeah. Anyone? Peripherally as well as centrally. Simple. Out of this entacapone and tolcapone, which one is it? Kavishwara says tolcapone. Exactly. Tolcapone is the one which acts centrally as well as peripherally also. Okay. So this is you have to remember. Exactly. Anna? Tamila Rasaj. Yes. Tolcapone. Okay. Drug which is not used in the treatment of malaria caused by Plasmodium falciparum. Not used. Not used. Artemisinin, primaquine, quinine, or mefloquine, guys. What's that? Yeah. Drug which is not used in the treatment of malaria caused by Plasmodium falciparum. That is nothing but your artemisinin. Okay. Artemisinin is not being used over here. Okay. Mostly can be treated with mefloquine, combination of quinine sulfate, primaquine, chloroquine, right? Okay. Antibiotic which is effective as single dose therapy for trachoma. Okay. Trachoma. Is it your doxycycline, clarithromycin, azithromycin, or erythromycin? Yeah. That's it, your azithromycin, which has been useful for your trachoma, guys. Okay. Chlamydia, trachomitis, this which is your STD, sexually transmitted disease, right? Okay. Now, Z-track injections are made by route. Okay. Z-track injections. Z-track injections are made by route. Intravenous, subcutaneous, intramuscular, or intracisternal. Okay. Which one? Over here. That's your intramuscular route. Z-track injections are being made. Z-track. Over here you can see. Z-track method is a special intramuscular IM technique used to prevent the drug leakage into subcutaneous tissue and reduce the local irritation. What's that? Steps: pull the skin and subcutaneous tissue sideways. Here you can see this is the sideways. And they have just pushed it away into the sideways. Insert the your needle into the 90-degree, and you know that. Just punch it downwards, right? Chalo. Mechanism of action, please, sir. Which one? Which one? Chalo. The antibiotic that is highly effective in the treatment of bubonic plague. Okay. Bubonic plague, guys. Bubonic plague. Penicillin, erythromycin, tetracycline, or chloramphenicol. Yeah. Bubonic plague. Anyone over here? Bubonic plague. That's your tetracycline, which has been useful for this. Bubonic plague is caused by the bacterium Yersinia pestis. Okay. Yersinia pestis bite to the infection of rat fleas. Okay. Tetracycline, especially doxycycline derivative, highly effective against Yersinia pestis over here. Okay. So make sure you remember this one. All right. Iatrogenic disease is induced by, okay, iatrogenic, physician induced disease, right? Physician induced disease. Physician induced disease, that is known to be as your iatrogenic. Patient induced, no. Pathogen, no. Antibiotics, no. That's your physician induced, this one. Anna. And there is one more term which is associated with physician. What is that? Nocebo effect. Remember? Nocebo effect, right? Nocebo effect over here, Anna, which is associated with physician, which is a negative feedback of that particular physician that leads to the nocebo effect, in which the drug will not be able to show any kind of pharmacological effect through psychodynamic thing over here. Okay, the nocebo effect. All right. Now, okay. Now, one of the following is the adverse effect of pyrazinamide. Pyrazinamide: neurotoxicity, hyperuricemia, flu syndrome, or acidosis. What's that? Yeah. What's that? Neurotoxicity, hyperuricemia, flu syndrome, or acidosis? Huh, guys? That is your hyperuricemia, right? Hyperuricemia is going to be your correct answer, right? Hyperuricemia, which is your pyrazinamide, है ना? Apart from that, pyrazinamide also have the adverse effect of pain in joints, right? Pain in joints, है ना? Neurotoxicity, that is what considered with INH. That is what considered with INH over here, isoniazid, है ना? I for insanity, I for insanity, right? N for neurotoxicity and H for hepatotoxicity, है ना? Hepatotoxicity. This neurotoxicity can be prevented by which thing, guys? This neurotoxicity can be prevented by vitamin B6, right? Vitamin B6. Hyperuricemia, you know that, pyrazinamide. Flu syndrome. Flu syndrome is associated with rifampicin. Flu syndrome is associated with rifampicin over here. Okay, so make sure you remember this one. है ना? Rifampicin, Dr. Rifa, DNA dependent RNA polymerase enzyme को they're going to inhibit, right? Rifampicin flu. Okay, chalo. All right. Now, beta adrenergic receptor does not cause increase in heart rate, heart muscle contraction, decrease in heart rate, relaxation of smooth muscles in bronchial tubes. NIPER JEE 2023. What's that? What's that over here? Increase heart rate, in heart muscle contraction, decrease in heart rate, relaxation of smooth muscles. Simple, right? That is nothing but your decrease in heart rate. Beta adrenergic receptor, adrenaline acting onto that. So beta 1, that is your obviously heart rate as well as contraction will be taking place. Leprosy mainly affects what? Leprosy mainly affects what, guys? Leprosy is nothing but your Hansen disease, right? Hansen disease. है Which one is mainly? Nerves and skin, muscles and bones, testes and eyes, or all of the above? Yeah, leprosy mein clofazimine is been used, dapsone is been used, है ना? Ethionamide is been used, right? What's that? Rifampicin is been used. Leprosy, mainly your nerves as well as skin, है ना? There is a brownish color skin pigmentation takes place with one drug. What is that drug, guys? What is that drug? That drug is nothing but your clofazimine. Clofazimine is that drug which is associated for the brownish color skin, right? Okay, Mycobacterium leprae. Okay, drug of choice in the treatment of pulmonary tuberculosis. Okay, guys. Pulmonary tuberculosis, carbamazepine, rifampicin, cycloserine, or pyrazinamide. Yeah. Pulmonary tuberculosis, drug of choice, carbamazepine, rifampicin, cycloserine, or pyrazinamide. Huh, guys? Anyone? Pyrazinamide, which is the drug of choice for pulmonary tuberculosis. Okay, rifampicin के साथ में you have one more thing, that is your orange color urine, है ना? Orange color urine can be taking place. Okay, the adrophonium test is primarily used to differentiate what? Okay, adrophonium. Adrophonium is nothing but what, guys? Cholinergic drug, है ना? Cholinergic drug, which is your shortest acting cholinergic drug. Shortest acting cholinergic drug, right? Shortest acting cholinergic drug, है ना? So that is used to primarily differentiate what? Lambert-Eaton syndrome as well as myasthenia gravis, myasthenic crisis and cholinergic crisis, multiple sclerosis, myasthenia gravis, Guillain-Barré syndrome, and myasthenia gravis. What's that? If adrophonium is being used in myasthenia gravis, then it would be having therapeutic effect. But if it would have treated into the not treated, if they would have been used into the cholinergic crisis, what's going to be happen? Versinity will be taking place because adrophonium is itself your cholinergic drug, right? Adrophonium is itself your cholinergic drug. The cholinergic crisis will be take place more. So that's why B is going to be your correct answer, right? Total 150 Tamil research. Okay, 150. By the 12 we will complete. Okay, don't worry. Now, ciprofloxacin is a drug of choice in what? Ciprofloxacin, tonsillitis, UTI, fungal infection, or scabies. What's that? Yeah, this is not going to stop, Tamil Rasij. This is not going to stop. What do you think? After 100 MCQs, we will stop? No, will not stop. Even after 150, will not stop. We will stop at 9 p.m. only. Have that thing in your mind. We are not going to stop right now. This is Thalapathy series, bacha. This is Thalapathy series, and this is going to be takes place till 9 p.m. evening. Okay, so this ciprofloxacin, fluoroquinolones, useful in your urinary tract infections, right? Fluoroquinolones. These fluoroquinolones are acting onto the DNA gyrase, right? DNA gyrase. है ना? What is the adverse drug reaction of fluoroquinolones? That is your, yeah, tendinitis. Tendinitis. This question was asked in GPAT 2022. Tendinitis, guys. Okay, so make sure you remember this one. Bahubali series nahi hai ye. That is your Thalapathy series. That's not a Bahubali series. This is a Thalapathy series. The preferred agent is management of neurocystic necrosis is niclosamide, praziquantel, albendazole, parental pamoate. Yeah, over here. The preferred agent in management of the neurocystic necrosis in niclosamide, praziquantel, albendazole or parental pamoate. This is your albendazole. Okay. Chalo. Mechanism of action of nicotinic acid hydrazide. Nicotinic acid hydrazide, that is nothing but your INH, right? INH, isoniazid. Isoniazid is useful in your tuberculosis. है So what does it do? Combine with bacterial ribosome, interfere with mRNA, inhibit phospholipid synthesis and damage bacterial cell wall. Okay. Inhibit with utilization of para-aminobenzoic acid. Inhibit bacterial DNA-dependent DNA polymerase. Yeah, RNA polymerase. What's that? Because INH is going to be decreased on the mycolic acid synthesis, right? These are going to inhibit the mycolic acid synthesis. That's why we can say that cell wall synthesis inhibitor, right? Cell wall synthesis inhibitor. So phospholipid synthesis and damage the bacterial cell wall. That's why B is going to be your correct answer. B is going to be your correct answer, right? Okay. Now, if I talk about this one, interfere with utilization of para-aminobenzoic acid, then which drug would be here? Which drug will be here over here? Para-aminobenzoic acid, that would be your PAS. Para-amino-salicylic acid, right? Para-amino-salicylic acid. Inhibits bacterial DNA-dependent RNA polymerase, that would be your rifampicin over here, na? Rifampicin, okay? Rifampicin would be the correct answer. Now, current first line drug preferred for hepatitis B. Hepatitis B, I told you. Hepatitis B is nothing but DNA virus mediator. Okay. DNA virus mediator. So what's that? What's that? Entecavir, adafovir, lamivudine or interferons. Yeah. Current first line drug preferred for hepatitis B. Entecavir, adafovir, lamivudine or interferons. Yeah, that would be your entecavir, which is your acyclovir ones, and a congener for hepatitis B. Drug of choice for type 1 and type 2 lepra reaction. Okay, lepra reaction, guys. Lepra reaction. Aspirin, chloroquine, thalidomide or prednisolone? Huh? Anyone? Current first line drug preferred in, sorry, this one. Drug of choice for type 1 and type 2 lepra reaction. Which one is it? Lepra reaction. Leprosy. Aspirin, chloroquine, thalidomide or prednisolone? What's that? That's your prednisolone over here, right? Prednisolone, glucocorticoid, which is going to reduce down the inflammatory episodes. Okay. Now, drug useful in lung cancer. Okay, guys, lung cancer. Cyclophosphamide, cyproterone, testosterone, and chlorambucil. What's that? Cyclophosphamide, cyproterone acetate, testosterone, chlorambucil. So yes, cyclophosphamide is useful in your lung cancer. Cyproterone acetate, that's your anti-androgenic in nature, and useful in PCOD. PCOD? No. PCOD mein that has been useful. Testosterone, chlorambucil, yeah, chlorambucil is a drug of choice for lymphatic leukemia, acute lymphatic leukemia. Okay, this chlorambucil. Remember that. Cyclophosphamide will be having two what? Your metabolites, right? This is your nitrogen mustard, phosphoramide, you can say nitrogen phosphoramide, है and then you'll be having your acrolein over here, acrolein, which can cause toxicity, hemorrhagic cystitis, right? And this hemorrhagic cystitis is done by acrolein only, where mesna is going to be act as an antidote over here. Mesna is going to be act as a antidote over here. Okay, chalo. The answer would be here is cyclophosphamide. Okay, this one is very much important, guys. Chlorambucil, where is chlorambucil? Yeah, chronic myeloid leukemia, acute lymphoid leukemia, that is also same. Okay, cyclophosphamide, lung cancer. Make sure remember this one. Antifungal drug inhibiting 14 alpha demethylase enzyme. 14 alpha demethylase enzyme. Your all azoles, right? All azoles are the ones which are going to inhibit this 14 alpha demethylase voriconazole. Okay. Now, abatacept blocks T cell activation and is useful to treat rheumatoid arthritis. What is going to happen? Abatacept blocks, no? Obviously, that is going to activation of T cells. Okay. Now, etoposide act onto the which phase of cycle? Etoposide, which phase of cycle? Okay. Etoposide is your topoisomerase 2 inhibitor. It is your topoisomerase 2 inhibitor. Okay. This portion is very much important over here, guys. Topoisomerase 2. Topoisomerase 2, etoposide. Where if I talk about irinotecan, this is your topoisomerase 1 inhibitor. Topoisomerase 1 inhibitor. Okay. Now, this topoisomerase 2 inhibitor acting onto the G1 phase, whereas irinotecan acts onto the G2 phase. Okay. 2 becomes 1 at phase. Okay. Irinotecan, which is your 1, becomes 2 at phase. Okay. So, answer would be your G1 phase. Guys, etoposide is acting onto the G1 phase as well as G2 phase, both. Okay. So, make sure you remember this one. Both ones. These are not specifically acting onto the G1, also act onto the G2 as well. Remember that. Which causes apparent volume of distribution of a drug exceeded total body volume, body fluid distribution. Okay. High plasma protein binding, slow elimination, poor lipid solubility, sequestration of body tissues. What's that? That's your sequestration in body tissue. Okay. Now, all of the following are examples of hit and run drugs except. Okay. Hit and run drugs except. What's that? Reserpine, prenylcypromine, omeprazole, or enalapril. Yeah. Reserpine, prenylcypromine, omeprazole, or enalapril. All the following are example of hit and run drugs except. That's your enalapril, because you know enalapril is your ACE inhibitor, and ACE inhibitor useful in your hypertension. Okay. Chalo. What is the term used to describe variation in shape and size of tumor size? Okay, there is a tumor size. If there is a variation between the tumor size, shape, and size, so what is that? Hyperchromatism, anaplasia, pleomorphism, or antinucleonic? Yeah, simple. That video. Pleo means change. Morphism is your structure, shape, and size, obviously, right? So this is your correct answer. Now, non-clinical safety evaluation data for an investigational new drug IND include all of the following except. What is that? Single dose toxicity, repeat dose toxicity, male infertility assessment studies, in vivo genotoxicity studies. Yeah, that is your male fertility assessment studies. That is not being required for that, because you are doing non-clinical, right? Non-clinical, and we're talking about male, so male becomes clinical. So that is a contraindicatory statement. No, over here, contraindicatory. So C obviously becomes your correct answer. Okay. Now, L-thyroxine is used in. L-thyroxine is what? L-thyroxine is nothing but T4. Is nothing but T4, right? T for thyroid hormone, right? T for thyroid hormone. Is it in your thyroid storm, cretinism, toxic goiter, or grave disease? Yeah, toxic goiter increase T4. Grave disease increase T3 and T4. Increase T3 and T4. Increase means thyroid levels are increased over here. Here also increase. Thyroid storm may be increased. But what about cretinism? Cretinism decrease the T3 and T4 level. Decrease T3 and T4 level. Right? In children, cretinism. In children, it is going to decrease. Right? So thyroid storm, no. Toxic goiter, no. Grave disease, no. What is left? Cretinism only. So cretinism becomes your correct answer. Okay. Yes. All right. Wolff-Chaikoff effect. Okay. Wolff-Chaikoff effect. Reduce thyroxine synthesis by radiotherapy. Reduce thyroxine synthesis by propylthiouracil. Okay. Reduce thyroxine synthesized by iodides or none of the above. Yeah. Important question, guys. Important question over here. I'm telling you. Wolff-Chaikoff effect. Important question. Radiotherapy, propylthiouracil or by iodides? Yeah. Anyone? This one, reduce thyroxine synthesized by iodides. Okay, C is going to be your correct answer. Okay, make sure you remember this one. Yeah, excess iodide inhibits its own transport in thyroid cells. That's why it is known to be as your Wolff-Chaikoff effect. Okay, which of the class belongs to the class of anti-androgens? Oh, मैं तो लुट-पुट गया लुट-पुट गया ओ मैं तो लुट-पुट. Have you heard this song, guys? Just tell me. Have you heard this song? ओ मैं तो लुट-पुट गया लुट-पुट गया लुट-पुट गया ओ मैं तो लुट-पुट. Have you guys heard this song before or not? It's a song of famous Shah Rukh Khan's movie. है ना? Yeah. Anyone? Anyone? Answer what I'm asking. Have you heard this song before or not? Obviously, you would have heard. So, when this anti-androgenic activity, है if we are talking about anti-androgenic activity, that means androgen is nothing but testosterone. Androgen is nothing but your testosterone. So, what if this becomes testosterone level is going to be decreased down. Testosterone level is going to be decreased down, right? So once this testosterone level is going to be decreased down, what will happen? The men will लुट जाएगा बिक जाएगा लुट जाएगा बिक जाएगा. If men के अंदर, if men lost his testosterone, the men will बिक गया as well as लुट गया. That's why I said लुट पुट गया, है ना? That's your flutamide as well as bicalutamide, है ना? Yes, global mind. Flutamide, bicalutamide. मैं तो लुट लुट गया पुट गया फ्लूटामाइड लूटा है ना टेस्टोस्टेरोन मैं तो लुट पुट गया. This is the way to answer this one. Okay, finasteride, finasteride is nothing but your 5-alpha reductase inhibitor. 5-alpha reductase inhibitor, right? 5-alpha reductase inhibitor, also useful in alopecia. Not only minoxidil useful in alopecia, also this finasteride useful in androgenic alopecia. What's that? Androgenic alopecia mein finasteride has been used. Okay, cyproterone acetate, yes, exactly, that is also your anti-androgenic in nature. Exactly. Now, sulfonylureas acts by, guys, okay, sulfonylureas acts by which other thing? Reducing intestinal absorption of glucose? No. Promoting anaerobic metabolism of glucose? No. Inhibiting DPP4? No. Insulin secretion? Yes. D is going to be your Correct answer. है ना? चलो. Now the anti-diabetic drug which carries increase the risk of bladder cancer and bone fracture. Tell me now. Into the starting only I told. Pioglitazone, metformin, sitagliptin or liraglutide. What's that, guys? Simple. In the starting only I told you guys. What's that? Global Minds. Do you got the use of that song or not? Hmm. Yeah. Pioglitazone. Yes, pioglitazone is going to be your correct answer. Now, which of the following acts as insoluble surface anesthetic? Insoluble surface anesthetic over here. Insoluble, that is your benzocaine. Okay. Chalo. Which of the following drug has greater potency of the local anesthetic action? Greatest potency. Greater potency of the local anesthetic action. Lidocaine, bupivacaine, procaine or mepivacaine? Yeah. Anyone? Over here. Lidocaine, bupivacaine, lidocaine. What's that? Yeah. That's your bupivacaine over here. Okay. Bupivacaine is going to be your correct answer. Now, anti-epileptic drug carbamazepine acts as carbamazepine, calcium channel, sodium channel, glutamate or both A and C. Carbamazepine. Simple. It will be acting onto the sodium channel blocker, right? Simple. Carbamazepine, partial seizure. Also, Stevens-Johnson syndrome, right? Chalo. Which of the following antiemetic is used as well as a anti-vertigo agent as well? Okay, anti-vertigo. Anti-vertigo. Yeah, anti-vertigo. Anti-vertigo means dizziness, chakkar aana. है ना? Chakkar aana, that is your anti-vertigo. If you feel some dizziness over here, dizziness, you are rounding all of a sudden. So cinnarizine, domperidone, triflupromazine or granisetron. Yes, so cinnarizine is going to be your correct answer, which is having also calcium channel blocking activity. Calcium channel blocking activity. Okay, calcium channel blocking activity. That is the correct answer. Okay, into the ear tubules. Remember, inhibiting influx of calcium from the endomyofil tool in the vestibular sensory cells, which mediates labyrinth reflexes. Okay, so which of the following receptor is not a ligand gated ion channel? Not they have asked. Okay, not a ligand gated ion channel receptor. Okay, nicotinic receptor. Nicotinic receptor, yes, they do. LGIC5-HT3, yes, they do. GABA A, yes, they do. S2 receptor, no. S2 receptor is your GS mediated. Okay, GS mediated. Okay, so D becomes your correct answer. NN, nicotinic receptor. 5-HT3 is the only serotonergic receptor. Right? Chalo. A patient taking a non-selective beta blocker is at risk for which of the following adverse reaction? Okay. Non-selective beta blocker. Simple, you have to remember that non-selective beta blocker should not be taken in 4 conditions. What's that? A, B, C, D. A for asthma. A for asthma. B for AV block. AV block. C for CHF and D for diabetes. D for diabetes. In these 4 conditions, you should not take non-selective beta blocker. Okay. Tachycardia. Okay, it can be given. Bronchospasm in asthmatic patient. Bronchospasm in asthmatic patient. You should not take the non-selective one. Bronchospasm. Simple. Which of the following compound is not a translation inhibitor? Translation inhibitor. Okay, chloramphenicol, cycloheximidine, puromycin or rifampicin. That's your rifampicin, which is not acting onto the protein synthesis inhibitor. That is not a protein synthesis inhibitor. These are acting onto the DNA dependent RNA polymerase. Okay, so this is your correct answer. Now, which of the following is an example of H2 antagonist? H2 antagonist, guys. Okay, H2 antagonist. अरे रे चले जाओ भाई. Yeah, cimetidine, cyclizine hydrochloride. What's that? pyrilamine maleate or azelastrine hydrochloride? H2 antagonist I'm asking. H2 would be your useful in peptic ulcer as well as gas, bloating kind of a thing. Hai. So that would be your cimetidine, right? Cimetidine having enzyme inhibitory action. It also causes gynecomastia, anti-androgenic effect as well. Okay, cimetidine. Make sure you remember. Now, acute decrease in response to a drug after initial or repeated intake is known as acute decrease in response. Response decrease, that means tolerance. Response decrease, that means tolerance, right? Hana? After initial or repeated intake is known as additive. Repeated, so that means again and again. Rapid tolerance, that is nothing known to be as your tachyphylaxis, right? Rapid tolerance, okay? Rapid tolerance, which is your nothing but tachyphylaxis, okay? Tachyphylaxis is going to be your correct answer. Now, which application must be submitted to FDA to market a generic version of a drug after patent expiry? Chalo guys, simple, come on, it's that so simple, guys. So simple. Yeah, anyone over here? So simple. Into the starting only I told you. After the phase 3, after phase 3rd, ANDA should be filed for generic version of a drug after patent expiry, right? C, ANDA is going to be your correct answer, right? Okay. Now, the primary mechanism of action of hydroxyl benzyl benzimidazole antivirus is to inhibit what? Benzimidazole. Yeah, viral RNA polymerase, both DNA and RNA polymerase, DNA dependent RNA polymerase or viral RNA polymerase. What it would be? That is your viral RNA synthesis, right? Chalo. Decreased drug responsiveness after prior exposure is termed as. After prior exposure, okay? Prior exposure case. What's that? Tolerance, habituation, addiction, or dependence. These are of same category, right? But this tolerance, what's that? That is only the correct thing over here, right? Tolerance. Now, the drug choice for mushroom poisoning by Amentia muscaria. Okay. Drug of choice for mushroom poisoning by Amentia muscaria. Adrenaline, atropine, tizanidine, or carisoprodol. What's that? In mushroom poisoning. Okay. There is a early mushroom poisoning. And there is late mushroom poisoning. Okay. So in early mushroom poisoning, atropine is drug of choice. Atropine is your drug of choice, right? Atropine is your drug of choice. Whereas if I talk about this late mushroom poisoning, here atropine is contraindicated. Okay. Which one is used then? Thioctic acid. Thioctic acid becomes the drug of choice over here. Okay, so make sure you remember this one. The thioctic acid useful in late mushroom poisoning, but in early mushroom poisoning, atropine is being used. Okay, very good, Tamil Rasich. Very nice. Atropine over here. Okay, which parameter you used to compare the relative viability of two equivalent drug products? Okay. In bioavailability, I'm asking, right? The bioavailability, what do you compare? Dissolution, peak concentration, time to peak concentration, area under the plasma time curve. Obviously, that would be your D only, area under the curve, right? Area under the curve. Now, according to current guidelines, the safest way to use ibuprofen, what's that? The safest way to use ibuprofen, what's that? Take the maximum dose for long periods, use the lowest effective dose for the shortest duration, preferential in severe heart failure patients, take freely with low dose aspirin. What's that? C to obviously not. C to obviously not. What it would be the correct answer over here? Guys, that would be your use the lowest effective dose for the shortest duration. Simple. That would be the safest thing. Okay. Now, ibuprofen. With ibuprofen, I got to know something, guys. Ibuprofen, endomethacin as well as aspirin. Huh? If you have seen my classes, I have told one thing that endomethacin, ibuprofen, right? Ibuprofen, endomethacin, as well as aspirin. Aspirin. These are useful to close pre-closure of ductus arteriosus. Pre-closure of ductus arteriosus. I don't know how many times they have asked this question. How many times they have asked this question? Pre-closure of ductus arteriosus. Yes, exactly. Exactly, Nazreen. Very good. IA. And what is one to keep the ductus arteriosus open? That is nothing but your 𝘿-prostadil. 𝘿-prostadil. That is going to open the ductus arteriosus. 𝘿-prostadil PGE1 analog. Right? Chalo. Now, pentamidine. Pentamidine is an anti-protozoal drug useful for the treatment of malaria, African sleeping sickness, okay, amoebiasis, or all of these. Yeah, very good, Tamilarasich, PGE1. Yeah, over here, that would be your African sleeping sickness, right? Chalo. A metabolite of spironolactone. Oh, simple. Spironolactone, guys. Spironolactone. Potassium sparing diuretic. Aldosterone, candrinone, corticosterone, or pregnenolone. Simple. Spironolactone acting onto the candrinone, right? Candrinone over here. Hana? Metabolite of candrinone. Alright. Acting onto the potassium sparing diuretic increases the reabsorption of sodium as well as water. That's why you're what? No. Increases in the level of aldosterone. Simple. Sorry. Spironolactone is your aldosterone antagonist. Aldosterone antagonist. And now it will be doing what? It will be doing decrease in sodium as well as H2O water retention. Okay. So that's how blood volume is going to be decreased down, and hence BP is also going to be decreased down. Blood volume. Okay. Yeah. Can be known. Alright, HIV/AIDS belongs to a class of viruses known as HIV/AIDS, adenovirus, retrovirus, herpes virus, or orthomyxovirus. Simple guys, simple. A metabolite of spironolactone. Simple. What is that? That's your retrovirus, right? Retrovirus, antiretroviral agents, retrovirus, right? Simple. Now, what is binding in a clinical trial? Blinding. Okay, blinding. Blinding means either the patient doesn't know that the clinical trial is doing on to that patient, or the doctor doesn't know that the clinical trial is doing on. Single blinded, double blinded. Single blinded, only patient doesn't know that clinical trial is done on him and he is a subject. Double blinded, nor even a doctor, neither your patient knows that clinical trial is going on. Lack of knowledge regarding the identity of a drug, assigning subjects to either placebo or active doses, okay. Obtaining written informed consent from subject, all of the above. What's that? Clinical trial. That is your lack of knowledge regarding the identity of the drug. Exactly. What is the drug which is being giving to that patient? That is lack of identity, lack of knowledge. An oral hypoglycemic agent, which is your dipeptidyl peptidase 4, DPP4 inhibitor. Yeah, DPP4 inhibitor, pioglitazone, sitagliptin, liraglutide, empagliflozin. Yeah, guys. Pioglitazone, yes, you know, PPAR gamma activator, PPAR gamma, sitagliptin, DPP4 inhibitor, right? DPP4 inhibitor, liraglutide is nothing but your GLP-1 analog inhibitor, right? PPAR gamma agonist, right? GLP-1 analog, Hana? And empagliflozin is nothing but your SGLT2 inhibitor. SGLT2 inhibitor, right? SGLT2 inhibitor. So what's that? DPP4? Obviously, this is your sitagliptin, vildagliptin, है ना? B is going to be your correct answer, right? 𝘎𝑔lyptin would be your correct answer. DPP4. Now, which of the following drug is useful in the treatment of organophosphates poisoning? Okay, organophosphates poisoning. Organophosphates are nothing but your anticholinesterases, not anticholinergic. Okay, these are your anticholinesterases, means cholinomimetics only cholinergic agonist, है ना? तो cholinergic agonist का poisoning है. So what will you do? Anticholinergics you will do, है ना? तो physostigmine, no. Trihexylphenadiol, no. Oxyphoninium, no. These are all your what? Cholinergic drugs. Whereas if I talk about pyridoxine, so pyridoxine is your ACHE reactivator, right? ACHE reactivator, है ना? Acetylcholinesterase, which is used to hydrolyze the acetylcholine, right? Which is used to hydrolyze the acetylcholine, ACHE reactivator. Okay, that is what useful in organophosphate along with atropine. Along with atropine. Okay, organophosphates poisoning. If I talk about carbamates poisoning, then we can say this pyridoxine is contraindicated. Pyridoxine is contraindicated. Only atropine can be used in carbamates poisoning. Okay, only atropine can be used in carbamates poisoning. Okay, chalo. Pyridoxine is your correct answer. Which of the following drug is withdrawn from the market due to 𝘖𝙎𝙎𝙎𝙬? Okay, 𝘖𝙎𝙎𝙎𝙬. Aspirin, naproxen, cyproheptadine, or estomazole? Yeah, what's that? What's that? Withdrawn from the market due to 𝘖𝙎𝙎𝙎𝙬. Aspirin, naproxen, cyproheptadine, estomazole. Estomazole, that's your H1 antihistaminic, guys. H1 antihistaminic. Estomazole, slowest and longest acting. Slowest and longest acting H1 antihistaminic. Apart from estomazole, we do have T over here. You know, T. T for terfenadine, right? E for Avastin, and A for estemezoles. A for estomazole, right? These three drugs, from antihistaminics cause 𝘖𝙎𝙎𝙎 point, which is nothing but your QT prolongation, right? Which is your QT prolongation. Okay, chalo. Estomazole, terfenadine, estomazole, as well as Avastin. TAE, chai, you know, that is what QT interval. All of these are written over here. Which drugs are used to prolong the QT interval? This table is very much important. Okay, you can get some question over here, one question at least. Okay, morphine can be used in all except head injury, asthma, hypothyroidism, or diabetes. Yeah, guys. Anyone? Morphine can be used in all except head injury, asthma, hypothyroidism, or diabetes. What's that? That's your head injury. We cannot use this morphine. Okay, contraindications. With injury, by retaining carbon dioxide, it increases the intracranial tension. Vomiting, meiosis, and altered mention produced by morphine interfere with assessment progress in head injury cases. Okay, chalo. Drug of choice for controlling severe pain in cancer patients. Okay, severe pain in cancer patients. Yeah, severe pain in cancer patients over here. So if someone has having bone cancer, to be precise, bone cancer, right? If someone is having bone cancer, so the bone cancer pain is too much. Bone cancer pain is too much. That's why the doctor used to give the patches, transdermal patches of morphine, guys. Transdermal patches of morphine, so that they can paste that patch over here, and there is a sustained controlled release of, you can say, morphine takes place, which relieves the pain to that patient who is suffering from this cancer, bone cancer. Okay, morphine is your correct answer. Right now, which of the following is not causes mydriasis? Okay, which of the following does not cause mydriasis, guys? Mydriasis is nothing but what? Mydriasis is nothing but the dilation of pupil. That is what mydriasis. Pilocarpine, cocaine, atropine, or tropicamide? Yeah, Tropicamide cause mydriasis. Atropine can cause mydriasis. Pilocarpine? No. Pilocarpine can cause meiosis, guys. It can cause meiosis. Why? Because it is acting onto the M3 agonist. M3 agonistic having, so in muscles, for example, this is your eye, this is your muscles, right? And this is your pupil. This is your circular muscles, right? This circular muscles have the innervation of M3, and M3 is nothing but your GQ protein coupled mediated. So pilocarpine acts onto the M3 receptor GQ mediation, then constriction will be taking place. Constriction will be taking place. The pupil size will be decreased down. This will be going this side. The pupil size will be decreasing down. That's why meiosis is going to be takes place. So pilocarpine is your correct answer over here. Okay, pilocarpine. Now, a patient developed severe hypotension, bronchospasm, and laryngeal edema following penicillin administration. The drug of choice is, okay, following penicillin administration, bronchospasm, laryngeal edema, hypotension. Okay, guys. So, phenylephrine, salbutamol, epinephrine, or hydrocortisone. What should be the correct answer over here? That would be your adrenaline. Okay, adrenaline can be used in that condition because bronchospasm, the adrenaline acting onto the beta 2 agonist, so broncho dilation takes place. Hypotension will be taking place, BP will be elevated for in the context of epinephrine, right? Now, epsilon aminocaproic acid, EACA, can be used in the treatment of adverse effect caused by streptokinase, heparin, warfarin, or any of these. Yeah, anyone? Here you can see epsilon aminocaproic acid, that's your EACA, as well as tranexamic acid, tranexamic acid, okay, tranexa, which is nothing but these are your anti-fibrinolytic drugs, anti-fibrinolytic drug, okay, fibrinolytic drug, which can be useful as a fibrinolytic, but anti-fibrinolytic, but streptokinase, this is a fibrinolytic drug. Fibrinolytic drug. So fibrinolytic, if exceeds, obviously streptokinase, in this condition only EACA and your tranexamic acid is going to be very much useful. Okay, streptokinase, fibrinolytic. Here you can see fibrinolytic, streptokinase, urokinase, LT plus. Out of this, they can ask this question also. This LT plus is your recombinant DNA technology mediated preparation. LT plus, that's your fibrinolytic. Antifibrinolytic, epsilon aminocaproic as well as tranexamic acid. See, yeah. Now, which of the following is used as a prophylaxis of meningococcal meningitis? Okay, simple, guys. Meningococcal meningitis. What's that? Gentamicin, erythromycin, rifampicin, or chloramphenicol? That's your rifampicin, guys. Meningococcal meningitis mein rifampicin is being used. Passive diffusion follows which order of kinetics? Passive diffusion, non-selective and mixed order, selective and first order, non-selective and first order, selective and mixed order. That is for sure that passive diffusion follows first order kinetics. First order kinetics. That is for sure. But follows which order exactly? Non-selective or selective? What's that? Selective or non-selective? That is your non-selective and first order kinetics. Okay. Why non-selective? Relies simply on the drug moving down it concentration gradient from a region of higher concentration to lower concentration, and without any need of for specific carriers, proteins, or energy. That is why it is non-selective over here. Okay. Chalo. Which of the following agents leads to frame shift mutation? Okay, frame shift mutation, guys. 5-fluorouracil, 6-mercaptopurine. Okay, 5-fluorouracils, mercaptopurine, flucytosine, or acrylflavin over here. What's that? Yeah. Yeah, anyone? That is your acrylflavin, right? Acrylflavin is going to be your correct answer over here. Yeah. Now, which of the following pair of drugs is considered as selective alpha 1 blocker? Considered as selective alpha 1 blocker, guys? Yeah. Alpha 1 selective blocker. Obviously, that timolol and metoprolol, no, that is your beta blocker. Prazosin, terazosin, alpha 1 selective, yes, that is your correct answer. Formoterol, levometrol, these are your long acting beta 2 agonist. Yohambin and carnicine, that's your non selective alpha blocker. Okay, chalo. Now, drug with widest antifungal spectrum is what? Amphotericin B, griseofulvin. Yeah, griseofulvin, flucytosine, or itraconazole. What's that, guys? This is your amphotericin B, widest spectrum of the antifungal agent. Okay, amphotericin B is going to be your correct answer. Now, most effective and ideal anti-tubercular since it exerts least toxic effect and is the least expensive as well. Least toxic effect and least expensive. What should be that? Isoniazid, ethambutol, rifampicin, or streptomycin. What's that, guys? Yeah, isoniazid, ethambutol, rifampicin, or streptomycin. What's that, guys, over here? Huh? That's your isoniazid, least expensive, least toxic effects. All right. Now, anti-tubercular drug lethal to only extracellular located bacilli. Okay, extracellular located bacilli. Extracellular located bacilli. Hmm. That's your streptomycin. Okay. Now, the alpha receptor function is mediated mainly by alpha receptor. Okay, alpha receptor. Which alpha receptor? Which alpha receptor? If alpha 1 they would have talked about, then it would be GQ mediated. If we have talked about alpha 2, then it is your GI mediated. The GQ has IP3 DAG pathway, IP3 DAG pathway, है ना? GI is your CAMP, right? CAMP. IP3 DHA calcium level will be increased, calcium level will be increased. In CAMP level is going to be decreased in GI, है ना? So alpha, if they would have asked alpha 1, then IP3 DAG. If they would have asked about GI, then CMP. Okay, but they have not mentioned over here anything, है ना? So IP3 DAG, okay, alpha 1 they have considered. Okay, alpha 1 receptor. Okay, the most widely used anticholinergic agent useful for treating myasthenia gravis. Okay, treating myasthenia gravis, guys. Treating myasthenia gravis. Myasthenia gravis, that's your autoimmune disease, you know. That is your autoimmune disease. है ना? Autoimmune disease, you know it, right? Atropine, pyridostigmine, tolazoline, or ephedrine. Pyridostigmine, adrophonium, as well as neostigmine, right? These three. Pen, pyridostigmine, adrophonium, and neostigmine are useful for your myasthenia gravis because these pen ink is water soluble. Pen ink is water soluble, right? And these are having quaternary ammonium structure. Quaternary ammonium structure over here. That's why pen inks is water soluble and can be used in your myasthenia gravis. Physostigmine is not being used. Physostigmine is useful in your what? Alzheimer condition. Okay. Now, NM receptor, exactly. So, Somya. Okay. Now, myasthenia gravis. Okay. Which statement is true about carbamazepine? All right, guys. Carbamazepine used in trigeminal neuralgia. Carbamazepine is an enzyme inhibitor. Can cause megaloblastic anemia. It is a drug of choice for status epilepticus. Yeah. Anyone? Pretty simple. Pretty simple. Huh, guys? Yeah. What's that? Used in trigeminal neuralgia. Carbamazepine is an enzyme inhibitor. Megaloblastic anemia, drug of choice for status epilepticus. Used in trigeminal neuralgia over here, right? Used in trigeminal neuralgia over here. If I talk about carbamazepine is enzyme inhibitor, no, it is your enzyme inducer. Carbamazepine is your enzyme inducer over here. Drug of choice for status epilepticus, that is diazepam as well as lorazepam. Okay, chalo. All right. Now, which type of toxicity is associated with iron tapping effects of aspirin, guys. Okay, iron tapping effects of aspirin: hepatotoxicity, gastric toxicity, dermatotoxicity, or musculotoxicity. Yeah, that's your gastric toxicity aspirin. Okay, that's why it is known to be as NSAIDs induced peptic ulcer, है ना? Okay, okay. Now, when a drug binds to silent receptor, when a drug binds to silent receptor, no pharmacological response occurs. The drug gets metabolized, neuroendocrine hormone gets released, or DNA change occur. Silent receptor. Silent receptor, the receptor will not having kind of downstream signaling, so there will be no response. है ना? No pharmacological response will be there, right? Chalo. Varenicline useful in smoking cessation, acts primarily as muscarinic agonist, selective nicotinic agonist, muscarinic antagonist, or ganglionic blocker, guys. Yeah. Alpha 2 beta 4. No, not like that. Alpha 4 beta 2 nicotinic sympathetic agonist. Nicotinic agonist over here. Okay. This is the correct thing. That is your selective nicotinic agonist, I think. So B is going to be your correct answer. Smoking cessation, varenicline. Right? Yeah. Varenicline. Alpha 4 beta 2. Yeah. Alpha 4 beta 2 nicotinic receptor. Partial agonist. A drug of choice for Zollinger-Ellison syndrome. Zollinger-Ellison syndrome, just like the peptic ulcer, GERD, we will be using what, guys? We will be using PPIs only over here. Antihistaminics, no. Proton pump inhibitor, yes. Proton pump inhibitor are the ones which are very much useful over here, guys. Yeah. Proton pump inhibitor. Yes. Now, which drug may produce both physical dependence and a severe withdrawal syndrome? Severe withdrawal syndrome. Okay. Is it your lysergic acid derivative, cocaine, ethanol, or cannabis? Yeah. Anyone? Zollinger-Ellison syndrome. So ho gaya in this one. Dependence, physical dependence, and severe withdrawal syndrome. That is nothing but your ethanol, because ethanol can cause hypotension. It can cause hypotension, and physical dependence would be there. Okay, ethanol. Now, which prostaglandin is useful in NSAIDs induced ulcer? Prostaglandin is useful in NSAIDs induced ulcer. At the starting only I told you, right? Misoprostol, yes. Misoprostol is your PGE1 analog. PGE1 analog, right? PGE1 analog, which has been useful for your NSAID induced ulcer. But the drug of choice is what, guys? Over here. Yeah. Useful is misoprostol. But NSAID induced ulcer may, which drug is being considered to be as a drug of choice? Yeah. Anyone? Tell me that. Yeah, Ritax, Nazreen, exactly. Soumya, very nice. Yeah, over here. This is your PPI, exactly, Ritax, है ना? PPI are considered to be as the drug of choice for NSAID-induced peptic ulcer, right? Carboprost, mirtazapine, and miprinone, these are not having any correlation with NSAID-induced ulcer, right? Chalo. Okay. Which of the following decrease iron absorption by increasing gastric pH? Okay. Increasing the gastric pH, guys, over here. Yeah, very nice. Shravani, Nazreen, Suman, Metu, very good. Very good. Hana? Over here, guys. Which of the following decreases the iron absorption by increasing the gastric pH? Gastric HCl, vitamin C, antacids, or low molecular weight proteins? Yes. Anyone? Anyone, guys? Gastric HCl, vitamin C, antacids, or low molecular weight proteins? This is nothing but antacids, because antacids are the ones which are going to elevate the pH level, Hana? Because pH of stomach is only 1 to 3. But when you take antacid, for example, sodium citrate, Hana, sodium bicarbonate, Hana, all those things, your magnesium hydroxide, these are the ones which are going to increase the level of pH in stomach, है ना? These are going to increase the level of pH in stomach, है ना? And that way, sucral fate is also not going to act on. Sucral fate, which demands less than pH of 4, right? Which demand less than pH of 4, then only it will polymerizes. Okay, so antacids would be your correct answer. Explanation is this, है ना? Increase iron absorption, gastric HCl, vitamin C, alcohol, and low molecular protein, but decrease absorption, alkali, antacid, tetracycline, as well as food, they're going to decrease the absorption. Okay. All right. So here is the first segment that is done now. Okay, the first segment of this one is done now. Okay, pharmacology, 150 questions. Now the thing is Indu sir. Indu sir is coming for the pharmacognosy now. He will make you understand all the basic concepts of the pharmacognosy in a just matter of time, right? So make sure you are still over here and get those things in your subconscious mind. Okay, guys, satisfied with the session? Satisfied with the session, everyone? Tell me. Pharma profession, thank you. Okay. All right, Nazreen, thank you so much. Thank you. Okay, guys, be there with us because we will be the one who will make you the All India rankers in NIPER JEE 2026. Okay, chalo. Till then, signing off, and we'll see you into the next class of pharmacology tomorrow. Okay, bye bye. Chalo, guys. Thank you so much. Stay there, huh? Indu sir is coming. Yeah, it's completed. It's completed. Okay. Hello, students. Very good afternoon, all of you. Welcome back to GDC Class English, especially for the specially designed Thalapathy series for all the NIPER aspirants. To all my dear aspirants, could you please tell me whether I'm audible or not? Am I audible? Please to confirm my visuals and my vocals. Yes, it is audible. I got it. So, as you all know that, so this is a specially designed series for all the NIPER aspirants, okay, just because you are going to have your NIPER examination, just to boost up your preparation, GDC has started this Thalapathy series, you know very well, right? So, in this session, I'm going to start 150 MCQs with a very detailed explanation, okay? But what you need to do is, you need to answer the questions in the comment box, and as well as share this video to your friend who is preparing for NIPER, okay? Yes. So, I hope you're ready. If you're ready, let me know in the chat box. Can you please confirm? Can you please tell me? If you confirm, then I'll start the session. Yes, good afternoon, Shivani and Sahoderia. And yes, thank you so much for the confirming. Thanks. Yeah. Okay, so I hope you're ready for these 150 questions. Yes, it takes, yes, Nukaratnam. Okay, it takes 3 hours. Okay, so with this session, what you need to understand is time management is also very important. See,
all 150 questions. See, all these 150 questions you need to solve within 3 hours, which means you need to allocate 1 minute 12 seconds, 1.12 minute for each bit. Okay, so that's why you're going to improve your time management and accuracy as well. Okay, now the first question, without any delay, the first question from the pharmacokinetic Thalapathy series is the which of the following chemical concept uses an insect repellent? Come on, which of the following is an insect repellent? Option A, sandalol, B, adipole, C, citronella, and D, eugenol. What is the right answer? Come on. I'll be looking for your answers. Which of the following is a chemical concept used as insect repellent? Let me know your answers in the comment box. Which of the following? Sandalol, adipole, citronella, and eugenol. Yes, you got option C. Okay, option C. Citronella, yes, sandalol. Sandalol is nothing but a santalum album obtained from the sandalwood, right? Anethol and citronella and eugenol. Yes, very good, Soumya and Shivani and Yukaratna. Yes. So the right answer is obviously citronella. Yes, there are three important insect repellents. One is okay, neem. Okay, neem that azadirachtin and ninbin, and citronella is a two important insect repellents. Okay. You can see yes, sandalone it is an obtained from the sandalwood oil and used in the treatment of dysuria, and yes, anethol is obtained from the anethol, phenyl is obtained from the phenyl, and yes, it is maybe estrogen like activity will be seen in this one, and but whereas citronella is the only one can have the insect repellent properties, and yes, we know already eugenol is obtained from the tulsi. What's going to okay? Yes. So that's the right answer. Now, second question. Plant growth regulator whose discovery is related to the foolish seedlings? Yes, while you're studying the questions, or while you're going through the topics, should remember some specific terminology, specific topics also should remember, because from the point of view also we're going to get the questions. Is this clear? Okay, going with option A. Okay. For this one, you go with option A. Okay, I understand. Just a minute. Okay, for this question, you go with option A. Yes. Do not worry, now it will be clear. Okay, so foolish shading is seen in the gibberellins. Is it okay now? Yes, I hope it is okay. Is this clear? Need not to worry because because of some technical issues, so it is little small glitch will be there, but it will be adjusted. Okay, so the option A is the right answer for this one. Okay, option A is right. Okay, yes, obviously. Why? Because the foolish seedling is discovered by Kurosawa. The scientist name is Kurosawa. He is the one discovered. Okay, Kurosawa. Kurosawa. He's a scientist. Okay, it's a scientist who discovered this gibberellins in the fully seedling disease caused by the Gibberella fusicorae. Okay, Gibberella fusicorae. Gibberella fusicorae. Yeah. Yes. So that's the right answer. Gibberellins is the right answer. Yes, you can see. Okay. Eiichi Kurosawa is a Japanese scientist who discovered this fully seedlings in the okay, in the Bakani disease. Yeah, so this is also known as Bakani disease. Fully seedling. Exactly, Kurosawa is a scientist. Okay, which is caused by the Gibberella fusicorae. Gibberella fusicorae will cause foolish seedling, and that disease is known as Bakani disease. And this was identified by the Kurosawa. Okay, exactly. Very good. And main chief principle, chief chemical constant is GA3, gibberellic acid. And the skeleton present in this gibberellins is gibbene. Okay. Yes. That's it. And now, third question or 153rd question, physical method for direct transfer of gene. Okay. So now it's for the biotechnology question, nothing but mutagenic plants, okay, or hybrid plants. So this question is from that one. Come on, tell me physical method for direct transfer of genes. Option A, PEG mediated, dextron mediated, calcium mediated, electroporation. What is the right answer for this question? Okay, your option D, physical, exactly. See, these three are chemicals, right? PEG is a chemical, dextron is a chemical, calcium is a chemical, but whereas electroporation is a method. So that's why you're going with option D will be right answer. Very good, very good. So obviously, electroporation is a physical method, but whereas here we're using okay polyethylene glycol, dextron, calcium. These are chemical. That's why they comes under the chemical method of gene transfer. Okay, so that's how we need to correlate with the questions. Okay, yeah. So now you can see, okay, gene transfer, vector mediated, vector free, okay, in that agrobacterial mediated, plant one vectors, physical with physical, electroporation, microinjection, silicon carbide, and yes, in chemical, PEG mediated and fusion of protoplast mediated. So that's why electroporation is a physical separation technique, physical gene transfer technique. Very good. Now the third question, come on. Okay, pro-silaridine A upon hydroxylase gives option A, silaridine galactose, silaridine fructose, silaridine rannose, silaridine inverted sugar. So what is the right answer to this question? 154. Come on, kindly mention the question number, dear students, okay? And also, within 1 minute, you need to solve this question. There only you're going to have the good time management. Okay, improve your accuracy. Don't take much time. Even, okay, less than 1 minute, you need to solve this question. Thereby, you can improve your accuracy. Come on, what's the right answer? Yes, kindly mention the question number if you're answering. Okay, yes, the right answer is, what is the right answer? The right answer will be, okay, option C, which means rannose. Pro-silarinine upon hydrolysis gives rannose. Very good, very good. Okay, rannose, silarinine and rannose it gives. You can see here. Okay, so it is obtained from the squill. Okay, procellarin. Okay, cellulosides. These are all the chemical compounds of a glycoside containing squill plant. Okay, squill. It is known as a sea onion. The Indian squill is known as sea onion. From that we are going to get that silarin A, procellarin A. Okay, but from the procellarin A, okay, you can see we are going to get the silarin A and rannose. Okay, and these returns are directly from our JDC modules. Okay, navigator modules. Okay, yeah. Now, next question. Come on. 155 question. Liquefied cell wall when treated with the fluoroquinolone and HCl produce which color? Okay, liquefied cell wall when it is treated with the fluoroquinolone and HCl produce which color? pink color, red color, blue color, and orange color. What type of color is going to be produced? Which color? 155. What is the right answer? Don't take much time. Within 1 minute, you solve the question. Okay, the right answer is nothing but it gives a red color. It gives a red color. For the liquefied tissue, when we add a HCl and fluoroxanose, it gives red color. So thereby, you can confirm they have the lignin. Okay, yes. You can see, in order to confirm the lignified cell wall, fluoroxanose with HCl gives a red color. Okay, and there are different types of microevolutions for different okay tissues and the parts of the plant. You can see for cellulose cell wall, we need to it gives a blue to violet color. For starch, it gives a blue color. For tanks, bluish black color. Some okay, separate cell wall gives orange red color, and aluminum grains gives a brown color. Okay, yes. So that's the right answer. Very good. Now moving to the next question. Okay, now 156. So synonym based questions. Try to remember the synonyms are very, very important. Meadow saffron is a synonym of which of the following and which is used to induce meadow saffron. Okay, come on. Meadow saffron is synonym of which of the following? 𝙂𝙋𝘼𝙎𝙬𝙁, 𝘾𝙀𝙉, 𝘂𝙋𝑚, 𝘾𝙀𝙉. So while solving these questions, you need to eliminate the options, which means only two options which are not at all related to this question. So for such type of questions, for such type of options, eliminate the two direct wrong answers. And yes, come on, tell me. 155 𝘂𝙂𝙎𝑘𝑚 and Ritax, very good. Yes, meadow saffron is nothing but synonym of polyploid. If you look at the morphology also, the color is something like a meadow saffron, right? Saffron color. You can see here's option A is right. And the colchicine is the only one natural polyploid agent. Okay, in order to induce the polyploid, colchicine is the best alkaloid. Very good, very good. Yes, colchicum, meadow saffron, seed or atom crocus. It is obtained from the colchicum atom in colchicum luteum, family Liliaceae, and yes, it is used to induce the polyploidy. Yes, so look at this one. Okay, now the next question. In quantitative microscopy, the 𝘂𝙂𝙎𝙎𝙎𝙬 method is primarily used to determine quantitative microscopy and 𝘂𝙂𝙎𝙎𝙎𝙬 method. It is mainly for the quantitative microscopy for desired particles, like starch grains, and all this minute and microscopic characteristics. We are using this method, but tell me for which purpose we are using the 𝘂𝙂𝙎𝙎𝙎𝙬 method. Come on, 157. Okay, very good, Tamil Rasu. Tamil Rasuji, yes. But it's for the particle size or percentage purity of a drug or moisture content of the drug. Yes, it is undoubtedly, you're right. Undoubtedly, it is for the percentage purity. Yes, while you're writing the equation also, 𝘂𝙂𝙎𝙎𝙎𝙬 method, percentage is equal to, right, N into W into P by S into M into, right, 94,000 spores, right? Exactly. And now you can see this is the formula. N into W into 94,000 by S into M into P, into 100. So that's why because it's for the percentage purity. Very, very important method. Important microscopic evaluation method. Try to remember. Okay. And also, apart from that, try to remember what are the specific features of lycopodium. When you take each spore or each grain, they'll be uniform in size. 25 micrometers will be there. And when you take 1 mg of lycopodium powder, you're going to get a 94,000 spores per mg. So that's why that much accurate it is. That's why we're taking. Okay. Yes. So these are all directly from our cognitive modules from Navigator series. Next question. Come on. Very good. Now 158th question. Identify the incorrect pair of alkaloid and their heterocyclic current class. Come on. So tropine, belladonna hyacinthoscopa, quinoline, cinchona gampothica, indole, naxomica, alcohol, and coca and coffee, imidazole, pilocarpus, which is incorrect. They're asking about. Try to read the question carefully. The incorrect pair of alkaloid. They're asking pair of alkaloid. Go on. Incorrect pair of alkaloid. Go on. Question number 158. Incorrect pair of alkaloid. See, we have given a hint for, right? So, right, for indole alkaloids, you can use the shortcut. In India, the top institute or the top national institute for farm education is NIPER, right? IND stands for indole and IND stands for India. So in India, NIPER is the top institute. Yes, like how in indole, okay, in order to remember the indole alkaloids, we have NIPER, Naxomica, Vinca, Phytosigma, Ergot, and Rolfia. So, what is the right answer here? What is the wrong answer? I mean to say, what is the incorrect pair here? See, ergot is okay, naxomica is okay, but whereas coca and coffee, these are purine alkaloids. They are not at all indole alkaloids. Is this clear? And yes, these are correct. Belladonna, hyacinthus, and coca. Okay, and quinoline, cinchona, gampothica, and imidazole. These are right. But this will be the wrong answer. Okay. Yes. So try to remember for indole alkaloids, NIPER is the shortcut. Yes, this is the incorrect pair of matching you can see, and this is the classification that we have given our GTC Navigator module. Okay, go through it, and especially for the pharmacognosy for the alkaloids, it is very, very important to know about the classification of the drugs based on their structure. It is very, very important. Clear? Yes. Heterocyclic and typical alkaloids. Now the next question, come on. Which of the following alkaloids is respectively amorphous, colored, and optically inactive? See, they have us. Okay. Firstly, there was amorphous. Okay. Colored and optically inactive. Within one hint, right? So PA. Optically inactive, right? Optically inactive. Okay. P and A are the inactive drugs. But whereas you need to tell me colored alkaloids. See, okay, BBS, right? BBS means, okay, betadine, berberine, sanguinarine. These three are the colored alkaloids. Okay, and also SCN, okay, SCN. Spatine, quinine, nicotine. These three are the liquid alkaloids. Okay, but here optically inactive alkaloids are only two. That is papaverine and atropine. These two are the inactive alkaloids. Optically inactive alkaloids. Come on, tell me, what is the right answer? BBS is for color, okay, colorful, okay, and SCN, cyanide, okay, you can remember like cyanide short form, okay, SCN means liquid alkaloids, and whereas PA, okay, optically inactive, P means papa, nephropin. So yes, the right answer is obviously A. Very good, Tamil Rasu, Nazreen, and yes, okay, yes, you can see here. So there are some exceptions in the properties of alkaloids based on the physical properties and based on the chemical properties. We have exceptions like how in the alkaloids, okay, exceptions are mostly all are white. 95% of the alkaloids are colorless crystalline compounds except amitin. Amitin is amorphous in form. Like how all the alkaloids are solids, but except three, quinine, statine, and nicotine. These three are liquid alkaloids, and especially nicotine is a volatile alkaloid. Okay, and as you can see, exceptions colored are BPS, betadine, berberine, and sanguinarine. Yeah. So that's it. That's the right answer. Very good. Now the next question. Quinine and quinidine are different. Quinine and quinidine are different. A. Chemical nature. B. Molecular formula. C. Rotating the plane of polarized light. Precursors of biosynthesis. Come on. Now 160 question. Quinine and quinidine different. Chemical nature, molecular formula, rotating the plane of polarized light, and precursor of biosynthesis. Come on. So quinine and quinidine, they are different. Exactly. Rotating plane of polarized light. Rotating plane of polarized light. They have the same chemical nature. They have the same molecular formula. Okay. And also, precursor for the bias is also same for both of them. Okay. Very good. Very good. Ritax, Nazreen, and yes. That's it. You can see the chemical consistent is obtained from the cinchona. Okay, cinchona, you have four species: Ledgeriana, officinalis, saxirubra. Okay, and cinchona officinalis, Ledgeriana, saxirubra. Okay, and cinchona calisaya. But in that, okay, higher amounts will be present from the L. L means large, large means Ledgeriana. Okay, but in that, quinine and quinine are active. Okay. And also like how cinchona and cinchonidin both are the isomers of each other. Okay, yes. Now, which crude drug is obtained from the dried ripe seeds belong to the family Lohganaceae and contains lignified trichomes? Only 2 to 3 drugs are there belongs to the family Lohganaceae. Okay, and especially I have asked this one. Okay, try to remember lignified trichomes are the only one plant you are going to find out. Now, pharmacognosy lignified trichomes are only seen in only one major plant, one. That is known as a, okay, dog poison. I can give you the hint. Okay, dog poison, crowfig. It is a seed actually. What is the right answer? Yes, Nazreen, very good. Okay, aspirant pharma, very good, very good. Strychnus naxomica belongs to the family. Strychnus naxomica, nuts blenda, Lohganaceae. Only naxomica contains lignified trichomes. And also try to remember, okay, while you're going through the microscopical features, okay, try to remember the examples of the trichome based examples, stomata based examples, V-level based examples. They are very, very important. Okay, first one, very, very important. Try to remember the trichome based example like sunken stone. Okay, T-shaped trichomes. Okay, lignified trichomes. Okay, glandular trichomes. And like how stomata, special stomata is the right sunken stomata, circular stomata, radiate cell. Like how such type of examples also very, very important. Please go through it. Okay, look at crowfig and dog poison, and yes, family Lohganaceae, and yes, so this is a right answer for this question. Nuts blender. Okay, it's contain strychnine and brucin. Strychnine and brucin. Now, next question. Which of the following plants contain raphides or acicular type of calcium oxalate esters? Acicular types of calcium oxalate esters. Cinnamon, ipecac, gentian. What is the right answer for this question? 162. Okay. Okay, this is visible now, I think. Hopefully. Okay, yeah. So what is the right answer for this question? 162. Okay, you're going to option? Yeah, yes. The right answer is cinnamon, ipecac, and ginger. Yes, they contain raphides. Raphides means cinnamon. Just don't remember. The best example is raphide means cinnamon. Along with that, okay, ipecac and ginger also contain raphide type of uh, calcium oxalate crystals. Okay, yes. So you can see here. So these are the, and also next important, see trichome based examples, stomata based examples, and also calcium oxalate crystal based examples also very, very important. Okay, so you can see prismatic and cubical crystals. You can even have best examples. Okay, Canada Queen. Okay, Ruchi, silently love Rahul. So these are the examples that we have gone through. Okay, and we have given to all the students. And you can see Rosette or cluster type of crystals. Okay, Rosi, Sanna, passing between clusters, space between the clusters. Left side is cutting. Okay, that's why. Now it is okay. Now I think properly visible now. Okay. Yes. So these are the examples. I will go through it. Next, 163 question. Chiraglin and amara junction is an example of 163 question. Bitter glycoside, cyanogenic glycoside, isothiocyanate glycoside, flavonol glycoside, flavonoid glycoside. Now I think it is okay. Please go through with the answers. Come on. 163 question. Come on, what is the right answer? Chiraglin and amara junction. Example, okay, classification based on their chemical classification. Very, very important. So try to remember the examples. Okay, now it is clear. Kindly answer the question. Yes. So the right answer is obviously bitter glycoside. The right answer is bitter glycoside. Okay. So chiratin and amylase are okay. They are belongs to the bitter glycoside classification. Bitter glycoside. You can see this is the classification of chirata. Chirata, it is known as very, very important synonym is East Indian balmony. This synonym is very, very important. East Indian balmony synonym of chirata. Okay. And yes, but chirata memorization main bitter principles present in the Swershia chirata. Okay, the chirata herb, the main bitter principles are because of these emulation and chiratin. Okay. Yes. So that's it. Okay. Yes, next question. The main concept of spearmint oil is, come on, question number 164. The main concept of spearmint oil is L-carbon, L-menthol, santalol, D-carbon. And mention the question number. 164 question. The main constituents of spearmint oil, L-carbon, L-menthol, santalol, that's okay. Okay, santalol and D-carbon. Don't get confused, right? Yes. The right answer is it is L-carbon. In spearmint oil, it is L-carbon. Yeah. In mentha piperetta, L-menthol will be there, 70%. But in the spearmint oil, we are going to have the L-carbon. That is 80% L-carbon will be there. Okay. Just try to remember. The spearmint oil, you can see 50% is not less than 50%. Not less than 50% of L-carbon will be there. That's why it is okay. Spearmint oil. Mentha spicata. Yes. Next question. So 165 question. Red squill powders is marketed as a rodenticide. Its rodenticide action is due to okay, red squill. They are marketed as a rodenticide to kill the rodents, but that rodenticide properties be which of the following? Because of which of the following? Carbonic acid, strychnine, silarocide, and brucin. Come on, 165 question. Okay. So yes, the right answer is undoubtedly it is silarocide. Okay, silarocide. Why? Because brucin and strychnine belongs to naxomica, carbonic acid belongs to the okay cocaine. Okay. Yes, so stellaricide is a thing which is responsible for the red quill. Okay, which has a rodent cell property. Then that hit rat kill. Okay, in that the main ingredient is stellaricide. Okay, very good. You can see Archinia martima, okay, has two varieties, white and red quill. In that, we are going to have, okay, stellaricides are stellaricide, okay. The red quill containing glyphosate called stellaricide, which is responsible for the rodenticide property or rat poison. Next. Now, 166 question, the drug whose tuberous root is used for antioxidant property. Shatavari, Ashoka bark, Chirata, and Tulsi. Focus is adjusting in between the minutes. Okay, I think need not to worry. It is going to adjust. Okay, autofocus will be there. That's why. Need not to worry. The drug whose tuberous source is used for the antioxidant property. Option A Setavari, B Ashokabat, C Chirata, and D Tulsi. Okay, yes, antioxidant property means you can directly go with one option. That is nothing but Shatavari. Shatavari is the only drug which can have antioxidant property. Very good, very good. Saumya and aspirant pharma, very good. Okay, you can see, and these are the use of different herbs. Tulsi, okay, and it's a expectorant and bronchitis, usually treatment of bronchitis, carbonated stimulant, and Chirata, it's a beta tonic and stomachache. And this variant of Shatavari is a antioxidant property. Shatavari 1, 2, Shatavari 4. Now the next question, the red coloring matter obtained from the cochineal is. Cochineal is an insect, okay, female insect, and yes, from that the red coloring principle is obtained. But what is the name of the red coloring principle? Alizarin, carbonic acid, okay, and palagronidine and senoside. 167. Come on, come on. Yes, you got option B. Okay, exactly. The right answer is nothing but B. Clear? And yes, cochineal carbonic acid. C, cochineal and C for carbonic acid. Because of that one only, you want to get that red coloring principle. And that red coloring principle is used in cosmetics and the preparation of confectionaries. Okay. Very good. Cochineal. So this is a female insect. Okay. Coccus cacti, Coccidae family, carbonic acid. From that only we are going to get the, and that carbonic acid in the water gives a deep red color, and acidic solution gives a yellow to violet color. Okay, it is used in the coloring is in the food. Okay, in the food and drug and cosmetic products. Okay, yeah. Yes. So now the next question, the chief active concept of diaspora that serves as a precursor for the steroid hormone and oral contraceptive is, see, try to remember diaspora, okay, it's nothing but known as yam. The synonym is known as yam. Synonym is known as yam, okay, or wild yam or wild yam. And yes, it is used in the treatment of, okay, arthritis, okay, especially in the treatment of rheumatoid arthritis. Okay, and yes, this root is known as rheumatism root. And yes, and also this one contains a steroidal nucleus, and that's because it acts as a precursor for the steroidal hormone, precursor for the steroidal hormones, and that's why. Okay, and now tell me which was the right answer. 168 question. Very good, dear students. Very good. Okay, you go in option C. Diosinin. Diosinin is a, okay, major constituent of diosinin. Okay, sorry, diasporic deltoid. And yes, from that only we are going to get the steroidal hormones. And yes, it is due to the preparation of contraceptives as well. Now you can see that's what I said, yam or wild yam or rheumatism root. Okay, it's obtained from the Dioscorea deltoida, Dioscorea composite family, Dioscorea and dialzinian, right? And from that only, okay, so the steroidal in nature, and that's why it is used to, okay, synthesize the steroidal hormones and contraceptives. Very good, very good. Come on. Now, 169 question. What is the primary purpose of stability testing in helper formulation? When it comes to helper formulation, what is the primary purpose of testing their stability? Yes, come on, dear students, let me know. Stability testing. Yes, obviously. Stability means shelf life. Am I right or not? Yes, obviously. To determine the shelf life and storage, yes. See, if they have the good shelf life, if they have a good preservatives, then only they are stable. If they are stable, they have a good shelf life. Okay. Yes. Obviously, that's the right answer. And now you can see stability testing and Weber formulation is conducted to determine the shelf life, that is expired period of shelf life, and appropriate storage conditions. These are the two main reasons. Okay. Yep. Now, next question. Typical identification test of cyanogenetic glycoside is typical identification test for cyanogenetic glycoside. Come on. Typical identification test for cyanogenetic glycosides. Okay, it's a 170 question. Yes. Typical identification for cyanogenetic glycoside. See, apply your IQ, basic knowledge. See, they're asking typical, not a general. Okay, typical identification, which means these are all the basic confirmatory tests, right? 𝘿𝙄𝙎𝙎𝙄𝙊 test and 𝘾𝙀𝙉𝙗. But when it comes to the typical identification test, the right answer is nothing but the sodium picrate test. Okay, typical. See, if you want to identify the cyanogenetic glycosides, you can go with the sodium picrate test. So that's a specific test. Okay, yes, sodium picrate test is to confirm the cyanogenetic glycoside. So this is how we are going to perform sodium picrate test. The powder drug was moistened with water, and yes, the concentrated it's just what we are going to add, and thereby we need to filter that one, and then we add sodium picrate. Okay, and finally, brick red color is formed due to the cyanide, hydrocyanide. Very good. Now 171. Wavy sclerenchyma is a characteristic feature of wavy sclerenchyma. Yes. So this was from the world level question, especially from the umbelliferous fruits. Okay. Okay. Wavy sclerenchyma has semen. Okay. Come on. Wavy sclerenchyma. Yes. Option B is right. Okay. Yes. Coriander contains wavy sclerenchyma. Okay. In this structure, you can see wavy sclerenchyma. Okay. Wavy sclerenchyma will be present in the coriander. Okay. What is the family of coriander? Umbelliferae. Okay. Yeah. And this it contains umbelliferol and coriandrol, and it is known as D-linalol. The coriander contains an active one, and very very important thing. This coriandrol is known as D-linalol. D-linalol. Yeah. Yes. So that's another important question. Now, next question. Now, rancidity of fixed oils during the storage is mainly due to rancidity itself will be the answer. Rancidity itself will be the answer. Okay. Rancidity is rancidity is formed due to rancidity and due to acidity. Acidity leads to rancidity. Rancidity and acidity. Okay, free rancidity formation leads to the rancidity of the fixed oils. Already we have discussed this point before. Okay, so free acidity formation, Clear? Rancid of fixed oil during the storage is mainly due to free acidity formation. Very good. Because they turn rancid upon the storage due to free acidity. Okay, fixed oils and fats. And you can see we have divided the fixed oils and fats into two types. Okay, from vegetable origin and from fats origin. Try to go through this one. Yeah. Next, 173 question. Modified bond tracker test differ from the classical bond tracker test mainly because it includes. When you check the formula for the bond trackers and modified bond trackers test, there you're going to find that what you can say the difference between the modified and bond trackers. Okay. Yes. Yes. Addition of ammonia before extraction. Addition of FeCl prior to hydrolysis. Okay, if you see the formula, even though in our class I used to mention this point, okay, only one difference between the modified and bond trackers, okay, modified bond trackers and bond trackers. What is the difference between the modified and the classical bond trackers? Only one difference we used to mention. What is that? So obviously that is nothing but yes, it is B. Okay, FeCl is the only difference for the modified and bond trackers. Very good, very good. You can see the formula as well. Okay, yes. So here we are going to add up. Okay, in the modified bond trackers, we are going to add the FeCl3, whereas in bond trackers, we are not going to add the FeCl3. Okay, yep. That's it. Very good. And now the constant of phenylbutadiene, that is phenolic ether, and it is mainly responsible for the sweet flavoring property is the constant of phenyl water oil, that is phenolic ether, and is mainly responsible for the sweet flavoring property is. Okay. Sweetness. The sweet principle is due to which of the following? Anethole, phenol, eugenol, and carbonol. What is the right answer? Yes. Okay. So I'll give you one hint. Yes, aspartame is an artificial sweetener, right? A for aspartame, aspartame means artificial sweetener, and A for anethole, anethole is a sweetening agent. Okay, sweetening agent in the phenol. Yes. Very good. That's the right answer. Anethole is the right answer. Okay, that's a sweet principle, and also it's a phenolic ether. You can see. So anethole 50%. Okay, anethole is a 50%, and yes, anethole is a phenolic ether, it's the sweetest substance. Okay, and phenol is a colorless, pungent liquid with the aromatic oil. Okay, yes. F means flavor or odor. The smell is due to phenol. Okay, and sweetness is due to anethole. Very good. Now the next question. Come on. So resin which obtained from the animal source, only one resin is obtained from the animal source. Direct question. Direct question. No need to review all these things. Okay. Does 𝘎𝑒𝑐 obtained from the animal source? Does 𝘂𝙎𝑒𝑐 obtained from the animal source? Does thorax is obtained from the animal source? No, only one is obtained from the animal source. That is nothing but the right answer is yes, shellac. Okay. 𝘿𝙄𝙎𝘾𝙄𝑖𝑑 family, shellac. Okay. 𝘿𝙄𝑖𝑐 acid. 𝘿𝙄𝑖𝑐 acid. You can see. Okay. So that's what I said. It's not a sailing wax, right? Remember, lac. Okay, lucky for lacca. Okay, 𝘿𝙄𝑖𝑑 family or carica lacca, 𝘿𝙄𝑖𝑐 acid. Okay, and that's mostly this one, this wax, this the resin is used in the preparation of sustained osmosis forms. Okay, like a polymer. Very good. Now the next question. Come on. So, which of the following? Which of the following is correct? Let me check the question once. Yes, which is a mismatch between the special structures? What is the mismatch between the special structures of seeds? What is the mismatch? Okay, what is the mismatch between the special structures of seeds? Find the incorrect match in the special features of seeds. Special features of seeds. Find the incorrect match in the special features of seeds. Come on. 176 question. Okay, hidden source. Find the incorrect match in the special features of seeds. Incorrect match. So even though, come on, what's the incorrect match in the specialized structures of seeds or specialized species of seeds? Very good, Shravani. Very good. Very good. Okay. Yes, the right answer is undoubtedly C. Correct. Baradon is a leaf. Okay. Baradon is a leaf. But this question is for the special structures of seeds. Actually, right? Seeds. Constant seed, cardamom seed. Okay. Piper beet is also. It contains hydrozoes. That's what it is. Right answer is 𝘾𝙀𝙎𝙀. Okay. Baradon. Now the next question. So these are the special structures of seeds. Okay, aril is found in the maize, okay, nutmeg. Aloe is for the cardamom. Okay, arista around for the sopanthus. 𝘾𝙀𝙎𝙀 is for the okay castor seed. Stropiol is for the colchicum seed, and nails are for the cotton. Now the 177 question. Okay, come on, don't give up. In capsicum, the red color and the pungent taste are respectively due to. I'm checking your answers. Okay. In the capsicum, the red color and the pungent taste are respectively due to. In the capsicum. 177 question. Come on. Capsaicin, capsanthin. First they're asking about color and then pungent taste. Very good, Ritaj. Very good. Yes. So the right answer is option B, capsanthin and capsaicin. Capsanthin is responsible for the color. Okay, and whereas capsaicin for the pungent taste. Okay, you can see. So cyan pepper, so obtained from the capsicum atom Solanaceae family. And yes, capsaicin is obtained for the okay, it is responsible for the pungent principle. Okay, and yes, capsanthin and keratin is responsible for the red color. Bell pepper. Okay, now which of the following statement true about the ash values? Total ash is okay. Total ash is determined below 450 degrees centigrade. Ash and soluble ash it's earthy matter. Sulfuric ash uses sulfuric acid. All of the above. Xanthic color exactly. Okay, very good. Come on. The right answer is all of the above. Yes, the four ash values, all the above on the true statement. Yes, total ash should be determined below 450 degrees centigrade, and acid insoluble ash is what earthy matter, and sulfate ash uses okay sulfuric acid. That's it. Yes, you can see this is the difference between the okay total ash value. Okay, these are the features that we need to consider for the ash value. Okay, now next question. The alkaloids atropine, hyoscine, and hyoscine are differentiated chemically by which of the following tests? See, May's test is a test where you confirm the presence of alkaloid. Witten test where you confirm the troponucleus. But whereas Hager's test, it is nothing but Pickering test where it's a confirmatory test for the okay alkaloids. But differentiation test, okay, differentiation test is by the Gerard test, Gerard reagent. Okay, G for general differentiation. Right, remember? And yes, the right answer is Gerard test. Very good, all of you. Okay. Gerard test is mainly to differentiate. Okay, Gerard test is mainly to differentiate based on the color change. Based on the color change. After adding the mercury chloride solution of a sample, okay, in 50% alcohol, it gives a white color that is hyoscine. If it gives a red color with heat hyoscine, without heat, if it gives a red color, that is a atropine. So Gerard test. Right, remember? Gerard test is a identification test or differentiation test. Now, what's the primary function of prebiotics in the digestive system? Very easiest question. Primary function. Okay, prebiotics. Pre means before. Pre means before. Okay. So directly kill the harmful bacteria to enhance the growth and activity of beneficial gut bacteria to increase absorption of vitamins and minerals. Okay, obviously we know very well we have the prebiotics in our meal every day. We are going to have okay to enhance the growth and activity of the beneficial gut bacteria in the beneficial flora for the digestion. Okay, yes. So prebiotics, the substance induce the growth and activity of microorganisms, example bacteria and fungi, which are useful for our gut. Okay, yes. So that's it. and write down the examples as well. Now the diastase takes part in digestion of which of the one? Okay, diastase is an enzyme. It is an enzyme. Okay, but it is takes a part in digestion of which of the following? Protein. Okay, starch or amino acids and fat. Okay, so DAS is an enzyme, is important for the dextrose, or which means starch. DAS things is nothing but is an enzyme which is responsible for the digestion of sugars, complex sugars like starch. Clear? It is DAS things enzyme is it is for the complex sugars like starch. DAS is for the starch. You can see. So DAS is an enzyme which is meant for the starch digestion. Any set of enzymes that catalyze the breakdown of starch into maltose known as diastase. Okay, starch. You can see the starch digestion. Okay, it gives us sugar molecules. Complex sugars, that's what it said. Now the next question, come on. So in opium, alkaloid is present as a salt of, yes, generally the alkaloids are present as a, okay, free salts, okay, free bases. Free salts and free bases. Yeah. Free bases are soluble in organic solvents. Free salts are soluble in water. Okay, free salts of organic acids. Usually, okay, opium. I'll give you one hint. This, okay, M is the answer for this one. Why? Because, okay, opium. In opium, what we're going to get? Morphine. Okay, so M means morphine, and the same M means Marcus test. Marcus test, same with the same M, you can write the Marcus test, which is identification test for morphine. And same M means mechanoic gas, that is a acid present in it. Okay, M means morphine, same M means, okay, Marcus test, M for morphine, M for Marcus, and M for mechanoic acid. Very good, very good. Okay, yes, so you can see morphine is a monoester and levorotatory phenolic alkaloid, and yes, it is optically inactive. It is also, okay, papaverine and atropine. These two are optically inactive. Next question, come on. The endoalkaloid receptor is obtained from the plant. What is the right answer? Endoalkaloid. Obviously, reserpine. Okay, reserpine, 𝘿𝙬𝙎𝘾𝙄𝙎. They've asked me about, see, synonyms, sometimes synonyms also they use to identify the question. Okay, come on, what's the right answer? Quassia. Yes, I'm not really Sarpagandha. Yes, Chota Chanda Sarpagandha, the synonym of the rock. Yes, Serpentine. Okay, you can see Chota Chanda Sarpagandha Indian snake root. Okay, Sarpagandha means, okay, based on the morphology as well as it is used in antidote for the snake bite. That's why it is used as Rolfia. Sorry, Sarpagandha. Okay, yes, Reserpine. Source is Sarpagandha, or you can see Indian snake root or Rolfia Serpentine. Very good, very good. Now, the father of 𝘎𝙬𝙎𝙎, who is known as a, okay, father of natural history. We already discussed. Okay. Okay, the study of animals, right? Study of animals is nothing but the zoology. A for animals, A for Aristotle, right? So Aristotle is the father of zoology and father of natural history. Okay, history is not the father of surgery. C.V.D. Linnaeus is known for his binomial nomenclature, and certainly who isolated opium, right? Yes. So right answer is Aristotle. Yes, Aristotle is the father. And just right from the history of pharmacognosy, it is very, very important to know the fathers, important personalities and their titles. What is the titles from the important personalities from history of pharmacognosy is very, very important. Okay. Yes. Now the next question. Which of the following is correct regarding complex permanent tissue of plants? Okay, which of the following is correct regarding complex permanent tissue of plants? Phloem is responsible for the transport of water. Xylem responsible for the transport of organic nutrients. The tissues are essential for the plant transport systems. The tissues are essential for the one type of cell. What is the right answer? Okay, yes. Okay, so try to remember. Okay, so WX, what do you mean WX? Okay, xylem is mainly meant for the water circulation. Okay, phloem is mainly meant for the, okay, food, or nothing but a protein, nothing but a organic nutrients. Clear? P is equal to P. P means protein. Protein is nothing but a organic nutrient. Okay, whereas Xylem is mainly for water. Okay, like for vice versa, you can remember. Xylem is okay. WX. Okay, water is from the xylem. Obviously, if the water is supplied from the xylem, remind rest of the food will be applied from the phloem. Okay, so these two are wrong statements, and the right answer will be okay C. Why? Because phloem and xylem, these are the okay permanent tissues, complex permanent tissues meant for the transportation of the water and nutrients. That's why this is the right answer.
Created with free version for non-commercial use.
Yeah. Yes. Plant tissue, you can see we have two types of tissues: mesenchymal tissue and a permanent tissue. Okay, mesenchymal tissue and permanent tissue. And cells have a capacity to multiply. Mesenchymal tissues have the okay. Yep. So mesenchymal tissue and permanent tissue. Now the next question, come on. Right end of 𝘂𝙀𝙎 represents a core cells present in C. Simple answer. We know, right? 𝘂𝙀𝙎 is a which part of the plant? 𝘂𝙀𝙎. Whether 𝘂𝙀𝙎 is a root or stem or bark or leaf. Yes. 𝘂𝙀𝙎 is a dark. It is a bark. It is known as a soap nut. Right? Soap nut bark. Obviously. So right endoma is a dead tissue. See, nothing but right endoma is nothing but a dead collapsed cells of a bark. Okay, so that's why 𝘂𝙀𝙎 is a bark. We know already 𝘂𝙀𝙎 is a bark. 𝘂𝙀𝙎 is a bark, obviously. You can see this is structure. Yes. So see, right endoma is dead collapsed tissues. Dead collapsed tissues. Clear? And yes, so just outermost layer. So right endoma is present in the 𝘂𝙎𝙎 bark. Now the next question, come on. 187. Which hormone helps to reduce the rate of transpiration in leaves? Okay, abscisic acid, cytokinin, ethylene, and auxin. Come on, 187. Okay, so rate of transpiration is by the yes. The right answer is abscisic acid. By the abscisic acid will reduce the rate of transpiration in leaves. Okay, that's why it is in the drought condition. It prevents the rate of transpiration in the leaf and thereby it can save the plants. Okay, yes, you can see. So abscisic acid will prevent the in stress conditions. In stress conditions in flooding, at the time the plant is going to release or synthesize its own abscisic acid, thereby it closes to matter. Okay, thereby it prevents the loss of moisture. Okay, loss of moisture. Now, the plant shows particularly strong apical dominance, that is due to presence of which hormone? Apical dominance. Okay, apical dominance. Apical dominance. So, due to which hormone? Cytokinin, ethylene, and gibberellic acid. Gibberellic acid and auxin. What is the right answer? Yes, right answer is undoubtedly. Okay, the right answer is then what? Auxin. Yes, auxin can cause apical dominance. Apical dominance. You can see, so auxin can cause a apical dominance in the plant itself. We can see the apical dominance, and it prevents a premature leaf and fruit drop, and it node elongation. Okay, these are the things. Okay, yeah. And also try to remember for all the plant hormones, try to remember what is the natural one and what is the synthetic one. Okay, here IAA, PA, and IAN are the natural one. IPA, okay, NAA, and 24D and 24T, these are the synthetic options. Okay, next. For accumulation of secondary metabolites in culture, okay, which has been used much, culture which has been used much is, okay, in order to get the, higher accumulation of the secondary metabolites, which culture technique is suitable? Meristem culture, hairy culture, sterile culture, and none of them. Meristem dip culture, hairy culture, sterile culture, and none of them. Yes. So undoubtedly, just to accumulate higher amount of secondary metabolites, we use hairy culture. And what is the responsible organism for this hairy culture? Okay, Agrobacterium rhizogenus. Agrobacterium rhizogenus. Yes, you can induce the hairy roots to any part of the plant. Either you can do hybrid culture for leaf, root, stem, on any part. Okay, if you add this agrobacterium rhizogenus to the particular next plant, okay, and thereby it induces cells, tiny roots will be appeared. That tiny roots will be taken for the further culturing, and there we are going to get the higher amounts of secondary metabolites containing You can see Agrobacterium rhizosinus. Agrobacterium rhizosinus. Like how this agrobacterium is going to infected or we're going to transfer to the plant and thereby it can induce the roots and that roots are collected for the further culture. Next, which of the following mutagens is not under the class of chemical mutagens? Simple, try to remember. Okay, they're asking about chemical mutagens, but which of the following is not a chemical mutagen? Which of the following is not a chemical mutagen? Okay, chemical, not a chemical mutagen. So simple, very simple like you. Why? Because you can see nitrogen is a chemical, formaldehyde is a chemical, and nitrous is a chemical. But whereas ionization radiation is not at all a chemical. Okay, mutagen, it is a physical technique. Exactly, right, very good. Like how we need to solve the question. That's the approach that you need to have while you're solving the question. Okay. Yes. So yes, mutagenesis, which means inducing the mutations. Chemical means chemical agents are used. Physical means ionizing radiation, X-ray, and UV rays. Next, atropines. Atropines, based on the physical properties, based on the physical chemical properties, atropines. Atropines. Either optical active or optical inactive. Yes, already I have discussed, right? Optically, okay, inactive, okay. P for pepper and A. Yes, need not to worry. Yes, okay, okay. Now it's clear. Yes, so that's why 𝘎𝑃 is a powder drug. 𝘎𝑃 is a powder drug. It's clear now. Okay, so that's the right answer. Okay, where you can see these are the all different types of Ayurvedic medicines. Okay, need not to worry, don't worry. Okay, milk extract is nothing but 𝘎𝑃 and nothing but plant boiled in a milk and filter. That's why. Now next is Aganda Tantra is a branch of Ayurveda that deals with. Aganda Tantra is a branch that with treat with psychiatry, toxicology, treat with chemicals and surgery. Aganda Tantra. Aganda Tantra means psychiatry or toxicology or treat with chemicals. Okay. Yes, the right answer is Aganda Tantra is nothing but a toxicology. Okay. Aganda Tantra is nothing but toxicology. Why? Because there are several principles or several type of disciplines out there in Ayurveda where you can see 𝘖𝙬𝙎𝑘𝑠𝑎 means medicine. Okay. And Shalya Tantra means surgery. Okay. Shalya. See, S for Shalya, S for Shushruta, S for okay surgery. S means Shalya means surgery. Okay. Shalya ke tantra means ENT treatment. Bal chikitsa means pediatric. Rasayana means treatment chemical. Okay. Vasita means aphrodisiac therapy or Aganda tantra means toxicology. And both of them means psychiatry. Very good. These are the branches. And now chemically cavernous. Chemically cavernous. Hydrated magnesium silicate, hydrated potash, and aluminum silicate, and hydrated potassium hydroxide. Okay. Yes, the right answer is chemically it is aluminum silicate. Cavern is aluminum silicate. So cavern is a hydrated aluminum silicate and uses absorbent as filter. And try to go through the drugs obtained from the mineral origin. Okay. So there is a slight table will be there, small table that is sufficient. Next. Siam benzoin differ from the Sumatra benzoin variety due to insufficient amount of okay. So Sumatra benzoin and Siam benzoin both are belongs to the okay. They are balsamic resins. Okay, balsamic resins. Balsamic resin means they are going to have a both benzoic acid and cinnamic acid. Balsam means cinnamic acid and benzoic acid. Yeah, but how they are going to differentiate? How the Siam benzoin is different from the Sumatra variety benzoin due to insufficient amount of which one? Either benzoic acid or cinnamic acid. Okay, so that's the right answer. Yes, exactly. So they are insufficient. See, cinnamic acid is a insufficient content. Okay, so in the Siam benzoin, they are going to lack of cinnamic acid in a sufficient quantities. Okay, you can say Sumatra benzoin and Siam benzoin. Okay, so the Siam benzoin, they are insufficient cinnamic acid will be there. Okay, but in this both cinnamic as well as benzoic will be there. But whereas in the Siam benzoin, okay, Siam, Siam, C means C. Okay, C means cinnamic acid, insufficient amount. Next. To control the pest by using a parathion is a constant of which type of category? Parathion. Fungicide, insecticide, herbicide, and rodenticide. Come on, 196 question. Come on, yes, 4 more questions to complete 50 and 100 to go. Yes, right answer. That's right answer. It is insecticide. Okay. So parathion is an insecticide. Even though, see, fungicide, insecticide, herbicide, these are all pesticides. But the thing is that parathion is specifically belongs to insecticide. Okay, yes, you can see parathion is an insecticide. You can see parathion. Parathion is an insecticide. These are all the pesticides. Very good. Now, heating a drug at 105 degrees centigrade in an oven to constant weight is known as. This question is also again applied for the physical pharmaceutics. Water determination, moisture content determination, melting point, and ash value determination. For ash value, we are going to do the increase in temperature for 450 degrees centigrade. Okay, not for the water determination. Okay, not for the melting point, because melting point will varies for the drug to drug. Obviously, it is mainly for the moisture content determination. Moisture content determination. So physical evaluation techniques, we have melting point, boiling point, okay, moisture content, viscosity, solubility, optical rotation, and effect on easy. But moisture content means 105 degrees centigrade to check it. Now, troponucleus is a combination of, yes, troponucleus is a combination of pyridine and piperidine, pyridine, 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 oxygen, and piperidine, oxygen. Come on, what is the right answer? Troponucleus is a combination of pyridine, piperidine, pyridine, and pyridine, oxygen. Come on, these questions may reflect in your exam, so do not give up and do not take it for granted. Just do practice. If you know the answer, please comment down the answer. The practice makes maths perfect. Okay, yes, that's the right answer. Okay, pyridine and pyridine, these two rings are going to fuse together to form a troponucleus. You can see the structure here. Okay, troponucleus. Okay, pyridine and pyridine. Yes, examples are all the astronomical methods. Chemical classification very, very important. Now the secondary amine which is used in the treatment of asthma. Epidrab, atropine, and tuberculin and mescaline. We know already atropine. Okay. Skeleton, tuberculin is a skeleton was a laxant, and whereas atropine is a anti-muscarinic agent. So obviously the right answer is nothing but epidrab. Epidrab is used for the treatment of asthma. Epidrab. Okay, yes, epidra, and yes, okay, and we have given a short to remember this one, PM Sita QT. There is a PM, okay, PM Sita, she is so QT, okay, whereas primary amine example is mescaline, secondary amine example is epidrab, tertiary amine example is atropine, and whereas quaternary amine example is tuberculin, or in PM Sita QT. Okay, so that's how we remember the examples for the. Okay, it's now the which phytoenzyme produce anhydride clinker with a bromine water and dilute ammonia solution? Yes, this is known as Thalapathy test. Okay, this is known as a Thalapathy test. Thalapathy, queen means quinine, which means this is for the quinine alkaloids, which means cinchona. Okay, in this it gives anhydride clinker, thereby you can confirm it is a test belongs to cinchona or quinine. And also what you need to remember is there is another important test called blood red test. Blood red test. When you add a glyceric acid, gives a red color fumes, and thereby you can confirm it is a quinine. So it is for the quinine. Okay, Thalapathy test. Thalapathy test, blood red test. Okay, clear? Yes. Now the next question. The alkaloid of which sodium salt is used in the treatment of leukemia? So which of the following is used in the treatment of leukemia? Okay, alkaloid sodium salt. They are asking sodium salt. Vinca, Campotica, Cinchona, and Taxol. Okay, so you can invent this one. Okay, why? Because Cinchona is for anti-malaria. But from these three nutrients, Vinca is anti-cancer. 𝘾𝙀𝙎𝑃 also we can use for anti-cancer. Taxol is also well known for its anti-cancer property. Come on. Yes, so that's the right answer. Obviously, okay, the right answer is 𝘾𝙀𝙎𝑃. Sodium salt used in the treatment of leukemia. Okay, try to remember, especially, it is known as the synonym itself is known as cancer tree or happy tree. Cancer tree or happy tree. And the family is also very, very important. 𝘾𝙀𝙎𝑃 acuminata families, Nissaceae or Carnaceae. Okay, but try to remember C for 𝘾𝙀𝙎𝑃, C for cancer tree, C for 𝘾𝙀𝙎𝑃 annua, so acuminata, and C for Carnaceae. And there's a chemical derivatives of topotecan. They are nothing but a topotecan. And why? Because this topotecan, okay, commercially why it's known as, it is going to inhibit the topoisomerase 1 enzyme. Topoisomerase 1 enzyme. That's why it acts as an anti-cancerogen. And remember the function as well. Okay, topotecan means topoisomerase enzyme. That's why it is topotecan. Next question, come on. The 𝑑-methoxyquinone is called as quinine, quinidine, cinconidine, and quinoline. Very good, very good. 100 more questions. Go on. The name of 𝑑-methoxyquinone is quinidine, cinconidine, and quinoline. Yes, the right answer is yes. You're right. That's cinconidine. Okay. Quinine D-methoxy derivative is cinconidine. Okay. Next, you can see the D-methoxy derivative is the cinconidine. You can see there D-methoxy quinine. Okay. Now, what are the chemical functions of cascara? Okay, cascara. What are the chemical functions of cascara? Bark, cascara. You should be very careful. Why? Because more than 2 options are right here. Why? Because yes, it comes under 𝘂𝙃𝙎𝑃, it has a 𝑐-glycoside. Okay, and also it contains antranol as well. So that's why the right answer will be all of the above. They have the 𝘂𝙃𝙎𝑃 in their structure, they have the S-glycosides, sorry, they have a 𝑐-glycoside, and antranol is also there. So that's why all of the above are the important functions are there. Okay, clear? So here you can see antranol is an important thing. Okay, and yes, it contains C and 𝘂𝙃𝙎𝑃. Okay, C and 𝘂𝙃𝙎𝑃. So that's a special feature of cascara that you remember. And try to remember the name. The synonym is very, very important. The synonym is sacred bark. Synonym is sacred bark. It's very, very important for cascara. Rhamnaceae family. Rhamnaceae Rhamnaceae family. Now the next question. Come on. Indian rhubarb gives which color of fluorescence in UV light? Deep violet color, blue color, yellow fluorescence color, and green fluorescence. The name itself will be the hint. The name itself will be the hint, right? What's the present color, present jersey color of India? That is nothing but a deep violet color. Our Indian jersey or our GDC jersey, deep violet color. GDC, okay, color, yes, deep violet color. Indian rhubarb, okay, Indian is deep blue color. Okay, yes, deep Indian rhubarb gives a deep violet color or deep violet color. Now, the blue fluorescence and belladonna leaf is due to 𝘎𝑟𝑎choline, scopolamine, and scopolamine. What is the right answer? Okay, the blue fluorescence and belladonna is due to 𝘎𝑟𝑎choline, scopolamine, and scopolamine. Not scopolamine. Yes, it is by the scopolamine, right? It is a fluorescent substance. It is a fluorescent substance. That's why scopolamine, blue fluorescence is due to scopolamine. You can see the blue fluorescence is due to the scopolamine. See, not only blue, the fluorescent substance is blue itself. Okay, sorry, scopolamine is the only fluorescent substance. Okay, yes, and it is known as 𝘿𝙄𝙎𝑃. Now, a Gambier fluorescence test is a petroleum spirit layer shows for the they are for the 𝘃𝑇𝑠ℎ. Okay, and nothing but the 𝘃𝑇𝑠ℎ test. 𝘃𝑇𝑠ℎ. Okay, pale 𝘃𝑇𝑠ℎ and black 𝘃𝑇𝑠ℎ. Pale 𝘃𝑇𝑠ℎ and the black 𝘃𝑇𝑠ℎ. So this is what I'll give you one hint. Okay, P for positive result for the positive for the Gambier for green, which means pale 𝘃𝑇𝑠ℎ gives a positive results for the Gambier fluorescence, and Gambier fluorescence gives a green color. Okay, P for pale 𝘃𝑇𝑠ℎ and P for positive results. G for Gambier fluorescence test, and Gambier fluorescence test gives a green color. Okay, green fluorescence. G for Gambier and G for green color. Try to remember. G for Gambier and G for Gambier and G for green color. You can see. So yes, alcoholic green fluorescence for pale catechoid. That's what I said. Try to remember the test for the tangents. Now, 𝘂𝑃 and 𝑑𝑂𝑃 are the semi-synthetic derivatives of which of the following? Digoxin, vincristine, photophytoxin, toxin. Taxol. Yes, obviously, digoxin, no. Okay, vincristine, no. And yes, taxol or see taxol derivatives, palsitaxol. But whereas, okay, the synthetic derivatives are 𝘂𝑃 and 𝑑𝑂𝑃. Just now we came across 𝘂𝑃, topoisomerase. Okay, topotecan. Campotica, that's the campotica. Okay, yes, you can see 𝘂𝑃 and 𝑑𝑂𝑃. These are the main active constituents of photophytoxin, and yes, they are acting as a one is in the treatment of cancer, other one is in a pediatric neuroblastoma, anti-cancer. Okay, and try to remember the synonym is very important. Himalayan mayapple. Now the next one. Which of the following ones is responsible for the color of shellac? Shellac. Just now we have came across shellac is the only resin, right? Is the only insect containing resin used for the coloring purpose. Okay, shellac acid, lactic acid, 𝑙𝑖tic acid, all of this. Okay. So the right answer is only what? The right answer is lactic acid. Okay, lactic acid, lacca or lacca or carica lacca, caria lacca, lactic acid is a mainly red coloring principle, and 𝑙𝑖tic acid is a chief principle. But coloring principle is lactic acid. Yes. That's all I put. Next. When blast is formed by coupling of which of the following? Reserpine and ethanolysin. If you know, see, elimination option, elimination method. Morphine codeine not at all belong to vinca. Okay. Quinine and quinine not belongs to vinca. That's why elimination method is very, very important. You can eliminate direct two options because they are not all belongs to this question. Okay. And now maybe they are slightly belongs to this question. Why? Because 𝘎𝑗𝑒𝑚 is one of the important indole alkaloid present in the vinca. But whereas reserpine is not present in the vinca. That's why wind blasting. So that 𝘻𝑃 and windolin are the two things or two structures which are fused to form a wind blasting. Okay, you can see wind blasting is produced by coupling the 𝘻𝑃 and windolin. Yes, from the wind blasting by the demethylation, we are going to get the wind distance. Now the next question. Come on. The euphoric principle of cannabis plant is dihydroxycannabinol, dihydroxycannabinol, tetrahydroxycannabinol, and tetrahydrocannabinol. Tetrahydrocannabinol. What is the right answer? So the right answer is nothing but tetrahydrocannabinol. Tetrahydrocannabinol. Very good, very good. Good try. Good try. Tetrahydrocannabinol. Okay. If you know the answer, answer the question. Okay. Otherwise, if you don't know the answer, try to write it down or do remember. These questions may directly reflect in your NIPER exam. Okay. Yeah. So there's a clear sign I can tell you. These questions may repeat in your NIPER exam. Directly from these topics also you can get the questions. Okay. So tetrahydrocannabinol is a euphoric principle in the marijuana cannabis sativa. Yes. Okay. And yes, now mayapple root is a name of, just now we have chemicals. Okay, mayapple root is the name of the drug, that is Photophyllum, 𝘎𝑗𝑒𝑚, 𝘕𝑃𝑎𝑛𝑐𝑎, Rauwolfia. Mayapple root is the name of the drug, Photophyllum, 𝘎𝑗𝑒𝑚, 𝘕𝑃𝑎𝑛𝑐𝑎, and Rauwolfia. Yes, the right answer is nothing but obviously it is a Photophyllum hexandrum, Himalayan mayapple. Just now we have came across, right? Yeah. Etoposide and tegoposide. Okay, Himalayan 𝘎𝑃𝐿, lactobacillus and tinopacid. Himalayan 𝘎𝑃𝐿 is synonym. Very, very easy. Family is also very, very important. Yes. So there are some important tests for the tannins, Goldberg skin test. Okay. What I can say, gelatin test. Okay, and the Mansick test. And there are important tests for the identification of tannins. That is nothing but Goldberg test is for the tannins adaptation. But the main confirmatory test, you know, to differentiate whether it's a true tannin or pseudo tannin, this test is useful. That is Goldberg skin test is for the tannins undoubtedly. Okay, gelatin test, Mansick test, phenazone test, chlorogenic acid test. These are the tests important for the okay tannins especially. But whereas to differentiate whether it's a true tannin or pseudo tannin, Goldberg test will help you. Now the next question, come on. In Saptadhatu theory, rasa means. See, the same rasa is going to repeat in the Panchasila theory. Okay, Panchasila theory. In the Panchasila theory, rasa refers to rasa refers to taste. Okay, but whereas in Panchasila rasa refers to taste, but whereas the rasa in Saptadhatu theory, 7 important factors: rasa, rakta, mamsa, macha, asti, sukra, meda. Okay, and yes, yeah. So these factors are different. So these are for to describe the health. Rasa means very good, Shamini, very good. Okay, that's the right answer. Rasa means okay, lymph. Okay, yes. So these are the 7 important principles you can see. Okay, rasa, rakta, mamsa, meda, majja, asti, sukra. Okay, whereas here rasa means lymph. Try to remember here the rasa means taste, Panchasila means. Now, who isolated the constituent morphine? Who isolated the constituent of morphine? So who isolated the morphine? Who isolated morphine? Yes, obviously the right answer is so certain are isolated morphine. Okay, certain are isolated morphine. Okay, so morphine is nothing but okay. It can induce sedation or it is no. It can be considered as a sedative. Right? It causes sedation. As for sedation, sedation caused by morphine. As for certain, okay, certain has a sedation due to morphine. Okay, yes, they are very, very important when it comes to history of pharmacognosy. Important scientists who discovered the important chemical constants. Okay, so narcotin is from desone. Okay, certain are isolated the morphine. Strychnine is isolated with the palladium. Very, very important. Try to remember. Next, polyploid is induced through which are the following methods. Okay, irradiation, mutagenic chemicals, and yes, ethylene and colchicine. Polyploidy. Polyploidy. You have chemicals, okay, colchicum atom nail, colchicum luteum, okay, Liliaceae family, yeah, yes, uh, meadow saffron, atom crocus, obviously. The right answer is yes, the right answer is colchicine. Colchicine is enough, right? So it is a thing which can cause polyploidy. You can see the best known chemical cause of polyploidy is colchicine, natural polyploidy inducing agent. And you can find this same reference and same content from our GDC Navigator Module 1 from the page number 56. These are the references we have mentioned here. And now, I said already, special structures of stomata are very, very important. Sunken stomata is a characteristic feature of, which of the following? Sunken stomata. Okay, yes, very good. Sunken stomata is a feature of epidrama, but whereas colchicum contains C for colchicum, C for circular stomata. Right, remember. C for colchicum, C for circular stomata, whereas sunken stomata is seen in epidrama. Very good. Thanks. Okay, and yes, you can see C for circular and C for colchicum. Okay, sunken stomata is nothing but epidrama. Special structures, and you know already about this special structures. Very good, Shamini. Okay, next question. Come on. One mg of lycopodium spores contain average of how many spores? We have came across. Yes, already. When you check the each spore, it has a diameter of 25 micrometers, sorry, 25 micrometers. Okay, and yes, when you take 1 mg of spores, you're going to get how many spores? How many? 94,000. Yes, in the equation you can see 94,000 spores are present in the 1 mg of lycopodial spore method, and the size of the lycopodial spore is 25 micrometers. And yes, for the power drug evolution, we are going to have this one. N into W into 94,000 by S into M into P into 100. That's the formula. And this is mainly for the percentage purity. Only well-defined particles are only can be identified. Very good. Now, the pharmacopoeia in which the products are arranged according to the Latin titles, Latin. Except this one, all are following alphabetical order. Okay. Denominator. Very good, Savani and Soumya. Okay, come on, tell me the right answer. Latin means undoubtedly it is. Okay, only one pharmacopoeia, that is nothing but European pharmacopoeia. Only European pharmacopoeia will follow the Latin directly. Okay, Latin title is the pharmacopoeia.
Created with free version for non-commercial.
Okay, as you can see. So European pharmacopoeia is in the Latin itself. Yes. Now, the plants which are not differentiated into root and stem and leaves are, okay, which are the following are not differentiated into root and stem and leaves. Plant designates principes, thallophytes, and bromeliads. Go on. What's the right answer? Plant designates principles, thallophytes, and bromeliads. Yes, thallophytes are the right answer. Yes. T for thallophyte, okay, T for tissue, okay, the absence of tissue. Okay, they are not going to multiply, they are not going to differentiate. Okay, thallophyte. Okay. Yes. Thallophytes, you can see in the plant kingdom, okay, the typogrammy, thallophyte, they are not differentiated into a root or stem. They remain at the same tissue. Thallophytes. Okay, now. So, which of the following is unorganized drug here? Which of the following is unorganized drug here? Even though I don't know why it's happening like this. Which of the following is unorganized drug? The following is unorganized drug. What is the right answer? It's option B, right? Unorganized is nothing but option B. So why? Because Rolf is a root, okay? Leaf, bark, all things which are the cellular tissue, they are nothing but organized drugs. You can see organized drug and unorganized drugs. Yes, all the gums, latex, resins, milky exudates, and extracts, these are all the cells which the part of the plant which is not having any tissues or cells, that is unorganized. If it is containing cells or tissues, that is nothing but all the organs are organized. Now, under UV light, synchron and junction roots show which respective fluorescent color. Under UV light, synchron and junction root shows which respective color. Synchron and junction root. If you know the synchron, then you're going to get the answer. So, 221. Go on. Yes, that's the right answer. Okay. Yes, purple, blue, and whitish blue. Okay, purple, blue, and whitish blue is a fluorescence that you give in a UV light. Synchrona is a purple, blue, and okay. Robin, deep purple, greenish blue. Okay. Yes. Whitish blue. Sorry, purple, and whitish blue. Now the key intermediate for the binds of C63. C63 means phenyl propene. Phenyl propene derivatives. Phenyl propene, right? So phenyl propene means where you can have the phenylalanine, tyrosine, tryptophan. Obviously, is from the main thing is 𝘂𝙾𝑖c acid. Main thing is 𝘂𝙾𝑖c acid. Okay, yes. So pyruvic acid is a starting precursor. But they're asking about key intermediate. Try to remember key intermediate. Very good. You can see in the key intermediate C63. Okay, units are derived from the phenylpropane. Okay, they are from the 𝘂𝙾𝑖c acid. Okay, and see, you can see they are asked in 2023, GPAT 2021, GPAT 2024 also they have asked. And what are the three amino acids? Phenylalanine, tyrosine, and tryptophan. And now, eugenol is presented. Eugenol presented. Usually, the eugenol is rich in clove. Clove. Okay, why? Because usually in carophylla or aromaticum cytosine. But whereas here, clove is not called there. That's why, apart from the clove, from where we are going to get the eugenol? Highest amount. Yes, that's the right answer. From Tulasi, we are going to get the highest amount. You can see 70%, not less than 70% on the dried basis. Okay, we're going to get the eugenol, and you can see holy base and sacred base. Holy base and sacred base will be there. Synonyms. It's a good intermodulator and antibacterial family lamictin. Osimum sanctum. Next, the tropane alkaloids are biosynthesized from amino acids. Tropane alkaloids. What is the precursor for tropane alkaloids? Come on, hurry up. We are running out of time. Yes, so the right answer is obviously ornithine. Okay, ornithine. OR. Okay, ornithine. Remember. Okay, RO, propane and ornithine. OR. Okay, RO, OR, propane and ornithine. Ornithine is because and yes, this is a pathway. So this is the how the all the alkaloids are pathway. This is clearly given our GDC module series, especially from module 1. Okay, so these are all the amino acids, aromatic amino acids. And from the amino acids, what are the things we are going to get? Please go through it, and this table is very, very important. Try to prepare this one, or try to take a screenshot or maybe whatever you like. But it's very, very important. Now, citral obtained from the lemongrass oil is used for the sense of which one, and which serves as the starting material of which of the following. Okay, so basically from citral, elimination option, elimination. From the citral, you are not going to get the digoxin. Why? Because citral is obviously it's a volatile oil. Okay, and yes, so digoxin is a glycoside. Atropine is not at all. Why? Because from the citral and from water is no blood is going to obtain. That's why atropine is also eliminated. And also vitamin. So this one, reserpine is also alkaloid. Yeah. So that's why the option B is correct. Why? Because beta and then vitamin A. See, that's why elimination method, simple technique. Citral is a volatile oil. Okay, but whereas this is the glycoside and this is alkaloid and this is alkaloid. No alkaloid and no glycoside is obtained from the citral or maybe volatile oil. That's why the right answer is vitamin A. You can see, okay, citral lemongrass oil, okay, which is used in sense of beta alanine, and yes, that is a starting material for the vitamin A. Okay, next question. Come on. The terpene indole alkaloid derived from L-tryptophan 𝘎𝑂𝑠𝑖calcolone. Come on, what is the right answer? Yes, that's the right answer. The terpene indole alkaloid 𝘎𝑂sine. Terpene indole alkaloid they're asking. Clear? Simple. If you use a simple brain of yours, okay. See, they're asking indole. That's a hint you can get from here. They're asking about indole. But whereas morphine, codeine, these are all isoquinol alkaloids, especially phenyl or benzyl isoquinol alkaloids. Clear? So phenanthrene or benzyl isoquinol alkaloids. That's why simple answer, obviously indole alkaloid, 𝘎𝑂sine. These three are isoquinol alkaloids because these three are obtained from opium. Opium is isoquinol drug. Yeah, that's it. You can see. Okay, back the 𝘎𝑂sine is a terpene indole alkaloid. and yes, it is obtained from the derived from the tryptamine. From the tryptamine, like cyclocolone and tryptamine, by condensation, we are going to get that adjacency. Now, which of the following weights is entirely matched of the chemical constant and their uses? Come on, azadirachtin is enzyme repellent, 𝘿𝙄𝙎𝙎𝙬𝙎 antifeedant, nimbin antiviral, and margaron antifeedant. So that is repeated here, you know already. Okay, so no, margaron is antifeedant. Okay, margaron is also one of the, see, these are all the chemical concepts of name only. Azadirachtin, 𝘿𝙄𝙎𝙎𝙬𝙎, nimbin, and margaron. Okay, margos is a synonym of neem. Okay, but only 𝘿𝙄𝙎𝙎 is antifeedant. Okay, no margaron is a antifeedant. Right, remember. And you can see, okay, 𝘿𝙄𝙎𝙎 and salicylic are antifeedant. Okay, clear? Margaron is antibacterial. Margaron is antibacterial. That's why. Okay, now margosa is a tall evergreen tree. Same question. Margosa, tall evergreen tree of which of the following? Alpina garanal, Azadirachta indica, okay, Artemisia annua, and Artemisia sativum. So Artemisia is both Artemisia. Okay, Artemisia. Artemisia sativum means okay, garlic, whereas margosa means Azadirachta neem. Very good. Azadirachta neem. Azadirachta indica neem. Margosa. That's why it is nothing but a Margosa, Azadirachta indica, Meliaceae family. That's it. Very good. Now, source of diaster enzyme. So diaster enzyme already we discussed. Just to convert the starch to maltose. Okay, complex sugar to simple sugars. Okay, so it is obtained from which of the following? Bacillus subtilis, Aspergillus oryzae, human saliva, and rat pancreas, and all of the above. And all of the above. Come on. What's the right answer? Yes, that's the right answer. From all of the above, we are going to get the diacetyl. You can see. So diacetyl enzyme is obtained from the Bacillus subtilis, beta coagulons, Aspergillus oryzae, and also can be acid from the human saliva and the pancreas. Right, pancreas. Okay, yes, it is known as amylase. Diacetyl is known as amylase enzyme. Very good. Now the next question. The lennatocyte A and C are present in. Lennatocyte A and C are present in. This is lennata. Obviously, we know, right? Okay. Lennatocyte. Am I right or not? Is it right? Okay. Yes, obviously. Lennatocyte A and B. Obviously, Strophanthus cumbis, Strophanthine. Okay. Thivita, Pelvia, Thivitin. So what? So lennatocyte, lennata. That's what I said. From the biological name, from the genus and species name only, we are going to get these things. Okay. Yes, you can see. Lennatocyte A, B, C, D are obtained from the distalis purpura and distalis lennata. You can see. From the lennatocyte A only, we are going to get the digitoxin. From the lennatocyte B only, digoxin. C, digoxin, and D, digoxin. Next. Maidenhair tree is a synonym of. Maidenhair tree is a synonym of. Maidenhair tree. Which are the following? Come on. Maidenhair is a synonym of. Okay, Silamarin, buckwheat, Soleria. No, maiden tree is nothing but a �々𝙎𝙎 family Ginkgaceae. You can see. Okay. Maidenhead tree or Q tree. So this is known as okay. Maidenhead tree 𝘂𝙎𝙎 Ginkgaceae. So that is known as maidenhead tree. Next. Who describes healing property of essential oil? Okay, nothing but the aromatherapy. Who is father of aromatherapy? Come on, who is the father of aromatherapy? This is how the indirect questions you are going to get. Yes. So obviously, I have given the hint already. G means good, F means fragrance. Good fragrance means, okay, good fragrance means aroma. Okay, so G means gentle and F means fragrance, and G means good, F means fragrance. So Essential properties or essential oils is �㼧𝙁. Yes, that's right answer. And aromatherapy is defined by �㼧𝙁, where they can use essential oils. Now, okay, scale to reagent used for the detection of option A glyphosides, B alkaloids, tannins, and all of this. It's a special test to identify the specifically, and remember, okay, Mayer's, Hager's, Wagner's, Dagenberg, okay, like how scale plus test is also for the alkaloids. It's mainly for the identification of alkaloids. And remember, okay, scale plus reagent, and also Sonnenschein reagent, tichromonic acid, ammonia volcanic test. But whereas scale plus reagent is nothing but a phosphor tungstic acid would be there just to precipitate the alkaloids. Now, which of the following chemical content in the phenol contain phenol group? Which of the following chemical constants present in the phenol contains phenol group? Anethol, phenol, eugenol, carotol. Come on, anethol, phenol, eugenol, carotol. Yes, that's it. That's the right answer, Lakshmi. Yes. So nothing but it is an anethol. Okay, already we have discussed this one. Okay. So the sweetness is due to anethol, aspartame for aspartame is for anethol. Okay, the flavor, aroma, or odor is due to phenol. Already we have chemicals, right? So anethol is okay. Everything is a epiconic of sorry, outlet of epiconic acts as a which one? Is it clear now? Okay. So the right answer is obviously the right answer option B, antiprotozoal. Yes. Now, can it's known as Brazilian 𝙂𝙀 and radish 𝙂𝙀. Okay, I'm checking a few more comments. Okay, now the next question. Come on. So belladonna belongs to the family. Obviously, all the tropinol colors mostly they belong to which family? Okay, mostly they belong to which family? Only one family, that is nothing but the Solanaceae family. Correct or not? Nothing but the Solanaceae family. Okay, yes, the right answer is Solanaceae family. Belladonna, okay, belladonna, tomato, capsicum, datura, hyacinth, niger, and these are all. And the deadly nitrogen name is a synonym for this. And now next is genetically modified species of papaver, namely papaver bracteum and papaver orientate, contain a predominant alkaloid. Okay, so genetically modified species. Come on, what's the right answer for this question? Very good, very good. Uday Kiran. Genetically modified. That's the right answer. Very good. Yes. Right answer is thebaine. Okay. The genetically modified things, they only contain predominant alkaloid, thebaine. Okay. But they're not going to find out the MOSFET. Next. You can see thebaine. See, plants non-editor. Thebaine is the main principal alkaloid could be found in the codeine and relaxin. Next. The research gives a positive test for which of the following? Bond writers, Murexide and legal and Thalapathy. Obviously, 𝙂𝙂𝙎𝙬𝙬 is an alkaloid. Sorry, is a glycoside. Obviously, you can admit these two, Thalapathy and Murexide, because they are 4 alkaloids. Obviously, the right answer is nothing but the legal test. This gives a positive test for the legal test. Okay. Yes, this gives a positive test for the legal test. Pain color form. Okay, and now 𝙂𝙂𝙎𝙬𝙬 and steroidica prescribed the treatment of constipation access. 𝙂𝙂𝙎𝙬𝙬. Yes, with that hint you can find out the answer. 𝙂𝙂𝙎𝙬𝙬 and steroidica prescribed the treatment of constipation access. They are bulk forming laxative. They are bulk forming 𝙂𝙂𝙎𝙬𝙬 because they have the pectin. Okay, yes, pectin. Yes, you can see 𝙂𝙂𝙎𝙬𝙬. Okay, it's nothing but a bulk forming, nothing but the bulk forming laxative. They have the pectin and all these things. Next. The following are elements of clove except to choose the most appropriate option here. So on the clove itself we have discussed already. Okay. So clove, mother clove, blown clove, ancestor clove is used. Okay. Yeah. And yes, option D is nothing but the real one. Okay. Clove bud is a direct drug because it is not at all a clove bud is a direct drug. It is not adulterate one or it's not substitute. And these 3 are the substitute of the other things, mother clove or maybe okay, the cloves of a blown clove. Okay, yes, these are the adulterants. Now, Momotica charantia or Karela or Bittergourd belongs to family. Which family? Momotica charantia, Bittergourd. Okay, no Solanaceae, no Rutaceae, no Asteraceae. The family is Cucurbitaceae. Try to remember. Okay, Karela, Cucurbitaceae. Important. Okay, Bittergourd or Karela. And yes, consider the green fruits of Momotica charantia, Cucurbitaceae, Cheratin and Momoticin. But because of this steroidal saponin only, we are going to get the lowering blood sugar property or lowering blood sugar activity. Okay, yes, diabetes mellitus. And now, oxidosic effect of ergot is due to oxidosic effect of the ergot is due to. I'll give you one insight. Maternity, right? In the maternity, what all they're going to get that oxidosic effect, which means maternity or matron. Okay, maternity or matron. Try to remember like that. Very good. And yes, it is also a water soluble one. Water soluble. Okay, by the ergotamine treatment, migraine treatment will be there, right? For the migraine. So ergometer is used to the oxidosic and sometimes used to enhance the labor pain. Okay, and yes, migraine pressure. And now glyphosate present in the cinchona bark is glyphosate. Usually, yes, the glyphosate was present in alkaloids, but very minor concentration. Okay, quinine and cinchonine and cinchonidine, quinone. These are all alkaloids. Only one is glyphosate. Only one is, that is quinone is a glyphosate. Okay, so you need not to worry. Nothing but quinone is a glyphosate. Right? Remember. Okay, quinone contain quinone is a glyphosate of cinchona bark. Yes, cinchona is obtained from the 4 sources: 𝙂𝙂𝙎𝙬𝙬, Leptiriana, Saxifraga, Officinalis, Rubiaceae family. Okay, and yes, it contains a glyphosate called quinone. Next, Clun's test is for identification. This is our test for resins, especially for the aloe. Okay, Clun's test is for the aloe. What is the right answer? Yes, I saw your responses in the comment box. Yes, I saw your messages in the comment box, dear students. Yes. Okay. Yes. So, it is but an isobarbaroin test. Okay, Clun's test is also known as isobarbaroin test. Isobarbaroin test. Very good. For the isobarbaroin, yes, Clun's test is known as a isobarbaroin test or 𝘋𝙀𝙁 test also there. It is also known as isobarbaroin or 𝘋𝙀𝙁 test. Next question. Bacopa monifera is a plant known to family. Bacopa monifera belongs to the family. Okay. Bacopa monifera. Nothing but a plant. Brahmi. Okay. Which family it is? Nothing but a family. Okay. It is family Scrophulariaceae. Okay. You can see distance and this one is also for the same family. Brahmi. Bacopa monifera or Bacopa Scrophulariaceae. Okay. Yes, family. Now, in coffee seed and caffeine, the present is salt of, yes, every alkaloid is present as a salt of free salts of organic acid, free bases, but there could be a free salt of organic acid will be there. In that, option A, right? Lysergic acid, mecanoic acid for the opium, lysergic acid is for the ergot, but whereas chlorogenic acid is for the coffee and caffeine. They contain a chlorogenic acid. They contain the chlorogenic acid in the structure. Clear? Yes, they contain chlorogenic acid as a salt. Caffeine is present as salt of chlorogenic acid. Chlorogenic acid. And cavic acid of that. Chlorogenic acid, cavic acid. Next, which of the following is not a type of suture? Absorbable suture, wounded suture, metallic suture, and non-absorbable suture. Yes, that's the right answer. So there is no wounded sutures in the terminology of our sutures. Okay. Observed sutures will be there, non-observed will be there, hemostatic will be there, but there is no wounded sutures will be there. Now, synonym of Our Lady Thistle. Our Lady Thistle is used for Silybum marianum, Tarascum officinalis, Artemisia arcinthium, and Cyanara scolimus. Okay. So the right answer is Silybum. Is it right? Silybum marianum. Okay, milk thistle plant. Okay, milk thistle or Our-Lady milk thistle. Yeah, why? Because it is obtained from the milk thistle of this plant, Silymarin. It is a hepatoprotective liver disease. That's a very, very important drug case. Okay, now, and the next one. Ginger is widely used herbal drug containing many chemical constants and the pungent principle. So, what is the pungent principle present in the ginger? Direct question. Gingerol, gingiberin, gingerol, senior, gingerol. Yes, that's the right answer. Gingerol or 𝘎𝑔𝑜𝑙. 𝘎𝑔𝑜𝑙. Very good. So that's this gingerol or 𝘎𝑔𝑜𝑙, 𝘎𝑔𝑜𝑙. The pungency and the pharmacological selection you the gingerol or 𝘎𝑔𝑜𝑙. Now this cell is belong to which plant family? This cell is Apocynaceae, Solanaceae, Scrophulariaceae, and Longanaceae. This cell is belong to which family? Yes, obviously this cell is and the Bacopa monifera Brahmi. Both are belong to family Scrophulariaceae only. Okay, and here's the synonyms: foxglove plant. I remember foxglove leaves. This is Lenata, Lenata A and B, and it is an important cardiac glyphosate. Okay, and try to remember it should not be dried temperature below 60 degrees temperature, and the moisture should not be less than 0.3%. Otherwise, it leads to chemical degradation. Okay, that's what I remember. Now the red sandalwood. Okay, the red sandalwood is obtained with synonym of which one? �々𝙀𝙀 marsupium. The synonym is �々𝙀𝙀 marsupium. You can see here. Okay, 𝘊𝙀𝙀 marsupium. The synonym is sorry. The red sandalwood synonym is 𝘊𝙀𝙀 marsupium. You can see here. Okay. So Indian 𝘂𝙀 tree, red sandalwood or Rakta Chandan or Malabar 𝘂𝙀, this synonym is good. Indian 𝘂𝙀 or Malabar 𝘂𝙀. Okay. And yes, 𝘊𝙀𝙀 marsupium, family Leguminaceae, red sandalwood. Here Rakta Chandan or red sandalwood. Okay, Pushparaj. Yeah. Yes, as a powerful astringent, and this is a hypoglycemic agent also. Try to remember 𝘊𝙀𝙀. Red sandalwood is also used as a anti-diabetic. Okay. Okay. Now, Saccharine buck is synonym of Saccharine buck. Come on. Just I've already came across this one. Saccharine buck. 50 more questions to go. Very good, very good. Yes, do not give up. Okay. Your hard work will be paid off definitely within a very few days. Okay. Your practice and your efforts, okay, and your study, all your sacrifices will be paid off. I know, because already so many students have qualified GPAT. You're almost there. Okay, you're almost into your goal. Very two more steps ahead, two more steps to go to crack your goal and to enter your destiny. Okay, come on. Saccharine bark is synonym of. Obviously, you know already saccharine bark is. Okay, chitin bark or saccharine bark is synonym for the cascara bark. Now the already chitin bark or saccharine bark, cascara, cascarosides, C and O glycosides. Next. What is the term used to the initial tissue or organ used for the starting culture? Okay, initial tissue. What are the tissue that they have taken for the culturing? That's known as, okay, undifferentiated mass of cells is known as callus. Okay, cell without cell wall. Cell without a cell wall is known as protoplast. And the cell and the tissues, okay, when you look at the plant cell, in that we are going to have a complex tissue and meristem tissues. Okay, which are ready for multiply. So that is what the explant is the right answer. Explant, the starting tissue, initial tissue for the culturing. Okay, explant. You can see the explant is the excellent part of the cell used for the plant tissue culture. And yes, a piece of plant is taken to culture, to start the culture. So this is how. Okay. Yeah. Now, so Anantamol is also known by which English name? Anantamol is also known as by which English name? Expand. Very good, Shalina. Okay, yes. Anantamol. Right answer is Indian sarsaparilla. So this Anantamol plant is known as Anantamol or Saiba or Indian sarsaparilla. Okay, Indian sarsaparilla. It is obtained from the root of the plant Hemidesmus indicus from the family Aspirants. Isobanane is obtained from this one. Okay, next. Following are the correctly matched amino acid precursors of the derivative of plant except which of the following is not at all a correct match. Sorry, correctly matched, except one wrong match will be there. What is the right answer? Yes, right answer is undoubtedly lysine. Okay, and lysergic acid. Yeah, from the lysine, no lysergic acid is obtained. In the lysine, lupinin and anabacin is going to obtain. Clear? In the lysine, lupinin and anabacin, no lysergic acid is going to obtain. Okay. Next. So which means here we are going to get the ornithine. Okay, from the ornithine we are going to get the lysergic acid. Next. Amino acid precursor of phytosigmanes. Okay, amino acid precursor of phytosigmanes. Okay, tryptophan, tyrosine, and ornithine, and arginine. There is a hint already given here. Tryptophan, tyrosine, ornithine, and arginine. Yes, right answer is Tryptophan is amino acid which is precursor of phytosigmine. Already we have given this table. Okay, see. Indole are obtained from the tryptophan, that is nothing but phytosigmine. Very good. Now, which of the following alkaloids is derived from the tyrosine? Quinine, morphine, atropine, epigen. Which of the following alkaloid is derived from the tyrosine? What's the right answer? Okay. Yes, let me check. The right answer obviously is from morphine. Morphine is from the tyrosine. That's because of the morphine. The next question. And you can see, already we have discussed this pathways. Very, very important. Okay, now, Brahma Muni and Pulipini ancient texts are associated with. Okay, Brahma Muni, Naga Muni, 𝘎𝙬𝙎𝙬𝙬. So when it comes to the systems of medicine, we need to go through all the important literatures or important books, important principles, important theories, important persons. Okay, like how this Brahma Muni and Pulipini, okay, and 𝘎𝙬𝙎𝙬 belongs to which system of medicine? They all belongs to which system? Yes, Siddha system of medicine. Yes, in the Brahma Muni. These are the some important books. Okay, Ayurveda, 𝘎𝙬𝙎𝙬𝙬 Samhita, Shastra Samhita, Vaidya, Chintamani, Ayurveda. Okay, Ayurveda Chintamani. Okay, Aryavishak, Ark Prakasha. Okay, 𝘎𝙬𝙎𝙬𝙬, Nagamani, Brahmamani, 𝘾𝙀𝙉𝙎, Philippani, Bhogat. When it comes to Unani will be okay, is a Greek or Arabic person. That's why this the words will be mostly in Greek or Arabic. So that obviously is 𝘎𝙬𝙎𝙬𝙬. Next, the alcoholic constant associated with the steroidal lactone of Withania somnifera. So Withania somnifera is nothing but ashwagandha, right? Ashwagandha. So this is a source of ashwagandha. So ashwagandha contains, right, Withania somnifera. But they're asking about steroidal. Steroidal. Okay. If they're asking about alcohol derivatives, something, but you can go with somnitol. But steroidal, right? So obviously you can go with withanolide. Okay, they're asking about steroidal lactone means withanolide. Very good, very good. Vikash Kumar. Okay, so winter cherry, what I remember, winter cherry, Withania somnifera, Solanaceae family. Okay, main alcohol withanine. Okay, but whereas if they ask about steroidal, okay, withanolides. But if they ask about monohydric alcohols, somnitol and somnirol. So they are ashwagandha, sedative, and yes, immunomodulators. Next. So maize contain constant produces red color with iodine. Maize contain a constant produces red color with iodine. Yes, maize is a special structure present in which of the following? Maize is a special structure present in the nutmeg, right? Maize. Very good, Shravani and 𝘿𝙬𝙎𝙬𝙬. Okay, yes. So obviously it is from the amylodextrin. So because of the amylodextrin, okay, it gives obviously sugar, okay, iodine. Yeah. Yes. You see amylodextrin maize, okay, and gives a red color with iodine amylodextrin using treatment of 0.1. Next, yes, volatile oil and cardamom seeds are present in which of the following? Endosperm, witty, or mesocarp and epicarp. What's the right answer? See, most of the umbelliferous fruits, especially when it comes to umbelliferous fruits, the water is also present in witty, okay, especially in the dorsal witty. But whereas the cardamom is not at all, it belongs to family, okay, it belongs to family of Gingiveraceae, but mostly what are present in? Very good, Soumya, that's the right answer. So witty. If it's a seed, okay, mostly, especially umbelliferous and this one, okay, this cardamom also, they are present in the witty. Okay, yes. You can see, so yes, the cardamom, The epidermis and pericarp is made up of polygonal tubules of stomata, and yes, it present in the 𝘖𝙀. What does it present in the 𝘖𝙀? That's it. Now, the devil's tongue is a other name of devil's tongue is synonym of which one? Mir, Google, Asapointida, and 𝘾𝙀𝙍𝙐. So, devil's tongue is known as Thalapathy, Umbelliferæ family, ferulic acid is a main principle. So, what is the right answer? Umbelliferone will be there. Thalapathy, ferulic acid. Devil's tongue. Yes, that's it. That's how it revises all the things. Asapoid is the right answer. Okay, devil's tongue. Okay, 𝘾𝙀𝙍𝙐. Okay, 𝘿𝙄𝙎𝙎𝙬 belong family, Umbelliferæ. Okay, this contains umbelliferone, umbelliferone and ferulic acid. That's what we have discussed. Yes, mostly it is an important component to an intestinal antiflagellant. That's why they are adding in your lemon rice and all your condiments. Next, the most appropriate parameter used to access the purity of 𝘎𝙀𝙎 is based on its 𝘎𝙀𝙎 itself. Okay, it is an bulk laxative, right? The bulk laxative. So obviously, so it is mainly because it contains a pectin, okay, mucilage. So these things going to swell, and yes, obviously. So even though you perform the experiment called right swelling index of seeds, for that, obviously, the swelling factor of the mucil is okay. We are going to, in order to check the purity of 𝘎𝙀, we are going to check the swelling factor of mucilage. So 𝘎𝙀, Indian Psyllium, plant 𝘎𝙬𝙎, plant 𝘎𝙀𝙎. Okay, yes, obviously. Swelling factor to check the purity of 𝘎𝙀. Now, okay, very good. Which glycosid drug is used to treatment of Raynaud's disease? Raynaud's disease. Raynaud's disease. Very good, very good. Yes, that's the right answer. Obviously, ginkgo biloba or main tree or Q3. Okay, so it is in the treatment of Raynaud's disease, which means peripheral vascular disease. Peripheral vascular disease. So all the things will be going to swell. Okay, so peripheral vascular disease. So then what Raynaud's disease, that ginkgo biloba, ginkgo family. Next. And also try to remember this one also they are going to ask. Okay, the potent inhibitor for platelet aggregating factor PAF. Okay, PAF factor is also present in the ginkgo biloba. Okay, next. The bitter substance present in citrus aurantianum, nothing but orange peel. They're asking about the question for orange peel. Okay, citrus aurantianum. They're asking the question for orange peel. Coniferin, orange marin, okay, naranjana and aspirin. Yes. So the right answer is undoubtedly the citrus. Okay. Orange marin, orange marin, orange peel. Very good. Orange peel, it starts citrus orange marin, Rutaceae family, citrus aurantium. Okay. Orange marin is a bitter principle, whereas coniferin. Okay, clear. So I'll give you one hint to remember this one. Okay, the person with bitter or eating cone ice cream, which means here, okay, bitter means orange marin, okay, Okay, coniferin. Cone means ice means sweet. Person with a bitter aura eating cone ice cream, which means bitter aura means orange and coniferin. Cone means ice cream. Ice cream is sweet in nature. Like how try to remember. That's my call. Next question. What is soluble portion of Predacon? Come on, what is soluble portion of Predacon? Basorin, okay, Predacanthin, alginate, and agarapectin. Agarapectin, come on. What is the right answer? Yes, so obviously the right answer is Agarapectin. Why? Because I'll give you one hint here. Okay, Basorin is badly soluble. B for Basorin, B for badly soluble. One water. B for badly soluble. Okay. This badly soluble is a water soluble. So B for badly soluble. Basset means badly soluble, which is not at all soluble. That's why the right answer is Tegakandan. Okay, yes, Tegakandan. That's what I said. That's not soluble. Which of the following pairs gives a modified bond types test? Cascar and rhubarb, triangle and senna, senna and rhubarb, and aloe and cascar. If you know the classification based on the nucleus or based on the glycosidic linkage, you know the right answer. What is the right answer for the question? Come on. So the right answer is obviously right answer is aloe and cascara. Obviously aloe and cascara and cocaine. Okay, because these are all 𝘂𝙧𝙎𝙬𝙗. Aloe and cascara and cocaine is all 𝘂𝙧𝙎𝙬. That's why. Okay, you can see here the classification and the test is also modified bond brackets test. It is for the 𝘂𝙧𝙎𝙬𝙗. C and 𝘂𝙧𝙎𝙬𝙗. But where is cascara? We need to see in row glycoside as well. Okay, next. Extraction of Brazil drug with cold and boiling water in the short end pot. We extract a drug using a cold and hot water within a short time. That is known as maceration or infusion or prefusion. Yes. Okay. Short period of time what is infusion. Okay. Just infusing the within a short time. If you are adding hot water or short water, nothing but it is infusion. It is for free readily soluble drugs. So infusion is a generally dilute solution of a drug which are readily soluble drugs. Okay. Yes. Next question. Come on. So, what is the optical device used to draw the images for the microscope point? So, to draw the stomatal index, to draw the stomatal number, vein number, vein termination number, we use an instrument called. What is that? Yes. Okay, it is a camera lucida. Okay, camera lucida. To draw. Okay, not to focus. These are all see. These are all microscope and microscope. These optical and scanning and microscope just to watch and just to view. But whereas to draw, we use camera lucida. Right, camera lucida device to draw the microscopic images. Very good. I hope you performed the labs. Okay. Now the pharmacological activity of one mentioned drug is cardiac depressant. Which of the following is a drug is a cardiac depressant? Usinol, camphor, veratrum, and vincristine. Come on, right answer. Very good. Pharmacological activity of drug which is cardiac depressant. Usinol, camphor, veratrum, and vincristine. Okay. Yes. The right answer is veratrum. Okay, veratrum, known as green hellebore. Green hellebore. So it is obtained from the Veratrum viridae and Veratrum album family Aviaceae, but it is okay main related to business for okay lower blood pressure and decreased heart rate, and also it is the treatment of pregnancy related hypertension or gestational hypertension. Next. The Vedas contain medicinal properties plants are. See in which of the Vedas containing okay medicinal properties of the plants. The right answer, come on. Yes. So obviously, okay, where the certain medicinal properties of plants are, so even though from these two only Ayurveda got developed. So that is nothing but okay, Rigveda and Atharvaveda. Okay. Rigveda and Atharvaveda, they have contributed their knowledge. So from that Rigveda and Atharvaveda only our okay. So Dhanvantari has written the Ayurveda. Okay, yes, Rigveda and Atharvaveda. Mostly they are containing the treatment, okay, ancient medicines. Now, so the phytohormone stimulates the latex flow in rubber tree. Phytohormones reflects the rubber tree. Come on, what is the right answer? Yes, the phytohormone stimulates the latex flow in the rubber tree. Ethylene, abscisic acid, cytokinin, and auxin. I'll be checking your answers. What? Yes, that's the right answer. Ethylene. By spelling ethylene, it increased the okay, yield of the okay that rubber sheet. You can see it stimulates the latex fluid rubber sheet. Okay, so this reference is obtained from the Byron Shah. Make it safe. Next. Which of the following is a direct gene transfer method or vector free? Plant viral vector, okay, TR plasmid, microprojectile, bombardment, agrobacterial injection. Direct gene transfer, which means vector free. What is the right answer? Yes, 272. The right answer is microprojectile bombardment. There is no vector as you get directly with the okay bombardment. We are going to induce the gene to the another one. Okay, so this is one you can see microprojectile bombardment, vector free, direct gene transfer, ballistic, biostic, gene transfer, electroporation. These are physical. Okay, micro injection, physical method of separation, physical method of transfer, transgenic plant. For the preparation of transgenic plants, we need this method for the gene transfer. Okay, next. Ralphia and Cinchona belongs to which plant family? Yes, Ralphia and Cinchona. Within one option, you're going to find out the right answer. Obviously. We know the Ralphia is Ralphia. Ralphia is a belong family. Which family? Obviously, it's in a Apocynaceae family, right? And yes, the Cinchona is a Rubiaceae family. You can see Ralphia. Okay, it is family Apocynaceae. Chota Chansar Puganda. Okay, and hypertensive. Cinchona is known as Gisette bark or Peruvian bark family Rubiaceae. They are from four sources. Higher amount is from the okay 𝘿𝙄𝙎𝙎𝙎. Rubiaceae family. Next, come on, very good. Do not give up. Few more questions to go, dear students. Today's drug is an important constant of Ayurvedic formulation, that is Sudarshan powder. Liquorized, Quassia wood, Picrosia, Chirata. What is the right answer for this question? Yes. Sudarshan board. There's a organic formulation in that. The chief content is Chirata. Swarsha Chirata. Just now we have chemical was that one. Okay. Chirata is in a balmoni. Okay. It is an important ingredient in the Sudarshan powder where it is used okay, in a chronic fever. That's why it is known as a okay. Swarsha Chirata. Okay, is in a hay fever. And also it's a bitter tonic and treatment of dyspepsia. Very good, very good. Next. Yes. 25 more questions to go, dear students, so don't give up. Acacia and Dragagantha classified in the which of the following? They are seed gums, plant extract, and plant exudates, and biosynthetic gums. What is the right answer? Acacia and Dragagantha classified as a which of the seed gums, or plant extracts, or plant exudates, or biosynthetic gums. Okay, they are nothing but the yes, plant gums or plant exudates because they are unorganized drugs. They are the pathological agents. Okay, so yes, obviously, natural gums. You can see plant exudates. Nothing but the acacia and plant exudates. Now, according to the pharmacological grouping of natural drugs, which are the following drug work as a parasympathetic depressant? Obviously, okay, you can go for one option directly. Very good, very good. Come on. One option directly. What is that? Parasympathetic depressant. Okay, you go with option C. Okay, let me check. Obviously, it's a melatonin. Why? Because C, they are anti-muscarinic agent. All the troponin trace containing drugs have anti-muscarinic agent, has anti-muscarinic property, and also nothing but the parasympathetic depressant property. That's okay. Correlate the answers. Okay, that initially they are not the parasympathetic drugs with anticholinergic properties. And also, belladonna is an antidote for opium, right? Remember, opium and chloral hydrate poisoning. It is an antidote for both opium and chloral hydrate poisoning. Next, artificial invert sugar is an adulterant for honey which contains perfurol, which is detected by which test? Simple. If you know the test for the okay sugars, what's the identification test for honey? What's the identification test for honey? What's the identification test for honey? Yes, that's it. So simple. F means fructose, fructose means sugar. Yes, so fishy stress is an identification test for honey. Okay, honey. Honey is a sugar secretion deposited in the honeycomb. Apis mellifera, Apidae family. Okay, but okay, 45% will be sucrose. That's what I said. Highest amount. Okay, highest will be sucrose. That's why F for fishes, F for fructose. Okay, a real honey contains higher amount of fructose, and that's why fishy stress. Okay, clear. Artificial sugar, determine that fishy stress will be there. Right? Remember, real honey contains 45% of fructose, higher end of fructose. F means fructose, F means fishy stress. Real honey test is fishy stress. Okay, and all the contains enzymes. Right? Remember, invertase enzyme. This one also they're going to ask me your exam. Invertase enzyme is over there. And how to perform this test? When you take the honey and petroleum ether, you shake for 5 to 10 minutes. Okay, and then ethyl layer going to separate it. To that ethyl layer, we need to add 1% of resource and 1 of HCl, and then transient red color will be there. If it is produced a transient red color, then it's a natural honey. Okay, and after some time, okay, red color will persist for some time, then will be artificial honey. Next. So disease 𝘖𝙀𝙀 is connected with which drug? Naxomica, Ralphia, Ashwagandha, and Synthoma. 𝘖𝙀𝙀. Okay, disease 𝘖𝙀𝙀 connected with which drug? Naxomica, Ralphia, Ashwagandha, and Synthoma. Strips are mostly present on the outer surface of the plant. Okay, so that's why I will be giving you a hint. What is the right answer? Yes, redox. Very good. So that's absolutely right answer. 𝘖𝙀𝙀. You can see this is 𝘖𝙀𝙀. Okay, 𝘖𝙀𝙀. So you can see the stripes right here. so that the stripes are due to that. Okay, these are the stripe cancers, a common disease associated with the cinchona plant. Okay, and yes, which is a commercial source of quinoline and quinine and quinidine. So because of the stripe cancer. Okay, yes. Next, the process of separating cotton fiber from the seeds is known as, okay, the process of separating the cotton fibers from the seeds. Here is the retching, ginning, combing, or garbling. So garbling is nothing but a processing of herbs, like nothing but a garbling is nothing but removing the hard material, sorry, soil material from the or thin material from the herb. So garbling is not the right answer. But the right answer for this question 279 question. Okay, yes. It is nothing but option 79. It is option. It is option B. Gaining process. Try to remember gaining process. Cotton fibers from the seeds is gaining process. Okay, so yes, the gaining process. Nothing but separate the hair from the cotton balls. And also the short hairs are known as the linctors. Try to remember short hairs. They are linctors. They're used for the absorbable cotton, and the long fibers are used for the textile industry. Gossiping barkness and gossiping malvation. Yes, and testis coaxium test. Testis coaxium test here. But right, remember in this cotton, the major composition is 90% of cellulose. Okay, yes, sir. Next, Ayurvedic fermented preparation includes, which are the following: fermentation itself. If you know the Ayurvedic formulations, fermentation means either churnas or taira or basma or rasta or rasava. Which is it? Which of the following? Yes, Asava and Arista are the only fermented formulations in Ayurveda. Entire Ayurveda, only these two are fermented products. Okay, you can see Arista and Asava are the Ayurvedic fermented products, whereas Avai is a semi-solid decoction. Okay, Anjana Vati is nothing but the eye preparation. Arka means distilled product. Basma means powder, incinerated product. It's an incinerated ash, and Chona means powder. Now, which of the following rods we have considered has a pharmacological action similar to the quinidine and use the treatment of cardiac arrhythmia? Okay, serpine, serpentine, advanced, and deserpidine. They're asking about Ariston as well. Which of the following rods we have considered has a pharmacological action similar to the quinidine and use in the treatment of cardiac arrhythmia? Serpine or serpentine or advanced or deserpidine? Serpentine. Okay. Yes, the right answer is undoubtedly 𝘎𝑗𝑚𝑎𝑙. 𝘎𝑗𝑚𝑎𝑙. Okay, not 𝘎𝑗𝑚𝑎𝑙. 𝘎𝑗𝑚𝑎𝑙 is have the arrhythmia property. A for 𝘎𝑗𝑚𝑎𝑙, A for 𝘎𝑗𝑚𝑎𝑙, A for 𝘎𝑗𝑚𝑎𝑙, A for arrhythmia. Okay, A for 𝘎𝑗𝑚𝑎𝑙 and A for arrhythmia. And now, so this is how the entire pharmacognosy, cardiac arrhythmia. See, 𝘎𝑗𝑚𝑎𝑙 is in cardiac arrhythmia. And also 𝘎𝑗𝑚𝑎𝑙 is in the arrhythmia. 𝘎𝑗𝑚𝑎𝑙 is in the treatment of obstruction of normal cerebral blood flow. Next, the key intermediate for the biosynthesis of C5H8. What is this formula? See, what do you mean by C5H8? What do you mean by C5H8? C5H8 means is a formula for isoprene, right? Isoprene. So where you get from which of this one precursor for the isoprene or isoprene, and which pathway is known as isoprenoid pathway? Come on, 282 question. Yes, isoprene formula, right? So like how we remember that, right? Isoprenoids are obtained from the maverick acid. So maverick acid also known as isoprenoid pathway or HND seroreductase pathway. So that's why the right answer is obviously maverick acids. From the maverick acid we are going to get isoprenoids or isoprene units, right? And it's known as HND seroreductase pathway. That's right. Very good, right answer. Okay. Yes. So isoprene units. Yeah. This is known as a maverick acid pathway, where you're going to get that maverick acid. Okay, C5H8. C5H8 compounds. So this is the pathway. And now aloe contains which type of glycoside? Already we have given across. Okay. Aloe, cascara, and cocaine. These all belongs to which glycosides? Either the C glycoside or O glycoside, S or N. Okay, yes. They are nothing but the aloe is the C glycoside, right? Aloe, cascara, cocaine. C glycoside, C for cocaine, and C for cascara. And E. This is a. So I'll give you what you need to remember. Okay, C glycoside. Okay. O means senoside. Okay. O means senosides. Senosides or glycoside and above. S for silicon, S means S glycoside, as same as N and nucleotide. Okay. Next. So who was the first pharmacist known to use the opium in this apothecary? Who was the first pharmacist to use first one? They have given the hint already. Yes, the right answer is always. Yep. So it's nothing but Galen. They have given hints. See, in your answer they will give some hints. Try to find out them. First pharmacist is Galen. That's it. And yes, he used opium as apothecary in the treatment and in this preparations. Okay. Yes, Galen is known to be the first pharmacist. Okay. Yeah. So that's why it is very important to know the important personalities and important scientists and their titles and their contribution. Okay, yes, now the next question. Come on, 15 more questions to go. The indole operation collapses porphyria and is present as one of the following identified. Okay, so this question is on the 𝘙𝑔𝑜𝑡. So 𝘙𝑔𝑜𝑡 collapses porphyria, collapses DC. Okay. Come on now. So they are present as one of the following derivative of mechanoic acid. No. So because it is for opium, citric acid, no, it is for the okay. For all the OTC like all the vitamin C containing plants like lemon peel, orange peel. So now tell me gallic acid. Gallic acid is for the tannins. Okay. Obesity is for the lysergic acid. Very good. Okay. Because lysergic acid derivatives are more prominent for alcohol, all the lysergic acid products. Okay. Yes. It contains indole with lysergic acid. Okay, 0.25% indole with lysergic acid. Very good. Now, which of the following active points shows a strong fluorescence in alkali? Anthrone, anthraquinone, anthranol, and oxanthrone. Oxanthrone. What is the right answer? Yes. So the right answer is obviously anthranol, okay, because of the alcohol function too, but gives a strong fluorescence. Okay, anthranol, okay, soluble in alkali shows a strong fluorescence. Okay, but whereas they do not show any, anthranol do not show any strong fluorescence. Okay, now anti-sweet compound found in madhunashini. Okay, this madhunashini itself is an anti-diabetic drug, which means Zinnia sylvestra. Zinnia sylvestra. Okay, so now what is the active constant? Madhunashini. Come on, right answer. What is the right answer? Is it buffering? It's coming. Okay. Yes. Obviously, Zinnia sylvestra, gymnamic acid. That's the right answer. Gymnamic acid. Madhunashini, Zinnia sylvestre, Asclepiadaceae family. Gymnamic acid is an anti-sweet compound. Good one. Okay, the antibacterial of gallic acid is due to glycol is due to antibacterial activity. Mystic acid, sorry, allicin, align propyl disulfide, and dialyl disulfide. One. So the right answer for this one, antibacterial activity of glycol is due to allicin, and align. Yes, disulfide. Yes, the right answer is one. But allicin, yes, antibacterial activity is due to, and also the active principle. The order is also due to allicin only. Active principle. Synonymous is lasone. Okay, order antibacterial activity. Yeah, and it contains an enzyme called 𝘿𝙄𝙎 or 𝘿𝙄𝙎. Very important. Okay, where it breaks down the aline to allicin. So usually it contains aline, that aline is break down into allicin due to the allicin. And yes, it is important anti-hyperlipidemic. Very good. Next, the major vitamins present in cod liver oil. Okay, the major vitamin present in the cod liver oil. Okay, vitamin B and C, vitamin A and D, vitamin E and K, and vitamin B12 and folic acid. 289 questions. 11 more questions to go. Come on, dear students. Very good efforts. Okay. What is the right answer? The major vitamins present in the cod liver oil are vitamin B and C. Yes. So vitamin. Yes, exactly. Vitamin A and D. Exactly. Vitamin A and D. So when I guess cod liver oil contains vitamin A and D are the main important active constants. And also it contains omega-3 fatty acids. Now, D-limonene and menthol belong to. D-limonene and menthol belong to which of the following? Acyclic monoterpene, okay, monocyclic monoterpene, sesquiterpenes, and diterpenes. Okay, sesquiterpene, diterpenes. Just 10 more questions to come on. Do not give up. D-limonene and menthol belong to which of the following? Is the right answer. Yes. Monocyclic monoterpenes. D-limonene is a yes. Monocyclic monoterpenes. So that's why this classification is very, very important. Very important classification regarding the terpenes based on the rings present in it. Bicyclic monoterpenes, monocyclic monoterpenes, okay, bicyclic monoterpenes, okay, tricyclic diterpenes. Okay, classification is very, very important. Try to get it down. Okay. Yes. Now the next question, last 10 questions from pharmacology for today's session. Isothiocyanate and glycosides are also known as saponins, glucosinolates, anthraquinones, or cardiac glycosides. Come on, isothiocyanate and glycosides are also known as. Isothiocyanate and glycosides are also known as saponins or glucosinolates or anthraquinones or cardiac glycosides. Yes. So they are also known as undoubtedly glucosinolates. Isothiocyanate are also known as glucothiocyanates. Okay. So black mustard is the best example for that. Okay, they are known as glucosinolates because they contain sulfur along with nitrogen. That's why they are known as isothiocyanate. Thiocyanate. Okay. Black mustard example. Now, anhydrous form of gingerol is known as anhydrous form of gingerol is known as curcumin, gingiberol, 𝘎𝑃𝑔𝑜L, gingiberine. Okay, what is the right answer? Yes. You know it? 𝘎𝑃𝑔𝑜L. 𝘎𝑃𝑔𝑜L is a form, okay, anhydrous form of gingerol. Okay, yes, that's what I said. Gingerol's anhydrous form is anhydrous removal of our molecule, obviously. And yes, the pungency is due to the 𝘎𝑃𝑔𝑜L also. Okay. Next. What is synonym of Ralphia? Henbane, retinacea leaf, green hellebore, and Indian snake root. An Indian snake root. Because already we have came across this question. Okay, so synonym is Indian snake root, sarpagandha, okay, and chota chand. Okay. Yep. So green hellebore is synonym for Varacham, retinacea leaf is synonym for the belladonna, and henbane is for the common dog. For which one henbane is a synonym? Henbane. Hyocinus. Okay, next. The right answer is Indian snake root, chota chand or sarpagandha. Okay, yes. Apocynaceae. Now, anti-cancer drug obtained from the marine source. Haracy, okay, domic acid, kerosene, and thalapathy. Very good. Okay, so anti-cancer obtained from the marine source. Anti-cancer. So that's how I remember. Okay, yes, anti-cancer, RRC. So these are all the drugs which are obtained from the marine source. But whereas here, anti-cancer drugs from marine sources, here it's RRC. Okay, and go through this title, very, very important. Yes. Yes. 5 more questions to go. Very good, dear students. Merismatic tissues have the following characteristics, except they do not have any capacity for multiplication. The cells are small and isodiametric in nature. The cells are thin-walled and predominant nucleus. The cells are compactly arranged without any intracellular spaces. Come on, mention the question number 295. Okay. Okay, you're going option A. Let me check. Yes, they do not have any capacity for multiplication. Okay. Yes, except even in order true, this is not at all true statement. Okay. So merismatic tissues, you can see the cells divide repeatedly, they are undifferentiated, isodiametric. Okay. but permanent tissues they do not divide. Okay, modified tissues they multiply, but permanent tissues cannot multiply. That's why that's a one statement which is wrong, remaining all but. Now, identify the constituent present in the Seneca responsible for the sweet taste. Okay, so Seneca is identified polygonal Seneca, Polygalaceae family. Okay, so here what is our responsible thing for the sweetness of the Seneca plant? Amygdalin, polygalactone, 𝘎𝙗𝙎, and Seneca. Very good. Yes, very good. Meristem culture is a meristem culture is for the virus free plant. If you want virus free plant culture also, very good with us. Okay, identify the content present in the Seneca responsible for the sweet taste. Polygala Seneca. Synonym. The name bios coming. So polygalactone. Okay, is the right answer. And this is known as a rattle snake root or Seneca snake root. Obtained from the polygonal Seneca Polygalaceae family. Okay. They contain Seneca and the sweet taste is due to polygalactone. Polygalactone. Yes. Three more questions to go. Which pathway present cytosol is responsible for sterol and cholesterol synthesis? Simple answer. Cholesterol. With that, you need to answer the question. Yes, obviously. That's undoubtedly it's the right answer. Mammalate pathway. Mammalate pathway is the right answer. Yes, why? Because
Created with free version for non-commercial.
on the 20 we are going to get the C. 𝘎𝙬𝙎 and then finally squalene, sterol, cholesterol. These are all from the mammalic acid pathway only. We know already. Now the next question: the characteristic flavor and smell of asafoetide is due to umbelliferol, ferulic acid, and presence of sulfide compounds. Come on, 219 question. The characteristic flavor of smell of asafoetide is due to. Yes, it is due to obviously, okay, presence of disulfide or sulfide compounds. Because of the sulfide compounds only, the smell and characteristic flavor is going to be attained. Okay, the specific order is due to sulfur compounds. Okay, yes. And as last but not least, very good, dear students. Really, I appreciate your efforts and energy actually. Okay, which of the following are the biological role of spirulina? Biological use. Okay, spirulina, platensis spirulina maxima. It is a green algae from marine source, which is a very good superfood now. It's immunosuppressant activity, cancer treatment, reduce cholesterol level, and all of the above. Last but not least, come on. Okay, yes, the spirulina. What is superfood? Superfood means it can have all the uses. Okay, it's a immunomodulator and it's a cancer treatment, and yes, it's okay, reduce the cholesterol level. That's why all of the above are the uses. Spirulina is a superfood. Okay, it can be having so many uses. Okay, last but not least, or last, give an example of antidiabetic drug. Picrosia, Pterocarpus, Punarnava, Dipicac. What's the right answer? Okay, what's the right answer for this question? Last question, come on. Already we've discussed. Yes, Pterocarpus, we already discussed. Okay, Pterocarpus, marsupium, the red sandalwood, is also used as an anti-diabetic agent. So that's the right answer, Pterocarpus. So yes, it can be used as an anti-hyperglycemic action. So that's all for today's pharmacognosy 150 important MCQs for your NIPER preparation. Dear student, listen to me. This 4 days of your hard work, this 4 days of your commitment, this 4 days of your commitment, your discipline, and how genuine to yourself will really decide your future. Okay, this 4 days can really decide your future. Okay, so that be genuine to yourself, be disciplined, and also keep on putting your efforts till the examination. Okay, so that definitely you already you're already great students, you're already good students. Why? Because you have achieved a GPAT, you have cracked GPAT, and now you're aiming for the next biggest stone of your life or next biggest target of your life, so that you can achieve. Okay, for to achieve a good rank, good results, you need a good efforts. Okay, thank you so much. We'll see you in the tomorrow section. Jai Hind.
Good afternoon, everyone. Good afternoon. Yes, everyone present here. Are you here? Yes or no? Yes. So, how was the session so far? Are you people enjoying it? Are you people enjoying it? You must enjoy this session, right? We'll start with GK, GS, and General English, and total 150 question. Within 2 hours, we are going to complete it. The very first thing I want you people to do is, whenever you are finding anything which is new in this particular PPT from GKGS part, try to note down in your notebook one liner, just one liner. Okay, suppose I'm talking about certain sanctuary. If you don't know, write down that particular name of sanctuary, where it is located. That's it. You need to note it down if you are getting something new from this particular slides, right? And just revise it every day. How many days are left? Few, 3, 4 days are left, and revise it every day. If you will be so lucky, then the question will be straight away from the PPT itself. Okay, so don't worry. We'll start with very first thing, that is general knowledge, total 100 question, one by one. The very first thing, where is the Shekha Lake Bird Sanctuary, which has been designated as India's 99th Ramsar site located? Simply they are asking, where is this particular bird sanctuary? You people, if you, even if you are not knowing this particular locations, I don't think they will be specifically ask you the location. They will be asking you for the state, in which state it is located. These are more broad general question they target generally, right? So even though this question is more detailed, like you need to know Mathura, Aligarh, Patna, or Jaipur. We know Jaipur is in Rajasthan. First of all, you should know where it is, where the state is located, in which state this particular sanctuary is located, and then you need to try the elimination. First of all, Jaipur is in Rajasthan, and this is not correct. They can simply ask you where this is located. You will be having UP, Bihar, Rajasthan, and so option. So this is located in Uttar Pradesh, and we must know this. What is the Ramsar sites? Ramsar sites are nothing but they are the wetlands. Okay, ecologically very much important. And generally, the wetland day is celebrated on 2nd of February. 2nd Feb. The wetland day, World Wetland Day, is also celebrated. So you can even remember this. Ecology environment part is very much important, because every time there is something going happening in the news articles. So that's why you should know this. So this is located in Uttar Pradesh. To be very specific, this is located in Aligarh. Option B is correct answer. If you don't know, write this particular statement straight away, one liner, and you are done. Okay, so it becomes India's 99th Ramsar site. Next question. Which country has passed legislation for smoke-free generation? Which is that country? Even there is one country who has passed that the people with certain age category will not be using social media. Even you must be aware of it. Which is that country also, which has passed a legislation that certain age individual, there is a limit on the age of a people or child, will not be using social media. You can even see that. So here they are asking which country has passed the legislation on the smoke-free generation. So this is none other than England. England is the correct answer. In England, they have introduced a new anti-smoking law, which aims to stop the future generation from smoking, right? And every year, the legal smoking age will go on increasing, and it is also called as smoke-free generation policy. Okay, it is England. Next, which scientist has received the Nobel Prize in Physics in 2025? You have to write it down that you need to find the Nobel Prizes for the other category, like who got in medicine, who got in another, who got the Peace Prize. Now, the Peace Prize will be probable question because Donald Trump uh, every day try to ask for the Peace Prize. Now, this will be also in the eyes of the examiner that something is happening, that Peace Prize he is asking. So in 2025, who has got the Peace Prize? Do you know? Somebody from Venezuela. Who is that? Find it out. Who got the Nobel Peace Prize this time? Machado, if you remember. Okay, I don't know the first name. I just know the surname. I'm not recalling the first name. So Machado is the one who is from the Venezuela. She got the Nobel Peace Prize. So you can even check out for the correct name. So in physics, to be more specific, Clark, Devoret, and Martinez has got this particular physics Nobel Prize. Right? These are the three individual for Clark, Devoret, and CDM. You can remember CDM. Okay, CDM. For the electric circuit, something they have done a discovery of microscopic mechanical tunneling. What is tunneling? What they have done, if there is a barrier, how a particle or any ball, am I audible? Is my network okay? Am I audible? Am I audible? Because there is certain issue from my side on networking, on network side. Yes, let it be. So what was I telling? Quantum tunneling, whenever there is a barrier and anything needs to pass from it. So they have done certain kind of discovery that this particular ball will pass through this barrier without jumping. It will pass directly. So that was some kind of discovery they have done it. Quantum tunneling on microscopic level. On macroscopic level, because quantum mechanics don't work at macroscopic level, and they find out that this is also working at macroscopic level. So this was becoming a discovery. Next, the R-37M missile, which has been in the news, was developed by which country? Which country? USA, Israel, France, Russia. Which it is? It is R for Russia. You can remember R for Russia. Russia is the one who has developed this particular missile. It is a long range air to air missile. That means it will be launched in the air itself and will be targeting the air missile, other air missile itself, air to air missile, right? And developed by Russia. You must know this. Who was honored with the Global Green Icon Award at World Climate Leadership Summit, which is held in UK. Santosh Kumar, Ratan Tata, Narendra Modi, and Sunita Narain. Global Green Icon at World Climate Leadership Summit, which held in UK. Are you people aware about this fact? See, none other than Santosh Kumar is the one who got this particular prize. Initiated by Rajya Sabha MP J. Santosh Kumar, who got or he received this particular prize for participating, for successfully mobilizing millions of people to participate in plantation. Okay, so over 20 crores of sapling was distributed and planted accordingly. Next, who has become India's 95th chess grandmaster with it Gujarati R. Prag, 𝙂𝙀𝙎𝙎𝙎𝙬 and 𝘂𝙂𝙎𝙎𝙎𝙬, who is the one who has become 95th chess grandmaster. Any idea? You people have any idea? No. The 95th chess master has been gone to option D. 𝘂𝙂𝙎𝙎𝙎 is the correct answer, who has received this grandmaster title. He has become 95th grandmaster, and grandmaster is nothing but a highest chess title. The highest chess title is the grandmaster title. Okay. Nowadays, chess is becoming very popular. Who was the first grandmaster? Who was the first grandmaster? Who was the first grandmaster? See, now is not the time to search for the new material. I'm telling you, push. So just do whatever is being done here. That's it. Now you don't have to go finding more books and books, or you will be in the bad position. So that's why do from here itself. That is enough. Or else, if you have seen the classes lectures are enough. Vishwanath Anand, very nice. Who has been conferred with the prestigious Professor M.S. Swaminathan Award of 2026. Who was M.S. Swaminathan? He was the pioneer of the Green Revolution. Pioneer of the Green Revolution in India. Make sure you remember this. He was the pioneer of the Green Revolution in India. So, who has been conferred this particular prize? Dr. M.K. Das, Dr. C.H. Srinivas Rao, P.K. Mishra, and Dr. Ratan Lal. It is Dr. C.H. Srinivas Rao. Okay, he has been given this particular award, and he is a agricultural scientist. Understood? He has worked for improving the Indian agricultural system. Next, even remember when I talk about the Indian Green Revolution, father of Indian Green Revolution, then it is M.S. Swaminathan. Okay, and when I talk about from the world basic, from the global basic, so it is Norman Borlaug. Okay, so from global perspective, the father is Norman Borlaug. From Indian perspective, the father is M.S. Swaminathan. Next, where has India's first petroglyph conservation park aimed at protecting cultural heritage been established? Maharashtra, Goa, Kerala, Ladakh. Petroglyph is nothing but, what is petroglyph? Preserving the old heritage site, or the, what it is, a rock carving, especially a prehistoric rock carving, is called as petroglyph. So there has been India's first petroglyph conservation park, which is aimed for protecting the cultural site. It has been established at Ladakh. Okay, at Ladakh. Please remember this thing. It has been first, and this is also first petroglyph site. So that's why Ladakh to be known, and there are various ancient rock carving which is there, so to be preserved there. Okay, this will also promote tourism and historical awareness. Push, you are in the good range. Try to see whether this marks you are scoring is consistent, or you are just scoring in one or two tests and the rest tests are not that much very good marks. I should know what is the correct amount of answer you are giving and incorrect amount of answer you are giving. Accordingly, I can guide you. First of all, let us complete this. Who has won the title of Miss India World 2026? Sadhvi Satish Sen, Manasa Varanasi, Simi Shetty, and Hatnas Sandhu. For 2026, I am asking. Can you answer this, guys and girls? It is Sadhvi Satish Sen. She has won this particular award. Next, where has the Cheetah Andolan, Cheetah Movement, has been launched in protest against the 𝘾𝙀𝙎𝙎 river linkage project? Cheetah Movement, Rajasthan, Uttar Pradesh, Madhya Pradesh, Chhattisgarh. 𝘾𝙀𝙎𝙎 river linkage. What do you think? Where has been this particular movement going on for protection of cheetah against the 𝘾𝙀𝙎𝙎 river linkage? Whenever there is a linkage project, it is definitely going to harm flora and fauna there. And that's why people generally protest. As we have seen in the case of Aravallis also. Aravallis is the, please make sure you remember the Aravalli mountains are the oldest fold mountain. Question, most probable question this time could come that because it has been there in the current affairs since one last year. Oldest fold mountain which is there is Aravalli, and it is located in the, it is spread across 6 states, starting from Delhi till Gujarat. Okay, it is like this, and oldest fold mountain which is there is Aravalli. Please make sure you remember this. The major part lies in Rajasthan. Its peak is 𝙂𝙎𝙎𝙎𝙎, which is present in Mount Abu. At Mount Abu, there is a peak of this particular mountain, 𝙂𝙎𝙎𝙎, oldest fold mountain spread across 6 states, Delhi, from Delhi to Gujarat. This is how it is being spreading. So here the correct answer is Madhya Pradesh, MP, because 𝘾𝙀𝙎𝙎 river, you will find this particular river in Madhya Pradesh region. Okay, so Uttar Pradesh was not the answer. Rajasthan has a very less river linkage. You might see here not Sabarmati, that Luni river. Okay, and Chhattisgarh, not the correct answer. Option Madhya Pradesh was the correct answer. So the movement highlights the concern about the impact of cheetahs and biodiversity conservation in that particular region. Okay. Next, which Indian actor has been included in the list of Time 100 Most Influential People 2026? Shah Rukh Khan, Ayushmann Khurrana, Ranbir Kapoor, Amitabh Bachchan. I don't think you people might be aware of this, but Ranbir Kapoor was the one who has been there in the list. Okay, was included in this particular 100 Most Influential People list for the contribution in the Indian cinema and entertainment. Next, Squadron leader Manisha Padhi has become first female aide-de-camp (ADC) to the governor of which state? Meghalaya, Mizoram, Manipur, Nagaland. Leader Manisha Padhi has become the first female ADC. So even this can become a probable question. Who has become the first female ADC? And governor of which state? The state is Mizoram. Mizoram is also famous for molasses basin. Okay, Mizoram is famous for molasses basin. Manipur is famous for his 𝘾𝙀𝙎𝙎𝙎𝙬 National Park. 𝘾𝙀𝙎𝙎𝙎𝙬 National Park. Manipur is famous for this particular 𝘾𝙀𝙎𝙎𝙬 National Park, which has 𝘾𝙀𝙎 in it, which is called as floating something. This 𝘾𝙀𝙎 is nothing but a floating sections. So they are named as 𝘾𝙀𝙎s in this particular national park. Meghalaya, it is beside the Assam. Okay. If you hear it is Assam, then this is the Meghalaya part. Next, yes, she has become the first woman ADC to the governor of Mizoram. Okay, she is an officer of Indian Air Force and holds the rank of squadron leader. ADC, what is an ADC? It is a military officer who is appointed as a personal assistant to a governor. Who is appointed as a personal assistant to a governor, that is called as ADC. Make sure you remember this. who has been awarded the title of Leading Women Cricketer of the Year 2026 in the Wisden Cricket Almanac Award of 2026. Harmanpreet Kaur, Smriti Mandhana, Deepti Sharma, and Shafali Verma, who has been awarded as a leading women cricketer. Women are always in the spotlight whenever any examination has to ask a question. Make sure you remember all these phenomena, all these names, right? Yes, it is Deepti Sharma. Okay, she has been awarded as the title of Leading Women Cricketer of the Year 2026. One more thing you must remember is in GKGS portion, don't try to do a guesswork. Okay, here your guesswork will go. If the guesswork won't work here, please try to be very specific. If you know the answer, you know the answer. If you don't know the answer, don't attempt that question. But if you are able to eliminate, if you are able to eliminate two options, then definitely attempt that question. Even if guesswork, if you need to do a guesswork, then also it is okay. But only when you are able to eliminate two options accurately, you know that these two options are definitely not correct, then only. According to delimitation bill of 2026, what is the proposed increase in the number of member in the Lok Sabha from the current seat 543? Delimitation is nothing but again rearrangement of the constituencies. The region, suppose if I am talking about any state, so any state has been divided into further constituents. Okay, this has been divided into constituency based on the population. So constituency A, B, C, D, E, F. Accordingly, a leader is appointed there, and then further the MLA is appointed. MLAs are then appointing the MPs. The voting process happens. So now this delimitation commission has been set up, and this according to this particular bill, it is not hard to remember. You simply have to note it down and then have to go through it 4 to 5 times. Okay. So now from the current seat 543, it will be increased to 850. Can you see the jump? From 543, it will get increased to 850 number. That means the number of MP, it will become to 850. Okay. So 543 to 856, this proposal has been done to adjust the parliamentary representation based on population change, because still the census are not done. That's why, and the census data, redrawing the constituency's boundary so that fair representation should be happening. Every voice should be heard. Next, what is the name of India's first dedicated nuclear missile tracking and ocean surveillance ship deployed in the Arabian Sea? INS Vikrant, INS Arihant, INS Dhruv, INS Marmagua. See, remember, India's first dedicated nuclear missile, it is there, which is being deployed in Arabian Sea. This can be a probable question. They can simply ask you, the first dedicated nuclear missile has been deployed in Arabian Sea, Bay of Bengal, then Indian Ocean, and further none of the above. Both none of the above. And you must know that this has been deployed in the Arabian Sea, and that this has been INS Dhruv. Okay, this particular nuclear missile tracking and ocean surveillance ship has been deployed in Arabian Sea for tracking system, for radar, for advanced radar and tracking system, so that we can protect our integrity, maritime integrity also. Who has won the title of Women's Candidates Tournament 2026 held in Cyprus? Cyprus. Koneru Hampi, Tania Sachdev, Harika Dronavali, and R. Vaishali. Who has won the title in the Women's Candidate Tournament 2026 held in Cyprus? R. Vaishali is the one. She has won this, but she is the sister of R. Prag, right? She is the sister of Pragna Nanda. She has won this particular tournament in Cyprus. One of the leading chess player, again, you can remember this. In which state was the Sri Guru Bhairavya temple inaugurated by PM? Again, an important thing. Andhra Pradesh, Tamil Nadu, Karnataka, Telangana. You must know this, people from the South India. You should be aware of this. Sri Guru Bhairavya, inaugurated by Prime Minister. At which location? at Karnataka. Okay. So this temple is located at the famous Sri Adi Chunchana Giri Mahasthan Mutt in Mandya district. It was built in the memory of Dr. 𝘖𝙃𝙎𝙎𝙎 Mahesh Swami, a respected spiritual leader and social reformer. Next, which death anniversary of Dr. Sarvapalli Radhakrishnan was observed on April 17th, 2026? Now, they can simply ask you this, that on which date Dr. Sarvapalli Radhakrishnan death anniversaries are observed. It is April 17th. Now, this time it was the 51st anniversary. Okay, this was 51st anniversary. Okay, he was the second president of India, please remember, and his birthday was generally celebrated as a Teacher's Day, 5th of September. Next, who has become India's top trading partner in financial year 2026? China, USA, Japan, Russia. First or top trading partner of India in financial year 2026. Connected. Finally, hello, hello, hello. Am I audible, guys? I am back. Sorry for the interruption, technical issue. Don't know why it is happening today only. Am I audible properly? Just a minute. Just a minute. The screen has to be again mirrored. Just a minute. Sorry for the interruption. Huh. PPT now visible? Everyone? You got a break till that time. Yes. Now it is visible. I think everything is fine from my side also. In starting itself, I was knowing that something is going to happen because my internet was not working well. Yes. So the last question which we were looking was who has become India's top trading partner in financial year 2026? So it was China. China has become the India's top trading partner in the year of 2026. You must know this. Okay. China become it. And the trade between India and China happens in which all perspective or which all thing? The electronic imports, machinery, chemicals, and industrial goods. Okay, this all part has been generally traded between India and China. Understood, all of you? Right? Let's go for the next question. Which foundation day did Himachal Pradesh celebrate on April 15, 2026? 75th, 80th, 70th, and 79th. On April 15, 2026, Himachal Pradesh celebrated the 79th Foundation Day. Very rarely this question will be asked. Okay? Very rarely this question will be asked, but still you should know. You should know it. Next, Himachal Pradesh 79th Foundation Day was celebrated. It has become state on 15th of April 1948. So how you can remember 15th of August 1947 is the day when we got freedom, and Himachal Pradesh has become state in 15th of April, not August, April 1948. Just for remembering purpose, you can link it with the Freedom Independence Day and this. Who has been honored with WWF Pink National Award? Sunita Jain, Kiran Majumdar, Anita Chaudhary, and Medha Patkar. WWF Pink National Award. WWF Pink National Award has been given to Anita Chaudhary. You can remember she has been given for contribution for world wildlife conservation, for the conservation of wildlife, and she has been forest guard at Sherghar Sanctuary, which is there in Rajasthan. Okay, this can simply ask you where is the Sherghar Sanctuary located. So it was located in Rajasthan. Okay, she has been known for rescuing wildlife such as crocodiles and other dangerous species. And what is WWF? It is Worldwide Fund. Okay, Worldwide Fund for Nature. Next, which ministry has organized the nationwide Nari Shakti Yuva Sansad? Yuva in the sense youth, Nari Shakti in the sense women empowerment. So, Ministry of Youth Affairs and Sports, Ministry of Women and Child Development, Ministry of Home Affairs, and Ministry of Education. What will be the correct answer? Option A. Simple. Okay. You can simply eliminate two options. And when you are eliminating two options, now this kind of question, if you are getting this such kind of question, you can simply eliminate two options, C and D automatically. We are left with A or B. And then you can do a guesswork. Here the guesswork will, even if it is getting you a negative marking, but statistically be it will be positive. Okay. Next. Nari Shakti Yuva Sansad was organized by Ministry of Youth Affairs and Sports to encourage women's participation in leadership, democracy, and policy making. Where has the one in the Sarovar project been launched for water security? Himachal Pradesh, Sikkim, Uttarakhand, and Ladakh. Sarovar project, one in Sarovar. What do you think? Himachal Pradesh, Sikkim, Uttarakhand, or Ladakh? Here, remember Ladakh is the one which is being launched this particular project for one in Sarovar. It is launched by Saxena in Ladakh, Vinay Kumar Saxena, for improving water security. Okay, through snow harvesting. You have learned about rain water harvesting, but here snow harvesting will be done because where it is present, it is simply in the northern side, in the Kashmir side, right, where it is so much glaciers are present. Snow is a phenomenon which generally occurs there. So snow harvesting. Who has been awarded the Wisden Trophy for outstanding performance in cricket? Virat Kohli, Rohit Sharma, Shubham Gill, and Yashasvi Jaiswal. Now this is a favorite question of cricket lover. Can you tell me Wisden Trophy given to whom? Anybody here to answer? Anybody here to answer this question? Make sure you remember option C. Shubham Gill got this particular trophy for outstanding performance in cricket. Okay. Against whom? Against England. Against England. He has scored a highest number of runs. Which birth century of Dr. B.R. Ambedkar was celebrated on April 14th, 2026? This question becomes important. 130, 140, 134, 135. Now you can simply see it may be revolving around 130 plus or minus 5. Sorry, 135 plus or minus 5. This is the one you can generally guess from the option which is given, and the correct answer is 135. Okay, option D is correct answer. Dr. Ambedkar, B.R. Ambedkar birth anniversary celebrated this time. It was 135th anniversary. Dr. B.R. Ambedkar is the one who is known as father of Indian Constitution. Okay, he is the father of Indian Constitution. He has led movement for untouchables, many movements for untouchables, and he was pioneer so that uh, the uh, the minorities could get reservation in the parliament. He was the one who was leading the campaign for it. Next, Susan Koyal has been appointed as the first female army chief of which country? Australia, New Zealand, Britain, Canada. Susan or Susan, what do you think? She has been appointed in the Australia. Australia's first woman to lead the Australian Army. Chief of Army, Susan Coyle. Okay. Next, in which state has the Indian Army launched the border radio station? Arunachal Pradesh, Ladakh, Jammu and Kashmir, Sikkim. Border radio station. Present at the border, please. present at the border place? It is Sikkim. Sikkim is also there is also known as Sikkim is present at Chicken Neck Corridor. Have you heard about this? This was very much in news recently. Chicken Neck Corridor. Why Chicken Neck Corridor? Because Sikkim is found to be like this. This is Sikkim present, right? If I am talking about from Indian perspective, let me draw the map for you guys. Okay, this part is now. If suppose this is India, so this particular portion is Sikkim. Sikkim is bordered by Nepal, Bhutan, and from above side it is China, and that's why it is known as Chicken Neck Corridor. Surrounded by three other countries, right? And from India. So definitely, if anybody wants to intrude in India, they generally found this place because it is very much covered from every region, right? So it is also been told to be as a chicken neck corridor. Sikkim is correct answer. India's army Tri-50 Corps has been launched the village border village radio station, and the station is known as Sikkim Sundari, chicken neck corridor. This particular station is known as Sikkim Sundari. Understood? Next, what is the name of seventh joint exercise which is conducted between India and Uzbekistan? Kanjar, Surya Kiran, Dastlin, and Mitra Shakti. India and Uzbekistan had a joint military exercise. Which that particular military exercise is known as? The most probable answer, the most correct answer for this is option C, Dastlin. Okay, between India and Uzbekistan. So you can remember US, Uzbekistan. US to be resembled with UZ. Okay, so you can simply remember just for remembering purpose because there are several military exercises happening every year. So you can remember for this joint military exercise between India and Uzbekistan is called as Dastlik. Dastlik. In which state Unnat Krishi Mela was organized? UP, MP, Punjab, Haryana. Unnat Krishi Mela regarding the farmers fair event. It is there in Madhya Pradesh. Okay, Madhya Pradesh is our correct answer. Madhya Pradesh is the one where this particular Unnat Krishi Mahotsav Mela has been organized for focusing on modern farming technology and scientific agriculture. So that agriculture could the agricultural technological advancement could be happening in agricultural perspective. Our land is not very much degraded. Modern technology will prevent the land degradation. Right? Next. Which medal did Vishwanath Surat win at Asian Boxing Championship 2026? Gold, silver, bronze, none. Gold, silver, bronze, and none. Please remember it was gold medal he won. Vishwanath Suresh won the gold medal in the men's category of 50 kg. He defeated Japan 𝙂𝙎𝙎𝙬𝙖. 𝙂𝙎𝙎𝙬𝙖 or Y something. Very hard to pronounce. So he defeated Japan's Daichi in the final match, and yes, he won the gold medal. This championship was held in Mongolia. Yes, good. Nobel Prize in Chemistry was awarded for polymer synthesis, DNA sequencing, protein folding, and metal organic frameworks. This year's chemistry Nobel Prize was there for the metal organic framework. Specifically, the metal organic framework was given to Kitagawa, Robson, and Yagi. Okay, Kitagawa, Robson, and Yagi. These are the three individuals who had got this particular Nobel Prize in Chemistry. The Clark, Devoret, and CDM. Clark, Devoret was got the Nobel Prize in Physics, and here they got it Chemistry. Who is the youngest Indian player to score 4,000 runs in IPL? Rishabh Pant, Sanju Samson, Shubham Gill, Ruturaj Gaikwad. Again, IPL cricket lovers, answer me. Who has won India's youngest Indian player to score 4,000 runs in IPL. Who was the one? Shub, Shubman Gill. Shubman Gill played from Gujarat Titans, was the one who scored total 4,000 runs in IPL. Which medal did Ayush Shetty win at badminton team championship? Ayush Shetty, please remember the name. What he is playing badminton. Okay, he has won silver medal. So silver medal won by Ayush Shetty in badminton team championship. Remember this very properly. Understood? As a team, they won gold medal. Ayush Shetty won the silver medal. Understood? Next, which anniversary of the Jallianwala Bagh massacre fell on April 13, 2026? It was 100, 105, 107, 110. Jallianwala Bagh massacre was the one where the British General Dyer, Michael O'Dyer, opened fire on the crowd and leads to several deaths. So this year it was 107th anniversary. Very rarely this question will be asked, but remember the date. It was happened on April 13th. Okay, happened on April 13th. To be more specific, April 13, 1919. Okay, General Dyer who openly fired on the people. Who has been selected for the Lata Dinanath Mangeshkar Award 2026? Amitabh Bachchan, A.R. Rahman, Narendra Modi, Kailash Satyarthi. Kailash Satyarthi was a very famous name is a very famous name for the honesty, right? Have you ever heard about this name, Kailash Satyarthi? Sometimes, if you get the time, please check. So, Kailash Satyarthi has been given this particular award in the memory of Lata Mangeshkar. It recognizes individual which is contributing to the national services, social work and culture. Okay, and he won this award because of his work against the child labor and for the child right. He is even the Nobel Peace Prize laureate of 2014. Which recombinant product is used to dissolve the blood clot? Filgrastimine, interferon, alteplase, and somatropine. Your ecology question. For dissolving the blood clot, we are using what? Somatropine is the growth hormone, right? Analog of growth hormone. So it has nothing to do with dissolving blood clot. Here the alteplase becomes the correct answer. Recombinant tissue plasminogen activator converting plasminogen to plasmin, right? And plasmin which dissolves the fibrin clot. Very nice. The trade name of Herceptin belongs to trastuzumab, rituximab, filgrastimine, and interferon. Herceptin. Herceptin belongs to the trade name Herceptin belongs to Herceptin belongs to it belongs to trastuzumab. Trastuzumab is a monoclonal antibody. Okay, recombinant monoclonal antibody which is targeting HER2 receptor, and Herceptin is the brand trade. Leprosy bacillus was invented by Hansen, Fleming, Koch, and Harvey. We know that we also know leprosy as a Hansen disease. So option A is our correct answer. Right? Hansen disease. In which year was Asha Bhosle honored with Padma Vibhushan? 2010, 2005, 2008, 2012. She has been honored in the year of 2008. Okay? In the year of 2008, she has been honored, and India's second highest civilian award is Padma Vibhushan. The the highest award is. Should I do MCQ or should I revise? It depends how many times you did your revision. If you have done enough of revision, then you can see the MCQs. Or else it is generally told to do the revision. Okay. Padma Vibhushan, we have Padma Bhushan, Padma Vibhushan, and Padma Shri. Padma Shri is the highest one. Which port has become India's largest automobile export hub? Mundra, Jawaharlal Nehru Port, JNVP Port, Chennai Port, and Visakhapatnam Port. This port is the Mundra Port. Okay, Mundra Port is operated by the Adani Port, and this has the highest capacity to handle the automobile exports. Which birth anniversary of Jyotirao Phule was celebrated on April 11, 2026? So Jyotirao Phule was the one who led to women's education, many campaigns of women education, right? He also was the one who teach his wife, right? So this year it was 200th anniversary of Jyotirao Phule. 2026 200th anniversary. He was born on 11th of April and was a social reformer, worked for women's education, against the caste discrimination. He founded Satya Shodhak Samaj, okay, for promoting equality and justice. Satya Shodhak Samaj. I'll suggest revision. Edited H. The Nobel Prize in Medicine has been given awarded for vaccine discovery, peripheral immune tolerance, DNA replication, antibiotic. In Hindi, I have uploaded in Hindi batch I have uploaded Science and Technology Current Affair of Part-1 last year. In that also I have told this that there was a peripheral immune tolerance discovery which was happening. So option B becomes our correct answer. It was given to Sakaguchi, Barkov and Ramsdell. Okay, SBR. In which country was 9th Indian Ocean Conference held? Maldives, Seychelles, Mauritius, Sri Lanka. In which country was the 9th Indian Ocean Conference held? What do you think? It was held in Mauritius. Where? Mauritius. For regional cooperation and diplomacy, generally such kind of things are generally happening. By whom was the latest edition of Constitution released by Shinde? Draupadi Murmu, Amit Shah, C.P. Radhakrishnan and Om Birla. Latest edition of Constitution being released by whom? It was C.P. Radhakrishnan. The updated edition of Constitution of India was launched in Maharashtra, and this was the Governor C.P. Radhakrishnan who played a key role here. Governor C.P. Radhakrishnan. Central Marine Research Station is situated at Mumbai, Delhi, Chennai, Kochi. Central Marine Research Station is located at Kochi. Okay, located at Kochi. Central Marine Research Center. Kochi, Kerala, established in 1947 for marine fishery research project. The father of White Revolution or Dairy Revolution, Patanjali, Jagdish Chandra Bose, Varghese Kurian and Raja Ramana. So Varghese Kurian is the one who is the founder of Amul as well. Okay, Amul is a cooperative. So the Varghese Kurian is the one who is known as the father of White Revolution. Option C becomes our correct answer. He was a chief architect who has been made India as the largest milk producer, and even the Amul is named or been recognized beside him. Next, who is known as the father of nanomedicine? Richard Feynman, Eric Drexler, Robert Pretas Jr., and C.V. Raman. For the nanomedicine, this particular junior has been remembered Robert Pretas Jr. He has been widely known as father of nanomedicine. He also introduced the concept of medical nanobots at molecular level, even nanomedicines. So you can remember him. Who is known as father of nuclear physics? Isaac Newton, Albert Einstein, Ernest Rutherford, and Niels Bohr. Father of nuclear physics. Who will be the one? Ernest Rutherford is the one who is known as father of nuclear physics. He discovered neutron as well in 1942. So neutron is discovered by W. Got a Nobel Prize as well. Who discovered the ABO blood group system? Louis Pasteur, Carl Lednister, Alexander Fleming, Edward Jenner. We know that Carl Lednister is the one. Ledsteiner is the one who has discovered this ABO blood grouping system. Louis Pasteur, pasteurization. Fleming, what does Fleming do? Penicillin. Edward Jenner, or vaccine. Polio vaccine, right? Option B becomes correct answer. Father of Indian physics. Father of Indian physics. Homi Baba, C.V. Raman, APJ Abdul Kalam, Satyendra Nath Bose. Who is known as father of Indian physics? Still, there are 100 question more. We have reached till 350 question. I think there are 100 question, right? No, 250. Yes, C.V. Raman is the one who is the father of Indian physics. He discovered the Raman effect. Father of Indian nuclear program, C.V. Raman, Vikram Sarabhai, Homi Baba, and Jagdish Chandra Bose. Indian nuclear program. For Indian nuclear program, we generally remember Homi Baba. Okay, he is the one who is father of Indian nuclear program. Who is the world first female cricketer to take 9 wicket in T20 match? Ellis Perry, Julian Goswami, Ned Shiver, and Laura Cardoso. So the Laura Cardoso is the one who has been the first female cricketer who took the 9 wickets in T20 match. Okay. Where was the second airdrop test for Gaganyaan mission conducted? Sri Harikota. It is Sri Kota, not it is Sri Harikota. Chandipur, Pokhran, and then Tiruvananthapuram. So Sri Harikota is the one where the second airdrop test has been done. Okay, Sri Harikota. Where is the tri-service seminar title Run Samsad organized? New Delhi, Pune, Hyderabad, Bengaluru. Where is the one this tri-service seminar title Run Samsad organized? Where? Yes, correct. Bengaluru. Bengaluru. This has been organized and it is a joint defense discussion platform of Army, Navy, and Air Force. Sigma Stat software is mainly used for chemical drawing, statistical analysis, drug formulation, clinical diagnosis. See, I have to go a bit faster. Why? Because we are left with still 100 more question and we have only 60 minutes to do it. Either I can stop for all of your answers or I can go bit faster. Yes, for the stat analysis or statistical analysis. Next, which software is used for quantum chemical calculations? Chemistry calculation, MM2, MOPAX, AM1, PM3, Gaussian, Sigma Stat, and Tripos. So for quantum chemical calculation, do remember Gaussian is the one software which is generally used. Very nice. And these are for the molecular dynamics, right? Sigma Stat for the statistical calculation and Tripos is for the molecular designing and drug design. Molecular and drug design. ChemDraw Ultra is used to draw the structure of drug molecule in 2D and then to convert in 3D. Used to visualize protein peptide 3D structure. For sequence alignment of protein, molecular dynamic energy minimization. You must have used this particular software. Have you used this software? ChemDraw Ultra. This is a simple software which is used to draw the structure of drug molecule in 2D and then we are converting it into 3D. Right? These are the other software, PyMol, mole, BMD for the visualizing the protein structure, Clustal for alignment of the protein, right? Next, which software is mainly used for molecular design and drug design? Tripos, TopCat, Autodoc, and FASTA. Which software is mainly used for molecular design and drug design? Tripos, TopCat, Autodoc, and FASTA. Remember, Tripos is the one which is there for molecular design and drug design. Yes. In bioinformatics, DASH is a program to identify complete gene structure in genomic DNA. GenScan, FASTA, BLAST, and COMSIA. You can remember gen means genetic or genomic DNA scan. Okay, so it is a GenScan is the correct answer. Genomic DNA scan is the correct answer. Next, Which software is used for 3D researching or searching program? 2D, 3D, Tomcat, Caveat, and Siddharth. For 3D searching program, we have Caveat. Okay, 3D searching program, Caveat is the correct answer. Tomcat is nothing for toxicity prediction. Toxicity prediction, Tomcat. 2D, 3D, we have 2D, 3D, we have Concord, Corina, Caveat for 3D searching program. CDART is for nothing but it is a conversed domain architect retrieve tool for protein sequence. Anything related to protein sequence being here. Which governing body has organized IPL? IPL is organized by whom? Very easy question. Who organized it? This is not a government body. Okay, this is BCCI. BCCI is the one who organized the IPL. DRDO mainly associated with medicine, defense research, agriculture, space. DRDO is associated with answer please. Defense research. Very nice. Defense. DRDO is Defense Research Organization. Defense is the correct answer. It is Defense Research and Development Organization. Headquarters is located at New Delhi. Which institution regulates the Olympic Games? FIFA, ISA, IOC, and ICC. ICC World Cup. No, this is not. FIFA will not be there. FIFA is for the football. We have ISA and IOC. So Olympic will be there in option C, right? In full form itself, Indian Olympic Committee. Sorry, International Olympic Committee. So it is the one which associated with the Olympic. CDSCO belongs to USA has FDA, UK has Australia has TEA, USA has FDA, India has CDSCO, UK MHRA, right? So option D is correct answer. Anvisa is for Brazil, okay? They can simply ask you Anvisa. It is for Brazil. MCAS belongs to which country? Zambia, Zimbabwe, Kenya, Nigeria. So Zimbabwe is the one where the MCAS is nothing but Medicine Control Authority of Zimbabwe. Medicine Control Authority of Zimbabwe. NAFDAC belongs to which country? Ghana, Kenya, South Africa, Nigeria. NAFDAC. Ghana, Kenya, South Africa, and Nigeria. It is nothing but National Essential for Food and Drug Administration and Control. National Agency for Food and Drug Administration and Control belonging to Nigeria. Which country has withdrawn its bid to host a COP33 is Conference of Party 33 Summit in 2028. This is generally for environmental concerns, okay? For environment related committee or conference which is happening. Brazil, India, South Africa, China. It has been already done in India. So it has been already done in India in 2025. But now here, the India was further given the chance, but it have withdrawn. India has withdrawn from it. Option B is correct answer. So India earlier considered hosting this COP 2033 in 2028, but later we withdraw from it. We are not now hosting it in 2028. Which has become the first Indian FMCG company to achieve a turnover of 1 trillion. Hindustan Unilever, ITC, Amul, Patanjali. First Indian FMCG company to achieve turnover of 1 trillion. 1 trillion turnover. Amul. It's Amul. Amul is a dairy cooperative brand. We know that. And crossed 1 trillion market. Next question. Which state has declared cancer as a notifiable disease? Kerala, Tamil Nadu, Karnataka, Telangana. Cancer as a notifiable disease. What do you think? Telangana. South Indian people, you must know this. Telangana is the one who has declared the cancer as a notifiable disease, and they will prepare a register for identifying and tracking it. Who introduced the concept of magic bullet in chemotherapy? Alexander Fleming, Paul Ehrlich, Robert Koch, and Louis Pasteur. Who introduced this magic bullet therapy? Magic bullet in chemotherapy. Paul Ehrlich. Paul Ehrlich is the one who has introduced this particular concept, right? Paul Ehrlich is the one. Because chemotherapy generally been discovered by him only. He introduced the concept of magic bullet, which means a drug which selectively targeted destroy the disease-causing organism. Paul Ehrlich is the correct answer. Streptomycin is discovered by whom? Alexander Fleming, Paul Ehrlich, Gerard Dockmark, and Salzman-Waxman. Who discovered the streptomycin? Streptomycin being discovered by Salzman-Waxman, right? Option B is correct answer. Salzman-Waxman is the correct answer. Ether anesthesia was first publicly demonstrated by James Young Simpson, William Thomas Green Morton, Robert Koch, Edward Jenner. So ether anesthesia was first publicly demonstrated by whom? First publicly demonstrated by none other than Morton. Option B is correct answer. Okay, Morton. Hypodermic syringe was introduced by Alexander Wood, Louis Pasteur, Robert Koch, and Morton. Hypodermic syringes been discovered by whom? Alexander Wood. Wood is the one who has discovered the hypodermic syringes. This allowed direct injection of a drug into body, improving the drug delivery and rapid action. Next, yellow fever vaccine was developed by Max Thieler, Louis Pasteur, Edward Jenner, and Robert Koch. Yellow fever vaccine developed by all pharma questions. Nothing as such non-pharma in it. Max Thieler is the one who has developed this particular yellow fever vaccine. Right? Who successfully cultured the polio virus in tissue culture? Jonas Edward Salk, John Franklin Ender, Albert Bruce Sabin, and Edward Jenner. Polio virus cultured. Who cultured this? Culture is been done by the Ender. Okay. John Franklin Ender is the one who is responsible for it, for cultured the polio virus in the tissue culture. Later, there was a development of Salk and Sabin vaccine, but he has done the culture. Ender. Who helped to decipher the genetic code? Mendel, Khurana, Watson, and Pasteur. Deciphering or decoding of the genetic code has been done by 𝘖𝐺𝑜bind Khurana. Okay, 𝘖𝐺𝑜bind Khurana was the one who has deciphered the coding. 𝘖𝐺𝑜bind Khurana. Option B is correct answer. In genetic coding, deciphering of the genetic code. Which animal is considered as the most preferred large experimental animal due to ease of training? Rabbit, rat, dog, and guinea pig. Large animal in the category of large animal. Dog is the one which is generally considered that it is easy to train the option C is our correct answer. Right? Dogs are preferred. Study on mast cell is commonly carried out using which of the animal model? On which animal model? Rabbit, rat, dog, or frog? Mast cell study is generally done on rats. Rats is the correct answer. Generally done on rats. Why do you use for studying the mast cell? So for mast cell studies, we are using rat for it. Okay, because they are useful in finding out the allergic and inflammatory experiments. Why are rats not used for anti-emetic screening? Because of small size, because of lack of vomiting reflexes, short lifespan, and poor metabolism. Simple answer C. Anti-emetic screening should be done when a certain species will undergo emesis, right? Rat is the one which does not undergo emesis. In the sense they lack the vomiting reflex. And that's why we are not choosing rat for the anti-emesis screening. Option B is correct answer. Guinea pig ileum is commonly used for study of effect of antibiotic, anti-cancer drug, histamine, acetylcholine, and insulin. Guinea pig's ileum is generally used, which you must have studied. Already हो गया time. Divek, 1 hour and 15 minutes back. 4:45 minutes to go. You must have done the experiment also, right? We generally use acetylcholine and histamine. Option C is correct answer. The DRACE test in rabbit is used to evaluate cardiac activity, skin infection, eye irritation and toxicity, and kidney function. DRACE test is for DRACE test in the rabbits generally done for which purpose? Yes, eye irritation and toxicity evaluation is generally done. Which CSIR lab is located in Pune? NCL, NIDI, NPL, CIMFR. Please remember National Chemical Laboratory, NCL. National Chemical Laboratory is present at Pune. National Chemical Laboratory is present at Pune. It is a premium research laboratory established in 1950, which focuses on chemical sciences, catalysis, polymers, and drug research. National Aerospace Laboratory is located at Delhi, Bengaluru, Pune, Hyderabad. Aerospace Laboratory, where it will be located? Very correct answer, tell me. Bengaluru is the one where this particular laboratory is located. BARC is located at Chennai, Kolkata, Mumbai, Delhi. BARC is nothing but Baba Atomic Research Center. Baba Atomic Research Center, a very premium Indian nuclear research center which is located at Mumbai in Bombay. Okay. Who declared not who? It is WHO declared COVID-19 as pandemic in January 2020, March 2020, June 2020, or December 2020. It was the time frame of March 2020 when this particular virus has been declared as a pandemic, and hence from that time till 1 year we were in the lockdown, intermittent lockdown. Indian Institute of Petroleum is situated at Delhi, Dehradun, Mumbai, Chennai. Indian Institute of Petroleum is situated at Dehradun. Okay, Dehradun, Uttarakhand. The Pavlov pouch experiment in dogs is used to study kidney function, gastric secretion, liver metabolism, and lung metabolism. The Pavlov pouch experiment is generally done to study the gastric secretion. Okay, Pavlov pouch experiment in dogs is generally done to study the gastric secretion. A small pouch of a stomach is surgically separated but retain the nerve supply, and hence it is used to study the secretion of HCl, nervous system role, and effect of food and stimuli on the secretion. The first cholera pandemic started in India, China. No, it started in India. India is the one where first cholera pandemic was started in 1817. India was the one. Where was India's first driverless pod taxi project launched? UP, Delhi, Maharashtra, Gujarat. So please remember, Maharashtra is the one where this pod taxi project has been launched. Pod taxi project. Which corps of the army organized Operation Namaste? Tri Shakti Corps, Chinar Corps, Gajraj Corps, or Sudarshan Corps? So the Operation Namaste was launched during the COVID-19 pandemic, and it was Tri Shakti Corps, all the Indian all the corps of army, leadership of Tri-Shakti corps. Okay. Next, where is the India's first petabyte fast breeder reactor located? Maharashtra, Rajasthan, Karnataka, and Tamil Nadu. So the first breeder reactor program was located at Kalpakkam, and this is present where? At Tamil Nadu. Option D is correct answer. D is correct answer. Kalpakkam is the correct answer. Who is the first Indian woman to reach Everest base camp by bicycle? Arunima Sinha, Bache, Bachendri Pal, Santosh Yadav, and Divya Singh. So it was Divya Singh who has reached the Everest base camp using bicycle. She was the one, Divya Singh. When was PM Mudra Yojana launched, which recently completed 11 years? This particular Yojana, no need to remember the date. They will not ask the date. It was on April 2015. If they want to ask, they can ask you of the ICDS scheme when it was launched. They can ask you one more. There was one more scheme, midday meal scheme. Midday meal scheme when was it launched? They can be asking you, not this. Okay. Next, Mudra Yojana is simply giving funds to the small businesses so that they can further grow. Which High Court has banned the use of AI in the court judgment? Punjab, Haryana, Bombay High Court, Delhi High Court, and the Allahabad High Court. So it was done by the Punjab and Haryana High Court so that it will not affect the judicial integrity. Which state secured the first position in training for the Namo Drone Didi Yojana? Madhya Pradesh, Uttar Pradesh, Karnataka, and Maharashtra. It was Karnataka was the one which secured the first position in training the Namo Drone Didi Yojana, and this particular Yojana promotes the drone usage by women SHG's self-help group in agriculture. SHG in the sense self-help group. Self-help group. Which state has recently been declared as a Naxal-free state? It was Telangana, which recently declared itself as a Naxal-free state. Which country ranked first in world in terms of having maximum wolf population? Maximum wolf population is there in Scandinavian country, that is Sweden. Sweden is the correct answer. Who has become the world first quadriplegic archer champion? Sheetal Devi, Jyoti Baliyan, Pooja Jadyan, and Deepika Kumari. So Sheetal Devi is the one. She been in the first quadriplegic archer champion, and she is the one who has played without any arms. Without any arms, she don't have any arms. Who has become the India's first openly queer member of parliament? Lokesh Ganiyani, Aparna Reddy, Menaka Guruswamy, and Shabnam Mosi. So it was Menaka Guruswamy who has become open queer member of the parliament. Okay. She is recognized internationally for her LGBTQ plus right advocacy, and now she has become a member of parliament. Which anniversary of the WHO's founding was celebrated on April 7, 2026? It was 878. No need to remember. Don't remember this kind of stuff. Now we are going to look at 50 questions of general English. Are you people ready? 50 question, and we have almost 37 minutes in our head. Will be able to do it? Will we be able to do it? 37 minutes and 50 questions. It is our task of speed as well as understanding, right? English is a simple, simply they will be asking. Very first question, filling the blanks. Heavy storm was forecast because unless, see, a heavy storm was forecast, but because unless and the weather was clear, but the weather was clear. It was forecasted, but the weather was clear. Next, the boy dash came to see me this morning had come from Agra. The boy which came to see me, who came to see me, that came to see me, whom. So it was the boy who came to see me. The boy who came to see me this morning had came from Agra. He did a lot of letters yesterday. He had written, he had been writing, he wrote, he has written. Yesterday, past tense, he wrote a lot of letters yesterday. Sahil read the letter dash carefully the second time to ensure he hadn't missed any details. Sahil read the letter much carefully, many carefully, more carefully, most carefully. So he had read the letter more carefully. Right? Very simple. More carefully is the correct answer. Try to place. Try to place the options in the filling the blanks location and you will get the correct answers. Are you looking forward seeing Nikhil's action? Nikhil again, to see Nikhil again, to be seeing Nikhil, or to seeing Nikhil again. Are you looking forward to seeing Nikhil again? Option B is correct answer. Okay, to seeing Nikhil again? Question mark. Spot the grammatical error here. He is the most intelligent and also very talented student of the college. He is the most intelligent and also the very talented student of the college. Which is the mistaken part here? See, the very talented is the wrong wordings. Okay, grammatical error is option C. The very talented is not the correct grammatical framework. So error is the very talented after the most intelligent and also the adjective should be in the same form. So it should be like he is the most intelligent and also the most talented student, not the very talented. So that's why God. Choose the correct spelling here. Very easy. Choose it. Spelling of achieve. A or B, which is the correct answer? B is the correct, right? B is our correct answer. Which sentence is correct? She don't like ice cream. She doesn't 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 like ice cream. She don't like ice creams. So option C is correct answer. She doesn't like ice cream. Option C, where the structure is subject, doesn't, and verb first format. So she don't like ice cream. She is singular, so doesn't should be used instead of don't. So we are using doesn't. And we should be knowing that she doesn't like ice cream. Likes is not used. Likes is not used. We use like the first base verb format, V1 format. Which one is the complete statement or sentence? Running fast, he runs fast. Fast and furious, very smart. Complete statement. Complete sentence in the sense subject plus object plus subject plus verb plus object. That means full statement or full sentence. So option B is correct answer. He runs fast. He is your brother. Which is the correct question tag? Isn't he? Is he? Doesn't he? Won't he? He is your brother. Isn't he? Right? Option A is correct answer. Isn't he is the correct one. Select the correct plural form. Choose the correct plural form of knife. Knives, knives, knife, knives with apostrophe mark. Plural in the sense when there are many knives, then we are telling it as knives or knives, right? Option B is the correct answer. Knives is the correct answer, right? Identify the state sentence with proper subject verb agreement. The boy plays football. The boys play football. The boy play football. The boys playing football. Correct one. The boys plays football. The boys play football. What do you think? Correct subject verb. The base form of the verb will be used. So option B is our correct answer. Option B, the boy play football, is the correct answer. So the boy is a plural. The verb format play will be coming. So option A was correct. The boys play football. Which sentence is a passive? Is in passive voice. They are writing a letter. A letter is written by them. They write letters. They will write a letter. Passive voice. Passive voice from the in the sense from the third person. We are from the third person point of view. We are identifying it. Which one is the correct one? Yes, option B is correct. A letter is written by them. Object will come first, then helping verb, then past participle, by, and then the subject. Identify the error. One of the student is absent. One of the student is. Where is the error? One of the student is correct, incorrect, because it should be students. One of the students is absent. Option C, eliminated. Next, choose the synonym of brave. Forward, timid, courageous, lazy. Synonym, same synonym of the brave. Forward is the antonym. Timid, courageous, and lazy. What do you think? Synonym of brave. Are you brave enough? Are you courageous enough? Option C. Courageous is the one showing the strength. Brave means showing the courage or fearlessness. Coward means a person who lacks the courage. Timid means shy or very fear. And lazy means unwilling to do a work. Transparent means invisible, see-through, solid or dark. Transparent means it is a see-through. And the opposite of transparent will be opaque, right? Choose the correct collective noun. A group of lion, a herd of sheep, a school of wolves, a team of cow. Correct collective noun. Correct collective noun. There is no a group of lion. There is a pride of lion. Herd of sheep is correct answer. School is used for fishes, not wolves. Fishes. Right? And team is generally used for team is not used. Team of people we could say women's. So option B is correct answer. There is a herd of sheep, a pride of lion, pack of wolves, and herd of cows. Again, herd of. A word that sounds like another but has different meaning is called as homonym, synonym, antonym, pronoun. Sounds. It sounds like another but have a different meaning. Meaning is different. If it could have been the synonym one, then the meaning would have been the same. So synonym is not the correct answer. So option A is the correct answer. Homonym is the one which has the same pronunciation or spelling but a different meaning. Bat and bat. One is animal and the another one is used for playing cricket. Choose the correct antonym of fascinating. Clever, uniform, charming, boring. Fascinating. Antonym. Fascinating means very interesting, or very captivating. And opposite of this will be boring. Select the most appropriate synonym of the given word assault. Anxiety, anger, attack, or alibi. Assault. Yes, attack is the correct answer. Anxiety means worry. We know that alibi means evidence that a person was elsewhere when a crime occurred. Okay, when a crime occurred, the person was somewhere else, so it is called as alibi. Change the sentence into passive voice. The boys were playing cricket. Cricket had been played by the boys. Cricket has been played by the boys. Cricket was played by the boys. Cricket was being played by the boys. Passive voice. What will be the correct answer? Cricket was being played by the boys. Option D is correct answer. Very nice. Option D is the correct answer. Select the grammatically correct sentence. He ate the sweet ready. I could not find it anywhere. I haven't got none. He is much weak. Every statement feels very errorful, right? So option B is correct. I could not find it anywhere is the correct grammatical sentence. The rest are wrong. He already passed the examination. The examination was already passed by him. The examination has already been passed by him. The examination has already passed by him. The examination has already been passed by him. Already been passed by him. What is the correct answer? Correct passive form. The examination had already been passed by him. Option B is the correct answer. Subject had past participle of three format and object. A child likes toy. Passive voice you need to form. Toys have liked by a child. Toys liked by a child. Toys are liked by a child. Toys is liked by a child. 24 answer. Option. Option C. Very nice. Toys are liked by a child. Very nice. Correct passive form. I do not use soap. Soap did not used by me. Soap has not been used by me. Soap was not used by me. Soap is not used by me. Choose the correct passive form. A, B, C, D. Correct passive form. Yes, D is correct answer. Soap is not used by me. Subject plus do or does not plus verb first format and object. Open the window. Choose the correct passive form. Let the window be open. Let the window should be open. Let the window open and the window is open. Correct form. A, B, C, D. Which one is the correct one? What do you think? Open the window. Passive format. Let the window be opened. Option A is the correct answer. Yes, A is the correct answer. One word substitution. Person who loves mankind is philanthropist, stingy, egoistic, and detractor. A person who loves mankind. Person who loves mankind. Philanthropist is our correct answer, right? A person who loves humanity and work for the welfare of others is called as philanthropist. Stringy in the sense thin or fibrous, egoistic or self-centered person, and detractor is one who always criticizes others. Choose the correct indirect speech. Do not go there. He said to him, do not go there. He forbade him not to go there. He told him not to go there. He told him to not go there. He told him to go there. Option D is automatically out because it is opposite of what being asked. Option D is eliminated. You have to go for indirect speech. So he forbade him not to go there, not correct. He told him not to go there. Yes, this is correct. Okay, option B is correct. He told him not to go there. Told or order plus object not to and verb. You said to me, you will pass the examination. You told me that I could pass the examination. You told me that he would pass the examination. You told me that you would pass the examination. and you told me that I would pass the examination. Which one is the correct answer from indirect speech? You said me, that means you told me, right? Then the next connecting word is that. You told me that you will pass the examination. That I would pass the examination. Option D here is the correct answer. The D. Indirect speech again. The old woman said, "May you live long." The old woman wished that he might live long. The old woman prayed that he may live long. The old woman wished that he may live long. And the old woman prayed that he might live long. Might live long. Okay. What do you think is the correct answer for this? Option A is correct answer. The old woman wished that he might live long. Wished. The rule is may, subject, and verb. And wished that subject plus might and then the verb. May will change to might. Select the indirect speech again. Rahul said to his mother, what he said. For sometimes I'm going out so that you people can see the questions very directly. Rahul said to his mother, "Can I go out and play now?" Rahul asked to his mother, could he go out and play now? Then Rahul asked his mother that could he go out and play then? Rahul asked his mother if he could go out and play then. Rahul asked his mother if can he go out and play now. Correct answer for this indirect speech been asked. Yes, Nazreen. Very nice. Option C. Rahul asked his mother if he could go out and play then. Next question. The next question here is solemn. Select the most appropriate synonym for this word. Ignorant, serious, ordinary, and furious. Synonym. I solemnly resolve. Have you heard this sentence in political connection? Solemnly is nothing but serious. Option B is correct answer. Again, the next statement. Try to solve it out. Fortunately, the fire did not cause much damage. Fortunately, not much damage is caused by the fire. Fortunately, not much damage was caused by the fire. Fortunately, not much damage was being caused by the fire. Fortunately, not much damage is being caused by the fire. Correct passive form been asked. Correct passive form been asked. Yes, option B is our correct answer. Fortunately, not much damage was caused by the fire. Very nice. Somia. Now, select the most appropriate meaning of the given idiom. Kill two birds with one stone. एक तीर से दो निशान. To try something impossible. To achieve two results with single effort. To be expert shooter. And to plan two murders simultaneously. Very easy, right? Very easy one. Answer it, answer. Yes, to achieve two results with one single effort. Now, select the incorrect spelled word. Pageant, pamphlet, persevere, and portrait. Incorrect spelled word. Pageant is correct. Pamphlet is correct. Persevere is correct. Portrait is incorrect. What is the correct spelling of portrait? Portrait. This is the correct one. Option D. Fill in the blanks with the most appropriate word. Your demands are bound to lead to dash in family, barrier, discord, decrease or absence. It will lead to discord in the family. Discord in the family. Discord in the sense disagreement, conflict, or lack of harmony in the family. Next, select the word which means the same as the group of word given. Central character in the story or a play is hedonist, opportunist, protagonist, and cartoonist. Central character in the story or play is called as the central or the main character, I could say. Yes, the correct answer here is protagonist. Very nice. Protagonist is the main or central character of the story, novel, drama. Select the most appropriate meaning of the given idiom. Make off with, to discover, to transfer, to run away, to understand. Make off with. Make off with. What do you think? Make off with means to run away. To run away. It is means to steal something and escape with it, or to run away carrying something usually unlawfully obtained or illegally obtained. So the thief made off with the jewelries before the police arrived. In the sentence, identify the segment which contain the grammatical error. If a few drops of lemons are put in the milk, it has turned sour. It has turned sour if a few drops of lemon are put in the milk, which is the correct answer or grammatical error. Grammatical error. Yes. Option A is incorrect because it should be it turns sour. Option A is incorrect. It should be it turns sour. Select the word which means the same as the group. Person or animal living on another, successor, pupil, parasite, higher. Living on another, an animal which is living on another animal for the survival, food, or anything is called as parasite. Cockroach is a parasite. Understood? Where I am linking the story to. Cockroach is a parasite. Parasite is the one which depends on another, live inside or onto the another organism for obtaining the nourishment benefit. Right? Next, select the incorrectly spelled word. Delicious, failure, furious, journey. Incorrectly spelled word. Delicious is correct. Correct. Failure is correct. Correct. Furious is correct. Correct. Journey. The word of journey is never written like this. Journey is written like this. Alright. So option D is incorrect. Now, check this out. The principal has said what to whom? The principal had said Mr. Surinder will coach the football team. Select the indirect form of it. Choose the indirect form, which is correct one. Only 8 more questions are left. Only 8 questions. And we are done with this English part for your examination. The principal has said that Mr. Surinder would coach the football team. Incorrect. The principal has said that Mr. Surinder will, yes, coach the football team. Yes, this is correct. Option B is correct. Next, in this statement, what it is written. In the sentence, identify the segment which contained the grammatical error. Mohit did not went to school yesterday as he was unwell, which is the grammatical error. Grammatical error number 1, 2, 3, 4. Option A. Very nice. Because he did not go to school. Went is not the correct one. Next, select the most appropriate antonym of the given word persuade. Induce, pervade, deceive, and impress. Persuade. Correct antonym for this. Persuade in the sense to convince someone. Okay. So the antonym or the opposite one for this will be to dissuade. Option C is our correct answer, which means to discourage or prevent someone from doing something. Tell me the correct passive form for this. Correct passive form. She is teaching French to children. Children were taught French by her. Children are being taught French by her. Children are taught French by her, and children have been taught French by her. Correct one. 45 option. Correct option is yes. Option B is correct. Children are being taught French by her. B is our correct answer. Next, last 5 questions. Select the incorrectly spelled word. 80, 40, 50, 90. Incorrectly. Now this is very, very simple. Which is incorrectly spelled word? 80, 40, 50, 90. Let me see. You people must go to kindergarten again or will go for NIPER examination. Answer it very quickly. Nursery, look at the spellings very carefully. I need everyone to answer this. Everyone to answer this. 90 is correctly written. How you are writing 90 then? 90 is correctly written. This is right. We write like this only. Yes. Option B is correct answer. 40 is written like this. Not you. Option B is incorrect. Yeah, correct. Select the most appropriate meaning of the given idiom. Cut and dried. Already decided. Badly hurt. Dead and gone. Very old. Cut and dried. You cut it. Now things are against your will because something has already been decided, settled. So cut and dried means something has been already decided. Option A is correct answer. Refers to something that has been already decided, settled, arranged in advance. Dead and gone means no longer alive. Very old means refer to the age. Select the most appropriate antonym. Malice, goodwill, hypocrisy, humility, and truth. Most appropriate antonym. Most appropriate antonym. Option yes, A is our correct answer. Goodwill. Antonym. Malice is in the sense what ill will or hatred or desire to harm someone, and antonym will be the goodwill. Right? Hypocrisy in the sense pretending to have a virtues or belief one does not possess. Humility means modesty and lack of arrogance. Truth means honesty or factual correctness. Next, select the incorrectly spelled word. Incorrectly spelled word. Correspond, colleague, commission, committee. Second last question of the series today for from English part. Yes. Which one is incorrectly spelled? Colleague is correct, right? Colleague is correct. What happened? Colleague is correct. Commission is correct. Committee is correct. Double M, double T, double E. Double M, double S, and double I also. Correspond is incorrect. Correspond is generally written as this way. Double R and single S, not double S. Right? So correspond, which means to communicate by letters, emails, or be in agreement with something. Option wise, colleague means commission and committee are all correct. Sometimes, now see, in NIPER examination, C and D could be the most appropriate one which they will be asking. So please make sure you remember how commission is written, how committee is written. Commission is written by double M, I, double S. Okay, double M, I, double S, and then I. And committee is double M, I, double T, and double P. Both of them are very important. You must know both of them. Last question. The speaker dashed the audience with his fine speech, depressed the audience, expressed the audience, suppressed the audience, and impressed the audience. Yes, the speaker. What speaker did? Yes, the speaker impressed the audience with his speech. Impress means to make someone feel admire, to feel admiration, respect, or appreciation. The speaker impressed the audience with his fine speeches. Depress means sad or unhappy. Express means to communicate the thought. Suppress means to restrain from doing something. Okay. So this was about our English and the GKGS part. Don't be afraid of the examination. A general tip from my side for you guys is that you should focus more on pharma first. Like make pharma part as your king, your defense part, your shield for the NIPER examination is your pharma part. If your pharma part is done very nice, very good, then your non-pharma will not be able to do anything because you just need to solve only those questions. Suppose there are 80 questions. Try to focus on certain 50 questions which are doable. We don't have to do every question, right? You can skip 30 questions. 30 question or more. If your pharma part is very good and done, and you have seen that you have solved it very nicely, then you don't have to take stress from the non-pharma part. Okay? Make sure your strength, you have made your strength your pharma part. Your pharma part is your shield, and this shield will be supported by the non-pharma part. So, non-pharma part is a supporter. Yes, non-pharma part is also important, but you need to make your pharma part the core king of your examination. Understood? Okay. Thank you so much. The next teacher will be joining very soon. Right now, Sutix is your part. The next part is the Sutix.
Okay, good evening students. I hope screen is visible to all of you and my voice is clear. Okay, very good evening. So as you know that we have started a series since morning you are attending that, and the subject that we are going to discuss next is about the pharmaceutical technology, and I hope you all are ready for that. So now we are going to start with pharmaceutical technology. I hope that your preparations are going really well, and this series will be add on to your preparation to make sure that your preparation will go to another level. So please make sure that you attend all the MCQs of all the subject, because we are going to see along with the explanation. And I hope that you will get more and more MCQ practice in this pharmaceutical technology topic as well. So let's get started with the very first question from the technology. Chalo. XRPD stands for, option A is X-ray powder diffraction, option B is X-ray phase detection, option C is X-ray particle determination, or option D X-ray polar diffusion. What should be the answer? And since you know this is a revision kind of thing, so I hope everyone is aware of most of the MCQ through the theory, through the whatever MCQs we have seen, right? So I'm expecting that you will answer this question. If you get stuck, definitely we are going to discuss on that, okay? Chalo, X-ray powder diffraction, very good. Option A is the right answer. This is a technique. So whenever a crystalline substance is there, the X-rays will fall on the crystalline substance and you will get a certain diffraction pattern. Remember, X-ray powder diffraction, that is also useful technique to determine or to distinguish between your crystalline and amorphous substance. I hope you remember this. Can you tell me the another techniques also? One is XRD, next is the DSC. So these are various techniques that will also help you to understand or to distinguish between your crystalline and the amorphous substance. So a very good option is the right answer. Next question. Hot stage microscopy is classified as which type of technique? Hot stage microscopy is classified as which type of technique? Option A is chromatographic technique, option B is fusion technique, option C is spectroscopic technique, or option D is filtration technique. Which technique is that? Basically, you should know what exactly happens in the hot stage microscopy. Based on the principle of HSM only, we are going to solve this question. Which technique is it? Very good. It is a fusion technique. What do you mean by fusion? Fusion is nothing but the melting. Fusion is nothing but the melting. Approximately, say 1 mg of the sample you will keep under the microscope. The fusion will happen, and that is the reason this is also known as hot stage microscopy. Okay, it is a melting, right? So it is a fusion technique. Option B is the right answer. Very good. It is not a chromatographic technique. Remember, chromatographic technique is to identify the sample which is present or identify the molecule which is present, right? So for chromatographic technique, we have HPLC, we have gas chromatography, we have LCMS, spectroscopic, you know, FTIR and all. Filtration technique, it is not a filtration technique, right? So it is a fusion technique. Very good, option B is the right answer. Next question is, which of the following represents the solubility order from highest to lowest? Which of the following represents the solubility? Remember, solubility and stability will be opposite. Crystalline, amorphous and metastable, right? You know, crystalline form is the most stable. If something which is more stable, it is not ready to form a bond with the solvent molecule, and that is the reason the solubility will be less. Now, based on this technique, you tell me that which of the following will have higher solubility and which of the following will have lower solubility. Okay, B. Let's see. Now you know that, as I told you, which one will be lesser stable, amorphous, right? If we talk about the stability, amorphous one will be least stable, followed by metastable and then crystalline. Whereas if we talk about the solubility, the amorphous state will have higher solubility, then followed by metastable and stable. The name itself suggests that it is in the stable form. It will have the least solubility. Very good. Amorphous form will have the more solubility. Remember, the melting point will be opposite. That crystalline will have a sharp broader melting point. Remember, there are some crucial points regarding crystalline amorphous, so that also you remember. Okay, very good. Option B is the right answer. So next question is, I don't know, is it visible here? I'll read it out. Okay, a crystalline powder that contains water of crystallization or hydration. See, the question is easy, but they have given you so much detail. But you should read that carefully. Okay, this water can be liberated. This word is important. This water can be liberated either during manipulation or an exposure to a low humidity environment. Then the powder will become sticky and pasty, or it may even liquefy. Such a powder is called as eutectate, hygroscopic, deliquescent, or efflorescent. Very good. Efflorescent is the right answer. Why it is not eutectic? Because eutectic is when you mix two ingredients, there is lowering in their melting point. When you mix two ingredients, the melting point is lower, and that is the reason it gets melted. But there is no liberation of the water in case of eutectic mixture. Hygroscopic and deliquescent are absorption of the moisture. Now depend. If it is absorbing to certain extent, we call it as hygroscopic, slightly hygroscopic or very hygroscopic. But if it is absorbing to such an extent that it may liquefy, after absorbing it is getting liquefied, then we call it as deliquescent material. This you remember, okay? LIQ. And efflorescent is the liberation. That is the reason I told you, remember the word. So this is nothing but the liberation of the water molecule. Okay, liberation of the water molecule. That is nothing but efflorescent. Chalo, very good. Option D is the right answer. And I hope you understood why not the earlier one. Okay. Okay, so the next question is, according to IP, which of the following can be used as co-solvent? According to IP, which of the following is used as co-solvent? Option A is acetone, option B is water, option C is glycerine, option D is benzoic acid. Now, first of all, what do you mean by co-solvent? If your drug is insoluble in water, right, you will use one co-solvent in which your drug will be soluble, and this co-solvent should also be miscible with the water. So which of the following co-solvents you will be using? Yes, very good. We are using glycerine, right? Not acetone. Water itself is a solvent and not the benzoic acid, right? So a solvent which will be miscible along with the water that will enhance the solubility of the drug is glycerine. Very good. Option C, glycerine is the right answer. So next question is, microscopy is suitable for measuring the particle size in which range? 50 to 1500 micrometer, 0.2 to 100 micrometer, 0.5 to 500, or 1 to 200 micrometer. Very good. Option B is the right answer. That is microscopy. We are measuring from 0.2 to 100 micrometer in that range. Obviously, if it is a sieving, because that is a mechanical shaker, so you can go up to higher particle size. Okay. Very good. Next question is, surface area determination by the adsorption method measures. There are various methods, right? Air permeability and all. So that measures what is the surface area of that particular powder. Option is rate of gas flow. Option is volume of nitrogen adsorbed to form a monolayer, density of a powder, or solubility of a powder. Say for example, this is a irregular any kind of particle. So what we are doing is we are passing a nitrogen being the inert one, and it will form a monolayer. That monolayer, because it is a single layer, that monolayer will tell you how much volume of nitrogen is required. That is proportional to the surface area of that powder or surface area of that particle, right? Surface area of the particle. So what should be your answer? Chalo, very good. Option B is the right answer. The next question is, if drug has partition coefficient of less than 1, the drug will be hydrophilic, polar, both A and B, or lipophilic. So how do you measure the partition coefficient? We measure using the log P value. We measure using the log P value. And what are the solvents that we are using in this one? As a part of organic layer, we are using octanol, right? And as a part of aqueous layer, obviously we are using water. We are using which method? Shake flask method. Remember, the methods are important. We are using shake flask method, right? Okay, I'll try to stay here. Okay. So we are using shake flask method, right? So we are using octanol and we are using water. Octanol we are using as organic layer and water as a aqueous layer. You have to take the amount of the drug and shake it. Now, depending if drug is lipophilic, it will go into the octanol layer. If it is hydrophilic, it will go into the aqueous layer, right? And then we are checking the concentration in the organic and in the aqueous layer, right? That means your water layer. What should be the answer now? We cannot say it as a polar. Log P will only tell you about whether it is hydrophilic or whether it is lipophilic, right? See, this is the ratio. If the ratio is higher, that means more concentration is going into your organic layer and it is lipophilic. If it is lesser as in less than 1, then it is hydrophilic. It won't be polar. See, log P will not tell you whether it is polar or non-polar. Okay, that is your Henderson-Hasselbalch equation, unionized, ionized form. But log P will tell you, or the partition coefficient will tell you about whether it is hydrophilic or whether it is lipophilic. Okay. So that is the reason it is hydrophilic. Okay, remember it is hydrophilic in nature. So next question is, higher bloom gelatins are generally required for. Option A is soft gelatin capsule only, small capsule, large capsule, or enteric coated capsule only. Minims is nothing but it is a unit for volume. Okay, it is a unit for volume. Now see, higher bloom strength. What do you mean by bloom strength? You know there is a procedure is there that the plunger should pass through the 4 inches diameter. It should go 4 mm deep, right? 0.5 inches in a diameter and 4 mm deep. So that is the reason higher blooms are required, because see, volume is more for the large capsule. If volume is more, the strength of the gelatin should be higher. You cannot use the gelatin, the raw gelatin, which is having a lesser bloom strength. Okay. So that it won't be soft gelatin only. Okay, it is a large capsule. Okay, it is a large capsule. So remember that the cost of gelatin, it is directly proportional to the bloom strength, and we are using it for the large capsules. Okay, we are using it for the large capsules over 15 minutes. Minims is the unit for the volume. Okay, please remember, whoever thinks that earlier question is there, remember it is for the large capsule. Okay. Next question is, bloom strength is related to cohesive strength of cross-linking that occurs between gelatin molecule. Higher the bloom strength, more is the capsule stability. Cost of gelatin is proportional to bloom strength, or all of the above. Remember, what is bloom strength? As I told you earlier that bloom strength is nothing but you are taking the weight in grams, and you are adding it, so that the plastic plunger, which is 0.5 inches in diameter, it will go 4 mm deep inside what? Inside the gelatin, okay, which is held at 10 degrees Celsius for 17 hours, right? Higher the gelatin, higher the cross linking, higher will be the bloom strength, right? So definitely the cohesive strength. What do you mean by cohesive strength? Cohesive strength is nothing but the whatever your force of attraction is there between gelatin molecule, that is nothing but the cohesive strength. Higher the cross linking, higher will be the higher will be the cross-linking between the gelatin molecule, and more force, more weight, more Bloom strength is required. So option A is there. Higher the Bloom, more is the capsule stability. Yes, definitely. Because if strength is higher, the capsule will have good stability. Cost of gelatin, of course, if you want a stable gelatin, the cost also increases. So option D, all of this is the right answer. Okay. Chalo, very good. Option D is the right answer. Next question is, which one of the following is not considered a modified release capsule? Now remember, this word modified can be in any of the terminologies. Okay. So read the question and then let me know what is your answer. Which one of the following is not considered? Okay, not considered. First is delayed release capsule. Now, whether it is a capsule, whether it is a tablet, delayed release is a type of modified release, right? Delayed, it can be in terms of time, it can be in terms of location. Say, for example, instead of releasing the contents in the stomach, if you are releasing into the intestine, that also becomes the delayed release. Enteric coated is a type of delayed release only, right? Because it is releasing instead of in the stomach, it is releasing into the intestine. Sustained release, obviously, instead of immediate release, if you are getting a constant concentration, then we call it as sustained release. Very good. Soft gelatin capsule, option D is the right answer. That is not a modified release. Okay, that does not comes under your modified release capsule. Option D is the right answer. Okay. So next question is, migration of which metal from the gelatin is responsible for the formation of dark spot in the capsule shell? Migration of which metal here? Now, if you remember, there are three important specifications of the gelatin. First, we have seen the Bloom strength. Second is the viscosity. And third is the related to the metal which is present. Okay, so this metal is generally present as a raw, in the raw gelatin, this metal is present, and that is the reason there is a limit for this particular metal also. Option is chromium, iron, manganese, or cobalt. Very good. Option B is the right answer. This is the iron, right? So remember, iron is always present as impurity, as a metal impurities in the raw gelatin, and that is the reason before proceeding further, we take whatever your raw gelatin is there, you have to first check the limit of this iron content. Can you tell me what is the limit, acceptable limit of the iron content? So the acceptable limit is 15 ppm. Okay, 15 parts per million. Okay, so that is the limit for the iron content in the gelatin. Because it will have, if the iron content is more, it will react, and that is the reason you have to make sure that it is present within that limit. Okay. So next question is, which alcohol is used in soft gelatin capsule formulation depending on concentration and packaging condition? Which alcohol is used? Methanol, ethanol, isopropyl alcohol, or butanol? Very good. Depending upon that, we are using isopropyl alcohol. So on the concentration and the various conditions also. Remember, apart from IPA, we can also use propylene glycol. Okay. Very good. Option C is the right answer. Next question. Chalo, next is, what is the commonly used lubricant in filling capsule? Lubricant. If it is a capsule, you know that we are filling various materials in the capsule as well. Which is the filling material in the capsule? Option A is glycerin, option B is methyl paraben and propyl paraben, option C is magnesium stearate, option D is titanium dioxide. What is the use of glycerin in the soft gelatin capsule or the hard gelatin capsule? See, glycerin act as a plasticizer. We know that it gives required flexibility to the capsule. It is not used as a lubricant, right? Methyl paraben and propyl paraben. What is the use of methyl and propyl paraben? They are your preservatives. Remember, the concentration is 4:1. Magnesium stearate, yes, very good. Option C, lubricant is the right answer. And titanium dioxide is your opacifier, okay? So this is opacifier, this is preservative, and this is your plasticizer. Remember, glycerin, apart from that you have sorbitol, propylene glycol, PEG. Very good. Plasticizer, so they are asking lubricant. Option C is the right answer. Very good. Option C. And that too, if you are filling powders into that, then we are using lubricant. Edible oil is used for lubricant, shining agent, anti-dusting compound, none of these. For what purpose we are using edible oil? Lubricant, shining agent, anti-dusting compound, or none of this? See, very good anti-dusting compound, because you are going to fill some powder material into hard gelatin capsule, right? There are chances that some powder may stick onto the capsule, and that is the reason anti-dusting compound we are using edible oil. It will prevent any kind of material from sticking onto the capsule shell. Very good. Option C, anti-dusting is the right answer. Chalo, next question. Already discussed, but still, the iron content present in the gelatin for the manufacturing of soft gelatin capsule shell should be how much? They are asking the limit. Option A is 50 ppm, 15, 20, or 25 ppm. Very good. Option B is the right answer. That is 15 ppm. A straightforward question. Remember, this little bit numerical values are very, very important. Okay. Option B, 15 ppm is the right answer. And also remember that which of the following metal is present, that is iron. And remember, they may ask you which of the following is a specification of gelatin, which of the following is not a specification of gelatin, such questions. Okay. So three important, as I told you, bloom strength, viscosity, and iron content. Apart from that, nothing, solubility and all will not come under the specifications of the gelatin. Okay. Chalo, next question is, which of the following works on the principle of vibration in the capsule? Hofliger and Karg, Osaka, Perry, and Zanassi. Very good. Option B, Osaka is the right answer. That works on the principle of vibration. See, all are bulk powder, that is Hofliger and Karg, Perry, Pharmatic, and Macopar. Osaka, we know that it works on the principle of vibration. Park Davis and Lilly work for pelletized or granular material. Zanassi, as I told you, it is the last alphabet in A to Z. So remember, it is used for filling almost all types of materials like powder, pellet, granules, and tablet. And MG2, it is continuous motion filling of a powder. I told you as a trick also, like 𝑚g_Hector, the car, that you can remember. Okay. Chalo. Very good. Next question is, the moisture content of a capsule shell, this is shell, is determined by IR spectroscopy, Tolman distillation method, 𝘎𝙀𝙎𝙎 machine, or Erwica Kia. This is also Kia actually. You know, this is a de-dusting and polishing machine. Last time again I gave the trick that there is a car brand which is known as Kia. So you are de-dusting and polishing the Kia car. So that is your de-dusting and polishing, right? But here they are asking moisture content. So this is not there. 𝘎𝙀𝙎 is a filling machine. IR spectroscopy is not there. Tolman distillation. Very good. Option B is the right answer. Very good. 468, option B is the right answer. Okay. If you feel you need explanation for any question, then do let me know. Okay. Like as in more explanation. During direct compression, tablets split into layers after ejection from the die. Which corrective measure is most appropriate? Now they are not asking you the terminology for that particular defect. They are asking what is the remedy for that. Okay. Option A is increase the coloring agent, use a forced feeder to reduce air entrapment, increase the polishing time, or reduce tablet diameter. See, first of all, if your tablet is removed as a layer, if they use the word layer, as I told you earlier, remember L for layers, L for lamination. That means the defect that is happening here is layers. And that happens when your air is getting entrapped. The capping also happens because of that reason. Okay. Increase coloring agent. This is not the defect related to the coloring agent. Option A will not be there. Option B is use a force feeder to reduce the air entrapment. Yes, because if the tablet is been removed as a layers, you have to go for the force feeder to remove the entrapped air. Very good, option B is the right answer. Increasing polishing time, nothing. That won't help you in the layers. Reduce tablet diameter, no. Option B, very good. Option B is the right answer. Next question is the segregation of a tablet into two or more distinct layers is termed as capping, lamination, chipping, or cracking. So as we have discussed earlier, capping means if something is been removed as a cap or crown, then we call it as capping. Remember L for lamination and L for layers, right? Option B is the right answer. Cracking means if you see a certain cracks in the tablet, that is cracking. Chipping means some part is been removed from the edges. If they use the word edges, then you go for the chipping. Very good. Option B, lamination is the right answer. Very good. So next question is, and I hope everyone knows all the defects. Okay, please go through it. They are very important. The dwell time in tablet compression refers to time required for granulation, time during which punches remain under the maximum compression force, time for ejection of tablet, time for coating. See, dwell time means, say for example, this is your upper punch, this is your lower punch. It will be like this. They will come like this, like this. A compression will happen and then it will remove. So it will look somewhat like this. The path will look like this, right? So during this time, your upper punch and lower punch are in contact with each other, right? It is rotating, right, at certain RPM. Your upper punch and lower punch, it will come like this. It will compress the tablet, whatever is present in the die, compress the material, and then it will go. So the path, this time at which it is in the maximum compression force, that is nothing but your dwell time. That is nothing but your dwell time. Very good, option B is the right answer. It is the time during which punches remain under maximum compression force, this time. And at that time only maximum compression happens and you get the tablet, right? Very good, option B is the right answer. So next is, in a tablet compression machine, the shape and the diameter of the tablet are determined by shape and the diameter, punch, hopper, die, or cam track. What the punches will do, the work of the punch is to compress the material into a tablet. Hopper from where your feed material will come. Hopper is nothing but from where your feed material will come, right? So that is not going to decide what will be the tablet shape and all, right? Cam track will guide the movement of the punches, right? It is rotating at certain RPM. So cam track will guide the movement of the punches. Dies and the die cavity is there, right? Now depending, it is a circular with a cavity. It can be circular, your die cavity can be round, it can be oblong, oval, any kind of thing, right? So that is the reason dies will decide what will be the tablet shape and what will be the size, right? Option C, very good. Option C is the right answer. Chalo, next question is, which of the following tablet coating methods allow the display of break lines on the tablet? You might have seen a tablet like this. A break line will be there. Sometimes it is useful to divide the tablet into two halves, if at all it is required. Okay. Option A is sugar coating. Option B is film coating. Option C is sugar and film coating, and none of these. What should be the answer? Very good. Option B is the right answer. Remember, sugar coating, if you know the steps for the sugar coating, you know that sugar coating is meant to clear all the imperfections which are there in the tablet on the surface of the tablet. It increases the weight of the tablet and it gives the smooth texture rather than giving the break lines. So break lines will be there only in the film coating. Why we do film coating? That is also important. Film coating is done to prevent if your drug is sensitive to the oxygen, atmospheric oxygen, if your drug is sensitive towards your moisture also, at that time you can give the film coating. Okay, it is not enteric, it is a film coating. So very good, option B, film coating is the right answer. Sugar coating is definitely not there. Okay, so the break lines which are there, see, it forms a thin transparent layer over the tablet, and because it is very thin, the break line remains visible, right? But even if sugar coating, if you even keep the break lines, during the process of coating, the break lines will not be visible. And that, because it forms a very thick layer, because it is a syrup, right? And it forms the thick layer. Very good option, that film coating is the right answer. Chalo, next is, if the Car's index of a powder is 10%, then the type of powder flow is. There are three measures to see the flow properties of the powder, right? First is Car's index, second is Hausner's ratio, and third is angle of repose. Always remember, in all the three cases, lesser the value, better is the flow. That means in all the three cases, you should have lesser Car's index, you should have lesser Hausner's ratio, you should have lesser angle of repose. Very good. Now it is 10%. If Car's index is 10%, you will be having excellent flow. As you increase, then from excellent, it will go very good, good, poor, maybe fairly passable, and so on. Lesser the value, be it your Car's index, be it your Hausner's ratio or angle of repose, lesser the value, better is the flow. Okay. Chalo, very good. Excellent is the right answer, and you guys are excellent. Chalo, next question is, for tablets made by direct compression, powder filled capsule, the dissolution apparatus mostly preferred is. You have various dissolution apparatus. Their applications are important. You should know which is type 1, type 2, and all. Okay. Chalo, next is, options are paddle apparatus, basket, paddle over disc, or reciprocating holder. Here they are not asking any complicated thing. It is just that a direct compression. What should be the answer? Chalo, very good option A, paddle apparatus is the right answer. Okay. Remember, paddle over disc. This is type 5. I already told you. This V is there. It is like a Roman. Remember, paddle over disc. That is for the transdermal drug delivery system. Whereas your paddle and basket, type 1, type 2 is for the simple one. Okay. Next question is, you remember, please remember all the types, okay? What is type 1, 2? Flow through cell, FF, remember, F for 4, F for flow through cell. So next is plating of punch faces is done using chromium, zinc, iron, none of this. So to make it more smooth so that your tablet will not have any kind of problem during compression. So what we use as a plating of punch faces? Or which material is used? Very good. Chromium is the right answer. Earlier also we have seen chromium we are using to make sure that the punch faces are plain. Next is diclofenac tablet coated with cellulose acetate phthalate administered to a patient will release the drug. Remember, they have given you as a thing that okay, this is the drug. That drug has nothing to do with the release until and unless you use specific polymers. Okay, so here you have to focus on what kind of polymers they have used. So what is your answer? I am on question number 477 and still I can see the comment still 474. Like, is it lagging? Chalo, no, okay. Yes, you know all the types of phthalates, cellulose acetate phthalate. Remember, phthalates will release, they are enteric coated polymer, okay? Sometimes very easy question, identify the enteric polymer, non-enteric polymer, like this also questions may come. Do not get confused. No, it will not release in the stomach, okay? Remember, cellulose acetate phthalate, they are your enteric polymers. Enteric polymers means something which will prevent the drug from releasing into the stomach, but it will release into the small intestine. And why it happens? Because the solubility of these kinds of polymers are pH dependent. It will not release into the stomach pH, it will release into the intestinal pH. Okay, please. Okay. Sure. Option C, whoever got confused, and it's okay to get confused at this stage. Like now, it's fine. But out of this all 100 questions that we are seeing for technology, you make it a list. Okay, this is something I have to revise. This is something I have to revise. Okay, so a quick revision will be there. Okay. Option C, small intestine is the right answer. Very good. Chalo. Next is, how you got this question? Anyways, chalo. The uneven distribution of the color on the surface of the tablet is known as, you know, only one defect is there related to the color. What is that defect? Picking. Picking is a tablet has been removed and pick a small part of the tablet. So obviously picking is not there. What is lamination? Lamination, as I told you, remember L for lamination, L for layers. So lamination is not there. Chipping is about the edges. If they use the word edges, then that is nothing but chipping, right? So option B is the right answer. Very good. Only one defect related to tablet. I am not talking about the coating defects. I'm talking only about the tablet defects. Option B, very good, is the right answer. Okay. Chalo, next is in the materials where the fracture occurs across the grain, a stronger tablet will be formed from. You have small granules and you are having larger granules. This is a tablet and this is a compact tablet. Basically, just imagine your flocculated and deflocculated suspension. So they are asking a stronger tablet will be formed from. If you remember, if you have attended the classes of flocculated and deflocculated, what do you think? Same phenomena here also, there also, right? Here they are talking about the smaller grains or the granules. There it was the particle size of the deflocculated suspension. You know, deflocculated suspensions, they forms the hard cake, right? So ultimately, if your granules or if your particle size is less, that is going to form something harder tablet if we talk in this context, and your suspension will form the hard cake if we talk in the suspension context. Okay, remember, smaller granules will form the stronger tablet. If you get confused, remember S for smaller, S for stronger, right? Very good. Option A is the right answer. Remember, larger granules, they will form a weaker tablet because they have so much of interparticular space, and that will form the weaker tablet. Same goes for deflocculated. There is a space, and that is the reason it is easy to break. Remember, okay? Option B is the right answer. Option A is the right answer. Smaller granules. Larger granules will give you the weaker tablets. Very good. Next question. Which of the following is not directly compressible? I told you on the first day of the class to make a list which is compressible, directly compressible, and which is not. The same thing I have passed through juniors also because of such questions. See, it is like pictorial. Even if you directly don't remember, at least if you have made the list, you will understand. Okay, this was on the left side, this was on the right side, and it is easy to remember. Okay. Mannitol, lactitol, dextrose, or xylitol. Very good. See, remember, all the mannitol, lactitol, and xylitol are directly compressible, but dextrose is not directly compressible. Very good. Option C is the right answer. Remember, there are certain important things also regarding mannitol, because I don't think so we'll have that question, but we'll revise the things also. What is the important things regarding mannitol? Remember, which letter is repeated here? Letter N, right? So N for non-hygroscopic. It is non-hygroscopic. It is non-carcinogenic. It is having negative Hettos solution. That means it will give you the cooling effect, and that is the reason it is used in the chewable tablets. Important things regarding mannitol. Okay. Next question is, monophasic liquid dosage forms that are prepared for cutaneous applications include, remember, you just do not have to identify monophasic, you also have to see which of them are used for the cutaneous application. Option A is elixirs and collodions, linctors and liniments, collodions and liniments, or elixirs and douches. C, very good. Option C is the right answer, collodions and liniments. What about elixirs? Elixirs are meant for the oral dosage form, not for the cutaneous application. Linctors are also for the oral one, not for the cutaneous, and elixirs again. So option C is the right answer, collodions and the liniments. Liniments are something which should be applied with friction, that means with rubbing action. Chalo, next question is, in the preparation of calamine lotion, sodium citrate is used as suspending agent, solubilizer, buffering agent, or bacteriostatic. Suspending agent, solubilizer, buffering agent, or bacteriostatic. Very good. Option C, buffering agent. It is not a suspending agent. For the suspending agent, we are using certain kind of polymers and all. Solubilizer, if it is a solubility enhancing agent, we are using bacteriostatics are preservatives, so it is a buffering agent. Sodium citrate, citric acid, tartaric acid, all the weak acids are your buffers. Okay, not only weak acid, weak base also are the buffers. Okay. Chalo, next is the sugar content in the simple syrup IPEs. Chalo, come on. Sodium citrate was earlier. Okay, fine. Chalo, next is sugar content in the simple syrup IPEs. How much percentage? 66.67% weight by weight. Remember, in the syrup, according to IP, according to USP, depending upon weight by volume, they both differ. Okay. So 66.67% weight by weight, 66.67% weight by volume, 85% weight by weight, or 85% weight by volume. Why B? Do you think why it is B? Acha, for earlier. It is A. Okay, remember, according to IP and according to USP. According to IP, it is less. How to remember? The currency of USP is greater, right, as compared to Indian currency. Remember, so this is 85% and this is 66.67%. Now, two sixes are present. Actually, three are there, but this initially two sixes are there. So remember, it is weight by weight. Two W's are there. And if it is 85, then it is 85% weight by volume. So this is right. This is weight by volume is not correct. This is weight by weight is not correct. This is correct, but this is according to USP. And this is here they are asking according to IP. Sure, very good option is the right answer. Next question. Aromatic waters are unsaturated solution of volatile oil in water, saturated solution of volatile, non-volatile oil in water, or saturated solution of volatile oil in water. None of these. What is your answer? What are aromatic waters? As the name suggests, aromatic as in we are using volatile oils and it is a saturated solution, right? Whatever is the solubility, that much we are using, right? So it is a saturated solution of volatile oil in water. Very good option. C is the right answer. Next is, which of the following is a soft viscous preparation for external use applied to skin when they are hot? Cataplasm, paste, collodions, or gel? Remember, option A is the right answer. Cataplasm is the right answer. Paste, collodions, gels, they are not applying when they are hot, right? So that is the reason. And also, the alternative name is 𝘾𝙀𝙎𝑎𝑠𝑒𝑙ls, right? Option A is the right answer. Chalo, very good. Option A is the right answer. Are you guys tired attending the series since morning? Or you are enjoying? I hope you are gaining more knowledge, you are able to relate what you have studied in the theory, and then what are the questions where you are getting confused and solving the question. This is my personal experience as well, that only doing theory is not sufficient until and unless you solve the questions, right? So I hope that collodions means, collodions are nothing but it is the, what do you say, it is a preparation for the skin, but it contains some of the polymers like nitrocellulose. So collodions are something, three are there: lotion, liniments, and collodions. Lotion and liniment should be applied to the unbroken skin, I mean to intact skin. But collodions are meant for healing purpose. So there is a small cut or something is there, then you can apply collodions so that whatever the breakage was there or whatever small cuts will be there, that will be healed because of the polymers, and it contains organic solvents like ether and all. Okay, so collodions are the preparation of nitrocellulose into the organic solvents like ether and all. Understood? What is phenol? Acha, next question. Wait. Chalo. Next is preparation for oral uses does not contain sorbitol, glucose, phenol, glycerol. We know sorbitol we are using, glucose we are using, glycerol, but phenol is not meant for the oral purpose. Option C is the right answer. Very good. You know glycerin and all coloring agent. Okay, fine. Chalo. Next is fluted bottles are used to pack syrup, ointments, linctors, or mouthwashes. Fluted bottles, I mean, you might have seen if there is certain kind of grooves or ridges. Like here are some ridges you can see on this bottles. Like that, a grooves or the ridges will be there on the bottles instead of plain bottle. The only reason is to make sure that by touching the water you can identify. Okay, so that is to differentiate between the waters. Okay, so they are used to pack the lincters because they are the viscous preparations. So here you can see these kinds of regions are there, or the grooves we call it as, so that if you, even if you touch, you can take it. Okay, not siraba, it is for the lincters. Remember, it is for the relief of the curve. Next is slightly soluble compound. As per IP specification, solubility is very important table. All the time we have discussed this, right? 1 part in 10 to 30 parts of solvent, 1 part in 30 to 100 parts of the solvent, 1 part. This 1 part is of the solute. Okay, 1 part in 100 to 1000 parts of the solvent, or 1 part in 1 to 10 parts of the solvent. Very good. Option C is the right answer. That is 1 part in 100 to 1000 parts. Okay. If it is less than 1, very soluble. 1 to 10, freely. 10 to 30, soluble. 30 to 100, sparingly soluble. 100 to 1000, slightly. 1000. At least just remember this series, and this is easy. A descriptive term is very freely. Students sip vanilla passionately. So that trick is easy to remember. S for sparingly and slightly. Okay. The only thing is that this series you remember. Less than 1, then 1 to 10, 10 to 30, 30 to 100, 100 to 1000, and more than 10,000. Okay. So the next is, what is liniment? Liquid medicament applied with friction on the affected area. Liquid medicament applied as a paint. Liquid medicament as enema. Liquid medicament given orally. Basically, it is a liquid medicament. At least from the options, it is clear. What is ads? Ad is coming in between. Yeah, hello, good evening, all of you. Achha, some have joined now. Chalo. As I told you, there are three out there: collodions, liniment, and lotion. Collodions are applied on the affected area like small cuts and all. Liniment lotion on the unbroken skin, affected as in unbroken skin. The only thing is that it should be applied with friction, whereas lotions should be applied without friction. If at all you get confused, remember the letter O. Without, and lotion contains letter O. Liniment does not contain letter O, and liniment is applied with friction. So if without is there, that means it is a lotion. If liniment is there, that is with friction. Okay. Enema is not there. It is not orally. It is not a paint. Paint as in throat paint, not your color paint. Okay. Very good. Lotion without friction. Chalo, option A is the right answer. Next question is, which of the following glass containers can be used to protect against IR rays? Amber colored, yellow colored, green colored, or transparent? Very easy question. Which of the following glass containers can be used to protect against IR rays? Very good. Amber colored bottles we are using to protect from the IR rays, and that is the reason you might have seen, right? So amber color protecting drugs from harmful radiation. Yellow, that is a partial light filtration. Okay, not a complete protection. It won't give you that much protection. Green color also mild protection, filters some visible light, and used in beverages more than medicine. You might have seen this type of green color bottles. And transparent, so they will not at all protect your drug from the light. Okay. So next is, which forming method is used for the production of hollow glasses? Blowing, drawing, pressing, or casting? These are the methods of glasses only. They are asking for the hollow glasses. Blowing, drawing, pressing, or casting. Which method is used? Yes, very good option A, blowing is the right answer. We are using for the preparation of the hollow glasses. Next is which is used as protective layer for steel. That is a plating is given, right? Which metal we are using? Option A is chromium, aluminium. Amber color vials also you can use. It depends. Vials are for like placing tablets or granules. If it is a bottle, if it is a suspension solution, then going for a bottle. Amber color vials are also there. Yes, that is also there. Chalo, which is used as a protective layer for steel? Chromium, aluminium, boron or iron? Very good. Option A, chromium is the right answer, 492. So remember, chromium is mostly used as a protective layer. Here also we have seen as a protective layer to a steel. In the punches, plating of the punches also we have seen chromium is used. Okay. Let's see if anything. If chromium is used to provide corrosion protection, the resulting material is called as electrolytic chromium coated steel or tin free steel. Remember this question, these things also. Is it visible? So if you are using chromium, then it is known as electrolytic chromium coated steel or tin free steel. ECCS has better heat resistance than tin plated and it is less expensive. Chalo, next question is which chemical indicator is used for the gaseous sterilization? You know there are chemical indicators, there are biological indicators which shows that this method is how much efficient, right? So 𝘂𝙎𝙎𝙎𝙄𝙊𝙎𝙎, dosimeters, Bovidic heat sensitive tapes or stripe papers. Very good option A, 𝘂𝙎𝙎𝙎 is the right answer. That is for the gaseous sterilization. For dry heat, bronze tube is there, moist heat, stripe papers are there, radiation, dosimeters and filtration, bubble point test. Okay. So next question is wait. Wait, even I am getting ads. Am I audible now? Clear? Oh, I missed the earlier question. What was the question? Boron is also the composition of steel or not? Not only steel, obviously if you are using a stainless steel, then they do add a boron, a little quantity of a boron. Why? To make it harder. Okay, so for that purpose, it can be a composition of a stainless steel. Okay, I hope, I don't know the name. I hope the voice is clear now. If you have doubts, you please let me know. Okay. Chalo. Drying sterilization is usually achieved by exposing materials to hot air at 150 to 170 degrees Celsius for at least 2 hours. This method is particularly suitable for dried sterilization. Means your substances or whatever materials you are using, that has to be stable at that temperature, right? Very good option C, glassware and metallic instrument is the right answer. Chalo. Which chemical indicator is used for the radiation sterilization? Stripe papers, brown tube, 𝘂𝙎𝙎𝙎 or dosimeters? DD you remember from this one. Radiation sterilizations and dosimeters. Stripe papers is for the moist heat sterilization, right? So for the radiation sterilization, we are using dosimeters. Option D is the right answer. Very good. Chalo, next is The time taken, this is from the engineering part, the time taken at a fixed temperature or the radiation dose required to achieve a 90% reduction in viable bacterial cells is called as. So this is a percentage viable count. This is how much time specifically at 60 degrees Celsius, and this will be a reduction. Say for example, this part is the 90% reduction, then this value is known as. Very good option C, that is your D value is the right answer. So how much time is required to reduce or to achieve a 90% log reduction is nothing but the D value. Okay. Next is about the HEPA filter. HEPA filter, as the name suggests, high efficient particulate air filter. Okay. They are defined as what? How much is the efficiency? B particles generated by vaporization of the hydrocarbon. Basically, they are asking what is the efficiency of HEPA filter and till what particle size HEPA filter can remove. Obviously, it cannot remove the nano size particle also, right? There is a certain limit for the particles. What is that limit? And what is the efficiency? Very good. 99.99% is the efficiency and 0.3 micrometer is the particle size limit for the HEPA filters. It can remove the particles which are greater than 0.3 micrometer and it is 99.99% efficient. In most of the book it is 99.99%. I think only in Martin or Remington it is 99.97. I would suggest if the question comes, you first give the priority to 99.99%, not 99. I'm talking about 99.99%. If this is not there in the option, you go for 99.97. But 3 9 are important at least. Okay. Very good. Option C is the right answer. Let's see some of the important points also. I just don't want that we are going only through the MCQs. Okay. Chalo, HEPA, you know, high efficient particulate air filters. See, GPAT 21, they asked the full form. Efficiency, see, I told 99.97 in some books 99.99%. What is the particle size limit? 0.3 micrometer. Do not get confused. If you talk about class 100, class 1000, class 10,000, what is the particle size there? You have to tell me. This is not the question as in MCQ, but I'm asking. When we talk about class 100 area, class 1000, class 10,000, what is the particle size limit there? You have to answer in the comment section. Okay. So efficiency testing, that is we are using 𝘈𝙁 test. What is the concentration of DOP that we are using? 66.6 ppm. Alternative to DOP, we are using liquid paraffin, hydrocarbon vapor, and the flow rate also remember 20 plus minus 5 feet per minute. What is the particle size limit when we talk about class 100, class 1000, class 10,000 area? Remember we are using there the limit is 0.5 micrometer because they are very closely related, right? Even HEPA filters, that class 100 area, do not get confused. If it is HEPA filter, 0.3 micrometer. If it is class 100, class 1000, class 10,000, then that is your 0.5 micrometer. So next is, which of the following is not a component of pharmaceutical aerosol? Not a component. Propellant, container, valve or roll tube. Propellant is there, right? We are using various kinds of propellant. It will help to expel the product out, right? Propellant is there. Container, of course, aerosol containers are there, made up of metal, made up of glass. Valve is there. Roll tube is not a part of aerosol containers, right? Option D is the right answer. Very good. Chalo, next is the dip tube in an aerosol container is made from one of the following. Choose the correct one. Propylene, glass, stainless steel or aluminium. Dip tube as in you might have seen in the perfumes, in any kind of spray bottle, the tube which is present inside that perfume bottles or the aerosol containers, it is made up of what? Polypropylene, glass, stainless steel or aluminium? It's a plastic, right? Option A, polypropylene is the right answer. Very good. If it is a spring, then it is a stainless steel. Okay, if it is a spring, then it is a stainless steel. Chalo, very good option. A, polypropylene is the right answer. Next is the particle size of aerosol can be determined by, most of the time I have seen this question as well. How do you determine the particle size of aerosol? Cascade impactor, flame photometry, microscopy or UV spectroscopy? First of all, UV spectroscopy is not a method to determine any particle size. It is to identify the amount of substance which is present, right? So option D is not there. Flame photometry is not there. Normal microscopy is to check the particle size of like suspension or any kind of powder material. But cascade impactor, option A, cascade impactor is the right answer. Oh my god, 500 questions completed. That means good. Since morning, I think you have completed 500 questions, and I hope along with the explanation, 1000 questions you have come across all the subjects, right? Chalo, very good. Option A is the right answer. Next is, which of the following is a critical factor in formulating ophthalmic solution to ensure the comfort and efficacy? Slow dissolution rate, isotonicity with the tear fluid, high osmolarity, high molecular weight compounds. It is a critical factor for the ophthalmic. Very good. Isotonicity, remember that isotonicity is the critical factor with the tear fluid. If it is a parenteral, isotonicity with the blood and the sterilization as well as pyrogen free. If in the case of ophthalmic, even if it is not pyrogen free, that is not the critical factor, because pyrogens, if you, even if it is present in your ophthalmic, say for example, I'm not talking about microorganisms, I'm talking about pyrogens. Even if pyrogens are present, they will not cross the membrane and they will not go inside the blood. That is the reason in case of parenteral, three important things: it should be free from pyrogen, it should be free from microorganism and isotonicity. In case of ophthalmic, sterilization and isotonicity are the critical factor. Very good, option B is the right answer. Next question is, large molecules like heparin and insulin can be easily made absorbable by the presence of syrup, suspension, emulsions or lotions. You know, if it is a larger molecule, then it becomes difficult for the absorption process and all, right? So that is the reason we give it as a emulsion one, so that the larger molecules are present as a droplet, small fine droplets, and because there is a reduction in the droplet size, it will have greater surface area and the absorption will increase. So option C, very good, emulsion is the right answer. Next is, example of suspension produced by chemical reaction is sulfur lotion, zinc sulfide lotion, BPC, sulfadimidine mixture, chalk and opium mixture. Okay, I got one question. How to do the nomenclature of propellant? We have one question in this. At that time, I will tell you nomenclature of propellant also. Then we will solve. Okay. I think now it will come the question. I'll explain at that time. Okay. Good question, anyways. Chalo. C, option C is the right answer for the earlier question, right? 503B is the right. Okay. Because sulfur lotion, sulfidimidine, and chalk and opium, they are dispersion. Okay, they are by the dispersion method, whereas zinc sulfide is by the chemical method. Okay, you please tell me the number also. Okay, sometimes I get confused between earlier and this one if there is a lag time. Okay, Chalo, rest of them are prepared by dispersion, whereas zinc sulfide lotion, that is a chemical method by precipitation. Chalo, next is beta cyclodextrin consists of dash 𝘂𝙎𝙎 unit. You know beta cyclodextrin, it is the hydrophilic in nature. If your drug is insoluble, you can use HP beta cyclodextrin and your drug will be incorporated into this ring and it will increase the solubility of the water. Okay. Chalo. Very good. Option B, 7 is the right answer. There are 7 𝘂𝙎𝙎 unit. Okay. Next is, how does the addition of magnesia and alumina affect soda lime glass? Enhances the mechanical strength, increase softening temperature, reduce porosity, improves chemical durability. It won't enhance mechanical strength. To some extent it's fine, but it won't enhance or it will not increase to that softening temperature. No, it will. Option D, actually, option D is the right answer. It improves the chemical durability. Okay, remember, not about the softening temperature. Okay. Next is primary control release system achieved by which of the following factor? Diffusion, degradation, swelling, or all of these? Diffusion is there, right? Drug will diffuse. Degradation of the polymers, polymers will swell. So all of these, right? Option D is the right answer. Very good. That's how the primary control release system will be there. The polymers will erode, right? In which dosage forms are used to treat local conditions such as hemorrhoids in rectum and infections in vagina? So as you know, they have specifically mentioned the routes, that rectum and the vaginal. Are we using emulsions? No. Are we using suspensions or powders? Suspension and emulsion, they are meant for the oral route. Powders can be oral or it can be topical, like dusting powders, body powders and all, right? So option D, suppositories, is the right answer. Very good. Remember, vaginal suppositories, they are also known as pessaries. Vaginal suppositories, pessaries. The trick we have remembered is VIP. So vaginal suppositories are also known as pessaries. Urethral suppositories are also known as 𝘎𝙬s. So USB we have remembered. Those who were not present for the earlier classes, remember U for urethral, S for suppositories, B for 𝘎𝙬s. Okay, these tricks are important. Remember the alternative names as well. Okay. Chalo, next question is, detergents work by reducing surface energy, contact between solid and liquid, surface tension, none of the above. You know, detergents, they have little bit higher HLB value, right? And we use, see, if any oil stain is there on the clothes, you use detergent, right? Because water and oil will not mix. If you use detergent, there will be a foaming action and it will remove, right? So whatever surface tension is present between these two, oil and water, that will be reduced by using detergent. So surface tension is the right answer. Very good. Option C is the right answer. Next is, which of the following is not a method for enhancing transdermal permeation of a drug? Iontophoresis, sonophoresis, electrophoresis, or hydration of skin? Not a method. They are asking not a method. Which of them is not a method? 16 to 18 HLB for detergent. Very good. Remember that table also. Very good. Option C, electrophoresis, is the right answer because it is a method for separating the charged molecules, right? Proteins and all. So electrophoresis is a technique for separation of the molecule based on charge, and that is the reason even zeta potential is based on that. But it is not for the enhancing transepidermal permeation. It is not the permeation technique. It is a separation technique, electrophoresis. As the name suggests, Based on charge, it is a separation technique. Option C is the right answer. Next is, what is the primary mechanism of drug release in osmotic pumps? What is the primary mechanism of drug release in osmotic pump? Absorption, filtration, osmosis, or digestion? Absorption, filtration, osmosis, or digestion? Obviously, as the name suggests, yes, osmotic pump we are using osmosis. Very good. Option C is the right answer. Absorption occurs after once the drug is released. It is not the releasing phenomena, right? Filtration, it is not used in the osmotic pump. Osmosis is there. And digestion, drug release does not depend on the process of digestion. Very good. So next is, solid fat index is determined by which technique? Okay. First of all, solid fat index is the specification for the whatever you are using as a base, right? So percentage of solid fats remaining, and whatever your temperature is there, right? So for example, at room temperature it is at solid only. As you increase the temperature, percentage of solid decreases because certain amount gets converted into liquid. This will tell you at what temperature there will be melting, so that you can use this kinds of bases in the suppositories, right? So for example, at 37 degrees Celsius it is melted. Then you can tell that this particular suppository base is suitable for suppository which melts at body temperature, right? So we are using dilatometry. Option C is the right answer. Very good. The most potent pyrogenic substances are produced by gram-positive bacteria, fungi, gram-negative, or viruses. And do you know what is the name of the most pyrogenic substances produced by these type of bacteria? Very good. Option C, gram-negative bacteria. And the most potent is the endotoxin. Endotoxins are produced by gram-negative bacteria, right? And that is the reason we do 𝙠 test, we do rabbit test to see whether endotoxins are present or not, because they are mostly produced from the gram-negative bacteria, which is your endotoxins. Okay. What is the melting range of cocoa butter used in the preparation of suppository? Used in the preparation. There are various forms, polymorphic forms of cocoa butter, but the one which is used in the suppository is, what is that? 31 to 32 degrees Celsius, 23 to 25, 34 to 35, 35 to 37 degrees Celsius. They are asking melting range or melting point of cocoa butter. Acha, sham test is also there. Very good, Rohit. Yes. C is the right answer. Remember that there is a temperature by which that particular form is produced, and there is a temperature which is a melting point. The two different things are there, even if you get confused in the question. Very good. Remember, the melting point is near the body temperature. Not only cocoa butter, any suppository base that you are using, you have to make sure that will have the melting point near to your body temperature or at body temperature. It should melt at body temperature and it should be solid at room temperature. Very good. Option C is the right answer. Chalo. In pyrogen test, the solution is slowly injected into marginal vein of the dash of the rabbit. Which part we are using for the rabbits? Ear, forelimb, hind limb, or tail? Ear. Option A is the right answer. Very good. Ear is the right answer. We are using marginal vein. Why? Because that is very much prominent and it is easy to administer. Okay. Nothing as such reason. Because whichever vein you inject, it will go into blood circulation, right? But if you see the ears, rabbit ears, the veins are very much prominent, right? For the humans, we are using this part, right? Because it is easy, accessible. Somebody was asking this one, right? Before moving towards this question, I will tell you the nomenclature of the propellant. They are by 3 digits: 1, 2, 3. The first digit indicates that whatever that propellant is there, number of carbons atoms in that propellant minus 1. Say for example, if it is having methane in that propellant, methane is there. So methane contains how many carbon? 1. So it will be 1 minus 1, 0. So first position will be 0. So like that, first position is number of carbon minus 1. Second position is number of hydrogen plus 1. Number of hydrogen plus 1. Say for example, some chlorine, fluorine, everything will be there. But for example, if it is a methane, you know it is CH4. So how many hydrogen? 4. So you will do 4 plus 1, write it down 5. Right. And the last indicates number of fluorine atoms. Number of fluorine atoms. Your nomenclature name has nothing to do with the number of chlorine atoms. Okay. Number of carbon minus 1, hydrogen plus 1, and number of fluorine atoms. Okay. Now here they are asking propellant 11. 11 means it is 0, 1 and 1. Now when this will come 0, when the number of carbon will be 1. So it will be 1 minus 1, 0. Understood how to solve? When it will be 1, when it is a methane, when the parent chain will be methane. So C is the option where your methane is present. In option A is also there B. This is ethane, this is ethane. So obviously option C and D will not be there. Okay. Now before hydrogen it is easy to find number of fluorine because here it is only 1. So it should be monofluoro. You don't have to do minus 1 plus 1 there. So it is a monofluoro. Where it is monofluoro? Here. Here it is difluoro. If it is difluoro, here it should be 1, 2. But it is a monofluoro, right? So option A is the right answer. And if they ask you to solve vice versa, that for example, if they give you trichloro, monofluoro, methane, how will you solve? So first what you have to do is, say for example, you don't know that there is a propellant level, nothing. They have given you this name and you have to identify the propellant number or the name, nomenclature of that. So this is a methane, you first draw methane. You know methane, right? You should know the structure for that, okay? Then what is that? They are asking trichloro. At least you know the carbon valency, right? Trichloro. Replace this 3 hydrogen because here you cannot draw chlorine. Obviously, you know the valency is 4. You have to replace hydrogen. So it will be trichloro like this. And what is there? Monofluoro. With this only, whatever they have given, you have to satisfy the valency of the carbon. If one carbon is there, satisfy the valency of the carbon with that, whatever they have given. If they have given dichloromonofluoro, so here it will be hydrogen only because it is a dichloro. But now it is trichloro, so you have to identifying the structure and the molecular formula is important. Okay. Now you go for the nomenclature. First digit is carbon minus 1. How many carbon? 1 carbon. So 1 minus 1, 0. First position is 0. Second position is hydrogen plus 1. How many hydrogens are there? 0. 0 plus 1, 1. How many fluorine are there? 1. So it is a monofluoro. So it is 1. So you should know from the structure how to identify the nomenclature as a number, and from the number how to identify the nomenclature. This is very easy, 11 to this. You just see how many fluorine atoms are there and how many carbons are there. Okay. Chalo. Next question is, option is the right answer. I think whoever has asked me earlier, you understood this. Chalo. Which class of propellant show ozone depletion as its drawback? There are various class of propellants. Chlorofluorocarbons, hydrocarbon, propane, or compressed gas. Okay, my pleasure. I think you understood this. Chalo, very good option A, that is chlorofluorocarbons. They have this drawback that the ozone layer, right, which is the protective layer of the earth, there is a depletion, right? Which agent is used as tonicity modifier in the range of 0.5 to 0.9%? Students think that it is only sodium chloride only. There are various are there, but in this particular range, which tonicity modifier you are using? As you know, option A, sodium chloride, very good. Remember, dextrose is also there, 5%. Boric acid is also there, okay. But if they have asked you particularly 0.5 to 0.9%, so that is your sodium chloride, okay. Chalo, very good. Next question is, which preservative is incompatible with anionic surfactant? Benzalkonium chloride, benzethonium chloride, benzyl alcohol, or chlorocresol? Which preservative is incompatible? Anionic surfactant, definitely something cationic will be there, so that is your benzethonium chloride. Option B is the right answer. See, benzalkonium is also cationic, but with that citrate, methyl cellulose, these are incompatible, okay. Remember, benzethonium chloride is incompatible with your this anionics. Next is emulsion made with twins are usually unstable, W by O by W, or clear. Which type of emulsion it will form if you use twins? Now, for your information, I would like to tell you that this is your Bancroft rule. What does Bancroft rule? What does Bancroft rule tells you that there is a lipophilic surfactant, there is a hydrophilic surfactant. Lipophilic surfactants are oil soluble, hydrophilic surfactants are water soluble. The examples are spans. Here the examples are twins. According to Bancroft rule, it tells that if your surfactant is soluble in oil, then oil becomes the external phase and it forms the W by O emulsion. If your surfactant is hydrophilic, it forms the external phase. I mean, what is the external phase? And it is used as O by W emulsions. Very good option C. Because twins are hydrophilic, right? O by W emulsion is the right answer. Chalo. A co-solvent used in the preparation of parenteral product is benzyl alcohol, methyl alcohol, DMA, or phenol. We are using DMA. Very good option C, and that too in a lesser concentration. Okay, DMA is solvent which can solubilize most of the drugs. Okay, but you have to use it in a lesser concentration. So that is a co-solvent. Very good option C is the right answer. Next question is, a cold compression method is used for the preparation of suppositories, tablet, ointments, or jellies. For what purpose we are using the cold compression method? Option A, suppository is the right answer. Remember, not for the ointment. When we are using ointment, not for the ointment. Okay, cold compression. Suppository is a earlier method. Pour molding, hand molding to very earlier method. Crib test is used to analyze the viscoelastic properties of emulsion, lotion, ointment, or suspension. So viscoelastic property is nothing but, I think you might have studied in the physical pharmacy, that rate of shear and the shearing stress. If you apply the force, how your ointment is behaving. Option C is the right answer. So you also have studied this graph, right? Shearing strain and the time. If you apply the stress till here, right, it will increase. But as soon as you remove the stress, the strain which was present, it will release, right? So ointment is the right answer. Note it down. Ointment. So next is, beeswax is an example of which type of ointment base? Hydrocarbon or oleaginous, absorption base, water miscible, removable, or water soluble base? Beeswax is an example of which type of ointment base? Plastic flow ointment. Okay, very good. Very good option B, absorption base is the right answer. Remember, it is a non-emulsified. Beeswax, wool alcohol, lanolin, cholesterol comes under your absorption bases. Okay, chalo, very good. Next question is number of milligrams of potassium hydroxide required to neutralize free acid and saponify ester in 1 gram of fat. Remember, both are there, neutralization of free acid and saponification. If only neutralization they ask, then it is acid value. If neutralization of acetic acid, that is your hydroxyl value. Neutralization of free acid and saponification, then that is your very good option D. Saponification value is the right answer. Chalo, very good. Next question is 𝙂𝙎𝘾𝙄𝙎𝙎 is a hydrocarbon wax, beeswax, mind wax, or carbo wax. Very good option C, mind wax. It is option C is the right answer. It is a mind wax, and sericin, it is a mixture of 𝙂𝙎𝘾𝙄𝙎 and paraffin. Okay, sericin is a mixture of 𝙂𝙎𝘾𝙄𝙎 and paraffin. Okay, very good. Chalo, in non-flocculated suspension, how do the particles behave? Non-flocculated as in your deflocculated suspensions. Okay, they form sticky cluster. Deflocculated means particles are present as separate entities. Particles are present as separate entities. So they will not form any kind of sticky clusters, right? They exist as separate entities, as the name suggests, yes. They aggregate into flocks? No. They aggregate into flocks, that will happen in the flocculated suspension. Next is they form a network structure? No. So option B is the right answer, where they exist as a separate entities. Why you thought C or D? It is a non-flocculated or deflocculated. CD won't be there. It is a B. They act as a separate entities. Okay. I hope earlier question is clear now. Chalo. Which one of the following is a flocculating agent for a negatively charged drug? Aluminium chloride, bentonite, tragacanth, or sodium biphosphate? Chalo. Option A, aluminium chloride. It's aluminium chloride. Because you know aluminium, it is a trivalent, right? If it is, what the question was for the negatively charged ion, right? So in order to form that particular flock, positive and negative should be there. If it is a negatively charged, you want something positive. And aluminium chloride will go as Cl3 minus. Aluminium is there, right? And it will have more tendency to form a bond with the negatively charged molecules because it is positive. And that is the reason, if you remember, we are using electrolytes as the flocculating agent. Okay, not very much a controlled flocculation. So the next is chemically 𝘂𝙎𝙎 is geminol, diol, polyhydric alcohol, liquid paraffin, hydrocarbon, or terpene. Very good, liquid paraffin hydrocarbon. It is a brand name for that. Liquid paraffin hydrocarbon. That is a 𝘂𝙎𝙎. Next is gallic acid is used as what? Preservatives, emulsifier, buffer, or antioxidant. Remember, gallic acid, sodium gallate, propyl gallate, these are used as what? Antioxidant. Very good. It is not a preservative. It is not emulsifier, buffer. Preservatives are your propyl paraben, methyl paraben. Those are your preservatives, right? Antioxidant, option D is the right answer. It's not a buffer, as I told you. If it is a citric acid or any kind of weaker acid, weaker base, that is your buffer. Okay. Chalo, very good. Next is antioxidant was the right answer. Next, what is the objective of controlled release drug delivery system? Delivery at specific tissue, to deliver API at predetermined speed, to modify the release time, or all of the above. Very good. Option D, all of the above is the right answer. If you want to deliver at a specific tissue, we call it as targeted drug delivery. That can happen at a predetermined speed. Now that speed depends upon what kind of polymer you are using, what kind of concentration you are using, and so on, and modify the release time. So everything can happen in the controlled delivery. Option D is the right answer. Next is, which of the following statement count as the consideration for instability of the emulsion? Formulation of a globules on standing, is that instability or not? You have to identify. Large globules rise on the top, all or part of a liquid becomes unemulsified, all of the above. See, formulation of a globules on standing, that we call it as coalescence, that is one of the instability. So option A is there. Next is, large globules rise on the top. We call it as upward creaming, right? If you remember, which happens due to the density difference between oil and water. So second is also there. Third is, all or part of a liquid becomes unemulsified. Unemulsified means this is a breaking phenomenon. When the layer which was there, whatever your surfactant layer was there, whatever your emulsifying agent layer was there, if that is broken, it becomes unemulsified. And that is an irreversible process. Remember, these two are reversible. This will become, if it is a breaking, it will become irreversible. So all of the above is the right answer. Very good. Which of the following is a vesicular drug delivery system? Implant, liposomes, antiphoresis, or collodions? Vesicles means you are using certain ingredient which will form a vesicle-like structure in which your drug, whether it is lipophilic, hydrophilic, will get entrapped. Very good. Liposomes is the right answer. It is a phospholipid bilayer, right? It is a phospholipid bilayer. So it is like this. Hydrophilic head and lipophilic tail. Like this, surrounding whole circle will be there. If you want to incorporate hydrophilic drug, hydrophilic head, here you can incorporate. If you want to incorporate lipophilic, here you can incorporate. So liposomes can be used to administer both hydrophilic head and lipophilic tail also. What is the typical pressure limit for a system using glass container? This is the question for the aerosol. Remember, they are asking how much pressure a glass container can withstand. If it is your normal container, then 140 to 180 psig. But if it is a glass container, that much pressure it cannot withstand. So always see the question whether they are asking for a normal container of aerosols or they are asking for the glass container. Very good. B is the right answer. That is less than 25 psig. Okay, less than 25 psig. In case of aerosol testing, valve delivery acceptance criteria for a volume of 55 to 200 microliter is. How you have the acceptance criteria for weight variation, content uniformity, right? Likewise, if the volume of that aerosol to be discharged is 55 to 200 microliter, how much percentage deviation is acceptable? Very good. C was the right answer, plus minus 10. Why you deleted? C is the right answer, plus minus 10%. If, remember, if it is less than 55 microliter or 54, then the limits is plus minus 15%. That much deviation is allowed. Okay. Chalo. Now the question is C. Containers of aerosol should withstand the following pressure as high as. Now here they are not asking glass containers or which containers. So here normally normal containers are there. 140 to 180 psig at 130 degree Fahrenheit, 100 to 160 psig at 130 degree Fahrenheit, 50 to 100 or 120 to 140 psig. Very good. Option A, 140 to 180 as discussed earlier. Remember, if it is a glass container, 25 psig, because glass cannot withstand this much pressure. Why we are talking about pressure? Because aerosols are the pressurized liquid dosage form. Inside the containers, you have the pressurized dosage form. That is the reason the containers should withstand this much amount of the pressure. Option A is the right answer. Very good. So next is, what is the maximum volume for small volume parenterals? Up to 30, up to 50 ml, up to 100 ml, more than 100 ml. What is the pressure that can be withstand? I'm still into that pressure withstand question only because there is, I think, 10-15 second lagging in the YouTube. I can see the comment for the previous question. Chalo, tell me the ml for this one. C is the right answer. Very good. Up to 100 ml. That is your small volume parenterals. Large volume goes up to 1 liter. Citric acid buffer has a pH range of, as the name suggests, it is a acid. So what is the pH range for citric acid buffer? 2.5 to 6 pH, 0.01 to 0.25. This is very less, right? This much pHs we are not taking. 6 to 8.2, that becomes basic. 7 to 9 becomes again basic. Citric acid, option A is the right answer. Very good. Doxorubicin is marketed under the trade name of, I already told you, whatever your famous APIs are there, remember their brand name, okay? Celex, Amphosil, Depoder, Donoxone. Celex option is the right answer. Next is total solid content in water for injection as per USP standard is. Again, the limits are very important, whichever is there, okay? So in the theory class, we have seen the table, right? For water for injection, sterile water for injection, bacteriostatic for water for injections, and so on. What is the limit for that? Very good, option C. Option C, this option C, okay, not more than 10 ppm. See, on the other hand, 10 ppm total solid officially permitted for water for injection may be much too high when used as the vehicle for many products, and it should contain some minimal amount of organic compounds. Okay, remember. Which antioxidant is a blocking agent? Antioxidant act by various ways. Act as a reducing agent, act as a blocking agent, and so on. Ascorbic acid ester, sodium bisulfite, EDTA, or thiourea. Chalo, very good option A. Ascorbic acid ester is the right answer. These are the antioxidants. As I told you, there are reducing, blocking, synergist, and the chelating agents. These are the 4 types by which it acts. Remember, okay? Chalo. Next is particles analyzed using the cascade impactor have diameters ranging from. It's a cascade impactor, that means which size they are talking about, the aerosol, the particle size of the aerosol. 1 to 100 micrometer, 0.01 to 10 micrometer, 0.1 to 30, or 5 to 50 microns. Very good, option C is the right answer, that is 0.1 to 30 micrometer. Very good. Remember, particle size determination by cascade impactor, that is your aerosols only, okay? Next is polysorb. Is an example of oleaginous base, absorption base, water removable base, or water soluble base. It comes under your beeswax kind of things only. So which is an example of? Very good, option B, absorption base is the right answer. 4 types are there: anhydrous or non-emulsified, hydrous, anionic, and the absorption bases. Which of the following ointment base is an ingredient of an absorption base? So many times are there, okay? The question, please go through it, okay? The tabular form, this or whatever earlier we have seen in the class, you can remember anything. Chalo. Petrol atom, lanolin, hydrogenated castor oil or cetyl alcohol. Very good. Option B, lanolin is the right answer. That is your absorption base. Lanolin is also known as hydrous wool fat and beeswax. These are the examples of absorption bases. Next is plastic containers are normally sterilized by, you know that plastic containers, they are not stable at very high temperature. So you have to select such an option which will have the lesser temperature or which will not use the temperature. So ethylene oxide being a gas, it is your gas sterilization. Dry heat, autoclave, none of these. See, for dry heat, you are going up to 170, 180 degrees Celsius. At that temperature, you cannot use plastic containers, right? Autoclaving, again, 120, 121 degrees Celsius, you cannot use. So we are using gas sterilization. Option is the right answer. Very good. Next is an antioxidant commonly used in the formulation of non-aqueous parenteral preparation. Thioglycolic acid, ascorbic acid, sodium metabisulfite or butylated hydroxytoluene. Non-aqueous preparations. Remember, BHT, BHA, they are your oil-soluble antioxidants. BHT, BHA, they are your oil-soluble antioxidant. That means they are for the non-aqueous preparation. Thioglycolic acid, ascorbic acid is your vitamin C, it is water soluble. Sodium metabisulfite is water soluble. Remember, BHT, that is your butylated hydroxytoluene, BHA, butylated hydroxyanisole, they are your oil soluble antioxidant and they are used for the non-aqueous preparation. Option D is the right answer. Very good. Chalo next. Achha, that came here, doxorubicin. That was the earlier explanation. Next is select an apparatus used to determine the particle size of suspension by sedimentation method. Pycnometer, Oswald viscometer, Anderson pipette apparatus or parameter. Pycnometer, you know, it is for the density. Option A is not there. Oswald viscometer is to measure the viscosity. Option B is not there. Frabliter is to check the tablet if you subject to shock and abrasion. So frabliter is not there. So Anderson pipette apparatus we are using to check the particle size of suspension, and since the sedimentation is based on Stokes law, the particle size which you will get or which will be obtained after Anderson pipette apparatus, we call it as Stokes diameter. Noyes-Whitney equation is for the dissolution. Okay, basically it is for the dissolution, and Fick's law is for the diffusion. Okay, chalo. Option C is the right answer. Next question is, which principle does a hydrometer rely on the measure of specific gravity? Buoyancy, viscosity, conductivity or magnetic susceptibility? Specific gravity, you know, it is measured, it is not a viscosity, right? Very good, Yash. For the earlier question, Anderson pipette, right? So option A, buoyancy is the right answer. It measures the specific gravity because it is hydrometer, it is proportional to the density. Whatever the force is acting, it is proportional to the density for the measurement of the specific gravity. Very good. So the next question is, which type of analysis is used to determine the chemical stability of the pharmaceutical aerosols? Here they are talking about the stability. X-ray fluorescence, FTIR, gas chromatography or accelerated stability testing. See, X-ray fluorescence is not for the stability, right? FTIR, if you want to check any kind of molecules, any kind of substances, gas chromatography is a quantitative technique. Accelerated stability testing is for all the dosage form. You are subjecting a particular dosage form at certain temperature. at the accelerated conditions in the terms of temperature, in the terms of humidity. And that is the reason, that's how you check for the stability, by subjecting it to higher temperature and higher humidity. That is a long-term stability studies, okay? And then depending upon the dosage form, you have to analyze. If it's a dissolution test, do dissolution, whatever drug release and all, okay? What is a typical setup distance for measuring the flame during a flame projection test? So there is a flame and you have to spray the aerosol, and then you have to see that how much, if it is catching fire, it will, the flame will be projected towards the higher distance. What is the answer? Chalo, very good option. B 15 centimeter is the right answer. So flame projection testing for aerosol products, the setup which is there, it will involve the spraying of the aerosol on that particular flame, right? And how much distance it is traveling, that is been seen. So if it travels longer distance, means it is having higher ability to catch the fire. So 15 centimeter you will keep the source of the flame, and then at 15 centimeter you will spray the nozzle, okay? This is the distance from the nozzle of the aerosol can to the ignition source, okay? Chalo, the next question is the acceptable limit of osmolarity with respect to tonicity for the parenteral solution is. The acceptable limit of osmolarity with respect to tonicity for parenteral solutions are 250 to 269 milliosmolar per liter, 278 to 328 milliosmolar per liter, 329 to 350 milliosmolar per liter, 242 to 16 milliosmolar per liter. So this is the last question now for the technology, okay, not for the entire series, for the technology. This is the last question. What is your answer? At least a guess. Yes, very good. So option B 278 to 328 milliosmolar per liter is the right answer. That is the acceptable limit for the osmolarity. That means what? It will have the same osmotic pressure. No, it is not option A. Remember 250 to 269. No, little bit higher 278 to 328. 279 to 328. So this range ensures that the solution is isotonic or nearly isotonic with the blood plasma, and because you know that it will make sure that your RBCs are intact, there is no swelling, there is no shrinkage of the RBC if you keep that much proper the osmolarity, okay? And there are various as I told you, isotonicity modifiers, including your NaCl, including your boric acid, dextrose. So do not only rely that NaCl is there, okay? So I hope that you have understood all the questions, 100 questions that we have seen from pharmaceutical technology along with their explanation. If you have doubts in any of the questions, then please make sure that, and you can comment also, I can reply on the chat box. And as Neelam ma'am told that pharma and non-pharma both part are there, right? So pharma being the core part and non-pharma is like a shield, right? I hope you remember if you have attended the previous her class, right? Just before technology. So please make sure the main body, that pharma, all whatever studies you have done for the GPAT examination and till now, please make sure that you are thorough with it. Do not lose your confidence at any stage. And as discussed earlier, now at this point, do not take any new topic which you haven't seen earlier at all. So you please revise the things you have done. Enough study. Enough as in, if you don't revise that study properly, then the new study will not have any value. So please make sure that whatever studies you have done, whatever notes you have, and please make a short note. As if you have attended the classes right from the day when I'm telling, your short notes should be ready. Whether it is in the terms of numerical values, whether it is in the terms of your tricks, mnemonics, whatever it is there, highlight those things and make sure you are doing only that thing. Do not take any new topic and scratch your head, and then, because instead of doing that, instead of doing one thing, you can do 10 different things. So that is the reason, please make sure that whatever things you have done till now, you have come this way, right? You have qualified GPAT and now you have come this way, this long. Then do not lose your hopes and do not feel demotivated at all. Okay, you have done studies, be confident, have faith, have your whatever your efforts are there, they are there with you. Okay, so please make sure that with the calm mind you appear for the exam. You have already given one exam, so you know the how the NIPER will be. Okay, so trust, believe in yourself, and all the very best for your examination. So see you all in the next class. Till then, thank you so much. Your another series is on the way. If you have doubts, you please let me know, or else I wind up the session for now. Chalo. As I have seen, you guys have answered very nicely all the questions, and you can do it. Okay, you have to tell yourself, I can do it. I did. 50% is done. Your GPAT is done, right? So the remaining 50%, I will do it. Okay, and you have to comment also in the chat box, in the comment section. Until unless you tell yourself, who else is going to tell for you, right? So make sure that you will achieve, and definitely after the exam you should be like, okay, this is done, this is done, this is done. Okay, chalo, all the best, and see you all in the next class. Till then, thank you so much, and continue the series. Next faculty will tell you another topic as well. Okay, so thank you so much, and all the very best for your preparation.
Hello, good evening everyone. Please confirm that is my voice audible to everyone and my screen is visible too, so that we can start with our medicinal chemistry part. Yes, can anyone please? Is the screen visible clearly to everyone? Okay, so hello everyone. So I know from morning you are attending the series, and from morning continuously are watching the series. So now we're gonna start with our medicinal chemistry part then. Okay, I need participation from everyone, so let's start with our questions. So first we have the chemical structure below represent. Okay, they have given us the chemical structure and what actually is the chemical structure belongs to. So is it aspirin, is it methyl salicylate, it is salicylic acid, or salicylamide? So according to you, which one? Yes, so the chemical structure is, yes, the chemical structure is it aspirin? Aspirin is acetyl salicylic acid. Okay, aspirin is acetyl salicylic acid, so we can't see any acetyl group here along with the acid group. Okay, so that is not again the aspirin. Next is methyl salicylate. So we can see we have a methyl group here, and then we have what? We have the salicylate group too. So yes, it can be methyl salicylate. Next is salicylic acid and salicylamide. So the option B, I guess that is the correct one. Yes, yes, the B one, not aspirin. It is not aspirin. Look onto it carefully. It is not aspirin. Okay, it is methyl salicylate. Okay, aspirin is when we have an acetyl group here. Acetyl salicylic acid is aspirin, not this one. Okay, next we come to the question. Okay, next Wait a second. Yes. Okay, so coming to our next question, then we have, okay, the next question says heterocyclic ring present in indomethacin. So in heterocyclic ring, indomethacin is an drug. So what heterocyclic ring is present in indomethacin? Imidazole, indole, indolin, or quinoline. So indomethacin, the name says it's structured. So indo means it contains an indole ring. Okay, so indole ring is present in our what? In our indomethacin. You can see the structure here. Yes, so this is the structure of an indomethacin. Here you can see we have an indole ring. It is an acid, okay, used for the, we can say, fever, as an antipyretic, as an anti-inflammatory, for the treatment of the redness we use that. Yes, yes. So next question, clonidine structurally is an derivative of what? So what is clonidine? I guess that everyone know it is an alpha-2 selective agonist. And if we talk about pyrimidine, triazine, pyrazolin, or imidazolin, so clonidine is an, yes, the structure of clonidine, it contains an benzene ring with 2 chloro groups, and this group is basically, we can say, not like this, sorry, we have like this, the structure, the benzene ring that is attached with 2 chloro groups, and this particular ring, this phenyl ring, is attached with our imidazolin ring. Yes, so basically it contains an imidazolin ring. Okay, next we have the D is the correct option. Here you can see the structure of our clonidine. Next we have an example of sulfonylurea is. So sulfonylurea example, yes, can anyone help me with that? Yes, what is an example for sulfonylurea? It is metformin, tolbutamine, or we can say rogestrelzone or repaglimide. Yes, which one? Then example of sulfonylurea. So what is sulfonylurea? Basically we have a sulfonyl group and we have a urea attached. Okay, so like this kind of structure we have. Okay, so that is our sulfonylurea. So if we talk about our tolbutamide, it contains a toluene ring along with a butane chain like this. So this is the structure of tolbutamide, and it contains a sulfonylurea group in its structure. Yes, yes, the answer is the B1. Okay, tolbutamide. So an amide group here and urea group here, and we have a toluene ring and an butane chain. Okay, so that is our tolbutamide structure. Next, the substitute position of chlorine in chlor-thiazide diuretic. Okay, so thiazide diuretic that works on distal convoluted tubules. Okay, that everyone know. So there is a substitution of chloro group, or we can say sometimes even bromo is present, CF3 is present. That is important for its diuretic activity, and where this position of this chlorine is there in that chlorothiazide, is it 6, 5, 7 or 3? So that is basically present at the 6th position. Here you can see this is the structure of an thiazide, the chlorothiazide, and here the chloro group is present at the 6th position. Okay, the 6th position substitution to that results in increasing of its diuretic activity. Okay, next, which of the following imidazolin derivative is a selective alpha-2 agonist? We already discussed this question. I guess you everyone remember that. Yes, the imidazolin derivative, that is an alpha-2 agonist. Right now I told you it is nefazolin, clonidine, silometazoline or tolazolin. So the answer for this is, yes, the answer is the B1, clonidine. I told you na, basically a ring with 2 chloro groups. Yes, that is clonidine, and we have an imidazole ring to the attached to that. Okay, so that is clonidine, and alpha-2 agonist. Okay, the B1 is the correct answer. Yes, Next, 7-alpha-acetyl-thio-3-oxo-7-alpha-pregnin 4-ene-21 17-beta-carbolactone is. So basically, what is the IUPAC norm belong to? Spironolactone, dipyridamole, mesoridazine or promazine. So if you can see the name carefully, you can see we have a pregnin, means it contains an steroidal nucleus, pregnin, 21 carbon containing nucleus, and the other thing is lactone. So if you remember the spironolactone, that is a type of an diuretic only. It contains what? It contains an lactone ring in its structure, plus it also has a steroidal nucleus, that is pregnin. Okay, so the structure, the IUPAC names belong to the spironolactone. Here you can see the 21 carbon containing nucleus and a lactone ring is present there. Okay, so that is our spironolactone. Yes, yes, very good, Yash. Next, the IUPAC name for warfarin. Warfarin, an anticoagulant. Yes, anyone can tell me the IUPAC name, which one is correct? So basically, warfarin contain a chromin ring. Yes, a chromin ring in its structures. So what is chromin ring? So basically this kind of ring, the chromin ring we have here, and in that chromin ring we have basically a ketone group that is present at the second position. Okay, so this is the ring we have there. Yes, and the answer is the second one. Yes, the 4-hydroxy-3-3-oxo-1-phenylbutone chromin 2 on, that is the IUPAC name for warfarin. Okay, this is the structure of warfarin, you can see. Okay, so that at fourth position we have an hydroxy, yes, and 3-oxo-1-phenylbutene, that is the structure here, the substituent here. So second one is the correct option here. Yes. Next is which is the leading molecule for the synthesis of semi-synthetic cephalosporin? Very easy question. Cephalosporin they are talking about. Okay, then antibiotic, a very well known antibiotic, 6-aminocephalosporanic acid, 2-aminocephalosporanic acid, 7-aminocephalosporanic acid, or 6-aminocephalosporanic acid. So basically the penicillin has an nucleus or the synthesis as a lead molecule as 6-aminopenicillinic acid, and the cephalosporin has it as 7-aminocephalosporanic acid. Yes, you are very right. The answer is the C1. Okay, don't get confused. 6-amino is for penicillin. Okay, so that is the structure we have here. Okay, so coming to the next question. The next question from CAD, the drug discovery part, computer aided drug designing. What does a docking refers to in the drug discovery? The process of attaching a drug label, the interaction between the drug and its target, the binding of a drug to its receptor, or the synthesis of a drug. So if we talk about docking, so docking is a technique where we have a receptor and we map the ligand to that receptor and we see its binding property. Okay, so that is docking. So basically what is the docking? Docking is the binding of a drug to its receptor. Okay, so the C1 goes with the answer. Yes, the C1 is very correct. Yes, you all are right. So C1, that is the docking. MESNA is co-administered with. What is MESNA? MESNA is basically 2-mercaptoethene sulfonyl sodium. So that is our MESNA. Okay, so what is MESNA and why it is co-administered and what it is co-administered with? So basically MESNA, it is an we can say a drug basically used for the treatment of hemorrhagic cystis. Okay, so hemorrhagic cystis, that is caused by an anti-cancer drug. Anti-cancer drug side effect, that is basically what type of anti-cancer drug? Like 𝘂𝙧𝙧𝙧𝙧𝙧. 𝘂𝙧𝙧𝙧𝙧 is a anti-cancer drug that cause side effect as the hemorrhagic cystis, and this mesna is used for basically in combination with the isophosphamide. Okay, it is co-administered with that so that that particular side effect can be treated. So yes, the answer here is ifosfamide. Okay, not AC1, ifosfamide. Okay, for the treatment of a side effect, that is hemorrhagic cystis, we take it. Okay, so you can go through the explanation part also. So that is ifosfamide. Next, docking techniques are often used to. Okay, again the question from the CAT: determine the color of the chemical compound, predict the solubility of a compound in different solvents, estimate the binding ability, affinity of ligands to the target receptor, assess the order of chemical compounds. So docking techniques, I already told you, to check the binding, to check the affinity of the ligand to its target or to its receptor, that is docking. Okay, so the answer for this here is again the yes, the C1, to estimate the binding affinity of a ligand to its target. Yes, the answer is the C1. Okay, next question: which of the following is a MAO inhibitor, monoamine oxidase inhibitor? Yes, it is 𝘿𝙬𝘾, it is estelofram, it is isocarboxide or venlafaxine. Yes, which one? So the MAO inhibitor is basically the isocarboxide. Yes, that is a antidepressant drug, a type of antidepressant. Okay, so basically the MAO, the monoamine oxidase inhibitor, isocarboxide. Okay, so that is our MAO inhibitor, the C1. Yes, the C1 is the correct one. Which form of adrenaline is having the maximum biological activity? Okay, that is a simple one. Adrenaline, epinephrine, whatever you say, S isomer, R isomer, cis or trans. Yes, the adrenaline that has the maximum biological activity. Yes, the R form of the epinephrine, or we can say adrenaline, is 10 to 12 times more active than its S form. Okay, so the R form is more active, and how much more active? About 10 to 12 times more active. So second one is the correct one, thus B1. Yes. Okay, next, again the question from clonidine. Clonidine structurally is a derivative. Okay, we have solved this question already. Pyrimidine, triazine, pyrazolin or imidazolin. Okay, so everyone knows this answer, that is the D1, imidazolin. We have already discussed it thrice, I guess, in this only. Next, an example of pyrazolin derivative analgesic is phenacetin, phenylbutazone, indomethacin or mefenamic acid. Pyrazolin derivative that contains a pyrazolin ring. Which particular structure contains a pyrazolin ring? Yes, the phenylbutazone. Okay, so pyrazolin derivative, so basically phenylbutazone is the drug that contains the pyrazolin. Okay, so phenylbutazone, that is the B1. Next, find out the given structure. So they have given the structure. What is the structure? The carbimazole, the methimazole, the methyl thiouracil or etinolol. Okay, starting with the D1, etinolol, it is LOL. So LOL is a beta blocker. Beta blocker is aryl oxypropanolamine or L-erythanolamine. That are the two nucleases of the beta blocker. So it is not an beta blocker, not an etinolol. Next, methyl thiouracil. Uracil is a 6-membered ring. Uracil is a 6-membered ring with nitrogens. The 2 nitrogens are there, but it is a 6-membered ring. So it is again not the methyl thiouracil. So C is removed, D is removed. Then methimazole. So methimazole. So Thi we can remember that it has a sulfur. Me we can remember it has a methyl group. Mazole we have an azole ring also. So yes, this structure belongs to the methimazole. This is a methimazole structure only. Okay, so that is the B1. Yes, the methimazole. Yes, very nice, Yash. Okay, so yeah, the second one is the correct one, that is the methimazole. It is an anti-thyroid drug. Okay, Identify the given structure. Is it 6-thioguanine? Is it 6-mercaptopurine, fludarabine, or 5-fluorouracil? So which one? Yes. So this structure is basically what? It is a 6-mercaptopurine. Okay, this structure belongs to 6-mercaptopurine. Yes, a very well known drug. I guess everyone knows its structure, the 6-mercaptopurine. So that is the answer. Next question we have here. Okay, the structural feature common for cyclazine, mecyclazine, citrazine is in the basic ring is diphenylmethylpiperazine, diphenylmethylpyrimidine, or diphenylmethylpyrazole. Yes, which one? Sorry for that. Coming to the next question, which of the following is an example of a soft drug design? So designing a drug to a highly stable in blood, designing a drug that undergoes predictable metabolism to inactivate metabolites, a drug that is activated only in liver, or the drug that lacks an heterocyclic ring. So basically the soft drug can be called as a drug that is designing a drug that undergoes a predictable metabolism to inactive metabolites. Okay, so the B1 is the correct option here, the soft drugs. Okay, next, the drug design bioisosters are the compound with identical molecular weights, the substituents or the groups with similar physical or chemical properties. Then we have the mirror images isomers of a drug, or the drugs that act on different receptors. So if we talk about bioisosters, so these are the substituents or the groups which have similar physical or chemical properties and they produce a similar biological effect. So those are bioisosters. Okay, coming to our next question. Yes, the B1. In the QSAR, the Hammett equation relates to which parameter? So Hammett's equation, that is basically denoted by our sigma. Okay, and it tells about the electron donating and the electron withdrawing group, how they have their effect if the substitution is that. So that is basically relates to the parameter that is called as the electronic effect. Yes. Okay, so the Hammett constant is basically for the electronic parameter. Which parameter is Hench equation represents lipophilicity? Okay, lipophilicity is represented by what? Lipophilicity is represented by our, yes, the pi, the hydrophilicity and the lipophilicity by the pi, Hench pi constant, we also call it that. Then the next question, what does a positive pi value for a substituent indicate? A positive pi value for a substituent, that a substituent is more hydrophilic, then the substituent is more lipophilic than hydrogen, it is an electron donor or it is an electron withdrawer. So basically the more lipophilic than hydrogen. So basically what we say, if we have a positive pi value, it says that the compound is, yes, the compound is more lipophilic than hydrogen. Yes. Okay, the B1 is the correct one here. Which QSAR method uses 3D descriptors like COMFA? Okay, that is again from the computer aided drug designing. So COMFA is used by the 3D descriptors like COMFA is used by the 3D QSAR only. Okay, so 3D QSAR uses the 3-dimensional COMFAs. Okay, then next, according to the Lipinski rule, the molecular weight of an orally active drug should be, the Lipinski rule, the molecular weight of orally active. So Lipinski rule says that the molecular weight of the drug that is orally active should be less than 500 Dalton. I guess everyone is aware of that. Basically Lipinski rule of 5 we call it. So 500 Dalton, it should be less than that. The A1 is the correct one here. Yes, the A1. Okay. Next, the substituent with a negative sigma value is considered. Negative sigma means negative electronic effect, negative electronic parameter. So basically the ones that can donate electron will release or will increase the negative nature. So electron donating will be donating, and negative sigma we will get with electron donating groups only. Okay, they increase the negative negative density there in the molecule. Okay, so that's why. Next, the docking in CAD is used to predict. Docking in CAD is used to predict the price of the drug? No. The preferred orientation of a ligand when bounded to the receptor, the metabolic rate in kidney, or the shelf life of a tablet. So yes, the B1, the preferred orientation of a ligand when bound to the receptor, that is shown by our docking. Okay. Next question again from CAD. De novo drug design refers to modifying an existing drug, building a new drug molecule from a scratch within a binding site, or testing drugs on animal, or searching a library of a known compound. So B1, I guess, yes, the building of a new molecule, that is our de novo synthesis, and even from a scratch. Then next, in SAR, the introduction of a fluorine atom often improves the metabolic stability because now fluorine is very small in size. Okay, so A1 we can remove it. So basically by having a small size, it can form extremely strong bond with chlorine. Okay, and hence it can resist the oxidation. That's why the metabolic stability is increased. So yes, the B1 is the correct answer here. Okay, so that's why it is stable with the fluorine. Next question, the combinatorial chemistry is used in drug discovery to synthesize one compound very carefully, rapidly synthesize a large library of compounds, study the history of a drug, or test drugs on humans. So basically combinatorial chemistry means to synthesize, it is a process to synthesize many compounds, a library of a compound in a single reaction. Okay, in a single time we synthesize a lot of compounds. So that is combinatorial chemistry. So we'll go with the B option. Okay, to synthesize large library of compounds. Next, what is the effect of N-methylation of a drug molecule on its lipophilicity? So if we talk about N-methylation, methylation means adding of an methyl group to the N position. So as we know, whenever we add an carbon atom or any carbon group, so that results in increasing the lipophilic nature, the lipid nature. So yes, the lipophilicity will be increased. Yes, the B1 is the correct answer here. Next, in QSAR, what is Lipinski rule of 5 used to predict? Is it drug toxicity, oral bioavailability, number of steps, or shelf life? So Lipinski rule of 5 is especially for the oral bioavailability testing. So yes, the B1 is the correct one here. Next, again from Lipinski rule of 5, does not include which of the following? Molecular weight less than 500, log P less than 5, number of rotatable bond less than 10, or hydrogen bond donor less than 5. So I guess here the C1, the Lipinski rule do not talks about the rotatable bond. So C1 is the correct option. Yes, the C1. Okay. Next question, which approach involves modifying a known drug to improve its property while keeping the same therapeutic effect? Okay, so we are modifying or improving its properties and we are keeping the therapeutic effect same. So is it SOSA, is it de novo, random screening, or throughput screening? So the option are very obvious. The answer is A1, the selective optimization of side activities. So that keeps the therapeutic effect as common, the same. Okay, similar one. Next question, which parameter is used to represent electronic effect in 3D QSAR confa? Okay, that is almost the same question, just they have twisted somewhat. Okay, so that is the electrostatic field only, na? Electronic effect is for electrostatic field. Yes. Next, the 𝘂𝙧 plot. Okay, the 𝘂𝙧 plot in 2D graph, that helps the medicinal chemists by plotting. So 𝘂𝙧 plot is basically plotted between the two basically dependable we can say parameters. Okay, so it depends on that. So two independent parameters we plot a 𝘂𝙧 plot. Okay, so it is basically plotted between the lipophilicity and electronic effect also, like pi and sigma. Okay, so the B1 is the correct option here. Then the next question, which of the following is a nitrogen analog of naphthalene? Nitrogen analog of naphthalene. Yes, anyone? Which one? The nitrogen analog. Okay, sorry, I skipped one question. Before that, what is the scaffold hopping in CAD? Before that, yes, scaffold hopping, changing the target protein, finding the structurally diverged compounds that have same biological activity, increasing the dosage of a drug, or hopping from one computer to another. So scaffold hopping is basically what? Scaffold hopping is, yes, it is finding the structurally diverse compound that have same biological activity. Okay, so that we do in scaffold hopping. The B1 is the correct option here. Next, which of the following is the nitrogen analog of naphthalene? Nitrogen analog means, what is naphthalene? This is the naphthalene ring we have here. Okay, so like this we have a naphthalene ring. Now nitrogen analog means we have a nitrogen attached here. So this ring is called as, is it indole, is it quinoline, is it anthracene, or is it phenothiazine? So this ring is basically what? This ring is an quinoline ring. Yes, the B1 is the correct answer. It is a quinoline ring. Okay, this is the quinoline ring, this is the naphthalene ring. Okay, yes, the B1. Next question, removing a methyl group from a lead compound to produce its lower homologue is called. Okay, we have removed a methyl group from a lead compound. Okay, so what is a lead compound? Basically a compound that is showing a favorable biological activity. So we have removed that a methyl group from that, and we have produced a lower homologue, and that process is called as homolization, non-derivatization, isosterism, or alkylation. Yes, yes, the answer is actually nor-derivatization. Okay, so basically removal of a CH3 group is normally called as NOR. So we represent it by NOR. Like in epinephrine, there is a presence of CH3. When we remove a CH3 from that, it is called as norepinephrine. Okay, so basically removal of CH3 is NOR. So nor-derivatization, that is the removal of methyl group from the lead compound, that is called as nor-derivatization. Okay, so the B1. Next question, the molar refractivity MR parameter in QSAR represent. The molar refractivity, yes, electronic effect, molar volume and polarizability, that is steric effect, lipophilicity, or only molecular weight. Yes, what does a molar refractivity parameter in QSAR represent? So basically it represents, yes, what? Yes, who's gonna tell me this one? It's a simple one, the molar refractivity. Yes, yes, it represents the molecular volume and polarizability, the steric effect, it represents that. Okay, so the answer is the B1. Okay, so it is the measure of the volume occupied by an atom or a group and its polarizability. Okay, acridine is a tricyclic system consisting of, okay, everyone knows about acridin. So what is an acridin? Acridin is a ring, okay, so it is a tricyclic ring. It is also present in the similar kind of ring is also present in tacrin, okay. Tacrin, it is an non-water soluble cholinergic drug that is used for the treatment of Alzheimer. If you remember the cholinergic drugs, there you must have heard about tacrin also. So tacrin also contains an acridin ring. And what actually is acridin ring? It is a basically tricyclic ring. Okay, so 3 cyclic rings are there, the 6-membered cyclic rings, and that cyclic rings basically are like, we can say, this kind of ring is called as the then we have nitrogen here. So this is an acridin ring. So basically what we have 2 benzene rings, and in between we have a pyridine ring. Yes, the B is the correct answer. The 2 benzene rings that is fused to the central pyridine ring, that is our acridin ring. Okay, yes, the acridin ring. Then we come to our next question. Which heterocycle is present in the structure of caffeine? Okay, caffeine, and yes, and CNS stimulant caffeine, what is the heterocyclic ring that is present in its structure? So is it quinoline, is it purine, is it indole, or is it isoquinoline? Which one? So if we talk about caffeine, it contains what? It contains a purine ring. If we specifically talk about, so it contains a xanthine ring. Yes, have you seen the structure of caffeine? So this is basically the structure of a purine, and if we add 2 double bond O's here, okay, and we remove these unsubstitutions, okay, unsaturations from here, so that is called as our xanthine ring. And 1,3,7-trimethyl-xanthine, that is a IUPAC name for caffeine, and it is present in the ring that is present, we can sometimes even call that xanthine, or we can say purine. Okay, so that is our caffeine. It is a CNS stimulant that everyone knows. Okay, next, which is the common software used in the 3D molecular visualization? The common software in 3D molecular visualization. So after our docking thing, what we do, we visualize our binding site. Okay, so basically the target and the receptor site, we see that what are the different bonds by which the target is binding to the receptor. How many hydrogen bonds are there, how many intermolecular forces are there, how many ionic bonds are there. Okay, so different bonds we see. So for that visualization, now the options are very clear: 𝚋mol, 𝑥𝐿, Word, or PowerPoint. So PowerPoint is not used for that, that we all know. Then Word, no. 𝑥𝐿, exactly, definitely no. So 𝚋mol is the only one. Now other than 𝚋mol, there is one other, Discovery Studio, that also we use. Okay, that are the other options. Okay, so that is the another we can say thing, or another software that can be used for the visualization, the molecular visualization, that is 𝚋mol is here the answer. Next, which drug design method is most useful when the target structure is unknown? Okay, when we do not know the structure of the target, then what is the drug designing method we use? Is it molecular docking? Is it ligand based pharmacophore modeling, X-ray crystallography, or de novo design? Which one? Yes, for the drug design method, what is the most useful target structure when the target structure is unknown? So what happens that sometimes there are 2 types of drug designing method. One is the LBDD and another one is the SBDD. Okay, so what happens in LBDD? LBDD is the ligand based drug designing, SBDD is the structure based drug designing. So what happens in the SBDD? SBDD means docking. Okay, the example of SBDD is docking. So what happens in docking, we already know the structure of protein, that what is the structure of protein, that is already known, means the structure of the target is already known here. So basically to that known target, we basically map the we can say ligand to that, and we see the binding affinity for that particular target of that ligand. Okay, and then we get a lipdock score. Okay, what is the score of that docking? Now the another type of we can say the drug designing is the ligand based drug designing, that is also called as pharmacophore modeling. So in that we make a pharmacophore, okay, based on the best parameters that it has or it blends with. Okay, so in that that particular type of drug designing is used whenever we don't have any structure of a target, the structure of a target is unknown. In that particular situation we use LBDD or ligand based drug designing, that comes under what, the pharmacophore generation. So pharmacophore we make, the model we make, and that is used as the filter to filter out the unwanted molecules that we don't need. Okay, so that the answer for this one is the second one, that is the ligand based drug designing, or we can say ligand based pharmacophore modeling, that uses the target which is unknown. The target structure here is unknown. You can go through the explanation part also. So basically a 3D structure, biological target which is unknown. So researchers, what they did, they introduced a ligand based drug designing, where we basically make a pharmacophore that can act as a pharmacophore model. We build a pharmacophore model, and that is used as the filter, okay, to filter out the different molecules from the particular things. Okay, so on the basis of a particular filter, we filter out the different things. Okay, so that was our question. Okay, so one question I guess was left here. Yes, this question. Yes, what is a pharmacophore? So pharmacophore, a molecule's 3D structure, a set of chemical feature essential for building a biological target, a protein's active site, or a drug's brand name. So what is a pharmacophore? So pharmacophore basically is what? A pharmacophore is a set of chemical features. Okay, so what is that? It is essential for building a biological target. Okay, so with the help of that, we basically make a model that can be helpful for filtering out the things based on the biological activity, that have the best biological activity, that is called as a pharmacophore. Next question, identify the structure of ciprofloxacin. Okay, so the structure of ciprofloxacin, what is that? So what is ciprofloxacin? That is a type of an antibiotic again. Okay, it comes under the class what? It comes under the class the quinoline. Okay, if we talk about ciprofloxacin, and it contains what? It contains a quinoline ring. Okay, the fluoroquinoline ring in its structure. So this and this, all three has a fluoroquinoline ring. So along with the fluoroquinoline ring, it also contains a cyclopropane in its structure. So that is our ciprofloxacin. So that cyclopropane is directly attached to the quinoline ring. So the C1 here is the structure of ciprofloxacin. It contains a fluoroquinoline ring along with a cyclopropane ring here and the piperazine ring here. Okay, so that is our ciprofloxacin structure. Okay, that is basically used in the UTI treatment. Okay, for the UTI infection we use it. Okay, then next question, which is the most common reactive intermediate formed by the mustin? Okay, anyone? The most common reactive intermediate that is formed by mustin, is it acridin, is it nitrine, is it aziridinium ion, or it is carbene, or is it carbene? So if we talk about mustin, so the most, we can say, the reactive compound that is formed, the highly reactive compound that is formed by the mustin is basically the what? Is it the aziridinium ion? Okay, that is the aziridinium ion that is formed by the mustin. That is a most common reactive intermediate, okay, of mustin. The C1 is the correct one here. Okay. One more question we have, a lead compound in drug discovery is. So what is a lead compound in drug discovery? I guess I have told you it before also, but still we can do this question. The final marketed product, the compound that shows promising biological activity but requires optimization, a toxic byproduct of synthesis, a naturally occurring metal used in medicine. So if we talk about the lead compound, so lead compound is a compound that we get that has a very good, a promising biological activity, and further it can be optimized so that we can make a molecule that can be useful, its biological activity can be useful further for treatment of different diseases. Okay, so that is our lead compound. So the answer that goes well is the B1, the compound that shows a promising biological activity but requires optimization. Okay, so that is our lead compound. Okay, so that is the thing. So I guess from here we have already done. So these were the questions of the medicinal chemistry today. So for now I want to just say that as you have already done with your GPAT, you have already qualified your GPAT, I know, I have the trust in you people that you will definitely be qualifying your NIPER also, and I just want to say that all the very best for your exam. Okay, I know you all can do it. Okay, and you will be successful with the flying colors, I know that, and keep on practicing, keep on preparing. Okay, and you will be definitely be doing that. Keep on going with us with the series. Okay, you can solve the questions. Okay, you can go we are taking the classes from 9 a.m. to 9 p.m. You can go on with us. Okay, you can practice the questions, you can do it. I know that you can definitely do it. Okay, so I hope you will be you will be getting placed in very nice colleges. We will see you next year in NIPER, we hope that. Okay, so today if you have any doubt in the questions that we have done today, you can ask anything to me. Okay, if you have any doubt in any question, you can ask me right now also. If afterwards you get any doubt, then you can even ask me in the comment section. I will try to reply to you people. Okay, if you have any doubt, you can definitely, anyone, if you have any doubt in any question, then please let me know. Yes, anyone, any doubt, you can have, we can solve it here. Otherwise you can also write it in the comment section. Okay, later on we can also answer it there in the comment section also. Yes, okay, so I guess everyone is prepared for your exam. Okay, so we believe in you people. We know that definitely you will be qualifying your exam. Okay, so you have already qualified GPAT, so I know you will also qualify your NIPER, and we wish you a very good luck. Okay, and all the best to everyone. If you have any doubt, you can still ask me. Okay, so I guess everything is clear to everyone and the preparation is also going well. Okay, so no doubts then. Okay, so the next faculty will be coming to you and they will he or she will take your further the process. Okay, okay then, thank you so much. And then the next faculty may be coming. Okay, so thank you. I'll be ending the session here.
Okay, good evening students. I hope screen is visible to all of you and my voice is clear. Okay, so we are back with the physical pharmacy topic. I hope screen is visible and my voice is clear to all of you. A very good evening all of you. So let's start with the first question from your physical pharmacy. So the very first question is, what is the volume in SI system is expressed? Volume in SI system is expressed as visible and audible. Very good. Chalo. You guys have patiently answered all the questions since morning, and this is the last subject of today that we are going to discuss. I hope that you will be as enthusiastic as you were previously. So tell me, what is the volume in SI system expressed as grams, meter cube, mole or Pascal? We know that volume is not gram, mole or Pascal, it is meter cube. Very good, option B is the right answer. Remember, in the metric system, pressure. For the pressure, we have Pascal, kilopascal, megapascal. Pascal is expressed in the terms of. No, mole is not there. Mole is for like concentration. Like we call it as mole fraction, right? Molality, right? These are the concentration, grams per ml, right? So remember, it is your volume is meter cube. Meter cube, we express it as liter also or meter cube. Okay, so remember, okay, do not get confused. See, pressure, you know, volume is meter cube or liter. Temperature, it can be Kelvin, degree Celsius. I'm talking SI as well as CGS units. Okay, and then mass or the concentration, you have kilomoles, moles. We talk about like mole fractions are there. Okay, so the next question is, the relationship between boiling point and the pressure can be calculated using Raoult's law, Henry's law, Clausius-Clapeyron equation or Boyle's law. Remember, they are asking boiling point and the pressure. Boiling point and the pressure. Which law is there? Very good. Option C, Clausius-Clapeyron equation is the right answer. Remember, the temperature at which the vapor pressure of the liquid equals the external or the atmospheric pressure, right? Earlier we used to think the temperature at which liquid is getting converted into the vapor. No. So at which your vapor pressure of that particular liquid is equal to the atmospheric pressure, that point is the boiling point, right? So this is whatever the change is there in the boiling point with respect to the pressure, that is given by Clausius-Clapeyron equation. Option C is the right answer. Chalo, very good. Next question is, pseudoplastic flow is also called as, right? So whenever we plot shearing stress versus rate of shear, we get different types of plots, right? Except the Newtonian, which is the straight line passing through the origin. But we have non-Newtonian as well, in which we have dilatant, pseudoplastic and the plastic flow. Remember, these four types comes under your non-Newtonian fluid. Plastic, pseudoplastic and the dilatant, in which they are asking pseudoplastic flow. They are also known as shear thickening, Bingham body, shear thinning or turbulent flow. Very good, option C, shear thinning is the right answer. Remember, shear thickening is for what? It is for the dilatant. That means as you apply the pressure, there is increase in the volume. As the name suggests, there is a thickening. So it is a dilatant. Okay. So if it is a dilatant, shear thickening. If it is a plastic, that is a Bingham bodies. Shear thinning means pseudoplastic. Okay. Here I'll write it down. This is a dilatant. Bingham bodies are the plastic, and this is pseudoplastic shear thinning systems. Okay. Turbulent flow, we are not discussing this in the non-Newtonian. Okay. Chalo, very good, option C is the right answer. Next question. Shear stress is defined as I told you, whenever we are plotting shear stress versus rate of shear, what do you mean by shear stress? Velocity gradient, force per unit area, mass per unit volume or work done per unit time. is shear stress? Very good. It is force per unit area. How much force you are applying? Say for example, very day-to-day life example is like a toothpaste, right? If you invert it, it will not come, whatever toothpaste is there. But if you apply the force, that is your shearing stress, then there will be a flow of that toothpaste. It will come out, right? So that is nothing but your force per unit area, shear stress. Option B is the right answer. Very good. Next is, which of the following parameter involves interparticle friction? Interparticle. Inter means between two particles. Intra means within the particles. Okay. Interparticles means between two particles. Dispersibility, Carr's index, Hausner's ratio, or particle size. Very good. Option C, Hausner's ratio. What is the formula for calculating the Hausner's ratio? Hausner's ratio tells you about the tap density divided by the bulk density. Okay, remember that will tell you about what is the interparticle friction. Option C is the right answer. So the next is, which of the following phase combination shows no interface possible, right? No interface means, for example, there is a surface of a table. So outside there is a gas and the surface of the table, there is an interface. But where the interface is not possible, gas liquid, gas solid, gas gas, or liquid liquid. Now, this is very easy. I hope you can answer this question. Students, I hope screen is visible to all of you. Very good. Option C, gas, gas. Because if two different gases are present, the interface visibly we cannot see that. Okay, very good. Gas, gas. It is right answer where no interface is possible. Okay. Chalo. Car's consolidation index is indirectly related to all except relative flow rate, cohesiveness, particle size, or the temperature. Relative flow rate, cohesiveness, particle size, or temperature. Flow rate as in the flow of the particles, right? Here we are not talking about any liquid. Cohesiveness means what is the force of attraction between two particles. Particle size and the temperature. Very good. Option D is the right answer. It is not at all related to the temperature. Carr's index, even the Hausner's ratio, they are related to the flow property. And if it is related to the flow property, ultimately particle size, everything will come into the picture. Say for example, if it is a powder material, it is not having a good flow property. What you will do? You will convert the powder into the granules. Ultimately, what you are trying to do, you are increasing the particle size, making it more regular in shape so that it will increase the flow. So particle size, cohesive, and flow rate. Option D, temperature is not related to the Carr's consolidation index. Chalo, very good. Next is, which of the following method is used for the measurement of sedimentation? Hydrometer, Anderson pipette method, balance method, all of these. Something similar we have already seen in the earlier pharmaceutical technology topic also. Yes, what should be your answer? Very good. Option D is the right answer. Hydrometer is also there. Remember sedimentation, balance method, and all of this. Anderson pipette, you are familiar. Remember, this is also given in your module number 8, okay, in your GDC book. Anderson pipette, balance method, and the hydrometer. Next question is, what is the HLB value of oleic acid? So many times I have told you a few examples. I know that there are so many examples are there, but at least the few one which are most commonly used, the surfactant, the oil, and everything. Like tragacanth you should know, acacia you should know, this oleic acid you should know. What is the HLB value of oleic acid? So the trick also I gave you when we have discussed in the class. Remember, oleic acid 1. So the HLB value of oleic acid word. Okay. Option C is the right answer. Option A is the right answer. Next question is polyoxyethylene sorbital monooleate belongs to which class of surfactant? Anionic, cationic, non-ionic, or hydrophilic colloid? So basically polyoxyethylene sorbital monooleate, these are nothing but your twins. Whether it is twin, whether it is span, they are your non-ionic. Okay, they are your non-ionic surfactant. Remember, anionic means triethanolamine, oleate. Cationic means if you see any of the word like enium, onium, that is your cation. Ammonium, enium. So these are your cationic. Non-ionic, two are their twins and span. Hydrophilic colloids are your naturally occurring compounds like acacia and gelatin, and then solid particles. Okay, please remember the class is very important. Chalo. Next is cholesterolic liquid crystals are observed in which condition? Diabetes mellitus, hypertension, atherosclerosis, or arthritis? Chalo. Very good option. C is the right answer. Atherosclerosis. Next is which of the following is an example of extensive property? Volume, density, viscosity, or the surface tension? Which of the following is the extensive property? Volume, density, viscosity, or the surface tension? So option A, right. Very good. Volume is the right answer. So in an open system where generally the exchange of matter happens, so you have to take any of the extensive property like volume, free energy into the consideration. Very good. Next is dry gum method is also known as, there are three methods: dry gum, wet gum, and the bottle method. You should know the alternative names for each of the methods. So dry gum method is also known as what? Very good option is the right answer. Remember, dry gum method is the continental method. English method is the wet gum method, and bottle method is nothing but your Forbes method. Okay, I hope option A is the right answer. Very good. So dry gum means first gum is mixed with the oil, triturate, mix it properly, and then water. Wet gum means gum is first mixed with the water. Okay. So next is that critical temperature of water is. The critical temperature of the water is. What do you mean by critical temperature? Critical temperature specifically for water is the temperature at which the liquefaction of the gases won't occur. Okay, so that is the critical temperature. What is the critical temperature of the water? C, right? 374 degrees Celsius. Very good option. C is the right answer. Sometimes they may even ask you in the terms of Kelvin. So remember 647 Kelvin, or you can also write it in the terms of 674 degrees Celsius. Okay. So critical temperature is the temperature at which liquefaction, that means gas, won't be converted into liquid, which does not occur, and that is the critical temperature for water. Likewise, every liquid will have different critical temperature. Critical pressure means how much minimum pressure is required to liquefy the gas. In the aerosol also we are using a pressurized dosage form, right? That means if you apply pressure to any of the gas, it gets converted. So how much pressure, how much minimum pressure is required to convert the gas into liquid is your critical pressure. Critical volume is how much volume is occupied by a mole of a gas, and critical phenomena means temperature and pressure both. Okay. Chalo, next is the particle size range covered by SEM and TEM analysis is 10 nanometer to 1 micrometer, 20 to 500 nanometer, 50 nanometer to 100 micrometer, or 1 to 1000 micrometer. By SEM and TEM, remember SEM, scanning electron microscopy, right? And transmission. So remember, it will go up to nanometer also. Very good option C, 50 nanometer to 100 micrometer is the right answer for SEM and TEM. Oh, the options are not visible. The angle of repose is calculated by. Okay, I'll directly tell you what is the answer. So you know theta is equal to tan inverse of h upon r. What is this h? What is this r? So basically a powder, required amount of the powder you have to use the funnel method if you are using, right? You will be pouring a powder, and if it is having a good flow property, it will form a cone, right? Like this. A pile. And obviously the diameter or the circle which is formed by this cone is not uniform, right? So you have to take the three distance. You remove this cone, make sure that whatever, after removing the funnel, you plot at least three diameters, take the average of that, radius or the diameter, right? Radius, for example, if you have taken. So take at least n is equal to 3 radius, right? Smaller, larger, medium, from all the sides, at least 3, then take the average. So you got the average of this one, height, that is the height, this is the height. And then you have to calculate tan inverse of h upon r. Theta is equal to, okay? Theta is equal to tan inverse of h upon r. So that is nothing but the angle of repose. That is nothing but the angle of repose. So next is phase rule was formulated by Van der Waals, 𝘎𝙬𝙎𝙎𝙬𝙎, Clausius and Clapeyron. Van der Waals forces of interaction, it is there, so it is not about the phase rule. Clausius-Clapeyron equation we have already seen. Then what is the answer? Very good, option B, 𝘎𝙬𝙎𝙎𝙬 is the right answer. So what is your phase rule? Phase rule is nothing but the F is equal to C minus P plus 2. F is equal to C minus P plus 2. So that will tell you how much number of phases, components and the degrees of freedoms, right? The relationship between these three. So F is equal to C minus P plus 2. F is your degrees of freedom. How many number of components are there? That is C, and P is nothing but number of phases. So that is nothing but phase rule, right? Very good. F is equal to C minus P plus 2. Do not get confused. Sometimes very small things are there. Sometimes F is equal to C plus P minus 2. These little things, make sure, okay? Clausius-Clapeyron, we have seen second law of thermodynamics. Then we have Van der Waals, they are the forces of interaction between real gases, and Clapeyron, that is the developed equation related to the phases. Which of these apparatus is used to measure the atmospheric pressure? Barometer, pyrometer, thermometer, or gyrometer? See, sometimes very, what happened? Got confused between any of the two? Why that emoji? It's okay, even if you get confused, that's fine. But I want to tell you that if you get confused in any of the question, just make a note and revise it afterwards. Okay, that okay, I have to revise this equation, I have to revise this formula, and so on. Okay, barometer is the right answer. You know, atmospheric pressure, pressure is measured by barometer, right? So pressure is measured by barometer. Thermometer, you know, that is for the temperature. Pyrometer is also for the temperature, but very high temperature. See, our normal temperature is okay for body temperature or any kind of. Chalo. Gyrometer, that is for the angular velocity. Okay, I remember again during the initial stage only I told that whichever instrument you see in the class, make a list of that. Okay, this instrument is for this purpose. Okay, so that you won't get confused. It's okay. Again, I'm telling it's okay, happens, but make a note wherever you feel that, okay, this is the point I have done, but I got confused. So that just make a note and revise it, okay? Chalo, powder with angle of repose of 25 is categorized as excellent, fair, passable, or poor. Lesser the value. In the technology also I told you, lesser the value, better is the flow property. Only thing is that you have to see that this particular flow property is starting from this one, okay? Chalo, very good. Option A, excellent, is the right answer. See, remember, angle of repose, the values are starting from 25, and the flowability, as the value increases, the flow decreases, okay? At least this little thing remember, then you will understand this. Chalo, next is particle size analysis is mainly done. Dose uniformity, dissolution rate, stability, all of this. What is the answer? Yes, very good, because we are doing it for dose uniformity, particle size analysis. We will understand the dissolution rate because according to Louis-Whitney equation, the dissolution rate is directly proportional to the particle size, because uh, lesser the, not directly, inversely, right? Lesser the particle size, higher will be the surface area, higher will be the dissolution, okay? Both are there actually. Stability is also there. That is the reason. All of this, okay? See, in the suspension, you know the stability, particle size, if it is lesser, it will settle afterwards, right? And hard cake will form. So that is the reason particle size analysis is important in every aspect. Method used for surface area determination is microscopic method, sedimentation. This is counter is there. This is not culture. Or option D, air permeability method. We know that microscopic is not for the surface area, it is for the particle size determination, right? Sedimentation is also particle size measurement. Counter is for the particle volume measurement, if you remember. And the air permeability method is for the surface area. Option D is the right answer. Very good. So next is quaternary ammonium compounds are cationic, anionic, bigonides, or phenolic derivatives. Just now I told you, if you see the word onium, enium, what it should be? If you see such kind of words, onium, enium, any kind of things, that is your cationic surfactant. Okay, remember, option A is the right answer. See, examples are given: pyridinium, tetradecyl-methylamine, and ampholytic are your amino acid, ammonium phosphate. So HLB value of a surfactant between 7 to 9 is used as what? Detergent, wetting agent, W/O emulsifying agent, anti-foaming agents. Detergents, HLB value between 7 to 9. W/O, we know it is around 3 to 6. It is because oil is your external phase, so lesser HLB, that is your 3 to 6. Detergents are your higher, like for example 13 to 15. Your twins will also come into your detergents, right? So it is your weighting agent. 7 to 9 is used as weighting agents. So very good, option B is the right answer. Next is multi-point viscometer, that is used to determine viscosity. All are viscometer. Read the question. Multi-point viscometer is what? Oswald viscometer, capillary viscometer, falling ball, or cup and bob viscometer. Multi-point viscometers: Oswald, capillary, falling bob, and cup and bob. Very good, option D is the right answer. Cup and bob viscometer. So cup is the outer stationary cylinder and bob is the rotating cylinder. And ozone viscometer, you know, this is mostly used in the laboratory, and you guys have used this also. Capillary viscometer, so start and end mark, falling ball is this one, right? Chalo, cup and bob is the right answer. I hope the construction and everything you might have studied earlier. Please remember that is also important. Fluid moves in a direction opposite to the sedimentation movement. This process or this phenomena is a settling, centrifugation, elutriation, or precipitation. In opposite, okay, they are telling if a fluid is moving in a direction opposite to the sedimentation movement. Very good option. B is the right answer because whatever your larger particles are there that will settle, smaller particles that will go upward along with the movement of fluid. So basically the direction of movement fluid is upward, the settling of the particles, larger particles is downward. So this becomes the opposite, right? So option, actually this is BC like this, okay? So elutriation is the right answer. So here you can see the movement, upward particle. So the lighter particles will go in the direction of the fluid. Fluid is moving out. But you can see that the separation of this particle, it is having the downward direction. I mean, because of the shape, size and all, right? So that is the reason it is opposite. Chalo, the questions we will see from the biopharmaceutics. Rectal administration of drugs mainly involves carrier mediated transport, passive diffusion, endocytosis, or active transport. How the drug will get absorbed from the rectal administration? Very good option B is the right answer. Your drugs like you have aspirin, paracetamol, these are the drugs that gets absorbed by the passive diffusion through the rectal route. Okay, so you have aspirin, paracetamol, �々𝙀𝑒𝑟𝑜𝑝HYLIN, certain kind of barbiturate. So these are the drugs that gets absorbed through the rectal route by passive diffusion. Chalo. The next question is the volume of distribution of a drug administered at a dose of 300 mg and exhibiting 30 microgram per milliliter instantaneous concentration in plasma shall be. So for that you should know what is the formula. Vd is equal to, you always see what is the unit given here, right? One is in the microgram and one is in the milligram. So dose divided by plasma drug concentration. Now what is given? Here they have given dose. What is the dose here? 300 mg. Remember it is mg. Calculate, you have to calculate, okay? And then plasma drug concentration is 30 microgram per ml. You can convert this milligram into microgram or microgram into milligram. If you convert this 300 into 1000 it will be, right? So if you calculate this you will get, so 10 into 1000, 10,000. But this unit is in ml, right? So it will be 10,000 unit ml, which is equal to 10 liters. Understood how to calculate? Just make sure that whatever units you are going to keep, that is constant, okay? Because this was in ml, we will convert it into a liters. Very good option is the right answer. I hope everybody was able to calculate. So next is what kind of substance can permeate membrane by passive diffusion? Lipid soluble, non-ionized, hydrophobic substance or hydrophilic substance? Cannot permeate. The question is cannot permeate. What is the membrane made up of? Membrane is a lipid bilayer, right? And we are talking about the passive diffusion. So the substance, see if it is a lipid soluble, it will get solubilized into the lipid bilayer and it will get absorbed. Option A is not the correct answer. Non-ionized substances, yes. We always say that the free drug is absorbing. So definitely drug in the unchanged form. So option B is not there because that can get permeated. Hydrophobic substance, definitely because it is a lipid bilayer. Very good option D is the right answer because these are hydrophilic. As such, by passive diffusion themselves, they cannot permeate because it is a lipid bilayer. Option D is the right answer. Very good. Next is, which marker is used for measuring the volume of plasma? Option is deuterium oxide, mannitol, Evans blue, or inulin. Mannitol and inulin is for the extravascular fluid, right? Extracellular fluid, right? Remaining is what? Deuterium oxide and Evans blue. You know that deuterium oxide is for what? Total body water, right? Remaining is your Evans blue. So option C, very good, is the right answer. Yes. Chalo, option C is the right answer. See, plasma, you have Evans blue, endocyanin green, I-131 and albumin. Erythrocytes, chromium 51, extracellular fluid, you have sodium chloride, bromide, sulfate, inulin. These are the certain kind of radioisotopes and certain kind of saccharides. And total body water, you have antipyrine and deuterium oxide. Chalo, very good. Now, two or more drug products are identical in strength, quality, purity, content uniformity. However, they do not have same excipient. That means they contain different excipient. Whether they are chemically equivalent, whether they are therapeutically equivalent, pharmaceutical equivalent, or bioequivalent. What is your answer? At least a guess. It is not chemically equivalent, right? Because they are telling that there are different excipients. If different excipients are present, how you can tell that it is a chemically equivalent? Therapeutically equivalent, no. It is a pharmaceutically equivalent. Pharmaceutically, the term says that the strength. Strength means what? If 25 mg is present, the other one will also have 25 mg. Quality, purity, content, uniformity, right? Very good. Option C is the right answer. They are pharmaceutically equivalent. Chalo, next question. The maximum pharmacological response produced by the peak plasma concentration of the drug is known as. Now they are talking about, say for example, I have given a drug, one certain amount of the drug, and at certain time points I have taken the blood. In that I got certain amount of the drug. Say for example 0 hours, 1, 2, 4 like that. And this is my plasma drug concentration and I got the graph. What is this known as? They are telling that peak plasma concentration. What do you mean by this? Intensity of action, duration of action, onset of action or onset time. See, this is your maximum safe concentration, minimum effective concentration, right? Now, intensity of action, that is your Cmax. So, option A is the right answer. Duration means for how long your plasma drug concentration is between this range. Say, for example, from 2 to 4 hours, then this is the duration of action. But this is not the intensity. Onset of action means, say, for example, in this case, I will get the action at this point. I mean, it will start there. So, onset is not there, onset time is not there, right? So option A, intensity of action, is the right answer. That is your Cmax. Remember, option is the right answer. Whether they are asking intensity, whether they are asking Cmax. Chalo. Next question is, the time period for which plasma concentration of drug remains above minimum effective concentration is known as. The same question it is there. For how long it is there, it is known as what? Onset of time, onset of action, duration of action, or therapeutic range. For how long? The time period for which plasma concentration of drugs remains above the minimum effective concentration. It is not onset, it is not onset of action, it is not the therapeutic range. It is nothing but the duration. So for example, if it is there for 2 hours, that 2 hours will be duration. The moment my graph falls below the minimum effective concentration, it will not show the action. That is the reason this is known as minimum effective concentration. Chalo. Very good, option C is the right answer. It's not D, okay? See why it is not D, I'll tell you. This particular range, if they tells you that whatever the concentration is present between minimum effective concentration and maximum safe concentration, that is nothing but your therapeutic range. Therapeutic range will be in terms of concentration. But what is this? They're asking the time period. So I will not see this axis, not the concentration y-axis. I will see the x-axis because they are asking me for the time period. Understood? So that is the reason there is a difference between this range and the time period. So that is the reason we will not go for the therapeutic range. Therapeutic range will always be in terms of concentration. But the question is about the time. So that is nothing but the duration. I hope whoever is having confusion now it is clear to all of you. Chalo, option C is the right answer. Okay, chalo. Next question is, a good in vitro and in vivo dissolution correlation can be obtained when the in vitro dissolution is performed under. So there is in vitro dissolution and in vivo. In vivo will be like how I explained the graph now, plasma concentration versus time, right? So normal conditions, sink condition, high temperature, a constant value. Whether you will do in the normal condition, sink condition, what are sink condition? Either you can increase the dissolution media, you can add the salt to make sure that whatever your in vivo conditions are there, that will mimic. So that is your sink condition. That is your sink condition. And that is the reason we always say that you perform the dissolution under the sink condition. There are various reasons and the various ways are there by which you can improve the sink condition. You can increase the dissolution volume, I mean the dissolution fluid, remove the dissolved drug. And that is the reason if you do dissolution studies, say for example 5 ml I have removed for 1 hour, for 2 hours 5 ml. You have to replace that much amount of the volume with the fresh media, okay? Very good. Next is, which of the following drugs show non-linearity due to active tubular secretion in excretion of the drug? Non-linear pharmacokinetics means what? Whatever the drug is administered and whatever drug is been absorbed, that is not linear, right? Now in this case, I mean it is not directly proportional. When it will happen, first case is like when the enzymes get saturated, you will see the non-linear pharmacokinetics, right? Likewise, glucose, penicillin G, ascorbic acid or carbamazepine. This is a very direct question, but still remember, it is option B, penicillin. Very good, Dhanalakshmi. Option B is the right answer. That is your penicillin G. Next question is, in plasma, phenobarbital is present as ionized and unionized forms in equal amount because it is weakly acidic drug, it is weakly basic, pH of plasma is 6.8 or pK of the phenobarbital is 7.4. It is present as ionized and unionized form because very good, it is a weakly acidic drug. Remember, phenobarbital is a weakly acidic drug, and if you calculate the pK, that will become 7.5, and you know the pH is 7.5. The plasma pH is 7.5. And what is pK? pK is nothing but the pH only where 50% of the drug is ionized. That means what? 50% is unionized. And because this drug is have a pK of 7.5, which is equal to your blood or plasma, that is the reason at this pH, which is plasma, 50% of the drug is ionized and 50% of the drug is unionized form, right? So next is volume of blood that flows per unit time, per unit volume of the tissue is residence time, elimination rate, gastric emptying rate or perfusion rate. Very good option D, perfusion rate is the right answer. Gastric emptying and all, you know that for how long a drug or any kind of material remains substance in your stomach and then pass to the intestine. Chalo. Which is used as a marker to determine total body water volume. Just now we have seen antipyrine, mannitol, Evans blue or raffinose. Okay, very good. Antipyrine option is the right answer. The same that we have seen for plasma, we have all the dyes like Evans blue, endocyanin green, erythrocyte CR151 you can remember, and then total body water. Two are there: deuterium oxide and antipyrine. So very good. Next question is drugs following one compartment open model pharmacokinetics eliminate. How they will eliminate? Bi exponentially, tri exponentially, non exponentially, or mono exponentially. The elimination happens how? So basically it is a first order kinetics, right? Elimination is first order kinetics, which is nothing but your mono exponentially. Very good option. D is the right answer. Remember, the elimination is a first order process with a first order rate constant. Next is fluctuation occurs in rate of excretion method. This can be minimized by Wagner-Nelson method, sigma minus, 𝘂𝙎𝙎𝑃𝐿 method, or method of residual. So very good. Option B, sigma minus method. This is the alternative for the whatever the fluctuation. This is one of the disadvantage that happens with your rate of excretion. So that can be minimized by the sigma minus method. So the next question is perfusion limited model for analysis of pharmacokinetic data comes under compartment model, distributed parameter model, physiological model, or non-compartmental model. Chalo, very good option C, physiological model. Remember that chart, I hope. This one. Model independent and the model dependent. You remember this. These are the various approaches for the analysis of whatever pharmacokinetic data you will get. Then compartmental PBPK models are also there and the distributed parameter model. Okay. So next question is, with respect to reaction kinetics, rate is independent of the concentration of drug undergoing reaction. They are referred to as, if not only in the excretion, any reaction where the rate of reaction is independent, that means the rate does not depend on how much is the initial concentration, then that particular rate is known as zero order kinetics. Very good, because it is telling that it is independent of the concentration. If it is dependent on one of the reactant, if they say, then that is a first order reaction. Okay, it is not first, second, mixed order. Okay, K0 is the zero order rate constant. Very good, option A is the right answer. Next is what? The loading dose divided by the maintenance dose is called as dose ratio, accumulation index, primary dose, or none of the above. Very good, because the name itself says that it is a dose ratio. Remember, dose ratio is equal to XL divided by XM. That is a loading dose divided by maintenance dose. Loading dose as an initial dose, initial release required to achieve that concentration from which the action can be shown. And the maintenance dose means it will maintain the concentration, right? So that is your dose ratio. Next is in 𝑚ichaelis-Menten equation, when value of Km is lesser than C, then what will happen? Becomes mixed order at higher concentration. Rate of process is equal to 1/2 its maximum rate. shows first order elimination or the rate process occurs at a constant rate Vmax. If it is a less, the process will occur at a constant rate, okay, at a Vmax, which is not applicable to protein binding. There are certain equations of the plots which are not applicable to the protein binding. Plots, reciprocal plot, Sandberg modified equation, Blanchard equation, or Detley plot. So many equations and all it is there with this. Instead of Detley, we have scattered plot, right? Option D is not there. Next is the following are used to determine the amount of drug bound to a protein. Equilibrium dialysis, solubility, pH titration, or the distribution. Very good option A, equilibrium dialysis is the right answer, that is used to measure the drug protein binding. Which mechanism of metabolism of a drug is not affected by weight change of patient? Conjugative metabolism, acetylation, hydrolytic, or oxidative? Oxidation, you know that oxidative product, whatever the oxygen will be there, that will be transferred to another substrate, right? So that is not affected by the weight change of the patient. So that is your oxidative metabolism. Very good, option D is the right answer. The next question is, the biological half-life of a drug is what? It is constant physical property of a drug. Is it a constant? It is a constant chemical property of a drug. It may be increased in patient with impaired renal failure. It may be decreased in patient by giving the drug by rapid IV injection. Remember, the half-life of the drug is how much time required for any drug to fall half of its concentration. That means half of the drug is metabolized, eliminated, right? But if you see the option C carefully, that it may be increased in the renal failure. Definitely, if any patient is suffering from renal failure, the kidneys are not able to eliminate the drug properly, and that is the reason for longer period of the time the drug will be accumulated in the body. So there is no chance that it will fall to 50%, right? So it will increase. So definitely the T half may be increased in the patient with the impaired renal failure. Okay, you understood this question? This is like an applicable question, application based question, but understand sometimes. Okay, the loading dose of a drug is usually based on what? On what you will decide the loading dose? Total body clearance of the drug, percentage of drug bound to plasma protein, fraction of drug excreted unchanged in the urine, or apparent volume of distribution and desired concentration in plasma. Just now I told you that based on the graph, I know that this is the concentration which is required to make sure that drug is present at that particular concentration. So how much plasma drug concentration is required? Based on that you will give the loading dose. If you give 1 mg and it is present here only, then what is the point? From this graph you will understand that I have to increase the concentration, because I can see that based on this I need to increase the concentration and based on the volume of distribution. So very good, option D is the right answer, apparent volume of distribution and the desired concentration. See, this is the concentration. Loading dose is equal to volume of distribution into target plasma concentration. So that will vary from drug to drug, what is your concentration and what is the volume of distribution. Volume of distribution as in how much amount of the drug is going to each organ. Because if the volume of distribution is higher, you will get lesser concentration in your blood. So next is, what is the renal clearance of a substance if its concentration in plasma is 10 mg, concentration in urine is 100 mg and the urine flow is 2 ml per minute. So what is the formula for clearance? Renal clearance is equal equal to what? Urine drug concentration divided by plasma drug concentration into urine flow rate, right? Now solve this, which is equal to given as 100. What is the plasma drug concentration you are given as? 100 into 2 by 10 basically. If you solve, what you will get? 20 ml per minute. 2 10 the 20. Okay. If you solve, now you don't have to convert because all are in mg. This is mg, this is mg. If it is different, then only you will have to calculate. Okay. So next. Okay, I hope everyone has solved. Is there anyone who have not solved this one? Okay, so the next question is, and the last, a direct method for determining creatinine clearance involves collection of urine for 6 hours, 12 hours, 24 or 48 hours. For how long you will collect to check the direct determining the creatinine clearance? Yes, very good. We check it for 24 hours. Okay, and the clearance, the rate of creatinine excretion divided by serum creatinine in mg percentage. Okay, so for 24 hours, that is a direct method. I hope you have understood all the questions from this as well as the technology, and this series will be really helpful for the upcoming 2 days more. And I hope your preparations are going well, and this will be the add-on, and definitely it will be having good impact for all of you for your preparations. And if you have doubts, do let me know in the comment section, and see you all in the next class. Till then, thank you so much and all the very best for your preparations.